Every single day, you find more and more people who need the help and get them the help they need. And that happens faster and faster, better and better. That keeps constricting the spread of this disease. That's why I'm so excited about this initiative. I think it's going to reach very, very far and have a profound impact on hastening the day when we end this era in our city. And the evidence is there from around the world. Other countries that had very creative and aggressive test and trace programs and the take care component as well. That was the magic combination, test, trace.
All right, shot there froze up. We're going to see if we can get it back here for you in just a moment. You're watching Worldwide on News Now, part of Fox10Phoenix.com, and of course, coronavirusnow.com. Hoping that we could get that shot there back for you and keep you live and worldwide at the same time. Does not look like it will come back. If it does, we will. Oh, there it is.
That's what has worked around the world, and that's what's going to work here in New York City. Now, all of this, of course, is to help protect New Yorkers, keep us healthy, keep us safe, constrain this disease, and one day rid us of this horrible challenge. And obviously, it's all about hastening the day that we can restart and go through the different phases of restarting.
Your health insurance, whether or not that health insurance is going to translate well to the place that you're going to be visiting, and the documents that you want to take with you, in addition to your financial documents. Like you might need to have access to your health records as well. And you're really looking at not just the bottom line of the best deal, but think about the other things that are going to come into place. Like, for example, maybe if the place that you're going to, are restaurants going to be readily available? Are markets, the place that you're going to, are you going to be able to stay there long term if things sort of shift all of a sudden? So when we're talking about managing your finances and preparing you for today and the future, now we're talking about also preparing for the just in cases before you book that travel.
Yeah, I didn't think about that. In case there's a second wave, and what
Hmm.
does the hospital system look like where you're going on vacation,
Right.
so
Right.
uh,
That's really critical because if you take a look at a place like Hawaii, right, you
yeah.
want to take a look how a lot of places in Hawaii, they have a shortage of beds compared to those of us here in California, right, in the hospital. So things to consider.
Speaking of vacation, lawmakers back east, they like to take vacations, and so where. And I asked this before we let you go here about because in our previous conversations we've talked about the next stimulus package if it's even going to happen.
Mhm.
What are you hearing in regards to are Americans going to get more stimulus financial relief from the government?
Well, it's going to come eventually at some point. We just don't know when, because unfortunately, the Democrats did their job. They passed it through the House, but unfortunately, Republicans have put this on a standstill, which, it could be a good thing because I think they really need to figure this out to make sure it's appropriate for Americans, that the funding goes to the appropriate ways, it's well thought out, and it's carefully planned out. But most importantly, that's an efficient matter so that it means that you're getting your checks that you need sooner rather than later. And there's because really they're not even completely paid out on the first round, believe it or not. But hopefully we have a decision soon because right now the one of the big factors is the matter of unemployment and the stimulus. Their Democrats are hoping that we're going to get up to $6,000 per family, which would be great. In addition, they're hoping to extend unemployment benefits to January of 2021, but Republicans have clearly said that they absolutely will not support that. So hopefully they can come to a happy medium, and most importantly, that Americans do find that financial stability that they need as we go through not just the next few months, but like long term. The next 6 months would be ideal.
So maybe by Independence Day, by the Fourth of July, we should know.
Yes. So
Yeah.
that's the idea. So June 1st, our politicians are coming together and discussing this starting June 1st. And the goal is to have some sort of resolution before Independence Day.
Okay. All right. Just a note for our viewers here. You can watch this interview and other interviews all tied to the coronavirus on our website that we're streaming 24/7, coronavirusnow.com. Winnie Sun, Managing Director at Sun Group Wealth Partners. Winnie, thanks again. Have a great rest of your week.
Thank you so much, Mike. See you soon.
Okay.
Yeah, the priest there came up with the idea while trying to come up with a safe way to continue the tradition of blessing the Easter baskets while making sure that their kids had a good time. He ended up doing both and then some.
Just on a lark, I said, well, what if we use a squirt gun?
It was the shot memed around the world. Images of Father Tim Pelk going viral. The priest of St. Ambrose Catholic Church in Grosse Pointe Park seen blessing Easter baskets with a squirt gun loaded with holy water.
I began thinking of what could we do that would give the kids...
That's what the Thrive Initiative is all about, making mental health as widely available to people as possible, mental health services that people need, mental health information they need. And it's a reminder this month and every month, if for any reason you need a trained counselor to talk to 24/7, multiple languages, and yes, for free, always for free, call 888-NYC-WELL. You are never alone in New York City. If you need mental health support or someone in your life needs mental health support and you want to talk about how to get it to them, call 888-NYC-WELL. Okay. Before I go to our daily indicators, and our thresholds, I want to talk about something that's been going on over these last weeks that we've talked about from time to time, and it's not the same as the human impact and the healthcare impact and the lives we've lost. Those are so much more important than anything we can talk about when it comes to dollars and cents. But we do have to come to grips with the fact that on top of the healthcare crisis, on top of the economic crisis, we are now in a fiscal crisis here in this city. It is not the responsibility or fault of anyone in these 5 boroughs. We didn't ask for the coronavirus, and we have spent so much time, energy, heart, soul, and money fighting back the coronavirus, and often alone without the help of our federal government. But New Yorkers have done it. And when you think about it, what's happened here in this city, what's happened in cities all over the country, what's happened in states all over the country, is the burden has been borne by cities and states to somehow make sense of this crisis, to go it alone in so many ways, and to fight back a disease that really is part of an international pandemic. Of course, it should be the responsibility of the federal government first and foremost to address this. And yet, here we are waiting once again for action. We're not hearing from the president. We're not hearing from the Senate Majority Leader. In fact, I spoke to Senator Schumer yesterday. There's literally no schedule for the 4th stimulus bill to be voted on. This is the stimulus that would actually help cities and states, that would actually help us back on our feet and help us deal with this crisis. Literally no vote scheduled. But here's the challenge. While they're not acting in the Senate, while the president remains silent, our fiscal situation has gotten worse. I originally reported to you last month that between the current fiscal year and the one that begins July 1st, we had $7.4 billion in projected lost revenue because, of course, the economy is not functioning the way it normally does. And that's taking away all the money that we use to provide services to all of you. $7.4 billion. We now have a new estimate that we have just published, and I'm very sorry to have to give you this news, but it's not shocking to me that things have gotten worse. We are now $9 billion in the hole between the current fiscal year and the one that begins July 1st. $9 billion, and we project, unfortunately, beyond next fiscal year, additional lost revenue that will hold us back further. There is literally no way that we can solve this problem without federal help or without having to make very, very painful choices that will affect the quality of life in this city, our ability to provide basic services, and how many people we're able to employ to support you in the middle of a pandemic, in the middle of a moment where people need that public support and help more than ever, in the middle of a moment where we are spending billions of dollars to protect your health and safety, to make sure you're fed, to make sure there's a roof over your head. This is the very time where we're not getting the help from the US Senate or the President, and we are getting to a point of really tough choices. We have to pass a budget by law by the end of June. So we have about 4 weeks. So this week, I asked the state of New York for help. I asked the state of New York to give us a fallback, to give us a safety net, and that is borrowing authority. It's not something we want to use or intend to use in the first instance, but it's something we need as a last resort if our federal government isn't there for us. If we're going to maintain basic services here in the city, we need some capacity to borrow. After 9/11, in the middle of that crisis, Mayor Bloomberg went to Albany, asked the legislature and the governor to support New York City and provide borrowing authority. They did. New York City handled that borrowing authority smartly, wisely, got us through that crisis, got us to the point we were just a few months ago before this pandemic, a strong city, economically strong, providing so much support to our people, safest big city in America, highest number of people employed in the history of New York City. That's where we were in February, that recently. Because this city has been smart in its stewardship of our resources, smart in the way we serve our people and grow our economy, we need to keep doing that. So we've asked the state for that borrowing authority. By the way, the state has granted itself the very same borrowing authority. In April, the state granted itself $11 billion in borrowing authority. There was no debate, there was no fanfare. It was obviously the right thing to do, to give it that fallback while we're all fighting shoulder to shoulder, city and state together and all cities and states together for the right kind of stimulus, because no one wants to borrow. What we want is our federal government to step up for it, us, all of us, as it should in a moment of crisis. And we'll keep fighting for that. Well, look, I've asked Albany for this borrowing authority so we can protect our people. And I know a lot of people are stepping up in this city and saying that's the right thing to do. A lot of folks in our labor community have stepped forward and let leaders in Albany know how important it is to protect working people and to keep working people working by having this authority as a last resort. So this is a city unlike the city we knew decades ago. Decades ago, New York City went through a lot of trouble and we learned a lot of valuable lessons. The city of today, a strong, careful, smart city when it comes to our finances. This is a city that can and must move forward, that can and must provide basic services. Let's keep fighting for that federal stimulus. That's the right way to do it. But in the meantime, let's get that borrowing authority from Albany to make sure we have that fallback and to make sure we can protect our people. Now, let me turn to our daily indicators and thresholds. And again, I'm going to refer to the structure we're using now, and this again is an example of the success that has been achieved in this city that we're talking now in terms of these thresholds. So the first one is the daily number of people admitted to hospitals for suspected COVID-19. Remember, we want to see that be under 200 individuals a day. That is a level that is sustainable. If it's under 200 a day, look at today's report, 55. For a city of 8.6 million people, only 55 people admitted to the hospital for suspected COVID-19. That's really good news. Now, daily number of people in our health and hospitals, intensive care units. So this threshold, we want to keep that under 375. We have a little more work to do. We're at 431 patients today, but we are confident that number can continue to go down and will continue to go down. So more work to do there, but on the right track. And so important, the percentage of people tested citywide who are positive for COVID-19. Again, staying under that 15% threshold is what we want to see. We are at 8% today, and that is so good to see. Every day we're in single digits. So that progress is because of you. Don't let up. Keep at it with the social distancing, shelter in place, wearing the face coverings. Let's be smart as we get ready for the next phase. Let's do things the right way, and that's what gets us to the next phase. Okay, a few quick words in Spanish. Necesitamos hacer más que seguir el rastro del virus. Hay que cuidar a los neoyorquinos que se tienen que separar de sus familias. Eso es justo lo que vamos a hacer. Les vamos a dar comida, medicina y un lugar donde quedarse a cada neoyorquino que lo necesite, gratis. Nuestra promesa a los neoyorquinos es simple. Les vamos a dar lo que necesitan para que se mantengan seguros. And with that, we will turn to our colleagues in the media. And please let me know the name and outlet of each journalist.
Hi all, just a reminder that we have First Deputy Mayor Foulahan, President and CEO of Health and Hospitals, Dr. Katz, Executive Director of the Test and Trace Corps, Dr. Long, and Director of Isolation for the Test and Trace Corps, Dr. Johnson, on the phone. With that, I will start with Katie from the Wall Street Journal.
Good morning, Mayor de Blasio and everyone on the call. I have two questions, and it has to do with our small businesses, our restaurants, and bars here in the city. San Francisco just announced a plan to open up streets and sidewalks to diners, including free permits, and California has had more guidance for businesses for weeks. With more people going outside, and it will probably increase as the weather gets warmer, when can the city see some sort of dining plan, if it's an outdoor plan? And then the second question is, I know the NYPD has been targeting certain bar-heavy areas, 9, I believe. What are those areas? Thank you.
Thank you very much, Katie. I love the phrase bar-heavy areas. That's like one of those government designations that always impress me. We will get you a list. Obviously, the Upper East Side was an area of particular concern, Katie, and that got a lot of attention, but I will get you, if we have in the course of this press conference the list of bar-heavy areas, I will turn to Freddie Goldstein, who will take great interest in this matter and will get me the list if we can now. But otherwise, we'll get it to you right after. On the outdoor dining question, this is a really important question. I'm glad you raised it. We've been talking to a lot of folks in the restaurant and bar industry. There's a lot of excitement about this possibility. Now, it's not in phase 1 as it's structured now. And again, right now we are on track with phase 1 to begin in the first or second week of June. But we are looking very intensely at what we can do with bars and restaurants, but again, with a safety first attitude. I really respect the wonderful work that's been done in California and in San Francisco particularly. They do have a very different circumstance for many, many reasons. So we look at other people's ideas and approaches, we look at them all over the world, but we know our circumstance is particular and we are very much in a safety first, health first approach. So we're going to figure out how and when we could reopen bars and restaurants, how much outdoors is going to play a crucial role in that. I think it is a very, very encouraging possibility to lean to the outdoors. But even with that, we got a lot to figure out in terms of social distancing, face coverings, protocols, and what amount of capacity you could create that would make it worthwhile. Because bar and restaurant owners have been really clear they need a certain level of capacity for it to be economically viable. So we are working on that. It is not part of phase 1, but it is something we'll have more to say on soon.
Next we have Gersh from Streets Blog.
Mr. Mayor, thank you for taking the call. How are you doing?
I'm all right, Gersh. Gersh, I feel there's been no cooking updates. I feel alone. I'm getting no information from you.
I owe you a couple of breads and some pizza dough. I admit that. It's funny. I wanted to follow up.
You keep saying that, but I've seen no bread, Gersh. No bread at all.
I am socially distancing, Mr. Mayor. I'm socially distancing. It's good you took the call right after Katie's question, because I actually wanted to follow up exactly on what she asked, which is, I have to say, Mr. Mayor, you often say in these kind of, when changes are being asked of you, that New York has unique circumstances. Other cities, do what they do, and we study it, et cetera. But then after a certain amount of time passes, you have a great ability to see what other cities do well and then adapt them, as you did with open streets. We now are the nation's leader in open streets, and you're doing it in a way that other cities had, in a very small way, pioneered. So what is different with the restaurant thing? As you know, the weather is improving, and these restaurant industries members are telling us that the window is going to close on them because they only have basically through September to really make that happen. So what's different? Can you talk about why we can't expedite this?
Yeah, Gersh, I think your observation's a good one, but I take it as a badge of honor, honestly, that we look at what other people do, often, honestly, in circumstances that are more propitious. I mean, let's face it. We've been the epicenter of the crisis here in this country. We have the toughest conditions, the most densely populated place that's been in the middle of this whole fight. We have a lot here that makes what we do very, very sensitive. Small steps can have a very big impact when you're talking about over 8 million people. And job one is safety and health and not allowing that boomerang. So I really think it is actually exactly right to say, we're watching what other people do. We watch a lot of people do things in easier circumstances, and then we decide what makes sense for us. The open streets is a great example. I did not think it made sense when we didn't have enough NYPD officers and all of our city personnel. Now that they came back, that really contributed. Great work with the council, great work with communities. When we started it, we were able to start it safely, and the proof has been in the pudding. It is a great idea, Gersh, and it's working real well, and it's been executed safely. So I think the parallel with the bars and restaurants is very, very clear. I would love them back up and running immediately. But the safety ramifications of bars and restaurants are very different than the phase one industries. What's phase one? Construction, manufacturing, wholesale, and retail, but only with things like curbside pickup. Calibrated to make sure that as we bring back hundreds of thousands of people, we do it safely and we don't hit that boomerang. Bars and restaurants implicitly come with much closer contact. We have to figure out how to do it right, how to enforce it, how to make it viable. So I know people want to get going. I respect it. As soon as we feel it's right, we'll be ready to act. But first, we got to get phase one going. It's just there is an important part of sequencing to keep everyone healthy. So that's how we're going to proceed.
Next, we have Matt Chase from Newsday.
Hey, good morning, all. How you doing?
Good, Matt. How you doing?
Good. Two quick questions for you. First, how is rideshare like Uber and Lyft going to be different during phase one reopening? And second, to what extent are you going to be restricting more streets than currently to bicycles for phase one?
Let me come to that, but first, if you'll just forgive me for a second, Matt, I have the coveted list of bar-heavy areas that Katie asked about. And again, this is sort of the historic reality, but Katie, we will obviously watch if there's other places that need to be addressed, so this can change according to what we see happening on the ground. But the formal bar-heavy areas are the Upper East Side, the East Village, the West Village, the Lower East Side, Williamsburg, Long Island City, Astoria, Hell's Kitchen, and City Island. So there's our formal list. Matt, look, we are going to, in phase one, focus on those industries and that I've talked about and obviously get them up and running the right way. So in terms of how people get there, the initial estimate is it's going to add at least a couple of 100,000 people into the workforce in the 5 boroughs. That's an area that's a reality that concerns me. We talked about yesterday. We want to make sure we're well coordinated with the MTA, and that makes sense. Right now, in terms of the basic structure of transportation, we have what we have. In terms of any changes we might make with rideshare or bikes, we're still evaluating if that makes sense and if there is something specific to change in the here and now. But it's all connected. We're trying to make sense of what's the right way to get people around in a new circumstance. I think that's an important consideration. Now I think it becomes an even bigger consideration when we go to phase 2. So the answer is still assessing, but we will have more to say on it.
Next, we have Brian from Cranes.
Hi, Mr. Mayor.
Hey, Brian, how you doing?
Good. I wanted to ask you, the New York coalition of 300 New York businesses called Reopen New York have defied the state and city and are reopening. We wanted to know what your thoughts are on that and if the city plans to take any action against them.
Yeah, I mean, the city and state are totally united on the approach to reopening. And I would urge everyone to look at the facts. This city has beat back this disease really impressively because of everyone's great effort, but we are far from done. And if we do this the wrong way and the disease reasserts, then you will go in the opposite direction, more restrictions, even more we could have than what we have right now. And that's the last thing anyone wants. So we're going to do this the smart way. Anybody who reopens in defiance with state and city orders, of course we're going to enforce. And if we have to, we'll summons. If we have to, we'll get a commissioner's order, and the place will not be allowed to be open in any way, shape, or form. So I'm a little confused when we've seen steady progress. I'm looking at the state indicators, 5 out of 7 now completed. We're confident that we'll get there in the first half of June on the contact tracers. We've only got a little bit more to go on the hospital beds. That's coming along. I've been really clear about the city indicators and thresholds. They're moving exactly where we want. I don't know what people need to hear to understand that things are moving because we're doing this the smart way. If we keep doing it the smart way, we get to that phase 1 reopening. Do that, we can get to the phase 2 reopening, which really is a vast amount of the economy back in the game. But if people jump the gun and they don't follow the rules, that's the best way to guarantee we don't get to our reopening. So of course we're going to enforce this, and we're going to enforce it aggressively because we have to get this right.
Next we have Jillian from WBAI Radio.
Good morning, everybody. I'd like to ask some follow-ups on my eviction questions from last week. You made your preferences very clear, but as a practical matter, what can and will the city do, including the timeline and grace period you mentioned? And also, what authority does the city have in the context of the governor's power? Thanks.
Thank you very much, Jillian. Very important question. Jillian, look, we have pushed many a time for the state to change its approach to tenants, and often with success. Many times sitting right here, I pushed for the state to allow tenants to use their security deposits to pay the rent. The state finally did that. We pushed for extensions on evictions and the eviction moratorium. They did that. We need to go, again, you're absolutely right. There's more to do, and I want to see the state expand the eviction moratorium through this crisis, past this crisis, at least several months. But I think it is true that when the voices of tenants and the voices of the city are heard in Albany, that we often see those changes. So we're going to keep fighting for that. I want to make sure all city agencies are doing all we can to keep people in their homes, to stop evictions. There's a lot we do all the time to do that in normal times. We'll keep doing that. And I want to emphasize, Jillian, anybody who is faced with eviction can call 311 and get legal help right away, because we do not want to see evictions in the middle of this crisis. So we will use every tool we have to support individual tenants to stop evictions. All city agencies know they should do anything and everything to stop evictions, and we'll keep working on the state to get the changes we need.
Next we have Jeff Mays from the New York Times.
Jeff?
Hey, good morning, Mr. Mayor.
How are you, Jeff?
Quick question. In terms of the budget deficit, there's been some critique about that the city hasn't dug deep enough for cuts and other budget saving measures. I'm wondering if you think there's more to be done on that front in order to help the city close this budget deficit.
Jeff, in the executive budget in April, we did between a variety of cuts and savings measures, $2.7 billion. That's a lot of money. We obviously have shown the ability over years to make a variety of savings actions, PEG programs, whatever it takes. Right now, we're getting to the point where if we have to sustain further cuts, it's going to start to affect all agencies. And I've said that at the level we're at now, Jeff, $9 billion in missing revenue. That leads us to a horrible place where we would be cutting back basic services, cutting back personnel, furloughs, layoffs, things we do not want to see, things that go against everything that we believe is right for New York City and would only contribute to the economic crisis and the hardship of our people. So right now, what we need is to get that stimulus done in Washington. Every city and state in America, I believe, truly deserves to be made whole. We did not do anything that caused us to lose billions upon billions of dollars in revenue. The federal government owes it to the cities and states of America to make us whole so we can lead this recovery. And Albany can help backstop that by giving us the borrowing authority, which, by the way, Jeff, is multi-year authority, because this is going to be a multi-year crisis. That $7 billion we're asking for could be used at any point over years. We, again, only would use it as a last resort, but I want to be clear. The upcoming fiscal year, huge budget problem. The next fiscal year, I can tell you right now, is also going to have a huge fiscal problem. We're not going to see the revenue recover anytime soon. So we're going to do everything we can to keep the city moving forward, but a strong recovery correlates to having those basic services in place and keeping our public workforce strong. If we have no choice, we will make tough decisions, but it won't help us recover if we have to make those tough decisions.
Next, we have David from Gothamist.
David?
David?
Hi. Can you hear me?
Yeah.
Hi. Can you hear me?
Yes, can you hear me? David.
Okay, I can hear you now.
There you go.
Good morning, Mr. Mayor. Can you hear me? Okay, great. Good morning, Mr. Mayor. I have a question for Dr. Katz on contact tracing. You mentioned previously that the contact tracing program will use a DOH mandatory quarantine order under its health code if it has to. Can you give me an example of what triggers a forced quarantine into a hotel? And what happens if someone refuses a hotel room for a variety of reasons?
So let me start, David, and then we'll turn to Dr. Katz is on the line, Dr. Ted Long, who's the Executive Director of Test and Trace, and Dr. Amanda Johnson, who is running the Take Care initiative, which is focused on the need to isolate those who need that help, that safe separation. So any of them can jump in, but I want to really make clear the approach we're taking, David. We believe the vast, overwhelming majority of New Yorkers are going to act the same way they've acted throughout this entire crisis. If you had asked me at the beginning, was it going to be easy for people to stay home or to do social distancing or to put on face coverings, I'd say these are really going to be immense challenges, but overwhelmingly we have seen New Yorkers abide by these rules because they understand it's about their safety, their family's safety, everyone they care about, and their entire community. And people have really been paying attention and doing what's right. So we take a positive view here, David. The positive view that once folks know this is what will keep everyone safe. No one wants to inadvertently infect a member of their family and risk lives. No one wants to see one of their elders in danger. But folks need to know they will get the support, and that's particularly the crucial work that Dr. Amanda Johnson and her team are doing. When we say take care, we're really trying to help people know this will be a very positive, supportive experience, well facilitated, everything for free, so that folks are comfortable if they have to isolate at home or if they need to go to a hotel. So that's where I see this going. I think the overwhelming reality will be a positive, voluntary approach. If we don't find that, we always will consider other options, but I want to accent the positive because that's what we've seen from the people of the city. Dr. Katz, Dr. Long, Dr. Johnson, who wants to jump in?
I'll start, Mr. Mayor. I think you've explained it very well. This is not a new issue. It has often been necessary in public health for people to isolate or quarantine. In our experience, overwhelmingly with other diseases such as tuberculosis, is that people do the right thing. And simply knowing that there is an order that can be made is another way of telling people, look, you need to stay. You don't want us to make any orders. It's really not necessary. It would have the same effect if you would just stay, in your room. I don't think this is going to turn out to be a problem for us.
Dr. Long, Dr. Johnson, what do you want to say? Are they out?
I can chime in.
Go ahead.
And just echo the sentiments expressed by Mayor de Blasio and by Dr. Katz. I think my experience as a primary care doctor does reinforce that people are willing and ready to do the right thing if you support them. And so I want to bring the same approach of trying to understand what the barriers are. What are the realities faced by New Yorkers that are preventing them from doing what they would want to do? And bring all of the resources we have to bear as a city as a healthcare organization to make this a possibility for them and to see them through this very time-limited period that is going to enable us to reopen the city and have them get back to their families and their communities. And so it's the investment in things like food in the hotel or food delivery, access to medication, access to mental health support and physical health supports, as we've mentioned before. You tell us what it is that you need to make the right choice. I want to take on the responsibility for making that work for you.
Thank you very much. All right.
Next, we have Mark Morales from CNN.
Hey, everybody. How you doing today?
Good, Mark. How you doing?
Doing good. So I had a couple of questions. One was, do we have a count as to how many local businesses have so far gone out of business or won't be reopening when June 7th rolls around? And the other is about enforcement. There's more cars on the road, there's more people out, and I know a lot of stores have not opened up yet. But how does enforcement change now? Is it still quite as stringent, or is it going to be more targeted, like say in those bar areas that you mentioned or in religious communities?
Yeah. Thank you, Mark. Very good question. So let me say on the enforcement side, we're going to be going through in the next couple of days the way our agencies are going to approach the enforcement. So I think the state has set up, I just want to sort of put it in frame here. The state's set up very clear indicators. We've set up clear indicators and thresholds. So that's telling us where we are. We're going to watch those every single day. We're not there till we're there. I keep saying I'm confident from everything I've seen first or second week of June. But everything's going to be based on these objective numbers, and it's a lot of different measures that all have to hit at once. And I think that's a really good high bar that has kept us safe. I think the fact that we've come this far is directly related to setting that high bar. Now, as you open up, what we're going to do is, of course, we'll pay special attention whenever we see a problem area. We had some issues in some parks. We've found some good ways to address that. We've had some issues with some bars. We've found some good ways to address it. But this last weekend, 3-day long weekend, we had very few issues between parks, bars, restaurants, beaches. We just didn't have a lot of problem because I think people, one, are overwhelmingly doing the right thing, and two, when they see that there's some real enforcement out there, it works. We're not trying to be heavy-handed. We're just trying to be present, and that has been working. So now what happens in this next phase is, you're talking about a very substantial number of businesses in phase one, many more in phase two. In phase one, the state rules about the exact way to comport yourself as a business are very clear. They're very helpful. We're going to now be creating the enforcement behind it. So each agency designated for a certain type of business will go out at the very beginning, communicate with those businesses. We're talking to a lot of them now to figure out what they need, how it's going to work, what they're concerned about. But once they start, we'll be in regular touch, inspections as per usual, going out to make sure that all the state protocols are being followed and everything that we need is being followed. And we're going to, again, have the spirit of we want to make it work with businesses. We want them to succeed. We want the economy to restart. So it's going to be light touch and a lot of communication and problem solving focused. We see a problem, we want the business to address it. We don't want to penalize, we want to fix problems. So that's what the enforcement will look like, but a lot more detail will come out on that shortly. On the number of businesses, Mark, I don't have a specific number for you today. I'll get a sense from our small business team what we're seeing. Look, so many businesses have been thrown for a loop, but I'm hearing across all of our advisory councils with the business community, the vast majority want to come back and believe they can. I think there's a huge amount of pent-up demand that has kind of come out. Last night, it was very interesting, Mark, talking to folks in the retail sector. These are larger businesses, but they said what they're seeing around the country is a huge amount of pent-up retail demand that kind of exploded once stores could open again, and they expect that here as well. So we know some businesses are going to have a very tough time coming back, but I don't want to count them out yet. Small business owners are incredibly resilient, and I think a lot of demand will start to be unleashed very soon. Phase one, especially in the retail sector, with the pickup model. But then phase two is, a fuller opening. And I'm confident a lot of businesses are going to find their way back as a result of that.
Last two for today. Next, we have Rosa from the city.
Hi, can you hear me okay?
Yeah, Rosa, how you doing?
I'm okay. How are you, Mr. Mayor? Good. So my question's about testing. It's two-pronged. First, is H&H concerned about false negatives in antigen testing? I understand what you're supposed to do with relatedly, like with a positive test, you stay home. But if you have a negative test for COVID, for having it right now, not the antibody test, what should you be doing with that information? Does that change your plans in terms of seeing other people or going out to do some kind of work? I mean, so those questions are kind of, that's a two-pronged kind of thing. Yeah. I've heard that antigen testing can have like 29% false negative. What does that mean for basing decisions off of this?
Rosa, great question. I'm going to turn to Dr. Katz and Dr. Long, but let me just quick frame and say, you're really hitting something very, very important here. We have said throughout this process, whether it's antibody that should, with a good antibody test, tell you you've been exposed before, but that doesn't tell you to change your habits. You still need to take precautions. You still need to observe social distancing, face coverings, PPEs if you work in certain areas. The same with a negative diagnostic test. It doesn't mean ball game over. It means at that moment you don't have the disease. But you still should take all the other precautions because that's what keeps people safe. And on top of that, Rosa, if you're symptomatic, even if you haven't taken the test, you need to take precautions. So I think you're raising a real important question that we have to keep telling people, stay safe no matter what the test result is the answer. But to your specific question about false positives, Dr. Katz, Dr. Long?
Thank you, Mr. Mayor. We are aware that this test, like all medical tests, is not perfect. So clinical judgment is always required. When I've taken care of patients with COVID, even if they are negative, if I strongly believe they have COVID because of their symptoms and exposures, I'll still tell them that they need to isolate. It has to do, what steps you take depends on what is the likelihood that your patient has COVID. And the test is very useful, but it's true that if they're very likely to have COVID, that a negative test does not make that impossible. As you say, Mr. Mayor, making sure that everybody maintains social distance and face coverings is a great way for us all to protect one another. And we will make decisions about isolation based on best clinical judgment and the test. Thank you.
Mitch and Ted, I might have misheard the question because I thought it was also about false positives. Freddie Goldstein's handed me a note that she thinks it's also to refer, or primarily about false negatives, which is obviously a very real issue. I still think all roads lead to the idea of you're taking precautions no matter what, and if you're symptomatic, you're acting on it. But talk about false negatives as well.
Again, I'll start, and Ted. So my answer was about false negatives. False positives, we don't, again, no test is perfect, but if that test comes back with evidence of a COVID antigen, we're going to ask that person to isolate, definitely. The question, though, does come up what to do when you think somebody has COVID based on their symptoms and or exposure, and the test is negative, test is not perfect. And we will, Mr. Mayor, in those cases, ask people to still isolate.
Ted, you want to add?
Yeah, the only thing I would add to that is that we look at your symptoms right then and there when we're first seeing you. So we're not waiting for the test results to come back. If you're symptomatic and your doctor believes that you keep your family safe by either self-separating at home or going to a hotel. And then if the result comes back, but your doctor still believes that you have the coronavirus, we're going to treat you as such.
Thank you.
Last question for today. We have Robert from Bronx Chronicle.
Robert? Robert, can you hear me?
We've almost got him. There we go.
Robert?
Can you hear me?
There we go.
Okay. I caught the virus on the subway in March, coming home from one of your press conferences, and recovered quickly. I took the antibody test on Saturday, May 16th, from BioReference which is a free city provider in the Bronx. When I tried to get my results online, I was transferred to a patient portal which requested I agree to an extremely long list of terms, which included me becoming one of BioReference's patients, allowing them to share my information with third parties, which they could not guarantee the security of my information, that they could change the terms of the agreement at any time, which included an area that mentioned payment of services. I refused to those terms and called BioReference, where I was told the only way to get my test results would be to agree to the agreement. What is going on? You said you go in, get tested, and get test results. How do I get my test results? Who is BioReference sharing, and who is BioReference sharing the information with?
Well, I appreciate the question. I'll turn to Dr. Katz, but first of all, I'm glad you are better, and that's what matters most. But this is a very fair question to make sure there's not some confusion. So, Dr. Katz, in terms of obviously all positive tests in New York City are from all sources are reported to the Department of Health. But in terms of the individual getting their test results, how do we address this question of the terms and conditions and make sure that someone gets their test results, or if they have a concern about the terms and conditions, there's someone to talk it through with?
Thanks, Mr. Mayor. I may also ask Dr. Long to help, because my experience has not included this. When my patients have gotten testing, they're able to look up the results themselves through our MyChart application and find out what their result is. I've had multiple of my patients who've gone for testing and looked up their own results. I can see their results and call patients with the results. I'm less familiar with the antibody program. Dr. Long, can you explain?
Yeah, so BioReference is a laboratory, so we would have to know the specifics about where you were tested to understand the link to the laboratory. They're not a provider though, so we'd be happy to follow up with that offline. But just to emphasize what Dr. Katz was saying, anybody that gets a test in our system or part of our program, you're in our system, a clinician is going to call you to talk about the result. But starting on June 1, through our program, for anybody in New York City that has a positive PCR or diagnostic test, our tracers are going to call you, explain everything, and see what you need to either safely self-separate at home or go to a hotel during that one phone call. So if you could give us specifics, happy to look into it, but our program is going to be calling everybody that has a PCR test.
Yeah, Robert, I'm glad you raised it. The team will follow up with you. As I was saying, I think one of the issues here in the language that you experienced was because it is a requirement for each testing company to share the information with the City Department of Health, and so that language probably referred to that. But I understand your hesitation about it. We need to make sure that people are not in any way confused by that language. So I think you've raised something here that if you experienced it and you were concerned about it, probably other New Yorkers are too, so I'm glad you raised it. I thank you for that. And Mitch, Ted, let's look carefully at the tests that people are taking through the Test and Trace initiative and make sure that if there's any accompanying language, it's clear to people and not confusing and not in any way off-putting, because that obviously would defeat the purpose. So, Robert, thank you for raising it. We'll talk to you about your specific situation, but also I think this will help us make sure there's not confusion for other people going forward. And let me wrap it together today and simply say the whole idea here is to make sure people are tested, that they know testing is more and more available, it's free, it's easy, it's something they can do quickly, it's something that's going to be more and more available in their own neighborhood. We want to keep building it out. The tracing, obviously all of that is a free service. The tracer identifies the contacts in someone's life who they've had a close contact with, quickly connects with those folks. Those folks get a test, any support they need. Again, even folks who are symptomatic get addressed because we want to protect them, obviously, and the people around them. And the Take Care initiative, so important. All free, supporting people either in their home or in a hotel. The idea is to make it a seamless process. Whatever you need, it's there for you. It happens quickly, it happens well, and you know you're being taken care of. We keep doing that over and over and over again. That's how we beat back this disease, and that's how we move forward in this city. And everyone will be a part of it. Everyone will be supporting each other during it. just as New Yorkers have done so far and so well in getting us to move forward in this crisis. So this is how we take the next big step. Thank you, everybody.
That is the New York City, their mayor, Bill de Blasio. We're going to continue to wait for more live events here on coronavirusnow.com. In the meantime, let's go to some more coverage of our sister stations around the country.
Easter, something positive that they would remember.
The sacred gunplay on target for practicing social distancing and limiting contact to stem the spread of COVID-19. The moment made news Easter weekend and is finding new life more than a month later after the pictures became part of a Photoshop contest and then epic memes.
So they started using the image of the blessing and putting it in action movies and action posters.
Father Pelk's favorite?
Doom, without question. And it represents all of those who are battling the disease. The hospital workers. It represents the vaccine. It represents someone who's going to be tough and be there to help when we can't help ourselves anymore.
The viral moment reminding us just how much the COVID-19 crisis is shaking up life as we know it. It's even changing, at least for now, how the faithful worship.
We're not going to be able to go to Eucharist under bread and wine like we used to. We're not going to see all the different ministries at the altar that we used to.
For Catholics in Metro Detroit, public masses resumed this week. And Pelk says while the changes meant to prevent a spike in COVID cases will leave many disappointed, it will not leave their faith unrecognizable.
The externals are constantly in a state of change. The essential core is going to be enhanced, and it has to be. And the essential core, at least for we Christians, is that the Lord comes into our lives and says, I got this. I got this. I've got you covered.
Pelk says their masses can only be at 25% capacity and everyone has to wear a face mask. Several other churches are getting back to public worship services, but they're only doing so, many of them, with strict social distancing guidelines in place, while other churches are for now holding off on those public gatherings. In Grosse Pointe Park, I'm Randy Wembley.
Well, I don't think God, I'm certain God doesn't make pandemics happen.
Yes, but like everyone, Father Mario had to stay home, stay safe.
Scripture tells us that God makes good out of all things, so he uses even a pandemic to bring others closer to him.
Maybe closer to God, but at least 6 feet away from any parishioner, and with a mask. Just some of the precautions that all places of worship had to follow religiously at Tuesday's reopening.
The Lord be with you.
Have you been praying to get back to church?
Of course.
As the flock flocked to St. Mary's Catholic Church in Greektown, the faithful noticed social distancing in the pews. Hand sanitizer in, holy water out. The hymnals were taken away. Not a traditional Catholic Mass.
No, there's a lot of singing, there's a lot of chanting in the Mass, but so it'll be limited. Be joyful nonetheless.
No handshaking. They're not even passing the basket for a collection. But the confessional is open for business. You think you're going to hear some doozies?
I don't know, it's been 2 months, so.
Anyone elderly or sick don't have to come. And as far as communion, the most sacred sacrament in the Catholic Church?
As Catholics, we believe that Jesus is present, body and blood, soul and divinity in the Holy Eucharist. And so Catholics have been longing for that.
Now, this was a Catholic service today, but under the governor's orders, all religious organizations can open today. But despite the restrictions, most parishioners very happy.
It was amazing. It was amazing.
And the message for those that may be a little afraid about going to a religious service?
God is alive and well, and he will win. Amen.
In Detroit, Charlie Langton, Fox 2 News.
I believe this is a virus that was sent to remind us how fragile life is, of how important it is to maximize every moment. I think that's what faith is for. Faith is not for the good times. Faith is for the times that make no sense. Faith is for the moments that we don't understand. Faith is for the moments when it's darkest.
Moments like this
Nearly 100,000 Americans killed by the coronavirus. Hateful imagery, nooses and Confederate flags, anger boiling over as fear of the unknown seems to be getting the best of us. It's moments like this when many look for something to believe in, a bit of hope to hold on to.
I need you to get bad and bougie with what God's about to do in your life. You done been through hell. You done been through pain. You done been through lack. You done been through loss. You might as well start walking like a boss.
Pastor John Gray, one of the most prolific preachers of our time, head pastor of Relentless Church in South Carolina. His one-of-a-kind, down-to-earth delivery garnered him a global following in the millions. Every Sunday, the online community tuned in from the States to Europe and beyond. Most have never even seen the pastor in person, but they are loyal. That's why when the pandemic forced the doors of his church to close, Relentless thrived.
How has taking your service online completely changed things for you?
Oh man, we're more creative. I get to be more free. I get to have conversations. I'm more conversational in my approach. I also think of other ways to express myself. So it's great. It's been a great opportunity for me to be able to try some new things.
When you are hurting and you feel like no one is there, and even your closest friends fall asleep on you, and you're by yourself in the middle of the garden and your enemies are on their way to take you out, you need to know that it's okay to not be okay.
We are literally seeing unprecedented growth online. People have been uncommonly kind and generous. We've been able to feed the people in our community. We've been able to drop off groceries to the elderly. We're doing the things that a church should do. And so we're not confined to the building.
What do you say to people now who feel stuck and maybe forced to choose between their livelihoods and their life?
I think this virus was sent to remind us that every human being that we'll ever see has equal inherent value, that we should treat each other right, with dignity, and respect. And even if I don't agree with you, that doesn't give me a right to dishonor you. Those are the things that I've learned. And my faith has informed the way I treat every other human being.
Several churches here in Michigan and really across the country, we've seen churches that are choosing to keep church open because they feel like they should. Here in Michigan, there is talk of some of the pastors trying to get together and sue the governor to be able to get into church now. What are you looking to be the sign for your church to reopen?
Well, I think the sign for me is a flattening of this curve. I'm very practical in this regard. My faith is not confined to a building. I have no comment on what pastors desire to do or how they navigate their own congregations. But if I have an 80-year-old church mother, I'm not going to bring her to a building to sit her next to a stranger who could be asymptomatic, coughs once, and now there's a disease in her lungs that ends her life prematurely, just so I can say that I joined. Now, there are people who say, you lack faith. It takes more faith to keep your doors closed as a nonprofit than to keep them open. So that's a non-starter for me. The faith that I have also informs me to make the wisest decision for the most people. I don't think the church should be the control group on how this virus transmits.
Sometimes I find myself praying, and then you realize you're praying about the same thing. And if you're supposed to give it to God, how many times are you supposed? I mean, you just wonder if you're doing it right.
Yeah, I think this is the thing. The beautiful thing about a relationship with God is there's a scripture that says we cry out with a spirit of adoption, Abba, Father, which literally means Daddy God. And so this idea of the far off God that I can't connect to is juxtaposed with the father relationship, the daddy son or the daddy daughter relationship, where I can be vulnerable, where I can ask the same question 50 times like my son does every day. And he asks questions he already knows the answer to, and I have to answer it again, and I do it with a smile on my face, because it's not so much that he wants to know, he wants to be reassured. So there's nothing wrong with you talking to God over and over about the same thing. We all need reassurance. We're just kids after all. And we've never been this way before. None of us who are living have seen anything like this. So we need to give ourselves the grace to navigate this and not know all the answers. It's okay to not be okay.
What is your favorite quarantine snack?
Pop chips. I don't know if
chips.
popcorners. It's like they look like Doritos, but they taste like kettle corn. They are from God. They're the best thing that's ever made. They're called popcorners. You gotta.
And I don't know if the rest of us have access to that. Are these
Everybody
snacks
has
from
access to
2025?
Everybody has access to popcorners. They're amazing.
I've never heard of those, but I am writing that down and I will be adding that to my cart.
Please.
Have you thought about your first meal? Once you feel safe enough to go to a restaurant, what is the one place where you want to go and just pull up a chair and say, I want one of everything on the menu?
That's a great question. I hadn't thought about it, but I'm thinking the first thing that came to my mind is Waffle House.
Mine too.
Yes. Let me get a waffle. Let me get some grilled chicken and some hash browns scattered in some other, and some raisin toast. And I am in there like swimwear. I can't wait.
Because people don't know about the hash browns covered with cheese, which blows my mind.
Yeah, it's amazing. It's the best thing ever. They don't have them in California. They don't know anything about it. It's a Southern thing, and it's amazing.
So sad. We have to put them up on that
Come on,
covered with cheese.
They have them in Detroit?
No, but I'm from Atlanta, so I grew up on Waffle House and
Okay,
Krispy Kreme and Chick-fil-A.
Okay, don't judge me, but I've got 2 boxes of Krispy Kreme. I've only had two, but I got them with the red light on. So it's been a challenge to be physically fit during this COVID crisis.
Very quickly, one of my co-anchors, a lot of folks in Michigan, they don't like Krispy Kreme. They go to Dunkin' Donuts instead. I know. I didn't even want to have to be the one to tell you this.
I know.
My co-anchor bought me some Krispy Kreme donuts, and I said, well, was the hot sign on? And thank you. And he said, I got them from the gas station.
That's not Krispy Kreme. That's
like, they don't know that.
Yeah, that's a knockoff. It's like generic brand of a pharmaceutical drug. You can't do it. You gotta go when the hot light is on. That's when you do it. Get real milk. Don't get rice milk. Don't get almond milk. Get the real thing, vitamin D.
Dr. Mike Sirigliano with Penn Medicine joining us from Philadelphia. Great to see you on this Tuesday, Dr. Mike.
Always a pleasure, Thomas.
I want to start with this warning from the World Health Organization coming out this morning, and they say a second peak of COVID-19 is possible. It's interesting because they're saying peak, not necessarily a second wave.
Well, you have to know the difference, Thomas. We're in the middle of the first wave. We're right in the middle of it. And so what they're talking about is having a second peak. That means that if people go to beachfronts in the Ozarks, or they go to the shores and they don't socially distance and they don't wear masks, that's going to lead to a peak down the road. Now, that is different than a second wave, which we think may occur in the fall, and that's the way pandemics work. And again, if you look back at the 1918 pandemic, bottom line is that the second wave was more dangerous than the first wave.
So let's talk about what you just mentioned there. Many Americans flocking to the beaches and pools this past Memorial Day. They ditch the face mask, social distancing. As a doctor, that has to make you cringe.
Well, they tended a lot to be people that seem to be oblivious to the nightmare that's going on right now. In fact, studies show, I mean, we're just about ready to hit 100,000 deaths, which makes this more dangerous than any other illness that has come along since 1918. And unless you've been living under a rock, you have to understand this is not just the flu. This is not made up. This is not some kind of conspiracy theory. This is the real deal. And if people don't take it seriously and own up to being a good citizen and caring about everyone else around them, we're going to find ourselves with that second peak and perhaps a backup to where we were in March. And I really, in my lifetime, don't want to go there again.
Yeah, some people still don't understand the severity, whether it's a peak, whether it's a wave. I mean, this is part of your concern, this possible second peak that could coincide with the flu season.
Well, the second wave in the fall is going to be potentially a big problem for people like me, because we already see increases in the flu at that time of year. We also see all kinds of upper respiratory illnesses like sinusitis. Now, the one silver lining here is that if everyone continues to wash their hands with soap and water and socially distance themselves, just maybe we'll see less cases of influenza and less cases of sinus disease. So there may be some glimmers of hope with all of this.
You know, I'm curious, what is our new gauge, Dr. Mike, of where we need to be to resume some normalcy? I mean, this virus may never go away. Are we just now waiting on a vaccine?
We're waiting on a treatment and a vaccine. Now, there's some interesting information in terms of ways that very smart people are tackling this problem. One study out of the University of Texas is looking at, believe it or not, antibodies from a llama. The llama's name is Winter. And this llama is able to, when injected with a watered down version of the coronavirus, the COVID-19 virus, has produced these unique antibodies. And it's thought that these antibodies will then be able to be replicated and used for both treatment and in experimentation. So it's very, very interesting that these antibodies are being generated that neutralize COVID-19, the coronavirus. And it's very exciting news to me. So if we can come up with something like that, that antibody treatment, just like with plasma, will be readily available. We'll give it right to the people that need it, and it will work instantaneously. Remember, vaccines, even if we get one, is going to take a few weeks, 2 to 4 weeks, to really have the body generate antibodies to be effective. But with the two of those, we're going to knock out coronavirus.
And as we speak about vaccines here, we're seeing promising results from another U.S. biotech company. It's Novavax, I believe. They're entering clinical trials for a vaccine. What do we know about the results so far?
Well, we're encouraged by all of these vaccine entries. And I believe the more, the merrier. It's just like with influenza vaccinations, different manufacturers make it. We want to make sure that we get one that works and that is safe, all right, and effective and has been studied. Now, that one is in phase 1 trials. There are other vaccines that are further along. And in fact, we talked about this in England. They're talking about even giving coronavirus to young people to see if their vaccine works, which will speed things rapidly up in terms of getting a vaccine that's proven and safe to market.
And when we talk about treatment options, I know the World Health Organization is now putting a pause on a global trial. It's concerning the controversial drug hydroxychloroquine. There are real safety concerns about this drug, Dr. Mike.
Well, the mortality was almost double in those patients who received hydroxychloroquine compared to placebo. Now, again, Thomas, I want to hear about a study early on in the illness and prophylactic use. I've already gotten enough information in my mind that it's not something that I'm going to want to be given if I am on a ventilator in the hospital. And very sick patients are not responding to hydroxychloroquine. The only left vista that has to be explored is it good early on and is it good prophylactically? That's what I want to hear from. That's what the studies are looking at. Let's move on. If it works, fine. If it doesn't, I'm done with hydroxychloroquine.
Move on, as you say. I want to talk about the patients here. Mysterious inflammatory syndrome tied to COVID-19. This is the same one reported in children.
All right, folks, we are going out to Capitol Hill right now. We got House Republicans speaking live here outside of the Capitol.
Where's Elliot? Elliot can answer questions.
Hey, Elliot, are you going to be by so you can answer questions too?
I was really looking forward to that. It wasn't good having to adjust from that.
We're all ready? Ready to begin? We thank you all for coming. You know, all across this country, we're seeing communities working towards opening up safely. In California, we're opening up churches, we're opening up hair salons. Even today in America, we're going to send astronauts back into space. The only place that hasn't been opening is here on the Capitol inside the House. We know that we have a responsibility that is essential that Congress does its work. Today, for more than 231 years, never have we seen a proxy vote on the floor of the House. This challenges the Constitution only to protect and empower a speaker. It violates the Constitution. It's a dereliction of duty by its members. We look at the history of America through yellow fever of 1793, the Civil War, the burning of this Capitol during the War of 1812, the Spanish flu of 1918, and even 9/11. Congress has never flinched from its constitutional duty to uphold and assemble inside this body. But today is different. As of right now, this morning, 71 Democrats have written to the House clerk to have their vote by another member. The last I checked, one member in this body on the Democratic side will vote for 5 different states, just in this proxy scheme. If I look to California Democrats, more than half of them, have last I checked, 27 Democrats, filed to vote by proxy. That means 19 million people in California will not have a voice, will be lent to somebody else. Across the country, looking at more than 71, there'll be 48 million people, constituents. These are the constituents that members of Congress believe that they would uphold their voice, have passed it to the side. When you look at the HEROES Act, I think it was only 12 Democrats who did not show, and now 71. Inside what Pelosi wanted to put forward on a proxy, she said, only if you physically cannot come to the Capitol to do your work. The Democrats continue to fail in their leadership. The Constitution is very clear about this. The founders believed we should assemble. If the Democrats are successful in allowing a proxy vote to make their own rules, what stops them from making a rule that only certain people can vote or certain members cannot have a full vote, a half vote? Nothing. Yes, the House can make their rules, but they cannot make something different than the Constitution says. It is very clear in the Constitution, from Article 1 all through, that the House is supposed to assemble. This is unconstitutional what the Democrats are doing. It'll be quite interesting today, even if they bring up the FISA bill and try to move a rule, there'll be more Republicans on the floor voting in person than there are Democrats. Whatever the Democrats propose to bring up cannot become law because it's unconstitutional. That is why I stand with the members behind me and constituents across this country in upholding the Constitution. Exactly what we swore we would do. The founders believe we should assemble and we should work just as we've done from every challenge this country has had. While other states open up, Pelosi continues to try to shrink. It is essential that Congress continues to meet, and that's why we'll move forward with the lawsuit to uphold for the constituents across this country. Now let me turn it over to Whip Scalise.
Thank you, Kevin, and it's good to see all of you here at the Capitol. It's really important that we show up here to work at the Capitol to do our job as we're calling on Americans all across the country to safely reopen. We're helping states safely reopen. The president's been getting additional protocols issued by CDC to show how states can do this safely. You can see so many states, over 36 states have already reopened, entering into phase one, and done it in a really smart way. We ought to be sharing the best practices, not only amongst states, but how different businesses are opening, how restaurants are doing this, how retail stores are reopening. We've seen the devastation that this has caused to our economy and the importance of getting that back up and running. We've also seen the health consequences of not having people be able to get out and go back to their doctor. Deaths that are up. In my own home parish, we've seen over a 40% increase in non-COVID related deaths from this year compared to last year, taking a 6-week period, because people aren't going out and seeing if they have chest pains. They're not going to the doctor, and they're dying in their houses of heart attacks. Children aren't being immunized. And we're seeing reports now, medical studies, that show we could have a wide outbreak of things like measles that could kill a lot of children that otherwise would have been able to get those shots. So there is a cost and a consequence. It's why we need to safely reopen. It's why so many states have shown how they can do it. But Congress ought to be leading the country in showing how to safely reopen. We shouldn't be the last to reopen and show up and do our job. We should be the first. And we've been able to have votes on the House floor successfully and safely. In the last few weeks, we've had votes with over 380 members here present and voting before Speaker Pelosi put in this unconstitutional proxy voting scheme. And so when you think about this, the idea that today on the House floor, someone could be sitting in the state of California and be registered as voting present on the House floor because someone else pushed the present button for them. There was a great article written, "Voting present by proxy is a political oxymoron." This is not constitutional. The Constitution makes it clear that we have to have a majority of members present for a quorum to do business. And then you look at this FISA bill, and we just formally announced a whip against it because, number one, it's not going to become law. Number two, there are still so many questions that need to be answered about real abuses that happen in the FISA system. I have been a strong supporter of the FISA court and its ability to properly help maintain the national security of our country. But the FISA process was abused. And those people who abused it haven't yet been held accountable. All of the facts haven't come out on what we know happened with the FISA court, and that needs to happen to reinstitute the credibility of that important program for our national security. And so I would urge the Democrats to pull that bill, because even if it were to pass, and again, think about this proxy voting, which is constitutionally challenged. If this vote were to pass, it would only pass with proxy votes, meaning the constitutionality of this program would be questioned for a program that's already got its own taint on it. So we need to work together to help reopen the country, to show America that Congress is here working for the American people. And it's time for that to happen. Speaker Pelosi needs to start insisting that all of her members show up to work here at the Capitol, doing it safely, and working to do things like holding China accountable. Why is it that Nancy Pelosi will not spend time on the House floor holding China accountable for their role in this? That's something that they're going to have to answer for, but we're going to keep pushing for those kind of reforms. With that, I yield to our conference chair, Liz Cheney.
Thank you, Steve. Thank you very much. We're in the midst of a grave national public health and economic crisis. And as members of Congress, we have an obligation to ensure that Congress can operate. Now, there are different views and perspectives up here in terms of remote voting. We've all tried very hard to work in a bipartisan fashion. We've all tried to reach across the aisle and work with our counterparts on the Democratic side to help to come up with ways that Congress can operate, to help to come up with ways that we can fulfill the constitutional requirement that we be present. Now, In my own view, being present doesn't necessarily require physical presence. I think that remote operations are possible. But that is not the path that the Democrats have gone down. What the Democrats have done, instead of working with us, is use this crisis to try to gain partisan benefit. What the Democrats have done counter to their own report. You know, a number of us, including ranking member of the Rules Committee, Mr. Cole, and the leader and the whip, a number of us have worked closely with the Democrats to try to say, listen, let's come up with ways, as we did after 9/11, that we can operate in the middle of a pandemic. And let's also look for ways to protect us in the future. We know there will be future crises, and we know that we've got to come up with ways that we can operate in the future. There may be circumstances when we cannot assemble at the Capitol. And it may be that we need to look at things like voting remotely. But instead of going down that path, despite the fact that we have tried to work together, after the Speaker of the House delayed for weeks and weeks, refused to even address the issue, she then commissioned a report. The report came up with some interesting suggestions. There were some good suggestions in the report. The report also noted that proxy voting was likely unconstitutional, the Democrats' own report. So instead of going down the path of saying, how can we do this together, the Democrats have adopted a completely partisan scheme, and they have done it in a way that absolutely infringes on the rights of the minority and infringes on the Constitution. And so we today, it's a sad day that we have got to be to the position where we're bringing suit against the Speaker. We're bringing suit against the Democrats in order to prevent them from pushing this proxy vote through. And I think it's also really important to mention that one of the first items on which they are planning to use this proxy vote is an item that deals directly with the national security of this nation. Now, I'm hopeful the leader and the whip have asked that they pull that FISA vote. FISA is a crucially important set of authorities, and it's a set of authorities that was abused. We have to make sure that we deal with the abuse and that we address the abuse, but we should not push through a bill which, in my view, would fundamentally weaken our ability to keep the nation safe because of the amendments that have been added to that bill. And we shouldn't do that with proxy vote. Imagine that. You've got millions of Americans across this country who will not be represented because their members have decided to use a proxy. And we're going to pass a bill that's going to fundamentally harm the security of the nation if the Democrats continue down that path. Now, if that's not an abuse of their constitutional authority and power, I can't imagine what is. So I urge the Democrats to pull that bill, and I also urge them to rescind this rule that allows proxy voting. There are ways that we can work together. As I said, many of us have been public about wanting to do that. This is not a time for partisanship. It's not a time to try to take partisan advantage of a crisis. And so with that, I'd like to turn things over to my colleague, Mr. Roy.
Well, thanks, Liz. I want to thank the leader and thank the whip for their efforts in bringing us together here to stand up for the Constitution. As a former federal prosecutor, a former first assistant attorney general of Texas, I've worked on a lot of these kinds of cases in my past. And it's important to me that we stand up for the Constitution, but it's also personal. My dad is a survivor of polio. He contracted the virus in 1949 and still deals with those effects today. I'm a cancer survivor. We had at least one plaintiff on our side who is battling cancer right now. And who didn't get to vote on this proxy measure, but believes that it's important for us to stand up and defend the Constitution. And I think that's what's really at stake right here. And so if you think about the founding fathers and what occurred, the leader referenced what happened with respect to Philadelphia and yellow fever. There were 5,000 deaths out of 50,000 people living in Philadelphia in 1793. 10% of the population. That would be the equivalent today of 170,000 or so people losing their lives. And that's where the Congress is supposed to meet. If you go look at a letter from October 24th of 1793 that James Madison wrote to President Washington, he outlines the concerns about how Congress should meet, where we should meet, walks through the consternation of following the Constitution to ensure that Congress does its job. And I would encourage you to look at that letter. The founders struggled with these issues. That's why it is important for us to stand up today. We cannot delegate away that which our constituents have delegated to us under the Constitution. We cannot hand that to another member, much less hand it to 10 other members. That's an extraordinary change in our constitutional system of government. And I would just point out, a year ago this last Sunday, I walked onto the floor of the House and I objected to $19.5 billion passing by unanimous consent. Why? You guys wrote stories that it was about trying to object to the funding. But the truth is, it was about process. It was about making sure our rights are protected so that we can have a vote, a roll call vote. Fast forward to March of this last year. What happened? We had a member of this body who demanded that we have a quorum and then demanded that we actually have a roll call vote. The Constitution provides that you have to have a fifth of the body agree, and the body didn't have a fifth that agreed, so we didn't have a roll call vote. That's the Constitution in action and working. That's what we're up here trying to defend and protect, to make sure that we protect our ability to represent our constituents without undermining the structure of government. I want to thank Chuck Cooper, my longtime friend, for being willing to take on this case and to do so with the excellence that he's known for. He's one of the most brilliant legal minds in the country, and I look forward to this moving forward through the system. I'll pass it off to Mr. Johnson.
Hey, thank you all for being here. Listen, for 20 years before I got to Congress, I litigated constitutional law cases in federal courts around the country. I had some difficult cases on occasion. This is a really easy one. I brought along a little visual aid here for our Democrat colleagues. I want them to take a look at the manual that each of us get each Congress. It even has our name on the front here. And it has all the rules and all the procedural goings on of the House incorporated here and published, but it is preceded by the United States Constitution. I know many of them don't carry one around in their lapel pocket like we do, but they do have a book. And I would just refer them to the actual language of the Constitution. It's been said this lawsuit and this effort is about politics. This is about the Constitution itself. Let me read you 3 excerpts. You just have to look at Article 1, the first article of the Constitution, and look at Section 4. It says, the Congress shall assemble at least once in every year, and such meeting shall be on the first Monday in December. Now we know that one, that provision was superseded by the 20th Amendment in 1933, but they echoed and adopted that same language. You flip over to Article 1, Section 5. It says, a majority of each house shall constitute a quorum to do business, and a smaller number may adjourn from day to day and may be authorized to compel the attendance of absent members in such manner and under such penalties as each house may provide. Flip over to the next section, Article 1, Section 6. It says the senators and representatives of each house shall be privileged from arrest during their attendance at the session of their respective houses. Now this is the 1780s, of course, when the Constitution was drafted and ratified. But 100 years later, the Supreme Court looked at that very specific question. We cite this in our lawsuit. It's U.S. v. Ballin, 1892. The Supreme Court said the Constitution requires, quote, the presence of a majority. And when that majority is present, the power of the House arrives. Look, this is really simple for folks back home. We have the greatest, most powerful, most free nation in the history of the world. We celebrate that on Memorial Day, as we all did this last weekend. Those who have given their lives to preserve that, to preserve this Constitution. But at only 243 years into this, we have to remember we're still a very young country. We're still a grand experiment in the ideas of liberty and self-governance. Our Constitution that is based upon the idea that we have a government of, by, and for the people is based on very particular foundations and presuppositions. And one of those is really important, that the members who are elected, the representatives who are elected to represent all the people throughout the country, will come together physically and arm wrestle over public policy. You'll have very different ideas, very different principles, philosophies represented. That's kind of the point. But the idea is that we would all get together and work together to find consensus, to move the ball forward for the most people. That's the premise of our Constitution. That's the premise of our republic. You can't have a republic operate any other way. We don't have a king who's a sovereign. The people are the sovereign, of, by, and for the people. And that's what meeting together and assembling and having a physical presence is all about. You can't do that by video, and you certainly can't do it by proxy. So that's what this is about. I'll tell you, I represent myself in this lawsuit. All of us are signed on as plaintiffs, and we also have constituents. And I talked to my constituent who signed on as a plaintiff last night, Lorene Spratt. She is deeply upset about this. She's a patriot. She votes in every election, and she is afraid that our votes are being watered down and that the Constitution is being violated, and she has a right to be heard. I think this goes to the Supreme Court pretty quickly, and I think the answer is pretty simple. It's right here in the book that we refer our colleagues to. I'll defer back to the majority leader. I'll say the future majority leader, Kevin McCarthy.
Well, let's open it up for questions. Yes, sir.
Leader McCarthy, can we get a reaction to Leader Hoyer's remarks yesterday that the GOP Senate is already voting, basically proxy voting with unanimous consent? Get your reaction to that?
No, because anybody can object in here. What we're finding on this floor when you have 71 Democrats
put a vote to somebody else, their constituents aren't being heard. They don't know what's coming up. They're not participating in it, and it's unconstitutional. Yes, sir.
What's the practical effect of the lawsuit? I mean, you're not going to stop the proxy vote happening today, right? So what do you see is the...
I look at it like this. If I could give you an analogy, it's playing a baseball game on a protest. At the end of the game, we'll figure out who's right. What's really going to happen here, whatever the Democrats move forward, probably will never become upheld to be law. It's a question whether the Senate will take it up if you listen to Leader McConnell, because he questions even the constitutionality of what we're going forward. Let me give you one example. What if we have a bill come forward, and in the process what Speaker Pelosi puts in this proxy, is that members have to sign over, and 20 people can have all the power, because they can all hold 10 proxies. And they have to pre-tell you how they're going to vote. What if an amendment is changed? What if a motion to recommit comes up? How can that person that already gave a letter that's supposed to be across the desk able to vote for the other? In this country, we believe trees don't vote, people vote, right? So it's equal every 10 years in a census. The constituents loan their power to that individual for 2 years to hold she or he accountable. Well, that person just lent it to somebody else. 19 million people in California believe they have a member of Congress that they're going to be able to uphold and accountable what they did. No, they gave that vote to somebody else. Somebody from another state, somebody from another district. That goes clearly against the process and the Constitution, what says we're able to do. Yes.
I'm going to follow up on that and then ask another question. So then is it your view that anything passed under proxy would be unconstitutional?
Yes.
Okay. And then as a follow-up, can you clarify, or perhaps Mr. Scalise can, something he said about FISA? Is it your view that this shouldn't pass until there's something fixed in the bill itself, or until unspecified investigations are completed, or that you're satisfied that the 2016 related investigations are done to your...
I think there's a combination of things of why FISA should take a pause. Just for instance, I'm interested in making law. I'm interested in making sure the FISA court has reform and able to sustain itself, that it's looking at foreigners, not Americans. Well, in moving forward today, it won't be signed into law. The president has questions, the attorney general has questions, but the senators themselves disagree with it. So in these moments of times, I take a deep breath, work together. When the first bill the House passed, Republicans and Democrats worked together, had a majority on both sides, be able to move it forward. We should do that same thing now. If the Democrats bring this bill up, they're just playing politics. And this is not something to play politics with, and we haven't done it all the way through. I called the leader, Steny Hoyer, last night, told him I just wanted to tell him where Republicans are, because we had worked very closely on this bill together, and I think we should take a deep breath. Let's work forward. The difference is, let's work with the administration, let's work with other House members, let's work with the Senate, and let's make sure we make law. Since the time that we had passed the bill in the House, there has been more information coming forward, with the FISA court being used in processes that it shouldn't have been on Americans as well. And I think we should get all that information as well if we think we're going to reform this. Yes, ma'am.
Just a quick change of gears for a moment. In one of your last press conferences, you touted California 25 as an indication of how Republicans are going to be doing in the upcoming House races. But still, historically speaking, the party that's in the minority, that just lost the minority, is more than likely not going to take back the House. How can you account for that?
Okay, let me account for that. If you want to take a fact that someone has lost the majority, we won it back in 4 years last time we lost the majority. I really look to what has the majority done with it. Majorities aren't given, majorities are earned. First of all, let's see what they've done. They wasted their time. They promised the American public that they would be different. They said they would act different. Well, they spent a year and a half investigating something even their own intelligent committee knew was a lie. So they spent all their time on impeachment, political. Now they changed the rules, challenged the Constitution itself just to empower a speaker, which I don't think the American public wants. They've taken the voice away from their constituents and has given it to somebody else. I think all those reasons is why they should not be given the power to govern again, because they wasted it and they lied to the American public. Now, what are the early indications? If you want to go with historical facts, I give you many historical facts. I give you historical facts about a special election each time prior was an early indication. May of 2010, a special election in Hawaii. People didn't think they had a chance to win, a Republican won.
Short time later, 63 Democrats lost the majority. Same thing happened in 2018. A Republican seat in Pennsylvania went to a Democrat of Connor Lamb. Lo and behold, they won the majority. So yes, I think 25 is an indicator of the election coming forward. If you don't want to take that one, let's look at North Carolina 9. Let's look at the election was a bigger win for Republicans than it was just a few short months prior. Yes, I think that's an early indication. Also in California 25, they changed the election law. They just won that seat by 9 points less than a year and a half ago. And they changed it where it was only a mail-in ballot. But they didn't even hold there. Friday before the election, they put an in-person ballot. But where'd they put it? Throughout the district? No. They put it in the most Democratic area of the district because they were concerned. Their own candidate said they were concerned Democrats weren't turning out. So every indication you have that there are more Democrats in that district than there are Republicans. It is the only seat inside Congress that a Republican will hold that Hillary Clinton carried by a majority. So if you want to go by facts, yes, it's an early indication. But elections are in November. And I think majorities are won and are not given. And I'm not sure why the American people will give the Democrats another majority if they lied to them and didn't follow out and carry what they promised. And what did they even achieve? Name me one problem they have solved since they become a majority. And you don't have to take that from a Republican. You can take it from the most popular freshman in the Democratic Party's former chief of staff. Said the exact same thing about his own party and his own leadership. Yes, sir.
Last question. Do you agree with the Wall Street Journal editorial board in which they basically said that the president's his comments toward this family and Joe Scarborough are sort of beneath the office, beneath the dignity?
I haven't read that editorial. I was not here with Joe Scarborough. I don't quite know about the subject itself. I don't know the subject well.
Keep tweeting, going
yes,
after
sir.
this.
Who's ever done the phone for calling the temperatures?
I have two, if you'll allow me.
Sure.
Councilwoman Cheney, you brought up the fact that you may be open to alternatives that would still be remote voting, but wouldn't be proxy. I'm wondering if somebody can elaborate on maybe what those alternatives might be. And the second one was just more generally, some of you are very active on Twitter. The fact that Twitter decided to add that addendum to two of the president's tweets, sort of doing a fact check, just your reaction to
My
that.
first reaction with Twitter would be concerned about who they have doing the fact check. I would think it would be pretty possible to find somebody who is nonpartisan. I think if you run a company like Twitter, you'd probably first look at what that individual would put out on Twitter themselves. I do not think somebody who would think Republicans are racist, label those who are in the Republican Party equal to people who is in the Nazi Party, talk about states that are in the United States in a manner that's not appropriate simply because a Republican carried it. I'm not quite sure that's the person I would have of being the individual in charge of Twitter determining whether the facts are correct or not. Because I think he already is biased in that opinion, and I think Twitter should actually change that person. Liz, you want to address this question?
Yeah, thank you. Listen, I think that we've all, as I mentioned, we've all looked at different ways that we could operate. And in fact, there could be circumstances. You could imagine a mass casualty attack. You could imagine any sort of a national security crisis where it might not be possible for members to assemble here in the chamber. And so I think looking at what presence means is a legal question. I would note, however, that this lawsuit does not get to that issue. This lawsuit does not get to the issue of whether remote voting is constitutional. The issue in this lawsuit is proxy voting. And the point that we are making is, you know, we all have an interest in joining together in a bipartisan fashion to make sure that the people's house can operate and that the people's voice can be heard. But unfortunately, in this case, the Democrats simply rammed through a change which they themselves said in their own report was questionable constitutionally. And they rammed it through on a partisan basis in a way that absolutely takes away the voice of many of the constituents of the people who are not represented. So I think with respect to the issue of the constitutionality of proxy voting, we are absolutely unified on that. And I think all of these issues require deep research, study, attention, as you saw from Mr. Johnson, to what the Constitution says, to what the framers intended, and also recognition of the most important thing is for this body to be able to operate. And if we create a situation where the Speaker of the House for weeks and weeks and weeks refused to deal with remote voting, refused to bring us together to operate, you create a situation where the body doesn't operate. And I cannot imagine that anybody who really has the interests of the American people at the forefront of their mind is going to think that in a national crisis, we ought to have only the President of the United States operating. The people's house have got to be here, and we got to be working. So I think there's no question.
Thank you all very much.
See ya.
That was House Republicans speaking on Capitol Hill. You're watching News Now on coronavirusnow.com. We do appreciate everyone joining us always worldwide here. We're going to get to some more coverage from our sister stations around the country in just a moment. In the meantime, let's show you this update from Chicago.
For our vulnerable populations. Assurances that our healthcare system can handle the very real possibility of a case surge, and having adequate testing and contact tracing resources to track and limit the disease's spread, which is what brings us here today. One of the most important weapons that we have in this fight is contact tracing, which is our ability to follow the path of this disease in order to learn where it's coming from, who's getting it, and how it's spreading in our communities. Since the beginning of this crisis, Dr. Arwady and her team at CDPH have done amazing work in conducting case investigations. That's finding information about the specifics of a person who's been affected, as well as doing contact tracing. But we know that we need to exponentially ramp up our contact tracing itself. And that's why I'm thrilled to announce a new $56 million RFP to expand contact tracing in Chicago. Yes, $56 million. The RFP will be awarded to a single lead organization, and 85% of the funds, which come from the CDC and IDPH, will be directed to support at least 30 organizations that are either neighborhood-based or primarily serve residents of the communities most impacted by COVID-19. These organizations will be responsible for recruiting, hiring, and supporting a total of at least 600 new contact tracers, supervisors, and referral coordinators across our city, all of whom will ultimately be able to trace 4,500 new contacts per day when fully ramped up. Most of these jobs will last 18 months, and we are talking about good-paying jobs here, with contact tracers making $20 per hour, supervisors making more, and all with health benefits. This RFP will be open. It's opening today, and it'll be open through June 19th, and can be found at our website, chicago.gov/coronavirus. But this RFP is about more than just new contact tracers, and about more than even COVID-19 itself. It's about expanding health equity in our city. The discrepancies we've seen with COVID-19 in our African American and Latinx communities didn't just start with this disease, as we all know. They are, in fact, the direct result of generations of disinvestment and neglect that have expressed themselves most recently in the pre-existing conditions COVID-19 preys upon. Over the past 2 months of this crisis, we have worked to address these discrepancies with initiatives like our racial equity rapid response teams, our new community-based testing sites, and now today's RFP. But while these efforts are focused on COVID-19, they are in fact the latest steps in our broader mission to close these community fault lines once and for all. That's why, in addition to expanding contact tracing in these communities, this RFP will also provide earn and learn opportunities to promote career pathways and real long-term growth for our community-based workforce within the healthcare economy. Even in the face of this crisis, we need to leverage every opportunity we can to grow, build, and recover in ways our city has never seen before, and become the inclusive, equitable, and supportive city we all know we can be. These communities this RFP will be focusing on were chosen because it's there where these fault lines are most pronounced. whether with COVID-19 itself or with long-term conditions like diabetes, obesity, heart disease, and cancer, all of which are closely linked to core determinants like access to health care, education, and jobs. I'm proud of our efforts to ramp up contact tracing in Chicago, which, as I mentioned, is a critical tool in stopping the spread of COVID-19. But we can't do it alone. This has to be an all-hands-on-deck effort involving hospitals, federally qualified health systems, and others who will be working closely in coordination with CDPH as they take on case investigation and contact tracing roles as part of their own priorities for their patients. These include organizations whose members are standing with me now. We have a representative from Howard Brown Health System, Mr. Schneider. Rush University Medical Center internist Elizabeth Davis. U of C Medicine's Chief Diversity, Inclusion, and Equity Officer, Brenda Battle. And Helen Margalos, Senior Research Director and Senior Epidemiologist of the Sinai Urban Health Institute. We are all tremendously grateful that these groups have stepped up for their city. And let me just say as an aside, all of these organizations who are here with us today, all the ones that I've identified, have been fighting the fight of healthcare disparities for a very long time. We are grateful for all the work that you have done, and we welcome you as part of this expanded partnership. I've said to my team all along on a range of different issues, we can't be focused on building temporary scaffolding. We've got to build foundations for the work that needs to be done now and into the future, and I am grateful for all that you're doing every single day in your communities and the peoples whose lives that you are changing for the better. So thank you so much for being here. At this point, I will now turn things over to Dr. Arwady, who will discuss the RFP in more detail. She'll be followed by Dr. John Snyder of the Howard Brown Health, Dr. Elizabeth Davis of Rush, Brenda Battle of U of C Medicine, and then Helen Margalos of Sinai Health Institute. Dr. Arwady.
Thank you, Mayor, and thank you to all of our partners for being here today. So I'm really proud to talk about how we are taking the scaffolding that the Mayor mentioned to really think about our response to COVID, not just as an immediate response, but as a way to grow our public health infrastructure and to build economic opportunities that will give people the opportunity to earn as they learn. So that, yes, we are thinking about contact tracing, meaning reaching out and limiting the spread of infection, and I'll talk more about that in 1 second. But also, we're thinking about really offering some entry-level jobs that people will, at the same time as they are doing this important work, get additional training. This will be done in conjunction with city colleges, as well as the Chicago Cook Workforce Partnership. And we think about taking individuals who have an interest in promoting health in their communities, doing the contact tracing initially, but building skills that over time, our hope is that these folks can move on to become the sorts of health coordinators that we want to see, pulling together social service needs, health needs, really making sure that people who have often had trouble having their needs met to be as healthy as they can be, making sure that those needs are met. Secondly, we want to help people build skills that will ensure they can have longer really jobs that will let them build a career in healthcare and in public health, in community health worker and other related opportunities. And so what we'll be doing, first of all, is the case investigation work. If folks are not very clear on case investigation, this is the work that the health department does year-round, every day, and has for decades. Every time someone is diagnosed with tuberculosis or measles or HIV or any of more than 70 other infectious diseases, people from the health department reach out confidentially to the person who has been diagnosed. We've been doing that from the beginning for folks who have COVID-19. We reach out, we connect, and we say, what are your symptoms? Do you have care? Do you have what you need to make sure that you can recover from this disease? But also, let's talk details about where you have been and who your contacts might have been, who you could have potentially exposed to that disease. And so for COVID, for example, we really go through some detail. When did you get sick? But then not just when did you start really feeling sick, when did the symptoms actually start? And then because we know that people are able to spread COVID in many cases for a few days even before their symptoms start, we go back even a little further than that. We speak to them and get a list of anyone who has been in close contact within 6 feet, especially for more than 10 minutes, especially without wearing those face coverings. So that would be people especially who share a household, but it could be people at work. It could be people riding in a car. It could be people if you've been out and about. The idea is to get that list. That case investigation work finishes. The information goes into a secure database, and then separate from this, we have contact tracers. And the contact tracers have the list of the contacts. So not the people who have been exposed and have been infected with COVID, that's protected health information, but the whole list of, so if I had been diagnosed with COVID, for example, I might say, here's the person I rode in the car with, here's the person who lives in my household, here's the person who I worked really closely with at work. The contact tracer is then reaching out to that person who rode in the car with me or that person from my workplace and saying, we have reason to believe you have been exposed to COVID-19 without ever naming me as the case patient, without ever being explicit about the way that they could have been exposed, but to work with that contact to then say, it's very important because you've been exposed, you need to then quarantine. You need to also think about not spreading disease further. We need to make sure you're connected to care and other resources that you may need, and we need to follow up and check in with you to see if you develop symptoms. We need to make sure if you get tested, particularly if you do develop symptoms, and we want to make sure that we're following along with you to help limit the spread. The health department has been doing this work from the beginning, but when we're still getting nearly 1,000 cases a day, 2 days over this 3-day weekend, we had nearly 1,000 new cases per day. We've not been able to do the full extent of the case investigation and contact tracing. We've been building up capacity within the health department first. We're now pulling in people from other city departments with appropriate training. And many of our clinical partners here have also stepped up to make sure that especially that initial case investigation can be done quickly and effectively. You have to pair case investigation with appropriate resources for isolation, for quarantine, for food, for shelter, for whatever people may need to ensure that we can limit disease. And so as part of this RFP, the goal is to take what we've already been expanding here within the city structure. We've got volunteers, we've got a lot of people who have been a part of this, and moving it into more of a long-term structure that allows us to work with community-based organizations, especially in the neighborhoods of high economic hardship in Chicago. So I want to be clear that the contact tracers and the resource coordinators who will ultimately be doing this work will be doing the work for everybody in the city of Chicago. This is a phone-based call. The resources are available, so it does not matter where someone lives in Chicago. They will get the same speed and the same attention in terms of the case investigation and contact tracing that's needed. But we want to work with the community-based organizations that are in these areas of higher economic hardship because that is where there's an opportunity to also grow in an economic way and in a way that lets us build up a capacity for community health work that we hope will long extend beyond the COVID response. We've had a goal with our Healthy Chicago 2025, for years now to really close the life expectancy gaps in Chicago, the racial life expectancy gaps. And a lot of that is based in decades of disinvestment, decades of difficulty not only accessing health care, but accessing some of the basic human needs that a lot of us take for granted. And this is one opportunity to take funding that is directed toward the COVID response, use it to first and foremost contain COVID in Chicago, but secondly, set the beginnings of what we hope will move from a COVID contact tracing core to really more of a healthy Chicago core, and be a place for long-term growth and improved health equity in Chicago. I'm sure people will have questions, but I want to make sure that I leave time to hear from the partners who have already stepped up to help fill in as part of what will be an all hands on deck for a long time here to keep us going and to keep improving what we're doing, getting COVID under control, and thinking beyond COVID to a healthier Chicago. So next I'll bring up Dr. John Schneider from Howard Brown Health.
Thank you, Mayor Lightfoot. Thank you, Dr. Arwady. So I'm just going to give a little bit of background about how Howard Brown Health started doing contact tracing. We had our first identified COVID case in March of this year, March 13th, 2020. And we quickly mobilized our existing contact tracing staff, which were doing contact tracing for HIV and STDs, to start working on the COVID contact tracing. We've kind of ramped that up quickly. We got a lot of volunteers. We relied also on the Latinx Medical Student Association. We got into some pockets of Spanish-speaking communities. And so we've rapidly expanded our workforce to now 40 people working on contact tracing. 3/4 of them are bilingual. I think, so we've initiated contact tracing on close to 2,000 people at Howard Brown Health, and we have, a robust, energetic, empathic workforce. And so I think that for a lot of the agencies working for this RFP, will be identifying empathic, caring people to work in these communities. I think, an example of how this works, we have a new contact tracer, Louis Spraggins, who accounted a call he made to someone who had been diagnosed 2 days earlier, and that individual was on the bus going to visit their aunt. They got off the bus, went back home, didn't visit their aunt that day, and importantly, they were appreciative. And the reason they were appreciative was not because there was this sort of big brother, get off the bus, go home, but it was an empathic conversation. Louis discussed other resources that the individual could obtain, things like health insurance, employment assistance, and other things. And so I think one of the main pieces of this that I think we need to remember is that we can contact trace people, we can make nice visuals of the networks and things like that, but what's important is really to meet people where they're at, offer resources. This is maybe a gateway into primary care across the city of Chicago, and also dispel misinformation. First thing someone does when they get COVID is they go online, get a lot of misinformation, and so we come a couple days later and try to work through some of the questions that people have. So those are my comments, and I thank the mayor and the leadership that the city is having in this area.
Thank you.
Oh, Dr. Liz.
Thank you. And I'd like to thank Mayor Lightfoot and Dr. Arwady for your inspiring leadership during the COVID-19 pandemic. Rush and our partners at UI Health, led by Dr. Stockton Mayer, have been on the front lines every day in congregate settings, as Mayor Lightfoot and Dr. Arwady mentioned. We do this because through our work in congregate settings, which are places like homeless shelters where multiple people live in one space, and through our work in those settings, we've seen encouraging results in the fight against COVID-19. A key piece of this strategy is that when one person tests positive in a congregate setting, such as a homeless shelter, our team shows up and tests everyone in that shelter, including both staff and residents. Because in a congregate setting, especially one like a homeless shelter, everyone is a contact. We then are able to isolate people who test positive, some of whom would not have known otherwise that they had COVID, and we are able to get them the care that they need. And then that way we can protect the remaining people at that shelter from contracting COVID. Through these steps of testing, isolating, and using infection control practices like universal masking, we've been able to stop outbreaks in the facilities where we've tested. The majority of the people who we have tested are people of color. This reflects the homeless population in Chicago, which is disproportionately African American and Latinx. So stopping outbreaks in these congregate settings is an important piece of improving racial health equity in our city. Our work in congregate settings has only been possible through partnership with multiple different healthcare and social service institutions, with leadership from the Chicago Department of Public Health and the Department of Family and Support Services. And we want to thank all of our partners for coming together in order to make this work happen. So thank you. And I'd like to introduce, thank you, Dr. Brenda Battle.
So I also want to thank Mayor Lightfoot and Dr. Awadi for your incredible support in this work and your leadership. So the University of Chicago has been actively working over the last several weeks to stand up testing sites across the South Side, including on our campus, in our Hyde Park campus and our Ingalls campus in the Southland, with drive-up and walk-up testing sites. But we've also been working with the federally qualified health centers and the hospitals on the South Side of Chicago to stand up testing sites at their sites. So as a result, we've stood up 10 additional testing sites by working alongside providing technical support, consultation, and testing for our partners on the South Side of Chicago. We most recently stood up a site with Friend Health in Auburn Gresham, one of the highest hit areas on the South Side. And we're very proud that we're in the process now of standing up a site in South Shore, along with Friend Health. And as other speakers have indicated, as we increase testing, it's imperative that we also to begin identifying persons that have been in contact with individuals who tested positive for COVID-19. So we recognize that contact tracing is historically not a health system endeavor, but mostly a health department endeavor. But we realize that in this unprecedented time, that it's really all hands on deck and that we've all got to be involved in this process. So on the South Side, nearly 77% of the population is African American, 12% is Latinx, and many of them have already been impacted by COVID-19. It's critically important for us that we participate in contact tracing to support the city's strategy in reducing the spread of COVID-19. As such, the University of Chicago will begin contact tracing in the very near future, focusing primarily on patients who've tested COVID positive at the University of Chicago Medicine and those who've tested positive within federally qualified health centers that are part of the network of providers on the South Side of Chicago. We've been in very close contact with CDPH and will align all of our efforts with those of CDPH, ensuring that our processes, our protocols, and our reporting are consistent with what the state is doing. We appreciate the guidance of CDPH, and again, we thank the mayor and we thank Dr. Awadi for your support. Next, we're calling Helen Morgelis from Sinai Urban Health Institute.
Hey, good afternoon. I also wanted to thank Mayor Lightfoot and Dr. Awadi for their wise leadership through this crisis and for being forward-thinking and proactive in putting forth a response that's centered on health equity. Sinai Urban Health Institute is the community-engaged research arm of Sinai Health System, and we have been working closely with Chicago's West and South Side communities for over 20 years to better understand health inequities and to develop, implement, and evaluate solutions that move us towards health equity. SUHI, as we call ourselves, is an innovator and respected leader in the training, hiring, and supervision of community health workers. We've successfully developed and implemented effective CHW-centered health interventions for a variety of populations and organizations. For those of you that may not be familiar with CHWs, the American Public Health Association defines a CHW as a frontline public health worker who is a trusted member of the community that they serve. A community health worker therefore serves as a liaison between health and social services and the community to facilitate access to services and better health. Through our Center for CHW Research, Outcomes, and Workforce Development, or CROWD, Sinai Urban Health Institute provides community health worker training and consulting, building on 2 decades of direct experience in developing, utilizing, and evaluating the CHW model. As you've heard, the goal of the City of Chicago in this effort is not just to hire contact tracers, but to ideally train a workforce that can fill that role now and then transition to CHW or other healthcare and support positions later. Consistent with the city's efforts in Healthy Chicago 2025, CROWD's model will help enhance workforce capacity and ensure this effort is more than a one-and-done opportunity. With the onset of COVID-19, SUHI, CROWD, and our CHW team worked quickly to transition our services to be responsive to the emerging needs of our patients, community members, and to the CHW's delivering services in a challenging new environment. We have developed and delivered a COVID-19 response training for CHWs and others supporting patients with their health and social needs. We have dedicated SUHI's CHWs to follow up with Sinai Health System patients diagnosed with COVID-19 once they are home. This includes patients who are admitted and discharged from our inpatient units and those discharged home from the emergency department with less severe symptoms. Our CHWs assist with social needs, support patients in following their discharge plans, provide needed social support, and communicate back to Sinai's clinical teams as needed. We're also working very closely with Sinai Community Institute, which is Sinai Health System's social service arm, to pilot a contact tracing program in North Lawndale focused on high-risk youth populations. CROWD will be providing training for the contact tracers, and SUHI will evaluate the initiative so it can be scaled and replicated as necessary. This is really a long-term investment in social justice. It is a critical investment into workforce development and employment opportunities for communities that have suffered historically from disinvestment and high unemployment rates. We are looking forward to working together to build a workforce not to just respond to this pandemic at this moment, but also to have the skills and training that will make them valuable and marketable in the environment that will evolve out of COVID-19. Sinai Health System and Sinai Urban Health Institute look forward to continuing to partner with the City of Chicago and CDPH in the pandemic response and in efforts to eliminate health inequities. At this point, the mayor will take your questions.
Thank you. Good afternoon, Dana.
I'm going to start on topic. I have a lot of questions, so I'll try to get through them. The first is from A.D. Quigg regarding the $56 million. Is it all from the CDC and a pass-through at IDPH, and will 85% of that $56 million be going to those community groups discussed?
So let me start, and then I'll have Dr. Artie. Our plan is that the lion's share of those resources will be going to the community groups that will actually do the recruiting, the vetting, and then working with individual community members who are going to be part of this expanded contact tracing infrastructure. And I'll let Dr. Artie take the question of the source of the funds.
Sure. So, yes, the Chicago Department of Public Health received funding from the CDC through what's called the Epidemiology and Laboratory Capacity Grant that is meant to, in part, help support contact tracing. So we just received notice of that award on Friday, worked very quickly to be able to turn some of that around. The second portion is funding through the Illinois Department of Public Health. That is also federal funding at its original base, but it is an award through the state to support contact tracing at the local level. So we've been really excited to be able to put some of this funding out to be able to support community-based organizations and add to all of the work that we've already been doing, and this allows us to do that.
Okay, next question is from Becky Vevia at WBEZ. How many contact tracers does the city currently have, and how long will the city be staffing up to do contact tracing through the end of 2020, through the end of 2021?
So we have a number of people that are already engaged in contact tracing. We are taking city workers and repurposing some that are available to really kind of expand the first stage of the increased number of contact tracers. I think our hope is to have this next tranche of folks identified and trained so that they can begin in August. And, as both Dr. Artie and I said, and I think it's borne out in the statements of the folks who were here, this isn't about just a short-term project. We want this to be a career path for individuals to get the training and then see that there are other opportunities for them in healthcare. And for me personally, I think the thing that's exciting about this is if you look at the places for which we're hiring, obviously we're focusing on areas where people are struggling with employment. And so I think that's one of the best things about this. But the other piece is from these same areas, you see significant healthcare disparities in part because they lack access to health care. So if we train up a legion of people from these same communities where there are health disparities, by virtue of the fact that they're involved in health care, their neighbors will know that they do this work. Their family members will know that they do this work. And we hope that one of the residual benefits is really demystifying the healthcare system so that people understand that they can be engaged with the healthcare system on a preventative basis and not just when they're urgently ill and then showing up in a hospital emergency room. And Dr. I don't know if you want to add to that.
Yeah, I'll just add that, so first of all, at Baseline, obviously we repurposed just about all of the contact tracing work that the health department does at Baseline. We do occasionally continue to have other outbreaks, and so we sometimes, we have additional work that we need to do. But we took our 35 or 40 sort of contact tracing people at Baseline who typically work in communicable disease, added onto that many other folks from within the health department, so pulled people who would normally be doing HIV work or maternal child work, but that same kind of outreach piece, have been building in that space. And then beyond that, we have pulled in folks from around the city. So we know that there are other city workers. Some departments are not working as much right now, and so there was some opportunity to pull people in there with training. But then we've been doing all of this partnering already in our to build it, especially with our clinical organization. So the way we're really trying to think about this is meeting the needs and growing with this to meet the needs that we have right now, but in a way that allows us to expand or contract depending on what happens with COVID over the next really 2 years. And so if you look at the language of the RFP, we talk about, training these folks as the contact tracers and as the referral coordinators, but that depending on what is happening with our numbers, we've already thought about other ways that we could use them or other ways that we could expand. So in the same way that we'll be partnering with clinical organizations, schools of public health, et cetera, and we've got some of this sort of additional workforce here, we can expand or contract that. We similarly are looking to be able to expand or contract, but have that more in these community-based organizations. So I feel very good about where we are now and very good about the ability to add hundreds more people to this workforce this summer.
And with that, this question from John Byrne. Based on Chicago's population, experts say the city should have a team of at least 810 contact tracers in place before the economy reopens. What's the fastest this RFP can be filled and these 600 contact tracers can be trained and up and running? Will it be before the city's economy reopens? And will this group of 600 bring Chicago's total number of contact tracers up to 810 or more?
First of all, the city's economy is open. It's never been entirely shut down. So that's a little bit of a misnomer and a question. As I indicated, we are adding to the resources that are already available in CDPH and expanding other people within CDPH, and then layering onto that individuals who are coming from other city departments that are going to be joining this team. And in fact, I believe that there's a training session that's happening even today to stand up even another group of people that are going to be. So we're going to continually be adding on to it. We feel comfortable with the sequence that we have, and then the new group that will be onboarded by August. I feel comfortable with that work.
So is August when you think the 600 contact tracers will be up?
I believe that's yeah.
Yeah, there's so I mean we already we're
Talking about the new tranche of...
Yeah, the new folks that will be coming through this RFP, just with the timing of how it works, we've basically, this RFP is for the overarching organization who will then be working with 30 subdelegates. So we've put August 1st as kind of the first deadline in terms of having a certain number in place, and then September 15th as the second deadline to have even more in place. But I want to be clear that we are not waiting to do the work of contact tracing. We're combining sort of the expansion that we're doing now, but of course the hope is that the city workforce, for example, will go back to doing the work of the city. Our clinical partners will, be able to expand and contract as is necessary. And obviously CDPH continues to need to not completely stop responding to other responses. And so the idea is we're expanding in the meantime. This will help us hire even more on. But we are aiming toward that goal. But we're not seeing having to hit that exact number as a particular milestone in terms of moving ahead, for example, through the phases. We want to make sure we have the capacity to meet the responses where we need to. We've put a lot of focus initially, of course, into these congregate settings, as you heard. And so in those settings where both the health department and partners, we said this is where we really want to double down on case investigation and contact tracing first. We've been successful and actually gotten our positivity down even below the numbers that we're now seeing in the community. And so that's been very successful where we've pushed that particular piece of contact tracing and case investigation. We're now expanding that out. So when I look at sort of moving through the metrics, if you look at what we use, we talk about it having expanded systems in place and being able to push resources to where they're most needed. And I'm really confident that we are making excellent progress on that and will continue to.
Okay.
And Dana, if I can just add, the premise of the question is basically we're starting from zero with contact tracers. That's just not right. As now Dr. Wardy has said multiple times, and I have said even today, we already have a significant core of people who do contact tracing as a matter of course. That's the bread and butter of public health. So whether it's CDPH, whether it's Cook County, whether it's IDPH, that work is done in addition to the work that's being done by a number of different healthcare providers. What's different about this RFP is that we're expanding that base exponentially through this RFP.
A question from my colleague at CBS 2, Tim McNicholas, regarding contact tracing jobs. You mentioned city colleges will be training, but will applicants maybe outside of city colleges have to take an online training course, perhaps through Johns Hopkins or Oakton Community College or somewhere else, or will all this be done within the city colleges and within organizations?
Well, the training is going to be on multiple levels, and again, I'll defer to Dr. Wardy to get into the specifics, but the issue that we're talking about regarding regarding community colleges is to earn and learn, so they'll get a specific kind of certification, and then that will be hopefully a pathway for them to have long-term involvement in community health work, which I think is critically important. Doctor, I don't know if you want to add to that or not.
I'll just add, just to be clear, that there is no requirement for any particular training to be eligible to be hired, related to specific training of contact tracing to be able to be hired by one of the subdelegates. There will be extensive training, of course, as people are hired to ensure that they have the competency within, for example, the data platform that CDPH will be using across all of these subdelegates to ensure that all data is being collected appropriately and getting back to where it needs to get. So there will be training on the job, if you will, and obviously in addition to the work of the contact tracing to this point, really trying to take the opportunity to build up people who hopefully will want to remain sort of long-term doing this kind of really important community health work. But if you look at the details in the RFP, we've not set any particular requirement in terms of education, for example. We've specifically called out that people who may have previously had difficulties getting employment, whether it's related to prior incarceration or disability or language assets, et cetera, subdelegates who particularly focus on those groups would be of particular interest here. But that'll be sort of in the next piece.
Okay. Mayor, I'd like to...
And if I can just add to that, I want to pick up on one point that Dr. Schneider mentioned. Really what you have to have is a passion and you have to be emphatic. These contact tracers are going to be calling people with information that's going to be frightening and scary to them. And so being a person who recognizes that and understands that they have to treat the person on the other end of the phone with care and with dignity, that's going to be a critical part of it. And again, we will be doing all the necessary training so that people understand the importance and the value of the work and the way in which they need to communicate in these challenging circumstances.
Okay, thank you. I need to move on to weekend violence because I have a lot of questions about it. But first, it was the most violent weekend, Memorial Day weekend in the city in 5 years. So
I actually don't know that headline from the Sun-Times is accurate, but look, suffice it to say this. The weekend of violence, and really it was Saturday and Monday. We had a pretty light day on Friday. Saturday was not a good day. Sunday was so-so, but yesterday in particular with 15 shootings was a terrible day. While I know that there was a lot of energy and coordination among a variety of groups, what I said to the superintendent this morning is this was a fail. And whatever the strategy is, it didn't work. And so they're hard at work and looking at the data. I have a meeting with them later this afternoon, but we have to do better. We cannot have weekends in the summer turn into a bloodbath. And this weekend's violence was out of control. And clearly, as I said before, whatever the strategy was, it didn't work.
A question from Franz Bielman at the Sun-Times, and also I'm combining a question from my colleague Chris Ty and myself at CBS 2. Police sources have told us that as a result of the OT crackdown, there were 1,000 fewer police officers on the street over the weekend.
100% not true.
That is not true.
Not true. In fact, there were more officers on the street this weekend. So your sources are incorrect. What we've been doing is pushing organized crime and gangs and narcotics to actually be involved with the district fight, to decentralize them and move them under the control of district commanders and area deputy chiefs. So that's just 100% wrong.
Just to be clear, so there were not 1,000 fewer officers on the street this year compared to last Memorial Day
No, in fact,
weekend.
there were more officers. Look, these organized crime, which is unhappy about the fact that we've called the question on what their value add is in the public safety fight. They're used to being off by themselves as a separate organization, frankly, with not a lot of accountability. I've been asking for a year, what do they do? And they haven't been able to demonstrate what they're doing to really significantly aid in the crime fight. So what's happened over the last couple of weeks is these officers have either been taken out of plain clothes, put in a uniform, and back in the districts under the control of district commanders and deputy chiefs, or if they're staying in plain clothes, they have to be actively involved in supporting different district efforts at crime suppression. They don't like that, and I get that, but the notion that somehow we had less people on the street this weekend is just fundamentally not true.
This question from Ryan Burrow at WGN Radio. Are you surprised the stay-at-home order isn't having a bigger impact on reducing gun violence in the city? And his second question you've addressed. So that's the question. Are you surprised the stay-at-home order isn't having a bigger impact on reducing gun violence in the city?
No, because you have to think about it in the context, not just of the stay-at-home order. And I've said this many times, and I'll repeat it. What we are experiencing over the last couple of months is basically the infrastructure of criminal justice and law enforcement is not there in the way that it used to be, meaning the federal government, the federal agents that are active and involved in the crime fight, many of them have been on the sidelines now for weeks. That's a problem. We have the courts that really aren't taking a lot of criminal cases. That's a problem. We have the jails that are effectively closed to new persons. So we have officers that are risking life and limb and arresting people who are absolute drivers of violence, and they're cycling in and out of the jail, out of the court system in 24 to 48 hours. So the pieces of the ecosystem, the infrastructure that the Chicago Police Department relies upon, our partners in this fight, they're not there, or if they're there at substantially diminished numbers and resources, which means the police department really is effectively on its own in fighting public safety across the city. And we have officers, and I understand this, who are concerned themselves with getting COVID and whether or not they're going to be sick themselves or take that to their family members. So this is probably one of the most difficult times for policing that we've experienced in the city, at least in my knowledge of local policing, which goes back 20 plus years. So while we obviously do the year-over-year comparisons, we do the 5-year or 6-year rolling average, the reality is there's no circumstance like the one that we are facing right now when it comes to public safety in recent memory. The only way we start to see and drive down the numbers, quite apart from the police department, is if all the other parts of the ecosystem, not just law enforcement, but law enforcement is important, if they come back online. We can't do this alone solely with the resources of the Chicago Police Department. I've said this many times. What we experience in this city every day with gun violence is a public health crisis, and we have to treat it as such. It means getting at the root causes. That is not a tool that law enforcement can address by itself. It can't. It's never worked. And so law enforcement, of course, plays a critical role, but all of the other resources that need to be there also have a role to play, from our sister agencies, from the libraries, from the schools, from the parks. All of those resources that are available that partner with our police department have been either unavailable or at reduced levels. And so we're seeing a surge, which is absolutely unfortunate and unacceptable, but it's not surprising given that the ecosystem isn't fully operational.
Also from Fran, what about Chance the Rapper's claims that Chicago police were more aggressive enforcing the stay-at-home order in black neighborhoods than they were in white neighborhoods?
You know, look, I understand why people have that concern, but it's just fundamentally untrue. I start out my day doing two things. Number one, looking at the violence numbers overnight, and number two, looking at the orders of dispersal. And I can tell you, based upon the statistics that we've been keeping now for weeks, those dispersal orders are happening all over the city. And yes, in white areas, in Latinx areas, in moneyed areas of the city. Why the media doesn't report that with equal interest? Well, I think there's probably some answers to that. But the reality is that the Chicago Police Department is active and engaged all over the city and doing it with an eye towards equity. And I would have it no other way as mayor of the city.
A question from Sarah Schulte at ABC7. We saw Memorial Day crowds from neighboring states and around the country gathering, and sometimes in huge numbers. Yeah. How will the city prevent the same thing when the lakefront opens up later this summer?
Well, that's why we're taking our time with coming up with a plan. I saw those reports, and my heart goes out to mayors in city like Houston, where people just utterly disregarded any suggestion that there's a deadly virus out there, and we're gathering in mass without masks on. I mean, that's a terrible thing. And I will say, I've said to my team, we are not going to let this happen in Chicago. So if that means slowing things down and taking our time and being thoughtful about the way that we start to reopen, we will do that, because we are not going to undo all the hard work, all the sacrifice that people have literally paid for with their lives. We're not going to allow that to be undone in a moment when people are not thinking and are congregating in ways that we absolutely know is high risk and will lead to hotspots, spread, and death. We're not going to do that.
A question, taking a backward step back to weekend violence, from Craig Dellamore at WBBM Radio. We've seen so many strategies for combating violence after a weekend like this past one. Is there anything that hasn't been tried, anything specific you might have discussed with Superintendent Brown?
Well, as I said, the challenge is the police department is effectively by itself. We have to have our other partners from law enforcement and from social services there. Now, social services there, but obviously a lot of their response has been on COVID specifically. But if there's no credible threat that somebody who is shooting in the crowds will actually get arrested and be imprisoned and taken off the street, we have a problem. And so I have been pushing and will continue to push. We've got to open up the courts. We've got to open up the jails for people who are violent and are wreaking havoc in our community. They can't cycle through the system and be back on the street in 24 hours. That is demoralizing to the police. It says to the victims of crime that no one's taking what's happening to them seriously. And so the courts absolutely have to step up.
A question from Politico, and Fran from the Sun-Times had some related questions about the Chicago casino.
Yes.
Now that Chicago has the green light for that, what are the next steps in advancing the Chicago casino? Where is it going to go? Any interested parties? How quickly can it be up and running?
Well, I'm never going to talk about where, and I've been very clear about that. I'm not going to speculate about that, and I'm not going to fuel the speculation. But the next steps roughly are these. We will, now that we have the authorization, the governor obviously has to sign it into law. We look forward to that. But once the governor signs, we will, and at start of the process of looking at focus groups and studies and surveys on what, of course, where, but also what amenities people want to see. I see this as a large entertainment district, not just the box of a casino. In order for us to maximize this once-in-a-generation opportunity that the General Assembly has given us, and to maximize the opportunities for revenue, for jobs, long-term economic viability of the city, and of course to address our pension debt, we've got to be thoughtful and intentional about what we're designing so it's something that attracts people from all over the world. That's what I see. Chicago is a global city. We need a world-class entertainment district of which a casino is a part, but not the entirety of part. So there's a lot of work that needs to be done between now and then, and we're anxious to get started.
I'm sorry. I'll let that go for now. ABC 7 question about rats. The CDC says now that restaurants are closed, rats are becoming more aggressive. What is the city doing to address the issue of aggressive rats that have increased during this pandemic?
Well, again, it's not my information that they've increased, but rodent abatement is always something that is top of mind for us, both through CDPH, but also through streets and sanitation. And here's the thing that I also want to add. With people staying at home, and I know this in my house, you're creating more garbage. Recycle as much as you can, compost whatever you can, but obviously get the compost off the ground because compost can be a breeding ground for rodents as well. But we also need to make sure that we are securing our garbage cans, putting the garbage in the can, making sure you've got a fully functioning lid. Those are all the things that are important. And then we will continue to step up our enforcement. If you see that there's a particular problem in an alley, in an area, please do call 311 because rodent abatement is something that we always take seriously all year round.
From Kelly Bauer at Block Club, what actions will you now take against churches that are holding services, and why are parties and rallies shut down with police help, but churches are only fined?
So, first of all, we're mixing apples and oranges. People out expressing their First Amendment rights is not the same thing as people gathering in the street partying, and it's obviously not the same thing as a church. So we allow people to express their First Amendment rights. We admonish them to adhere to social distance guidance, as well as other public health guidance like actually wearing masks. We can't force people to do that. We're certainly not going to waste precious police resources arresting people who are expressing their First Amendment rights. But as you saw from Saturday, I think it was, when there was a gathering around Buckingham Fountain, they ran their course, and then we made them disperse, and then they did. So lumping everything together doesn't make sense because they're very separate kinds of events. Regarding the churches, we're going to keep trying to get them to comply, but if they don't, we're going to fine them, and we're going to take more aggressive action. Those ministers who are basically thumbing their nose and putting their parishioners at risk, they can be foolish, but we're not going to, and we will be aggressive in making sure that we get compliance. Thank you.
7:47 right now. So Virginia Governor Ralph Northam is expected to announce later today his timeline for Northern Virginia to move into phase 1 as the rest of the Commonwealth gets set to move into phase 2. Now, part of the metric for reopening is testing, and the state is setting up free testing in communities, and it begins today. A testing site will open in Arlington County later this morning, and joining us now with more is the Arlington County Board Chair, Libby Garvey, on this Tuesday. Good morning.
Good morning.
Please tell me how Arlington, your district, has been impacted by COVID-19.
Well, I think pretty much like everyone, we've really had to shut down. We're asking people to stay home, wear face coverings when they're out. It's been very hard on our local economy and our small businesses. And hard on people just to be able to not able to go out and visit like they'd like. So I think we're experiencing it pretty much like everyone is.
The governor is talking about moving the closer in areas to the district, moving into phase 1 this week and phase 2 in the rest of the Commonwealth. Some people in Northern Virginia saying we want to be on par with the rest of the state. What do you think?
Well, it'd be great to be on par with the rest of the state, but that means that we have to have the same metrics and be as safe as we can be as we move into phase 1. And that's part of what this testing is about that you mentioned. And I'll just make one correction. We're not the first. We're actually all of the large 5 jurisdictions in Northern Virginia have done the testing. We're the last one to do it today for a one-day event. But we are hoping that this will continue to be an ongoing event, because the only way we can safely move into and stay in phase 1 is to have that increased testing. And this is part of that, but this has to be the start of a continuous series of events to be able to make sure that people can get tested and we can know where the virus is so we can work to eliminate it.
Absolutely. Thank you for that correction. Okay, let's talk about the free testing today, 10 to 6 at the Barcroft Fitness and Rec Center. What do we need to know? What do we need to pass on to residents before they come out today?
Thank you for asking that question. Actually, this testing is aimed at people who do not have a healthcare provider. And we're looking to get our most vulnerable population that has difficulty getting a healthcare provider and being able to get the test. So if you've got a healthcare provider and you've got other ways to get the test, and it's maybe possible you don't really need that test right now, please don't come, because there are a lot of people who really do need this testing and need to have the free testing without a doctor's prescription. So that's what we're aiming at, and we're hoping those folks will come out. It's probably, looking at what happened earlier in the state with our partner jurisdictions, it's probably going to get filled up quite quickly. But as I said, I'm hoping very much hoping this is the first of a series of these kinds of events. So if it doesn't work out today, there'll be another day, I hope.
So free, no doctor's note, no ID. What else do people need to know?
You can either walk up or drive up, both. So that's easy. So it's for people, if you get your car, you can come up and get in line. But you cannot get in line until 8:30, which you may or may not have mentioned. And that's important to know too, because they found in other areas, people have been lining up way early. It's been difficult with the traffic and things. So we're really trying to control the traffic and the number of people coming. And we'd like you to come if you live in Arlington. Not if you don't live in Arlington, we'd prefer you didn't come.
Okay. Also, there's been much talk about testing without symptoms, with symptoms. Do you need to be showing symptoms to get your test today?
Absolutely not. That's one of the crucial issues here, isn't it? Absolutely not. Because if we're going to move into the next phase and handle this this pandemic, we've got to start getting people when they do not show symptoms, because that's why it spreads so easily. People don't have symptoms, they have no clue they're sick, and yet they spread the germs to someone else who can get very sick. And often you're contagious before you show symptoms. So being able to test people without symptoms is absolutely crucial to moving forward to the next phase.
Okay, and you're asking people also to wear face masks 10 to 6 at the Barcroft Fitness and Rec Center. My goodness, that is an entire day. Before we let you go, how many tests do you hope to administer today?
Hope to do 1,000. Hope to do 1,000. And thank you for the reminder about the face coverings. That's just a given. Anybody who's outside with other people, please use a face covering. Thank you for that.
No question. Libby Garvey is the Arlington County Board Chair. Thank you so much for joining us. Good luck today with your all-day testing today there in Arlington. Thank you for joining us.
be hitting the road. But then you have to think about the coronavirus. You've got to take that into account. So this morning, we are ranking the risks associated with some of the things that you may have on that summer to-do list, things that you've done for years. And here to help us all out and sort through this is an expert, an infectious disease expert, Dr. Amira Roaz. So great to have you this morning, because really people are at a point now as things start to reopen where not only are they really itching to get out, but they're starting to plan for their summer, or the little summer that they have left. So I want to begin just with what we saw over the weekend, the backyard barbecue. Where does this rank along risks?
So going out to a backyard barbecue is really low to medium risk. And it really is going to depend on what you do when you're at the barbecue. So for example, it's going to be important to avoid sharing food. Consider bringing your own food, like a potluck. Avoiding sharing utensils is going to be very important. And then if you're going to talk with people, make sure that you wear the mask and you try to maintain that 6 feet apart, that social distance that we've been emphasizing. Doing those things will keep your risk low. But if you start to deviate from those recommendations, then you start to creep up into medium risk, and maybe even more if you're not careful and if you get too close to other people.
But the food itself is not something that we should be worried about, right? As far as getting the virus transferred through the actual, it's more like the utensils and things that you're holding and sharing.
Right, but you also do want to be careful about who prepared the food. And we do recommend that, maybe consider bringing your own food. The last thing that you want to do is ingest food that's been prepared by someone who is maybe sick, sneezing on the food and that kind of thing. Although I think at this point, all of us who are preparing food are very careful. But if you want to be extra careful, bring your own food with you.
A lot of people we saw over the weekend going to the beach, people wanting to go to pools or to neighbors' pools. What do we need to keep in mind? Where does this rank? And is the water, is that a risk at all?
This is a low risk activity. Going into the pool is really considered low risk. When you are out of the pool and around people and you're getting, within the 6 feet and you're talking, then wear your mask. But in general, it's considered a low risk activity. You have space around you. The water is not a vector for the virus. So it's a pretty low risk activity.
All right. I guess you probably just want to be careful on the entry points, to a pool or to a beach where you're going to be around people. Outdoor celebrations. This is stuff summers are made out of. Weddings, family gatherings, so forth, of more than 10 guests. What do we need to keep in mind? Where does this rank on the list?
It's going to be more of a medium risk because you are going to want to really put on the mask and avoid being too close to lots of people. So outdoor activities, outdoor weddings are probably somewhat lower risk than an indoor wedding in a traditional venue. One thing we worry about is ventilation, and you're going to have better ventilation when you're outside than when you're inside.
And what about these events where a lot of people are drinking? Is there a concern there too because of social distancing? And
Absolutely. So we know that when you are drinking, your judgment may be a little bit off, and you might find yourself getting closer to people than you usually would be in this situation. And so this is why we are recommending that when you're out in these social gatherings, you really limit your alcohol consumption, because you want to remember to maintain the 6 feet.
All right, folks, we are going out to Joint Base Andrews right now. President Trump on his way to Air Force One, where he will be heading to Florida, where he hopes, and really all of America, hoping that there will be a launch today of SpaceX.
about it. There's always a balance of managing risk as you go forward to execute a test point.
I love how you tossed to it.
Welcome everyone here to News and Now. President Trump is in the air heading to Florida for the historic SpaceX launch that will be launching 2 astronauts into the sky and into orbit, the first time on American soil since 2011 and the very first time for SpaceX and this NASA partnership. Take a look at Air Force One, though, in the sky. This is where President Trump is heading. Take a look at Cape Canaveral there in Florida. You could see the famed platform there where it was launching shuttles in the Apollo mission. Now going to be launching SpaceX. That is expected at 1:30 Arizona time, 4:30 out on the East Coast for all our Florida friends, as so many are getting ready for this historic launch. Thank you all so much for joining us here today on News Now. I'm your host, Mike Page. That will be such a sight to see. Think about it. It hasn't been done since 2011 when we were launching the last shuttle ride, and now it's a whole new ball game. And now NASA partnering with SpaceX to launch those 2 astronauts to the space station. It should be very special, and that's because, well, we will also have, it's going to be so special, and we have a special stream set up on our YouTube page. It's going to be set up around 12:30 Arizona time for NASA coverage. Hopefully this weather will hold. That way we can have that special stream and show you really all of the moments leading up to this historic launch. All right, folks, let's go now into COVID-19 territory, everyone, and show you the very latest numbers that we are seeing from the COVID-19 dashboard map. Just under 1.7 million cases here in the U.S., and we are unfortunately just under 100,000 deaths in this country due to the COVID-19 pandemic. Here's what we have coming up in just a little bit. Governor of New York, Andrew Cuomo, straight from his meeting with the president earlier this morning. He will be doing a update. We'll feature that for you when that does. Well, and look at this. Just on time, Governor Andrew Cuomo coming to the podium. He just spoke with the president earlier this morning. Let's listen to this live update.
Good afternoon. Pleasure to be here today. Let me introduce the people who are with us. To my left is Melissa DeRosa, Secretary to the Governor. To my right is Robert Mujica, Budget Director of the State of New York. We're at the National Press Club today. It's a great organization, great part of Washington's history and the legacy. And I want to thank Michael Friedman very much, who is the president of the National Press Club. Thank him for his hospitality and courtesy for having us here today. We are in Washington. I spent 8 years in Washington during the Clinton administration. I was Secretary of Housing and Urban Development, came down at the beginning of the Clinton administration, stayed until the end. Lived in Virginia. That's where I got my southern accent. Really southern Queens, but we had good discussions today, and we'll be heading back, but we wanted to do our briefing from Washington, so it was timely. And let's talk about some facts as to where we are. Number of hospitalizations in New York are dropping. The total change in hospitalizations is down and continuing to drop. The intubations are down, and that's a very good sign. It's rare that good things happen after an intubation. And the number of new cases is down, which is very encouraging news. These are the number of new cases that are walking through the door. In terms of number of New Yorkers that we have lost, 74 yesterday, which is just about what it was the day before, which is yesterday, the day before was an all-time low at 73. 74 is not as good as 73, but it is all headed in the right direction. Again, only in this time of crisis would 74 deaths be anything less than truly tragic news. But when you've gone through what we have gone through, it's a sign that we're headed in the right direction. And we are. When you look at the curve in the state of New York, we are down. We're on the other side of the mountain, as we say. And the decline is continuing. That's different than what we're seeing in some other parts of the nation, where you see the curve either going up or just starting to flatten. So we're pleased with the progress that we're making in New York, and we're ready to go to the next phase, open a new chapter. Memorial Day is often a time when society transitions. Memorial Day, normally we're getting ready for the summer, and people are starting to think about summer vacations and summer activity. We have that on a moderated basis in New York, but it's also a time of transition for us, and we're transitioning to a new chapter on reopening, restarting the economy. This is all a situation that has never happened before, so this is a first case for all of us. And we're trying to learn as we go along, and we don't want to just reopen the economy. We want to have a really smart reopening. We want to watch those numbers as we go forward. And we want to reopen the economy to make it stronger than it ever was before. How do you learn from this? And that's the beginning of the new chapter that we're going to write. We started yesterday by reopening the stock exchange in New York, where the stock exchange was actually had people in the building rather than just electronically. We're doing it on the numbers. Numbers matter. This is not about politics. This is about science, right? We're fighting a virus. The virus is not a Democratic virus. It's not a Republican virus. It's a virus. And viruses respond to science. And science is about facts and about numbers. And that's how we're doing it. We're doing it on the metrics. We're looking at the hospitalization rate. We're looking at the death rate. How many new people are coming in the door into hospitals? How many hospital beds do we have available? How many ICU beds do we have available? Do we have testing in place? And do we have tracing in place? Just take the politics out of it, right? Just do it on the facts and do it on the science. And that's what we're doing in New York. And then you wouldn't reopen everything immediately. You would do it in phases, and you would phase it by the most important businesses, the most essential businesses that pose the lowest risk first. And that's exactly what we're doing. And we then have several phases for the actual business openings. But we're in Washington, and the parameter is what should states be doing and what should the federal government be doing. I understand that states are responsible for the reopening. That's been the position of the states. It's also been the position of the federal government. So states are doing reopening. States are responsible for testing. States are responsible for tracing. States are responsible for their healthcare system. States are responsible for the enforcement of all the procedures around reopening. But at the same time, the federal government has a role to play, and the federal government has to do its part as we work our way through this crisis. And there cannot be a national recovery if the state and local governments are not funded. That is a fact. Washington is now debating their next bill that would aid in the reopening and the recovery. Prior bills have helped businesses, large businesses, small businesses, hotels, airlines, all sorts of business interests. That's great. But you also have state and local governments, and state governments do things like fund schools and fund hospitals. Do you really want to cut schools now? Do you really want to cut hospitals now? After what we've just gone through, when we're talking about a possible second wave, when we're talking about a fall with possible more cases, do you really think we should starve state governments and cut hospitals? Would that be smart? Do you really want to cut local governments right now? That's cutting police, that's cutting fire. Is now the time to savage essential services? And don't you realize that if you do this, if you cut state and local governments and you cause chaos on the state and local level, how does that help a nation striving to recover economically? The COVID states, the states that bore the brunt of the COVID virus, they're 1/3 of the national GDP. How can you tell 1/3 of the country to go to heck and then think you're going to see an economic rebound? Also, state governments, state economies, local economies, that's what the national economy is made of. What is the national economy but for a function of the states? There is no nation without the states. They tend to forget that in this town, but it's the obvious fact. And we've made this mistake before. Again, look at history. If you don't learn from the mistakes, you're going to repeat the mistakes. It's that simple. And we have seen in the past what has happened when state and local governments were savaged and how it hurt the national recovery. Wall Street Journal, not exactly a liberal publication, makes the point that on the economy, cuts to employment and spending likely to weigh on growth for years. So even if you believe the rhetoric, we're about reopening, we're about getting the economy back, great. Then if that's what you believe, you would provide funding to the state and local governments. The Federal Reserve Chairman, Powell, very smart man, respected on both sides of the aisle, said, we have evidence the global financial crisis and the years afterwards where state and local government layoffs and lack of hiring weighed on economic growth. We want to reopen the economy. We want to get this national economy better than ever. Fine. Then act accordingly and act appropriately. This hyper-partisan Washington environment is toxic for this country. You have people saying, well, we don't want to pass a bill that helps Democratic states. It would be a blue state bailout, is what some have said. Senator McConnell, stopping blue state bailouts. Senator Scott, we're supposed to go bail them out? That's not right. On Fox TV, Laffer, you want us to give our money to Cuomo in New York? Hello, not this week. First of all, this is really an ugly, ugly sentiment. It is an un-American response. We're still the United States of America. Those words meant something. United States of America. First of all, Mr. Federal Legislator, you're nothing without the states, and you represent the United States. Not only is it ugly, it is false. It is wholly untrue what they are saying. 100%. And there are facts. If you want to pose the question, which is, I think, divisive at this period of time, but if you want to pose the question, what states give money and what states take money, right? There is a financial equation that is the federal government. And if you want to ask, what states give money to other states and what states take money from other states, that's a question that Senator McConnell and Senator Scott and Mr. Laffer don't really want to ask. Because the truth is totally the opposite of what they're saying. You look at the states that give more money to the federal government than they get back. You know the top, what they call donor state? You know what one state pays in more to the pot than they take out of the federal pot than any other state in the United States? It's the state of New York. New York pays more every year, $29 billion more than they take back. You know the second state? New Jersey, Massachusetts, Connecticut, California. Every year they contribute more to the federal pot. You know who takes out more than they put in from that pot? You know whose hand goes in deeper and takes out more than they put in? Virginia, Maryland, Kentucky, Alabama, Florida. Those are the facts. Those are the numbers. The great irony is the conservatives want to argue against redistribution of wealth. Why should you take money from the rich and give it to the poor? That's exactly what you are doing. That is exactly what you have done every year. So it's only redistribution unless you wind up getting more money. Then it's fine. Then it's not redistribution. Take from the rich, give to the poor. That's redistribution. Yes, unless you're the poor. Senator McConnell, Senator Scott, because you were the ones who have your hand out. You are the ones who are taking more than others. Redistribution, you're against it. Except when the richer states give you more money every year. And then the great hypocrisy. They actually made the redistribution worse. When they passed 3 years ago a provision ending what's called state and local tax deductibility, that didn't level the playing field. What they did was they took the states that were already paying more money into the federal government, the quote-unquote richer states, and they increased the money they were taking from the richer states. They took another $23 billion from California, another $14 billion from New York, New Jersey, Massachusetts, Illinois, Connecticut. The hypocrisy is so insulting because when you start to talk about numbers, there are still facts. And people can still add, and people can still subtract. And they know what they put in, and they know what they take out. And I know it's Washington, D.C., but the truth actually still matters. And Americans are smart, and they find out the truth, even in the fog and the blather of Washington, D.C. So my point to our friends in the Congress, stop abusing New York, stop abusing New Jersey, stop abusing Massachusetts and Illinois and Michigan and Pennsylvania. Stop abusing the states who bore the brunt of the COVID virus through no fault of their own. Why did New York have so many cases? It's nothing about New York. It's because the virus came from Europe and no one in this nation told us. We were told the virus is coming from China. It's coming from China. Look to the West. Yeah, well, they missed it. We were looking to the West. It came from the East. The virus left China, went to Europe. 3 million Europeans come to New York, land in our airports, January, February, March, and bring the virus. And nobody knew. It was not New York's job. We don't do international global health. It didn't come from China. It came from Europe. And we bore the brunt of it. And now you want to hold that against us? Because we bore the brunt of a national mistake? And because we had more people die, we lost more lives? You want to now double the insult and the injury? By saying, well, Why should we help those states? Those states had more COVID deaths. That's why you're supposed to help those states. Because they did have more COVID deaths. And this is the United States. And when one state has a problem, the other states help. I was in the federal government for 8 years. When Los Angeles had earthquakes, we helped. When the Midwest had the Red River floods, we helped. When Florida had Hurricane Andrew, we helped. When Texas had floods, we helped. When Louisiana had Hurricane Katrina, we helped. We didn't say, well, that's Louisiana's fault. They had the hurricane. Well, that's Texas's fault. They had the floods. It was nobody's fault. And we were there to help because that's who we are. And that's what we believe. What happened to that American spirit? What happened to that concept of mutuality? You know, there is still a simple premise that you can't find in a book, and Washington hasn't written regulations for, called doing the right thing. There's still a right thing in life. The right thing you feel inside you. The right thing is a calibration of your principle and your belief and your soul and your heart and your spirit. And we do the right thing in this country. Not because a law says do the right thing, but because we believe in doing the right thing. As individuals, as people, we believe doing right by each other, by living your life by a code where you believe you are living it in an honorable way, acting on principle, and you're doing the right thing. Why can't the government, why can't the Congress reflect the right thing principle that Americans live their life by? Pass a piece of legislation that is honorable and decent and does the right thing for all Americans. Why is that so hard? And if you want to talk about reopening the economy, then do it in a productive way. People think this economy is just going to bounce back. I don't think it's going to bounce back. I think it's going to bounce back for some, and I think there's going to be collateral damage of others. We already know that tens of thousands of small businesses closed and probably won't come back. We already know that the large corporations are going to lay off thousands and thousands of workers, and they're going to use this pandemic as an excuse to get lean, to restructure, and they're going to boost their profits by reducing their payroll. We know it. We've been there before. We saw this in the 2008 mortgage crisis, where the government bailed them out, the big banks that created the problem, and they used the money to pay themselves bonuses, and they laid off their workers. They're going to do the same thing again. That's why I proposed the Americans First legislation that said a corporation can't get a dime of government bailout unless they rehire the same number of workers they had pre-pandemic as post. Don't take a gift from the taxpayer and then lay off Americans who are going to then file for uninsurance paid for by the taxpayers. Don't do that again. And if you want to be smart, we know that there's work to do in this nation. We've known it for years. You can fill a library with a number of books on the infrastructure and the decay of our infrastructure and how many roads and bridges have to be repaired, how this nation is grossly outpaced by nations across the world in terms of infrastructure and airports and development. Now is the time to stimulate the economy by doing that construction and doing that growth. You want to supercharge the reopening? That's how you do it. Then this nation was smart enough to do it before. We did it in the midst of the Great Depression. We created 8 million jobs. We built an infrastructure that we're still living on today. We're still living on the infrastructure built by our grandparents, not even our parents. What are we going to leave our children? And now is the time to do it. We have major infrastructure projects in New York that are ready to go, that are desperately needed, that were desperately needed 30 years ago. Build them now. Supercharge the reopening, grow the economy. That's what we would do if we were smart. You're not going to have a supercharged economy. You're not going to see this nation get up and start running again unless we do it together. That's states working with other states. That's a federal government that stands up and puts everything else aside. They were elected to provide good government. Nobody elected anyone to engage in partisan politics. There was a time when, as a nation, we were smart enough to say, you want to play politics? That's what a campaign is for. Run your campaign against your opponent, say all sorts of crazy things. That's crazy campaign time. But when government starts, stop the politics and do what's right and smart. Don't play your politics at the expense of the citizens you represent. There is no good government concept anymore. It's politics 365 days a year. From the moment they're elected to the moment they run again, it's all politics. And that is poison. We have to get to a point, if only for a moment, in response to a national crisis, where we say it's not red and blue. It's red, white, and blue. It's the United States. And we're going to act that way. In New York, we say that by saying New York tough, but it's America tough, which is smart and united and disciplined and loving and loving. That's what makes America, America. Thank you for having me. Any questions?
Welcome to Washington. You met with the president, obviously, and I was wondering, you were talking about stopping the politics. There are obviously a lot of political issues between you and the president, in particular the Gateway Project or New Yorkers on Trusted Traveler. I was wondering if you spoke about that and what his reaction was to what you originally classified as politically motivated actions.
Yeah, there are political differences between myself and the president. He'll say it. I will say it. I don't even need to say it. You can go do a Google search and you can find 400 nasty tweets about political differences between myself and the president. I said to the president when this started, forget all that. We'll have political differences and there'll be a time to wear our political differences. Not now. This is about getting things done for the country and getting things done for New York. And I have stayed 100 miles away from any political anything all through this. Personally, I went to great lengths to say to the people of my state, I have no political agenda. Personally, I have no political agenda. I'm not running for anything else. I'm not going anywhere. I don't want to go to Washington. There's no personal agenda that you have to worry about and calibrate. Well, is he doing what's right or is he doing what's right for him? Does he have a self-interest? I have no interest. I'm doing nothing. I'm governor of New York. That's all I'm doing. Just to take the politics out of it. I said to the president when this started, put the political stuff aside. Let's just figure out what we have to do, which is a heck of a mandate since nobody's ever done it before, and let's do it. And that's what we've been doing. At the meeting we just had, it was in the same way. It was not about politics. It was not about any of that. It was about how do we supercharge the reopening, especially in New York, which has been hardest hit? How do we take some of these big infrastructure projects that have been sitting around for a long time, which if we were all smarter and better, we would have done 30 years ago, and actually get them up and running because we have to do this work anyway, and because we need the jobs now more than ever. The Cross Harbor tunnels, not to get in the weeds, the Gateway project is a larger project. It's a $30 billion project, has many different components. The essence of the project are 2 tunnels that go across the Hudson River that carry Amtrak trains, by the way. Federal government owns Amtrak. State has nothing to do with Amtrak. And these Amtrak trains come in through New York and serve the entire Northeast. And the trains go through 2 tunnels. Those 2 tunnels are old, they're dilapidated. If there's a problem in those tunnels, you stop train service to the entire Northeast United States. It would be devastating for the nation because while in Washington we have this fragmented view of the country, either the national economy works or none of it works. You cut out the Northeast, you're cutting your nose to spite your face. So those tunnels have to be replaced. Amtrak, federally owned, has a proposal to build 2 new tunnels, so there's additional capacity. That's a project that New York and New Jersey said we'll pay 50% of, just to be good partners. There's a project called the 2nd Avenue Subway in New York, which goes up 2nd Avenue, hence the 2nd Avenue Subway, and it's pending federal approval, and we could start building on that immediately. There's also a project which is the air train, which goes from LaGuardia Airport, where we're building a new airport, to Manhattan. That would cut down traffic, congestion. It would be a great advancement. People have been talking about that for 30 years, and it's pending an environmental review by the federal DOT. And I asked if that could be accelerated because we've already done an environmental review, and nobody's more environmentally sensitive than our government. But can we get the bureaucracy to move faster so we can get that project done? And it was a good conversation. You know, the president is from New York, so he has a context for all the things we're talking about. I think the president also acknowledges and realizes that New York, we're very aggressive about getting these projects done and getting them done on time. This is not the typical government project. We actually get these things done. We're building the first new airport at LaGuardia in 25 years in this country. We built the largest infrastructure project in the United States, which was a bridge that went across the Hudson River, now named the Mario Cuomo Bridge. It was the largest infrastructure project in the United States. We got it done on time, on budget. So if he gives us the green light, this is not going to be years of discussion. I have a shovel in the trunk of my car. We'll start this afternoon, right? So it was a good discussion. He understood what we were talking about, understood what we need, and he's going to be thinking about it, talk to his team, and he said we'll talk next week.
Trusted traveler programs for the
Trusted Traveler Program did not come up. Trusted Traveler Program, I believe, was arbitrary by the federal government. I believe it was actually retaliatory by Department of Homeland Security. They want access to our driver's license data to give to ICE for purposes of deportation. We said we wouldn't give it to them. We would give it to the FBI for law enforcement, but not for deportation. And they then turned around and ended this Trusted Traveler Program, which is the exact opposite. These are people who get high-level security clearance, so you don't have to stop at the border check when you come in at an airport. You just show your card. It eases the burden at the airport. It's better for the officials at the airport. And the people who sit with Homeland Security and give all the documentation and get this special clearance. But they ended that, I believe, in retaliation, and that's nowhere. You want to add something?
Yeah, one thing I will say about the Trusted Traveler Program is that during this year's budget at the end of March, to the extent that there was a bona fide concern with federal access to the DMV database, specifically for those
Welcome back, everyone, here to News and Now, taking a live look right now at Cape Canaveral, where the 2 astronauts have just arrived at the launch pad ahead of their scheduled launch in less than 3 hours. Take a look at this very historic moment as you see the 2 astronauts arriving in style with the Tesla Model X's as they are going to be now climbing those steps and then hitting the elevator up all the way to get into their capsule as they make that waiting period now. They'll have less than 3 hours to wait until the launch, and we're hoping for the very best for them today as they get going and make history with SpaceX and NASA together there at Cape Canaveral in Florida. Hi, everyone. Mike Pace here. Thank you so much for joining us here worldwide on News Now and coronavirusnow.com. We will have special coverage on our Fox 10 Phoenix YouTube page a little bit later this afternoon, so you'll get to see the full launch and all of the pre and really post of that launch with full briefings as well. Now let's continue on here on News Now and coronavirusnow.com. We're going to go out to our sister station, Fox 29 in Philadelphia. Dr. Mike is here with more updates on COVID-19.
Dr. Mike Srigliano with Penn Medicine joining us out of Philadelphia this morning. Great to see you, Dr. Mike.
Always a pleasure, Thomas.
We talk about testing here. The CDC, though, offering a warning those antibody tests could produce inaccurate results half the time. What does that mean in this fight?
Well, what it means is if we're going to have data, it's got to be accurate data. And so there is a problem here, and we need better what we call sensitivity and specificity. That's where the tests are accurate and they tell whether someone has antibodies or not. Remember that there are other types of coronavirus out there, and some of these tests, they even put in their disclaimer that it could be falsely affected if you have had one of the other benign coronaviruses that has always been around. So these are issues that we need to sort out if we're going to have accurate data and know what's going on.
Should we get retested?
I think the testing is the key to, or one of the keys to solving our problems with coronavirus. I think that whenever you do a test, you need to expect that it is accurate. So if someone perhaps was convinced that they had COVID-19 and then had a negative test, it might be reasonable to recheck it. In fact, the Trump administration has pledged to order hundreds of millions of testing equipment, materials, and tests to both check molecular testing with swabs and to make sure that we are able to test to see where we stand from an epidemiologic point of view. It's critical.
Critical, yeah. Testing, testing, testing. Wear your mask. We hear it all the time, Dr. Mike, but now with some of the restrictions being lifted, our thoughts are back on working out, getting in shape. Should we be exercising with our mask on?
Well, it all has to do with social distancing and the fact that if you are an elite athlete, you might want to just cut back a little bit, or even if you're not an elite athlete, this is not the time to be really pushing the envelope, because you should have at least a gaiter that you can pull up when you are in close contact. So for instance, if you're running in a field and there's no one around, you don't need a mask. But if you're at the starting line with a bunch of other people, or you're on a crowded road that has lots of joggers and other people, you really need to wear some protection. I'm a fan of cloth masks. In fact, just yesterday, my son had his first little baseball practice. He's 11, and I bought him a gaiter so that he could pull it up. Now, interestingly, a lot of the kids did not have any protection, and this is a point of contention. The mask is really to protect everyone, not just you. And I think that it is important that we remember we need to protect our kids and ourselves by wearing a mask. Now, an N95 mask is going to cause some problems with breathing, and they have studied this. That's not the mask you want to use. If you're going out jogging, you have a gaiter or a bandana or something that you wear when you're in close contact with others. But the risk is very, very low if you are socially distanced and you are outdoors. So I would say be cautious, but be careful.
You talk about protecting our young. What about young children? At what age should they be wearing a mask? And is there a certain age where it can be dangerous?
Well, over the age of 2 is really the minimum age for a child to wear a mask. Remember, if they're under the age of 2, Thomas, they can choke. They can have trouble breathing. And in fact, there are kids with asthma, cystic fibrosis, and other kids who have learning disabilities who may struggle with a mask. And in those cases, they might not be appropriate to wear a mask. So it's an individual case-by-case situation that we need to decide on. And as kids are thinking about going back to school in the fall, I think this is going to be a big issue. Everyone has to wear a mask, even kids.
You talk about cloth mask may offer the better protection here. How often should you be washing your mask?
Anytime you have it outdoors, you have to wash it. Anytime. That's the beauty of a cloth mask, is that you can wash it. Unlike surgical masks or N95s, if you wash it, you're going to invariably destroy it. So what you want to do is get a cloth mask and wash it every day if you can.
Once again, what's the proper way to take off your mask?
When you have a mask on, you always work from behind. You don't want to touch your face. And I see it all the time, Thomas. People with their mask, and they're always adjusting it. Their nose is always exposed. I don't know why we can't get the concept that the mask has to cover above the nose down to the chin. If you do that, then you will protect yourself and others. You can't have your nose exposed and have your chin covered. It's not going to do anybody any good.
Yeah, both nose and mouth. Speaking of hand washing here, or washing at least, you've said in the past there could be a slight positive in all of this, a possible reduction in the need for antibiotics.
One of the positives out of all of this nightmare is the fact that if we wear masks, if we are washing our hands, if we're using products that are disinfectants, if we do that, we probably are going to reduce the need for antibiotics. And remember, that was a problem before the pandemic, widespread inappropriate use of antibiotics. And it probably will reduce the number of flu infections. So it's a win-win situation. This behavior with masks and washing hands needs to continue on indefinitely.
Makes all the difference. There are now additional cases, Dr. Mike, being reported of COVID-19 related meningitis and encephalitis. What are we dealing with?
Well, we know that the virus can get into the brain. It crosses the blood-brain barrier. We've seen this. We've also seen some studies indicating that the virus can even lead to depressive symptoms. So yes, this can involve encephalitis. It can cause problems with the neurological system. And so for that reason, yet again, it's something that we have to prevent because we don't have good treatments right now. We're working on it.
Well, can you further explain some of the symptoms of this virus and why the body reacts the way it does, the fever, the aches, the pains?
Well, Thomas, none of us, unless you've had the virus, has ever been exposed to this particular coronavirus. And so the body reacts by finding it and seeing it as an enemy, an alien invader. And the body has ways of dealing with infections. Temperature goes up, release of immune systems, antibodies eventually, but also an immune response, and the release of inflammatory markers. And this is known as cytokine storm. When this goes haywire, it can lead to all kinds of inflammation. And we're seeing this with children as well as adults, leading to significant amounts of problems.
I want to get back to testing, a question that just popped up here. Are we still only testing the sick, or are we now looking to test outside of those who show any symptoms?
Well, Thomas, it depends where you go. There are certain locations that will test you no matter what. There are other locations where they will only test you if you have had exposure, if you're a healthcare worker, if you have exposure and symptoms. This has been an evolving thing over time. In the beginning, remember, Thomas, just 2 months ago, we didn't have many tests. And so it was being used very judiciously. And so only people with symptoms were getting tested. In my opinion, everyone should be tested. Everyone should be tested to see if they have the virus, especially if they have symptoms. But remember, up to a third of people don't have symptoms. Secondly, everyone should be tested with accurate antibody tests to see if they had the virus in the past and are now developing antibodies.
And as far as the COVID-19 test, is the swab test still the primary test being administered?
Swab tests, saliva tests, those are the ways to see if you have the virus, and blood tests to see if you have had the virus and are developing antibodies.
Looking at the number of young adults out this past weekend, we heard a common thread here all across the news media, and that is they felt safe, in part because the warmer weather, the sunlight, is going to kill this virus. We still don't know this to be true, right?
Sunlight, Thomas, will not in itself kill the virus. Warm weather will not kill the virus. It may have an impact on contagiousness, if you will, transmission, but the bottom line is it ain't going anywhere. This virus is sticking around. You can see it. We may actually be hitting 100,000 deaths today. We're very, very close. So the bottom line here is that even though it's warm weather and people feel safe, they in reality are not.
And quickly, what about the ultraviolet lights that we hear about, the UV lights killing the virus?
UV light can kill the virus, but don't think that going out in the sun is going to do it for you. There are specific pieces of equipment that you can use to destroy the virus, but it is not something that you can use on yourself, as it can be very dangerous.
Can you clarify as far as the transmission? I heard someone say this morning that you shouldn't worry about surfaces anymore because you can't get the virus on the surface. What is the clarification on that?
The Centers for Disease Control basically said, well, that's one of the pathways, but the highway is aerosol. It's close contact. It's getting close to someone and breathing, coughing, or talking loudly like I do. Those are the ways. That's the major superhighway to give it to someone else. Smaller roads, country roads, involve touching things. You can still get it. You still need to wipe things down, but it's less of a concern. For a while there, we were very concerned about even boxes being delivered to our houses. That is possible theoretically, and it can happen, but mainly person-to-person transmission.
Looking at disturbing numbers here, 62,000 healthcare workers have tested positive and 291 have died so far. What steps need to happen to get back to work safely here?
Well, I think, Thomas, for healthcare workers, we definitely need more personal protective equipment. Everyone knows the term PPE now. We need to have reserves. We need to have stockpiles. We need to have equipment so that our frontline responders, our nurses, respiratory therapists, doctors, everyone involved in the care of COVID-19 patients needs to be protected. Absolutely essential. Now, I've made two observations. One, there is a shortage of these N95 masks, but there seems to be a lot of them around with the public, especially walking around places like Home Depot and at the supermarkets. I see a lot of people with N95s. They didn't get them illegally. Most people had them around the house for doing projects because they keep dust out of you. And so the bottom line is we need to get a way to manufacture them, and we are doing that. And I think, God forbid, there is another pandemic in our future, we will be better prepared.
Yeah, we need more protection for our healthcare workers. You mentioned the grim marker. We could see 100,000 deaths here shortly. It is also important to note, Dr. Mike, there's a growing recovery rate? People are leaving the hospital. They are recovering.
Well, there's no question about it, Thomas, that the more people that get sick, the majority of them will get better and they will recover. And the hope is that someday, through both natural infection and by immunization, we will have what's called herd immunity, where 80 to 90% of the population will have antibodies, and that will then protect everyone. If someone becomes positive, there is contact isolation. They are isolated, and contact tracing, where they find everyone that was in close contact with that person that tested positive.
All right, Dr. Mike, our daily reminder on staying safe.
Thomas, weather's getting nice. We just went through a holiday weekend. Remember, folks, I like the fact that you feel safe. Remember that we don't want to fear this virus. We want to respect it. And in respecting it, you need to wear a mask. You need to socially distance. You need to make sure that you follow the rules. And we will slowly, gradually, and in an educated way open this country, and we will be back better than ever.
We need to keep moving forward. Dr. Mike Strigliano with Penn Medicine in Philadelphia. Great to see you. Stay well, Dr. Mike.
Always a pleasure, Thomas.
And it's not just him, by the way.
All right, everybody, now let's go back out live right now to Governor Andrew Cuomo.
So I think he gets it. He understands the projects we were talking about. The nice thing about these projects is it doesn't require any new legislation, doesn't require any, they've been in the pipeline forever. And his administration can just do it, and we can get it up and running. And to the extent that jumpstarts a larger conversation about infrastructure, which is something I think we need desperately. And look, here's my last point. You know you need to do large-scale infrastructure. When is there going to be a better moment in history to do it? You're spending billions, if not trillions of dollars to handle COVID and bring back the economy. At least build things that we can leave our children, like our grandparents did for us. Thank you for the hospitality. Pleasure.
Now we'll listen to a little bit right now of the mayor of New York City, Bill de Blasio.
I wanted to follow up exactly on what she asked, which is, I have to say, Mr. Mayor, you often say in these kind of, when changes are being asked of you, that New York has unique circumstances. Other cities, do what they do, and we study it, et cetera. But then after a certain amount of time passes, you have a great ability to see what other cities do well and then adapt them, as you did with open streets. We now are the nation's leader in open streets, and you're doing it in a way that other cities had, in a very small way, pioneered. So what is different with the restaurant thing? As you know, the weather is improving, and these restaurant industries members are telling us that the window is going to close on them because they only have basically through September to really make that happen. So what's the difference? Can you talk about why?
Welcome back, everyone, here to News and Now. We are taking just a listen right now for a little bit
of but I
Mayor
take it
Bill
as
de
a
Blasio
badge of
out of New
honor,
York City.
honestly, that we look at what other people do, often, honestly, in circumstances that are more propitious. I mean, let's face it. We've been the epicenter of the crisis here in this country. We have the toughest conditions, the most densely populated place that's been in the middle of this whole fight. We have a lot here that makes what we do very, very sensitive. Small steps can have a very big impact when you're talking about over 8 million people. And job one is safety and health and not allowing that boomerang. So I really think it is actually exactly right to say, we're watching what other people do. We watch a lot of people do things in easier circumstances, and then we decide what makes sense for us. The open streets is a great example. I did not think it made sense when we didn't have enough NYPD officers and all of our city personnel. Now that they came back, that really contributed. Great work with the council, great work with communities. When we started it, we were able to start it safely, and the proof has been in the pudding. It is a great idea, Gersh, and it's working real well, and it's been executed safely. So I think the parallel with the bars and restaurants is very, very clear. I would love them back up and running immediately. But the safety ramifications of bars and restaurants are very different than the phase one industries. What's phase one? Construction, manufacturing, wholesale, and retail, but only with things like curbside pickup. Calibrated to make sure that as we bring back hundreds of thousands of people, we do it safely and we don't hit that boomerang. Bars and restaurants implicitly come with much closer contact. We have to figure out how to do it right, how to enforce it, how to make it viable. So I know people want to get going. I respect it. As soon as we feel it's right, we'll be ready to act. But first, we got to get phase one going. It's just there is an important part of sequencing to keep everyone healthy. So that's how we're going to proceed.
Next, we have Matt Chase from Newsday.
Hey, good morning, all. How you doing?
Good, Matt. How you doing?
Good. Two quick questions for you. First, how is rideshare like Uber and Lyft going to be different during phase one reopening? And second, to what extent are you going to be restricting more streets than currently to bicycles for phase one?
Let me come to that, but first, if you'll just forgive me for a second, Matt, I have the coveted list of bar-heavy areas that Katie asked about. And again, this is sort of the historic reality, but Katie, we will obviously watch if there's other places that need to be addressed, so this can change according to what we see happening on the ground. But the formal bar-heavy areas are the Upper East Side, the East Village, the West Village, the Lower East Side, Williamsburg, Long Island City, Astoria, Hell's Kitchen, and City Island. So there's our formal list. Matt, look, we are going to, in phase one, focus on those industries and that I've talked about and obviously get them up and running the right way. So in terms of how people get there, the initial estimate is it's going to add at least a couple of 100,000 people into the workforce in the 5 boroughs. That's an area that's a reality that concerns me. We talked about it yesterday. We want to make sure we're well coordinated with the MTA, and that makes sense. Right now, in terms of the basic structure of transportation, we have what we have. In terms of any changes we might make with rideshare or bikes, we're still evaluating if that makes sense and if there is something specific to change in the here and now. But it's all connected. We're trying to make sense of what's the right way to get people around in a new circumstance. I think that's an important consideration. Now I think it becomes an even bigger consideration when we go to phase 2. So the answer is still assessing, but we will have more to say on it.
Next, we have Brian from Cranes.
Hi, Mr. Mayor.
Hey, Brian, how you doing?
Good. I wanted to ask you, New York, a coalition of 300 New York businesses called Reopen New York have defied the state and city and are reopening. We wanted to know what your thoughts are on that and if the city plans to take any action against them.
Yeah, I mean, the city and state are totally united on the approach to reopening. And I would urge everyone to look at the facts. This city has beat back this disease really impressively because of everyone's great effort, but we are far from done. And if we do this the wrong way and the disease reasserts, then you will go in the opposite direction, more restrictions, even more we could have than what we have right now, and that's the last thing anyone wants. So we're going to do this the smart way. Anybody who reopens in defiance with state and city orders, of course we're going to enforce. And if we have to, we'll summons. If we have to, we'll get a commissioner's order, and the place will not be allowed to be open in any way, shape, or form. So I'm a little confused when we've seen steady progress. I'm looking at the state indicators, 5 out of 7 now completed. We're confident that we'll get there in the first half of June on the contact tracers. We've only got a little bit more to go on the hospital beds. That's coming along. I've been really clear about the city indicators and thresholds. They're moving exactly where we want. I don't know what people need to hear to understand that things are moving because we're doing this the smart way. If we keep doing it the smart way, we get to that phase 1 reopening. Do that, we can get to the phase 2 reopening, which really is a vast amount of the economy back in the game. But if people jump the gun and they don't follow the rules, that's the best way to guarantee we don't get to our reopening. So of course we're going to enforce this, and we're going to enforce it aggressively because we have to get this right.
Next we have Jillian from WB.
Welcome back, everyone. Here to news and now 11 o'clock in Arizona, 2 o'clock for our friends out on the East Coast on coronavirusnow.com, and around the world. You're taking a live look right now of the astronauts. They are strapped in, and we are now less than 3 hours away from the historic SpaceX launch, this time with 2 astronauts on board heading to the space station. Special coverage starting on our YouTube page at 3:30 Eastern. You can see that on our Fox 10 Phoenix YouTube page. Be sure to check out all the moments. You're not going to want to miss it on this historic day. President Trump in the air right now. Vice President already at Florida as he was welcoming and giving the thumbs up to the astronauts as they were leaving the NASA facility on their way to the launch pad about 30 minutes ago. Here's a live look here at the numbers that we are seeing with the Dow. It's another green rocket day, no doubt about it, up 260 points, already up more than 1% on the day's trading there. So thank you everyone for joining us worldwide on News Now, coronavirusnow.com. Let's go out to special coverage from Fox 2 Detroit. This is a special coverage on how kids are dealing with this pandemic right now. Let's listen in.
Me and my friends alike, we're all really bored looking for things to do, and it's no different for those elementary students. And I think that by connecting, it's pretty good for both sides.
Students stuck at home, missing their friends and wishing they were still learning at school rather than online. Enter Big Buddies of Bloomfield. 16-year-old Noah Roslin and his buddy, 15-year-old Noah Yeager, recently created the organization that is working to match mentors with younger students to tutor, play games, or just talk if they need to.
It's hard to get motivated to do your schoolwork as well as just being bored throughout the days and the weeks. So I feel like now once we schedule like a specific time period that we'll call with the kids and like help them do their schoolwork and just do activities, it's good because like they can get motivated much more easily.
Big Buddies of Bloomfield has only been around for a few weeks, but it's already getting plenty of interest from other high school student volunteers and elementary students throughout Metro Detroit who are looking for that virtual connection.
I was just thinking, at least like throughout quarantine, just like helping kids like once a week. And I didn't realize like how big it was going to get.
Parents, many who are working from home trying to balance it all, appreciating that extra positive attention directed toward their children.
To talk with them, to play games with them, and as much as we can work in of trying to be good role models, trying to help them along with their schoolwork if that's what they want. I think that's the goal, is just to build a connection for them to walk away thinking, I can't wait till next week.
The sessions are free, but donations are welcome. The Noahs aren't keeping a penny, instead donating 100% of the proceeds to the United Way of Southeastern Michigan COVID-19 Relief Fund.
We are enthusiastic about it. We really like the idea, and I think it's got a lot of potential to turn into something over the summer.
Our children are natural artists, and the quarantine has brought out their creativity, from sidewalk chalk creations to elaborate rainbows plastered over windows. So much color, so much time to create.
We have a lot of time, so why not art now?
Carol Hofgartner started the nonprofit Art Road back in 2004 to get art classes back in schools where budget cuts had cut out their creativity. Now Art Road teaches classes in 5 schools and to 2,200 students in Detroit and Ecorse. But it's COVID-19 that's cut art classes this time.
Art certainly brings joy and smiles during these dark times. And in normal times, when we ask our students, what does art mean to you? They're like, duh, Miss Carol. Art is life, art is everything, art is forever.
Which is why Art Road is working so hard to keep their kids engaged, handing out art kits and art lessons that families can pick up at their schools. But they wanted to reach more kids, so they've partnered with Comcast for art lessons on demand.
Hi kids, this is Miss Lindsay with Art Road. Today we're going to be making bubble letters. Today we're going to make some stencils. Today we're going to be making some dogs.
Step-by-step instructions for fun little art projects all kids can enjoy. This class isn't about running out to the store for supplies. It's about using what you have, which could be in your kitchen or in your closet or even your recycling bin.
You just need that piece of paper or something from the recycle bin, some markers and some scissors, and away you go.
Carol's hoping students everywhere will watch and create and continue their love of art.
Hi to our students, we miss you. Our 2,200 students, we miss you. We miss your creativity. We love you and we can't wait to see you again.
But until then, Art Road will be online and now on demand to reach as many students as they can.
The great thing about Comcast Xfinity On Demand is all across Michigan, students can access Art Road's art making videos. We can certainly use the power of art to get through this.
As people shelter at home to stay safe during the COVID-19 crisis, 12-year-old Dion Hooper has found a way to spread some joy through his DJ skills.
This is the software I use. We're all stuck in a house, so why not do the live if people want some music?
Dion, also known as DJ Hoop, knew he wanted to DJ when he was just 6 years old after he saw a family friend display his skills.
I asked, can I scratch? Can I scratch? And he always let me scratch all the time.
When the 7th grader is not busy with his schoolwork, he has been invited to DJ parties where he gravitates toward a certain groove.
He started to my granny because she put me on the old school. She like, go live, play some music for me while I'm cooking. Yeah, it started from here.
Now DJ Hoop goes live on his mom's Facebook page, hoping to provide an escape with his old school jams as people shelter in place.
Over in the chat like, hi DJ Hoop know this, how you know this? And I was real hype. I'm doing this for the crowd and doing this for a lot of people on the live, on the quarantine live.
DJ Hoop turns 13 on Tuesday, but he's having a celebration on Saturday, and he wants you to join him.
I'm doing a birthday bash. Share my live, like say if I go on Facebook, people share lives and I get like 1K.
His mom is proud of her son's accomplishments and how he's helping people to smile and find hope during a crisis.
Invest in your kids. Whatever it is that your kids want to do, push them.
Whatever needs to do.
To learn how to follow DJ Hoop, go to fox2detroit.com. In Southfield, Ingrid Kelly, Fox 2 News.
1, 2, 3, 4.
4-year-old Ida Morrow is spreading joy one rock at a time.
We paint them to make people happy,
transforming them into little works of art.
It's all about spreading love and happiness.
2 things we could definitely use more of during this global pandemic. Ida puts the rocks in front of her Royal Oak home, and there's a sign telling people what to do.
Take them and put them in their backyard.
It's so great watching it from inside. People walk by, they smile. Kids walk by, you hear them like, oh, look at that, look at that.
The painted rocks have become so popular.
We were running out of rocks, so we don't have any rocks to paint anymore.
So Stephanie put a post on Facebook asking for more rocks.
People liked the post so much, and a lot of people dropped off rocks in front of our house and notes. It was amazing.
The Royal Oak mom and daughter say the project has been fun and rewarding.
When she hears somebody out there, she opens the door. She's like, hi, hi. So she really loves it.
A simple gesture of kindness.
It's so easy. I mean, it's a rock and some paint. It's not really a lot, but it works. It works for all of us.
In Royal Oak, Camila Mary, Fox 2 News.
right, this is very exciting. We are making kid-friendly snacks during quarantine. It's never been more important. And who better to teach us how to make a healthy snack than kind of a kid, a teenager, 15 years old, Paul Kimball. Paul, you are a co-author of your own cookbook. Tell me about this.
Yeah, the book has 100 recipes, and they're all kid-friendly, and over 80 recipes are gluten-free, so it's allergy-friendly, and there's a range of skills from beginner to intermediate, or beginner, intermediate, and advanced.
This is fantastic. You wrote it with your friends, which I think is super duper cool. And you are going to teach us something today. We are making pineapple popsicles, right?
Yeah, pineapple lemon ice pops.
And these are, now you say they're healthy because of the ingredients we put in them, where no added sugars and stuff like that, right?
Right, sure. It's only 4 ingredients, and the base is yogurt. First, we're going to scoop 1 cup of yogurt into the 1 cup measuring cup.
You're up. You just keep eating your food. You're doing a great job.
All right, and then we can use the same measuring cup for the pineapple. So we'll just put pineapple, and we have a mix of frozen and fresh because quarantine.
Ah, that's awesome, because that's what I've got as well. Do you recommend one over the other? Does one taste better?
The recipe says frozen, but it really doesn't matter.
Okay, go ahead. You're doing great. Yeah, put them in there. Good job.
And the next step is putting in honey. So measure out a tablespoon.
Keep going, keep going, keep going, keep going, keep going, keep going. Stop.
So the next step is a tablespoon of lemon juice. We'll just blend it right away. Takes more time with kids, but it's always worth it.
Okay, so we're all blended, Paul. What do we do now?
Yeah, so the next step is pouring them into Dixie cups. But another way, you can actually use tin foil over the top.
Oh.
What you do is you poke a hole through it first so that you don't have to poke it through when it's on there. And then just cover the lid. That when you put the popsicle stick in, it stays up straight.
And poke it through. Good job. And leave it just like that. And then we're going to freeze it. So, Paul, what inspired you to write your own cookbook?
Yeah, all of our friends are in a mastermind group, so our parents help each other with their businesses, and that's how we met. And we one day cooked breakfast for the parents, and then one of the moms had already written a cookbook, so she was like, hey, you guys should write a cookbook, and we were like, no. And then we actually started doing it and got a proposal, and eventually started writing recipes, and it was like, wait, this is actually going to be a real thing. Chef Junior.
You can find it where?
It's available on Amazon for pre-order, or you can go to kidscookrealfood.com/Chef Junior to get some bonuses with your book.
Awesome. Guys, can you guys say thank you to Mr. Paul? Say thank you. And we're gonna, oh, that's so adorable. And we are going to, we'll send you a picture with how they all turn out, all right?
What do we think, Campbell? Good?
Good.
Hadley?
How to make brownies. It's a really cool recipe. And here, this is whole eggs. So you see we have 7 whole eggs here. We have sugar right here. We're gonna put the sugar in. And then we're gonna put this mixer up like this. You're gonna let this go for, probably about 5 minutes. Then take some melted butter that we have right here. And we also have some melted chocolate. You're gonna pour your melted butter into your melted chocolate. Get that nice together there. And you're gonna mix it a little bit. Just get it combined. No, you don't have to go too crazy with it. You're gonna take your sugar and egg mixture and your chocolate butter mixture. You're gonna combine those together. This recipe is really simple. You put the flour in. This is cake flour that we're using here. If you don't have cake flour, you can use all-purpose flour. That's totally fine. It's not gonna hurt it. The cake flour is nice because it makes it a little bit more fluffy. If you like those rich, dense, like fudgy brownies, all-purpose flour is the way to go. Makes it a little bit more like, rich for the kids at home. You're gonna dump in some salt, and then this is vanilla extract. You're gonna dump in your vanilla extract here. And it looks a little thick, a little fudgy, you know, brownie recipe.
Wow.
And then we're gonna take a baking tray. You can use any baking tray at home. We put a piece of parchment down like this and then spray it. So when the recipe's done, it comes off real easy. You're just gonna pour it all in there. The recipe that we gave you guys is for a half sheet pan like this. You can cut it or make it bigger depending on what kind of pan size you have, but this is a good like size for just general cooking. You can top it with whatever you want. So the simplest way, this is just turbinado sugar, like sugar in the raw. You can just put a whole bunch of that over the top of it, kind of go liberal on it. It makes a really nice crunch on the outside of it after it's baked. Then you're gonna take, this is Maldon salt. So this is like a French sea salt. Creates this really nice, like salty sweet combination on the top of it. You just put a whole bunch of that over the top of it. We crush it up just a little bit so it's not like big chunks of it.
You had me at salty.
And then we have a few different things here. We have sliced almonds, we have pecans, we have Heath Crunch. You can really do whatever you want. You can get chocolate chips, anything on top of it. So let's say we want to put a little pecans on top of that there. You can put some sliced almonds on it. You know, just kind of go to town, whatever you guys want to put on it. Once you have it like that, you're just going to chuck it in a 300-degree oven for about 20-25 minutes. It really depends on your oven at home. If you have a convection oven, I'd probably go closer to 15 and then check it. If you have just a still oven, that 20-25 is good. And then this is what it comes out like. You can see here we didn't put any of the nuts or anything. We just put the turbinado sugar and the Maldon salt on top of it. And then we have these beautiful like brownies here. You know, they're kind of just lightly fudgy, a little bit airy, but really, really delicious brownies. These are a great recipe.
Live look right now, everyone, here of the Dow Jones up 313 points, continues to rocket right now. We are all watching here on coronavirusnow.com. Coming up next, we are going to feature the newscast, part of it at least, from New York City, our sister station Fox 5. That is coming up here in just moments. Everybody, we appreciate you joining us here worldwide today on News Now. Live look at downtown Phoenix right now. It's going to be a hot one. Welcome back, everyone, here to News Now. Live look at downtown Phoenix. They're in the distance, and it is going to be a hot one today. We're expecting about 108, 109, and it's going to be a stretch of about 5-day stretch there of excessive heat warnings all across the valley and our state here, as we are dealing with some very dangerous weather temps there as we get close to 112 to close out the week and head into the weekend. Hi everyone, Mike Page here. Thank you so much for joining us worldwide today on News Now and coronavirusnow.com. We're going to take in some coverage from our sister station, Fox 5 in New York. Take a listen right now.
What the reopening would look like? Well, it entails under phase 1 construction, manufacturing, agriculture, hunting, fishing, and the big one for many small business owners, retail shops. 50% capacity inside, wearing masks when they're unable to socially distance, and also curbside pickup. Store owners say they'll take it. It's a lot different from what they've been doing since mid-March, as it's been many online sales. Landscaping companies went back to work about 2 weeks ago, and they got the green light to resume. Some other outdoor activities like tennis also got in play a few weeks ago, so now it's their turn here. People we spoke to say they're ready.
I am so ready to even browse and walk around a store with a mask on. I don't even care what store you send me to. It could be a shoe store, I don't really care. Just to walk around and be like a normal person again.
Can't wait for things to get back in the swing of things.
Just getting out, walking around, getting in the stores and getting what I need to get. I'm tired of ordering. I want to go look at what I want to buy.
I think if we just keep our masks on and we wash our hands a lot, that will really prevent the spread.
And that's what local officials have been saying. Wash your hands, keep your hands away from your eyes. As of yesterday around 3 o'clock, the cases on Long Island, those positive COVID-19 cases, about 79,000. And small business owners say now is the time, many of them in danger of having to close their doors forever. Governor Cuomo has been talking about that metric system. That's why we're allowed to reopen today. Those 7 metrics, we've hit them. The lower hospitalization rates, the lower death rates on the decline, and those tracers in place. He also talks about a valve for reopening. Carefully watch it. He says open the valve to allow them to reopen slowly, but close the valve if the numbers increase. Phase 1, as I said, construction, manufacturing, agriculture, hunting, fishing, and those retail shops. What does phase 2 look like? Hair salons. People are excited for that. Phase 3 is dining in restaurants, and phase 4, arts and entertainment. It's a one step closer, and I'm sure many people will look forward to it today.
All right, Jody, thank you. Just wondering, though, are people allowed to try clothes on in the retail or no?
You know, they don't go into that. It's really about social distancing, and so keeping your distance. I'd say for sanitary purposes, it's probably not best. A lot of people have been doing kind of virtual appointments, showing clothes over the phone. There has to be a return policy. I mean, I don't know if I could get a bathing suit if I don't try it on, but is it sanitary right now? I'm sure everything could really be sprayed down if you do it the right way and just take precaution.
Learn as they go along. All right, Jody Goldberg reporting for us. Thank you, Jody. And more trains, more cleaning, and don't forget your mask as the LIRR and Metro North roll out preparations for phase 1 reopening this morning. Joining us to tell us more about what riders can expect, the president of the Long Island Railroad, Phil Ing. Phil, great to have you with us. You are at the Jamaica station. Exciting day, huh?
Yes, Laurie, and thank you for having me on. It's a great opportunity, and we are looking forward to today's phase 1 for Long Island.
I think of all your commuters who have been home, either just practicing social distancing or working from home, and many of them might have forgotten how to ride the LIRR and what needs to be done, and it's a whole different phase now. They have to wear masks.
Well, it's definitely a new time for them. These are unprecedented times for all of us. And yes, the face coverings are critical to their safety, to everyone else's safety, and they're required anywhere on our system, both on platforms and our trains. It's really one of the key factors, I believe, along with all the daily disinfecting of all our cars and twice daily in our stations, that go hand in hand with what we're seeing now, that we are getting ahead of this virus, that we are seeing people able to slowly and carefully restart their lives, and this phase 1 is a critical part.
So what have you added when you take into consideration how you all scaled back significantly? How many trains are now running? What's different?
Well, back at the beginning of the essential service plan, we've been running about 70% of our normal trains every day. And what we've been doing is, in the beginning, monitoring ridership. And early on, we added 12 trains to accommodate certain peak rides. And what happened is, recently, with the restart and the Memorial Day weekend beaches, we wanted to make sure that as people come back, and some of these folks have not been on the trains, as you said, Laurie, for a few months, we want folks to feel a little more comfortable. Initially, we added 105 cars throughout the system at strategic key trains, such as on our Babylon branches, on our mainline branches for Ronkonkoma. And we wanted to make sure that in this first steps of people coming back to perhaps get ready for phase 1 or start phase 1 today, that they know that they can get on the trains and have a little opportunity to still spread out during this first days for them.
I'm curious, Phil, if these different rules are not practiced, is the subway being, is it or LIRR being patrolled at all? Will some type of citations be given?
Well, we're not looking to give citations. The one thing I will say, Laurie, is that the ridership to date has been phenomenal. They've been wearing face coverings, and we fully expect that they will be doing that. But however, we will continue to message to all of the riders, and this opportunity here gives me a chance to be speaking with the people that are coming back. Face coverings are a key component. We expect that they will. Hand sanitization, washing your hands frequently, and staying home if you're sick. These are all things that have worked well. And over the last 2+ months, we've seen not only the essential workers that have been using the railroad, but our own workforce continue to be able to do what they need to do to help us get through this pandemic save lives, and get us to this point where others can go back to work.
And buses also, they're being disinfected, correct?
Yes, the buses, the subway cars, Metro North, Long Island Railroad, you know, a real shout out to all those workforce at MTA. They are heroes moving heroes. We've found new ways to do this disinfecting of the train cars even more effectively than we've done before, and they continue to look at new technology to try and even build upon that.
All right, well, fingers crossed, Phil, that today will be smooth sailing for all of the workers and also for the commuters. President of the LIRR, Phil Ing, joining us. Thank you. Good to have you on.
Laurie, thank you. You stay safe, and to all your listeners and watchers, they stay safe as well. Thank you.
Thank you. For Long Island, after being completely closed since mid-March, Nassau and Suffolk counties are now able to begin the reopening process. The phase 1 reopen will be limited, though, to construction, curbside pickup, retail, and manufacturing. Joining us this morning, live from Hop Hog, Suffolk County Executive Steve Bellone. Great to have you with us, County Executive.
Great to be with you. Good morning.
I feel like you were a trailblazer in many ways. I mean, you were one of the first COVID-19 cases that hit that region. A, how are you feeling? And we had no idea of what was really down the road.
Feel great. My team, my deputy county executive, who was the first person, we have 10,000 people in this government, first person testing positive, and that really set this whole thing off in the last 2 months has really been one of the most trying times that we've experienced. We've lost nearly 2,000 people in our county in a matter of 8 weeks. But, you know, this Memorial Day weekend, as we opened our beaches, really represented the start of a new phase for us, a reopening of our economy as a whole. And, you know, people are ready for it. I think we're ready for it. The business community is ready, and we need to do it because the economic devastation has been real and it's deep.
All right, so let's talk about the phase 1 and really what's going to start to reopen with that. I know you're going to start construction. What else?
Construction, so manufacturing is coming back online now. Retail, so it's for curbside pickup, but at least now Main Street businesses can start to get back into business and hopefully be moving into being able to fully open those stores again very soon. Wholesale trade, agriculture, very important to us out here in Suffolk County on the East End, one of the biggest agricultural counties. So this really is a major restart of our economy. We've got a long way to go, but really is a big shot in the arm for us.
As far as the curbside pickup, not every retail facility has that space there. So A, how do you make sure that you can accommodate that? And B, how do you make sure that these businesses are going to go ahead and adhere to all the different provisions and rules that you set in place? Because we saw in Patch Hog how that bar was like shoulder to shoulder. They apologize, but we know it can happen.
Yeah, clearly that was unacceptable. I think for the most part, though, what we found, and I think moving forward we will find, businesses get this. First of all, entrepreneurs are the ones who are most able to adapt and adjust because it's what they do on a daily basis. And they know in order to be successful business-wise in this environment, they've got to protect their employees, they've got to protect their customers, and none of them want to go back into more restrictive environment. So it's really a business imperative. As far as the Main Street businesses, a lot of places getting creative, expanding sidewalk space, using some of the parking out front to expand that. So we're looking at supporting those efforts. And again, it is about creativity, and that's what entrepreneurs do.
Let's talk about contact tracers. I know you have a little bit over 1,300 of them. How's it going to work? How can you make sure that the communities help one another to make it beneficial and what it's supposed to really achieve?
Well, the contact tracing is really a key to reopening safely. You can reopen, but without the testing and the contact tracing, it's really hard to say that you're going to be able to do it safely. We have the contact tracers we need to go out. If we start to see a spike, we're going to know where it's happening. We'll be able to identify if it's a particular location and really take action there. Rather than targeting the whole economy, you're now going to be able to be acting in a much more targeted way, and that's a good thing going forward. And we have to, as cases start to spike, as we put more density into the economic environment here, we have to be able to stamp them out quickly, and contact tracing will allow us to do that, and we're prepared to do it.
When you're dealing with the phase 1, my understanding is it's supposed to last about 2 weeks to see how things progress, and then if they're done in the timely manner, the right way, then you can move on to phase 2. Can you possibly move to phase 2 even sooner?
I think that is possible. We've seen adjustments along the way for the metrics and changes in how we've reacted to this, because this is all brand new. We're learning new stuff every day, and where we were 2 months ago in our understanding, we're light years from that today. So moving forward, can there be changes? Yes. And I think the advantage we have now, we're one of the hardest places that were hit in the country. We're getting to see the experiences of other regions around the country and frankly, other counties in New York State and what they're experiencing. And we see that certain activity is not causing an issue. We may be able to open that up earlier.
I know a lot of businesses, of course, they want to get up and running again. They've been losing dollars, by the day.
Yeah.
But for your county workers who have been also home, working from home, will they be now required to actually commute, go to the office?
Well, this has been a real learning experience for all of us. There's always been talk about working from home, but we've never really pulled the trigger, not just in the county, but across the economy, I think. But what we have found, our experience in Suffolk County, is that we've had many employees who are incredibly productive working from home. We're not looking to add density that we don't need to add. So to the extent we can have people continuing to work from home, we're going to do that at this point. And then longer term, we'll see. This may be really change the way we do work here.
I know that you are an active guy. You like to stay in shape. I saw your Twitter the other day saying, I did the grid. Just paying homage to people that were lost and being out there.
Yeah, Memorial Day, we talk about it being the unofficial start of the summer, and I've said now for us in this COVID-19 crisis, it's the unofficial start, it's the official start of opening our economy. But Memorial Day is really about honoring the men and women who have served and sacrificed, and we did that placing flags at cemeteries across the county. And we really can take inspiration from them, the people who've served, the sacrifices that they've made going through this crisis. Knowing that we can and we will recover, inspired by those who've served our country.
All right, County Executive, Suffolk County Executive Steve Bellone joining us. It's been a while since you've been on Good Day.
It's good to be here. Maybe I can come in sometime to the studio.
I hope so.
Someday.
That'll be phase 4, 5,
yes.
Something like that.
Right, post phase.
All right, it's been too long. Thank you. Good to see you. Glad you're well.
You too. Thank you.
Living every day through the pandemic is challenging, and for those with a disability, it can be even harder. But the city is trying to help those in need. And to show us how is Commissioner of the Mayor's Office for People with Disabilities, Victor Calisi. Victor, thank you for being with us this morning.
Thank you for having me.
I would imagine the challenge for your office is also greater. I mean, thank goodness the office is there, but now compounded with the pandemic.
Yes, it certainly is. The Mayor's Office for People with Disabilities is here to ensure that anything the city is doing encompasses people with disabilities, making sure that we're looking at people with visual disabilities, hearing disabilities, cognitive disabilities, physical disabilities, and we even cross over to some aging issues as well.
And you also created a website for people to go to specifically for COVID?
Yeah, there was a lot of things that are happening throughout New York City, and we wanted people with disabilities to be able to understand the things that they need and put it all in one place. So yes, we've certainly set up a website at nyc.gov/disability-coronavirus. So check it out. It has all the latest information on how to get food, how to get protective equipment, digital accessibility, because we've all moved to these digital platforms, making sure that you get access to other city resources such as disability service facilitators that are placed throughout city agencies to ensure that people with disabilities can get what they need in that specific agency. So yeah, the website has been very important.
Have some of these digital entities that are put in place actually been helpful when you think of some people being able to stay at home, or just different options right now?
Yeah, the options are great, and it's something that people with disabilities have known for some time. They've been told, you're not really able to work at home, and now we have a large percentage of America working at home, and now this is an option. So we wanted to make sure that the platforms were accessible. And we put together these digital guidelines, these virtual digital guidelines of how to make sure you include a sign language interpreter, how you have captioning on there. But the digital platforms are certainly a game changer. but not everyone has them. And we have to be cognizant of that and make sure that when we're thinking about this, how do people with disabilities get access to tablets, to Wi-Fi, because these things are costly. And this is something that we're thinking about constantly and making sure that we can provide as much information as possible so people can have access to these things.
You briefly touched on one of the big concerns that you have, access to food and supplies. Talk to me about that a little bit.
Yeah, there are a lot of people out there that are struggling, and we have to ensure that what we do includes people with disabilities. We have our NYC Get Food program, and people could certainly get the food that they need. We've heard some hiccups along the way, and we've been changing them, but getting the information out to the community is important as well. And every week we have a weekly call, making sure that the disabled community knows what's happening through this pandemic and how to get access to food and how to get access to supplies. Right from the beginning, we understood that we had home care workers and personal care attendants who were coming into people's houses, and they didn't have the protective equipment that they needed. So it was, we don't want those people with disabilities to flood the hospitals because there can be some underlying issues, and we don't want them to get sick or die for any reason whatsoever. So we made sure that we're distributing protective equipment to the disabled community through service providers, through our office, whatever way we can do to get it out there. We've been working to get it out there.
And are many of the folks that you've been talking with, are they able to get out, to breathe the air, enjoy some of the things that so many of us are able to, or still practicing social distancing? Or is there a fear of stepping out for fear of, they could even end up in a worse state?
Yeah, there is some of that fear. People with compromised immune systems aren't able to go out, and they're worried about that, right? But protective equipment, social distancing is certainly one way to do that. And we've also come up with virtual workout sessions, virtual museum tours, virtual concerts that are happening. So we're trying to engage people on the digital end, but also making sure that people have the protective equipment so when they need to go out, that they have that, because we want to make sure that people don't get this.
Right.
Yeah, it's because it's quite scary. I think it's scary for everyone, but it can be magnified for some people with disabilities.
All right. Once again, Victor, where can people go who have questions or some needs and want them answered?
Yeah, there's a lot of different ways that people can get to us. It's nyc.gov/disability to find out information about our website, specifically for coronavirus. It's nyc.gov/disability-coronavirus. They can certainly call 311. We have, and if people need American Sign Language, they can call our office via video phone and get an interpreter who's fluent in ASL, and they can call 646-396-5830 or visit our website at nyc.gov/ASL.
All right, Commissioner Victor Calisi joining us, the Mayor's Office for People with Disabilities. Thank you, Victor. Nice to have you on.
Yes, thank you. Take care.
You too. Well, the pandemic has caused a lot of stress and emotions during the past few months, and those with troubled relationships during this time could be seeking divorce or even separation. But navigating the system can be tricky. One of the top divorce attorneys in our area is Marilyn Chenitz. Her long list of clients include actor Tom Cruise during his divorce from Katie Holmes, and Marilyn joining us. She's from Blank Rome LLP. Marilyn, great to have you with us.
Thank you. So nice to be here with you.
This is a tough time. I mean, we've talked about this because so many people feel like being in lockdown, all of a sudden you're with this person who you realize, there's some trouble here. But was there trouble probably before?
Absolutely. I mean, we're seeing a ripple effect of COVID having affected not only your business interests, your real estate, your investment portfolio, but also divorcing individuals are not immune. So quarantine is hard on everyone, but especially for those whose marriages have already shown cracks. And a lot of people ask, is quarantine the reason why I want a divorce? And the answer is no, but it can speed it up.
So, but at the same time, you look at the situation, the judicial system right now, where the courts are closed, and even with Mary Kate Olsen, who wanted her divorce, we're seeing that the judge in that case, Michael Katz, said that this was not essential. So is it?
So timing is everything. As of May 25th, the administrative judge just lifted the ban on starting new divorce actions. Perhaps if she waited a little longer, she would have been able to have access as a new case to proceed. But judges are and have been very receptive from the inception of this pandemic. But if you're going to get divorced during this era of COVID, you need to get acquainted with technology because the courts are accessible. They're doing it through Zoom. They're doing it through Skype. They're making themselves available. But you have to be able to get online and access those courts. But they are issuing orders of protection and all kinds of issues that need to get addressed, including hers.
I think of some of the couples that were already in the process of getting a divorce pre-pandemic, and now they're either still cooped up in the same house together, even with everything that's going on, or situations where they simply can't move out. You mentioned financial woes.
Well, so you're seeing a major economic downturn. People are losing their jobs, their businesses are closing. For example, if they had a restaurant, their lifetime investments have dropped significantly. So it's really a concern, and a lot of people are saying, should I get divorced now, or should I wait it out and let those assets appreciate in value?
And what do you tell them?
It's confusing. I mean, those who say, look, I'm not staying in this marriage, will figure out the best solution, I'll take my assets. We're even suggesting that if you do that, you can take the depreciated assets and put it into a trust so that the trust assets now grow tax-free. So there are others who say, I want to stay and I'll figure it out. Today I have a webinar with a renowned psychologist, Catherine Smerling, and we're going to talk about how to navigate through if in fact you decide that you are going to remain under the same roof in these circumstances.
I saw where a psychologist was saying that normally she has 3 to 5 calls a week about divorce or separating, and now she's getting 3 to 5 a day.
Yeah. So there's tremendous concerns. If you look at children, for example, they have enormous anxiety. They're feeling isolated. We're asking them to sanitize. They don't understand why they're doing this cleaning constantly. And there's a real fear created by the pandemic. Also, there's distance learning. So they are very, very stressed out.
And child custody, trying to maintain that, you know, whatever, if you've already gone through the process, trying to make sure you're still adhering to what the judge's orders were to have, you know, custody back and forth. A lot of parents don't want to put their kids on planes.
So we're seeing a lot of contentious issues that are being brought to the forefront. Children are being shuffled back and forth. There are a lot of parents who have left the city, have moved out, for example, to the Hamptons, where they feel the environment is safer for the children. And then we have the non-custodial parents who are saying, no, bring those children back. So the courts are dealing with these issues, but the bottom line is custody agreements are to be complied with, and they will be enforced unless you can show the court there's an imminent risk to those children. There's a mother who's a physician in New Jersey who lost custody. Why? Because she's a physician and she was working on the front lines saving people. So that's a devastating story, and judges are handling each case by case, making the right decisions.
You think it's going to be worse post-pandemic?
I think we have a lot of challenges ahead of us, and I think people have to be intelligent, smart, thoughtful, and if they have children, they need to really focus in on their best interests because they will live with this for a long time.
All right, your webinar today, it's at noon. Can people still register? Can they listen in?
They can. We have a few spots available. We had an overwhelming response. It's myself and Dr. Smerling.
Where do they go, Marilyn?
They go to Blank Rome's website and they will see a link to the webinar and they can register, and if they register immediately, they'll be able to hear some really interesting information.
All right, Marilyn Chin, it's great to have you on. Looking
Thank you
good.
so
Thank
much,
you,
Lori.
Marilyn.
Thank you.
Well, STD rates are skyrocketing as fewer people are getting tested and treated. Dr. Oz is joining us this morning. Dr. Oz, this is kind of alarming. I heard that this morning and I thought, oh my goodness, explain.
Or they're going to be allowed COVID babies. Let's get that out of the way. This, when people are boxed up in small rooms, they do other kinds of activities, keep them busy. But the problem with STDs is the way we screen and stop spread of STDs has to do with contact screeners. These contact tracers ask some awkward questions, but they'll often find out that if someone's got an illness, doesn't realize it, and they can get them treated. There are about 2,200 of these people. They're all redeployed. None of them are doing that anymore. They're all out there trying to figure out what's causing COVID-19 brush fires and putting them out. So the number of people paying attention to STD has dropped. People are scared about getting treated. 85% of folks for different chronic issues are saying they're concerned about going to the hospital to get checked, even for their heart, by the way, which is life-threatening, much less an STD. So you have these infectious diseases that we don't normally have to do much about except catch them, treat them. They all have medical treatments, unlike COVID-19. But if you don't know you got it or you haven't been checked, you can't get treated.
Right, or even if you have other illnesses, heart ailment, other maladies that you're just scared to go to the doctor or the hospital for to get checked that actually could magnify and be worse down the road.
Lori, vaccines are critical for young children, so they avoid getting contagious elements. About 2/3 of the population is usually up to date. Now we're under 50% because moms aren't taking their kids to the doctor's office. They don't want to have any infectious issues. We have 40% reduction in people getting evaluated for strokes and 40% reduction in people getting catheterized for heart attacks. They're still having the problems. I can't imagine if we've had that much of a decline in those two major threats to our well-being. People are scared. They're just waiting it out. And by the time they go to the hospital, it's more difficult. Same for dentist's office. If you're sitting at home right now with a sore tooth, it's a lot more expensive to treat if you need to have root canal than a more conventional treatment. You're scared, I get it. But doctors' offices, physicians, like our hospital, New York Presbyterian, has had incredibly good numbers, making sure that the COVID wards don't get contaminating problems into the non-COVID wards. Dentist's office are already trained for HIV and other conditions. So there's lots to pay attention to for your health, and there's no need to run away anymore. I get it in March, April even. There was so much going on in this area that I would have probably sat at home as well. But we're in a pretty good place. It's safe enough to go out, especially if you've got a chronic illness that needs treatment.
All right, and talking about Kawasaki-like disease, that we used to think that it was just really for young children, but now we're finding and seeing information where it's been 20-year-olds, young adults are being affected.
There's a lot more Kawasaki's disease than we probably appreciated. Some have estimated that even a few percentage of the weird conditions we see in young adults are caused by it. It doesn't happen in older folks, but it probably happens more than we ever originally appreciated. And again, this is an autoimmune problem. You don't get it while you're suffering from COVID-19. In fact, you may not have even known you had COVID-19, and a month later, you'll show up with.
And welcome back, everyone, here to News and Now. You're taking a live look in Florida right now, where we are just under 2 hours. If this weather does hold for this historic SpaceX launch, you're taking a look at the famed 39A launch pad, where so many great missions happened there. And now you do see the rain coming down just a little bit there. We're talking about space shuttle missions as well. Long shot right there of SpaceX in the distance, hoping the weather can move away so they could have that famed launch here in just a moment. All right, everybody, as we continue on here on coronavirusnow.com, so many things have, really changed in our lives, and part of some states are starting to reopen. We're seeing businesses reopen, but there's one sector that has not been able to get going, and it's a circus that is really halted at this moment. They were really trying to get things going internationally and then come over here to the U.S., and now they're just in a holding pattern. And we got Fox News' Hunter Davis here with the story. This is Hunter. This is amazing what they had to do.
Hey, Michael. Yeah, the circus prepared for about a year to bring its show to the United States. It was a venture that started off great, but then quickly crumbled, leaving the circus no place to go.
Congos breaking the silence as a stranded circus waits for its next move.
I'm the 8th generation of a Spanish circus family. My family has been doing
street performance since 1706.
Ramon Santos is one of 50 people with Cirque Monte Carlo, an international circus that finally came to the United States in 2020.
And then we're working together in France and Germany and Spain. Everybody was so excited to open.
Performing 7 weeks of an 11-month cross-country tour until COVID-19 left the Big Top empty.
We were all very devastated. But for me, it still is till this day. I'm just waiting. We're all waiting to get back on the road and start performing again.
The pandemic led to circus closures worldwide. Cirque du Soleil had to stop nearly 50 shows immediately, including 29 in the U.S. This Big Top is still in Houston, Texas. Performers there have been able to go home, but border closures have left Cirque Monte Carlo stranded in Texas.
We do practice every day. We try to keep our bodies in shape for the day we do start working again.
Since March, the circus has set up camp here in a parking lot, tightly limiting access to outsiders, hoping to protect themselves from COVID-19. The circus has already been hit with an $80,000 loss since their shutdown in mid-March. Cirque Monte Carlo hopes to be back on the road, operating at 50% capacity by the end of June. Those who attend will have to wear gloves, masks, and get temperature checks at the door.
Now, those new adjustments will also include venue cleanings every hour. They will also be working on separating families from one another, reducing their seating capacity from 1,400 people to 200 people. Michael?
Yeah, and Hunter, you mentioned that they're hoping for a June relaunch. What are some of the things that they're doing right now to prepare for this relaunch come just in a couple of weeks?
Yeah, so as you can imagine, they're having to rearrange their travel schedule just depending on what certain states are allowing and not allowing at this point because of the coronavirus. So they're adding some cities and getting away from other cities, and they're having to wait for some of those, approvals from certain cities to be able to travel. Michael?
Yeah, just really showing you that every sector pretty much affected because of this pandemic in our country. Thanks so much, Hunter Davis, for giving us this update with this circus that is trying to entertain so many. And, we all need this entertainment, especially now. This would be great if they could get going. Thanks so much, Hunter.
Thanks, Michael.
All right, more news does continue when we come back right here on News Now and coronavirusnow.com. Let's get you more coverage from our sister station Fox 5 in New York.
And a month later, you'll show up with some of these symptoms. So let me go over them again because we're seeing them now. There's a patient in Northwell, NYU Langona's reporting a couple cases. So it's a fever, abdominal pain, vomiting, and diarrhea. So intestinal stuff, right? That doesn't have much to do with your heart, you don't think, but it can cause heart issues. Then you'll get neck pain, rash. Often you'll get bloodshot eyes with that fever, and you'll feel very worn out. If those conditions are happening for whatever reason, just get checked out. It's simple to look into, and sometimes it's because the body's its immune system has overreacted, creating a little bit of an autoimmune reaction, and that can lead to this Kawasaki syndrome-like problem. That's what's at hand, we think.
You're talking about this is a good time, going back to the dentist, we are in a good place. And I think about the reopening of Long Island that we are starting to see, in the mid-Hudson region. We're starting to see the progress right here in New York and in the tri-state period.
And Lori, a lot of the opening is going to be, the success of the opening, I should say, is going to be based on people taking proactive steps. As an example, take a dentist, right? You don't have to wait in the waiting room. The most likely place you'll get infected probably is in the waiting room with other patients. Wait in your car. Call ahead. The doctors themselves don't want a lot of people in the waiting room. Make sure you're socially distanced or waiting outside your turn. And then if the doctor's office is doing their job, they'll check you for symptoms so people around you have been through the same checkup, and they'll avoid having infections when they go to see the doctor as well. We can do things that we control. It's not rocket science anymore. We understand the basics. Make sure you're 6 feet away from folks, wear a mask if you're not, and wash your hands. Those 3 things we can all do. If that allows us to open successfully, then I think it's a small sacrifice to make.
All right. Very good. Thank you, Dr. Oz. We'll be watching 1 o'clock right here on Fox 5. Have a great day.
Same, Lori. Take care.
Okay. 8:48, and for an update on the latest on the coronavirus, just download our Fox 5 NY News app, and you can also stream Good Day. Never miss a moment of the show. Search Fox 5 NY in your app store. Well, some say dating can be rough during the good times, but during a pandemic, is it possible? My next guest says yes, it is, but there are some do's and some don'ts to follow. Joining me is Tina Wilson, the CEO of Wingman Dating app, where friends may know best when it comes to love. Good morning, Tina. Thanks for being with us.
Thank you. Good morning.
So how did this app start, Wingman?
Well, I was thrown into the world of online dating like many people after a long relationship ended, and it was horrific. It was frustrating at best. And my girlfriends were kind of so encouraging about getting me back out there that they kind of took the reins. And it was at that point that I felt like something like this should exist. Surely your friends and family should be able to help you and become part of the journey. And that's when I started researching and realized there was a bit of a gap in the market. And so I took the leap.
So what's different about Wingman versus all these other online dating services?
So a traditional online dating service is pretty isolating. It's a single person looking for another single. With Wingman, you're literally passing over control of your dating life to your friends and family.
Oh.
So those that know you best are going to navigate your dating life. They're going to write your profile, they're going to provide the searching, and then they're going to make key introductions to people that they deem appropriate.
So I know you're in a relationship now, right?
Yes, I am.
So where did you meet this gentleman? Was it online, or did your friends help you out?
And my friend helped me out. She literally met this guy and she said, you know what? I met a guy who's more sarcastic than you. You guys have to meet. And it was literally that. And now, years on, here we are, locked down in quarantine together.
Well, I'll tell you, I have a dear friend who's decided that she is going to be a matchmaker for me. And I'm thinking, in the middle of a pandemic, so how do I get to know this person? So with Wingman, how do you get to know this person that you think, okay, this might be a match?
You know what, when people write your testimonials, so when friends are writing about you, they're going to give a completely different view of yourself. You know, when you write about yourself, it can be a little self-promotional, but whereas a friend can really toot your horn and shout about how great you are without it sounding kind of too condescending or contrived. So generally you get a very honest testimonial when you have friends writing your profile for you. When you start looking at singles and you see what their friends have said about them, can kind of have insights into some of their friends. When you look at if their mother has written a profile, sometimes their grandmother, their friends. So it gives you a kind of insight into a bit more of the personality.
Okay, so you decide to go on a date with this person. What can you do right now, virtually?
Well, I mean, there is a lot more to do than a Zoom call, right? We have to spice it up. And let's face it, we're going to be in this virtual world for some time. So for me, one of my most favorite things is going on an international date. New Yorkers are obsessed by meeting someone in their zip code. But did you know you can take a virtual tour around Machu Picchu, around the Eiffel Tower, or the Louvre? And these type of experiences are going to kind of be great conversation starters on a first date.
You mentioned also comedy clubs is a great date.
Yeah, because you want to know if somebody has the same humor as you, if you're going to like the same things. There are some clubs in New York that are streaming live shows, but if not, you can both stream into one of your old-fashioned comedy shows, because you're going to eventually meet this person and you are going to want to laugh and share, passions with them. So this is just kind of really, checking out that you're going to be on the same page.
So you say eventually you're going to meet this person. Okay, you're going to meet them wearing a mask and standing 6 feet apart from each other.
You are, but you know what? I feel like so many things now with online dating, it was all about hookup culture, and we've now swerved to an almost old-fashioned courtship and a more patient kind of way of meeting. Hookup culture is dead. For now, I mean, masks are not a hookup's friend. So when you look at stuff like that, people are going to be more cautious, they're taking their time, really wanting quality over quantity. When we look at some of the things we're seeing on trends, people have opened their distance settings on dating apps from 20 miles to over 200 miles, where they're looking for real quality now as opposed to just a convenient location.
Are you seeing that with all ages?
Yes. Yeah, and we're seeing, I mean, for us, Wingmen our wingman usage has quadrupled since pandemic as more and more people have time to become matchmakers and kind of help someone out and want to get involved in their life and help them find a match. And believe it or not, these wingmen and wingwomen, they take it pretty seriously. They get pretty involved. So, you know, when you look at it like that way, they're going to kind of match you with someone that they deem appropriate. That, you know, for what you look at yourself might not always be the best sense, right? You sometimes have a different view of what's good for you, but your friends sometimes know a bit more objectively what's going to be a great match for you.
I'm wondering what are the selling points that a friend would say about another friend. For instance, I know that recently we've seen on some of the dating apps that people are saying they had the antibody test. So they're signal to someone that, you know, I'm good. So give us an idea of what are the selling points.
When I think authenticity and total honesty is key. Right? You may have your friend who's going to throw you under the bus a little, but they're also going to, you know, they're doing it with love. So they're always going to end on a high. So they may say you can be a little lazy or a super fussy, or maybe you're a bit mean. But in that, it also then distracts other people that are not going to be a match for you. So you're kind of weeding them out. But for us, I remember when the pandemic first began, we saw 500 profiles created within the first 48 hours, all of them mentioning toilet paper and like Lysol, and that, you know, like looking for someone to quarantine. By the way, she's got some great toilet paper. You should meet her. Like, that became the selling point. Whereas ordinarily they'd be talking about their jobs and their attributes.
Right.
Now they're, you know, going back to their cleanliness factor.
Is there a fee for the app?
No. So the app is.
All right, everybody, good afternoon. All you news nowers across the country and world. PR areas hopping on a mission control. That's what I like to call the Fox News Now set, and fitting for a day like today, right? I'm going to bring you out to an update right here in Maricopa County, Arizona. It just got started and it's live.
You who are joining us by Facebook and YouTube, we appreciate you being here as well. And we will try to answer a lot of questions today, as well as give a short presentation on a couple of different subjects. We know a lot of parents, they're returning to work, or they're being asked to return to work very soon if they haven't already. Schools are obviously out for the most part, and a lot of people normally send their children to summer camps, whether those are overnight camps or day camps during this time. So Dr. Sonnenschein from Maricopa County Public Health, she is the health director there. She will talk a little bit about what owners of these camps can do to prevent or mitigate at least the spread of COVID-19 during this time. Also, she has some general guidelines that she wants to go over to talk about personal spacing, why public health experts are recommending all these different things, everything from physical distancing to wearing masks, and what that really means for you as an individual who's going out and being out in public a lot more, whether you're going to businesses or restaurants or what have you. So she'll go over a few of those things as well. I also have Robert Rowley here with us today. He is the Director of Emergency Management, and he can talk more about our personal protective equipment situation. It has improved in the last couple of weeks, and he's going to give us an update on that. So before we get started today, for members of the media, if you're having a little bit of difficulty with the GoToMeeting application, please keep trying. Don't keep clicking on the hand so you virtually raise your hand. We will unmute your mic from this side. Please make sure your mic is unmuted at the time you raise your hand. Also, if you're having a lot of difficulty with the software, you might need to log out of that meeting and then log back in to get it to work for you. I also have Joanna Molina here. She is a public information officer from Public Health. She will be answering questions during the question and answer period in Spanish for us as well, to help out all of our friends who are listening who might be bilingual or primarily speak Spanish, and also for those television stations and radio stations that are presenting their information in Spanish. So with that, I'd like to ask Dr. Rebecca Sonnenschein to join us.
Thank you, Fields. Good afternoon. As we go back to work and other activities, people are asking how to do that safely. A lot of the work that we do in public health for the COVID-19 response has been focused on infection control, which means keeping the disease from spreading from one person to another. And everyone in the community can play a part in preventing the spread of COVID-19. So I'm going to walk through the main infection control measures that we recommend in order of how effective they are at preventing disease spread from most effective to least effective. The most effective thing that we can do is maintain that 6 feet of distance between ourselves and others who are not part of our household. And that's because COVID-19 is spread through droplets when you cough or sneeze or even talk. And these droplets can travel up to 6 feet. And that's why the best thing you can do is stay 6 feet away from anyone else who may appear to be infected or who may be infected and not have any symptoms at all. That next level of protection, if you can't maintain 6 feet, is putting up a physical waterproof barrier, like a sheet of plexiglass, like the kinds you often see in grocery stores. And that way, if you cannot maintain distance, there's a physical barrier between you and the other person so that it will catch any droplets that come out of one person's mouth. If you cannot have a physical waterproof barrier, then the next best thing is to have both people wearing cloth face coverings. And that keeps the droplets in, which is much better than just having no barrier at all. Lastly, if both people cannot be masked, then having at least one person masked is better than having nothing. And then a few other general tips to remember is it's better to be outside than inside, particularly in Arizona where the air is dry. Any droplets that come out of your mouth will dry up much quicker outdoors than they will indoors. And if you find yourself stuck in an elevator or other close quarters, it's best for everyone to face in the same direction so that if droplets do come out of the mouth or nose, they'll land on an elevator door instead of somebody else. So we've also gotten a lot of questions about how to make summer camp a safe environment. The number one thing is it's important to screen all campers and staff every day before going to camp for fever and symptoms of COVID-19. Anyone with symptoms should absolutely be sent home. Keeping groups of campers or others to 10 people or less, and keeping those groups physically separated from other groups will help keep the same people together every day so that they're not constantly interacting with a lot of other people. That way, if someone gets infected, you only have to worry about that small group. Staff that interact with multiple groups, like maybe an instructor for an activity that all the campers will see, should wear a mask when they're 6 feet away from a camper or other staff members. Campers and staff should bring their own meals and snacks to camp to avoid touching the same items, and frequently touched surfaces such as doorknobs, bathrooms, and light switches should be disinfected frequently with an EPA-recommended disinfectant. And most importantly, kids and adults with chronic medical conditions or those who are 65 and older should not attend camp. For anyone who is trying to decide whether to send their child or their children to camp, it's best to consult with your healthcare provider and talk about the risks and benefits of camp for your child based on their personal medical history. Lastly, in general, anyone who is 65 and older or with chronic health conditions should continue to limit their in-person social interactions with those outside their household to reduce any potential exposure. And if you're not in this high-risk group, remember to be careful around those who are and wear a mask when you're in public to protect our most vulnerable community members because we are all in this together. Thank you.
All right, thank you, Dr. Rebecca Sonnenschein from Maricopa County Department of Public Health. I now want to introduce you once again to Robert Rowley. He is our Director of Emergency Management here at Maricopa County.
Thank you, Fields. Yes, my name is Robert Rowley, R-O-B-E-R-T-R-O-W-L-E-Y, and I'm the Director of the Maricopa County Department of Emergency Management. Today marks the 54th day and operational period of the Maricopa County COVID-19 Unified Command, and 4 months since the initial response for Maricopa County Public Health. One of the many reasons for forming the Unified Command was to more efficiently manage the logistics process for the county response. The acquisition and distribution of personal protective equipment, or PPE, has been particularly challenging. Throughout this event, requests for PPE have exceeded supply, and it has been a struggle to find reliable sources to order from. Even with limited resources arriving from the strategic national stockpile, local manufacturers, state and local supplies, we had to make the difficult decision to focus PPE requests to long-term care facilities, where more than 70% of Maricopa County COVID-19 related fatalities have occurred. Although it has been difficult to keep our long-term care facilities supplied with PPE, through careful management of our inventory, along with judicious PPE conservation measures, we have successfully prevented any of these facilities from running out of needed supplies. To date, the Unified Command has distributed the following amounts of PPE: 82,000 N95 masks, 200,000 surgical masks, 34,000 face shields, 270,000 gloves, and over 46,000 gowns. In the last couple of weeks, we have seen some hopeful signs that our traditional supply chains have begun to improve. Orders of PPE are starting to arrive more reliably and in greater numbers. This has significantly improved our ability to stockpile PPE to the point where we will now be able to start fulfilling requests to our EMS first responders. We remain hopeful that this improvement will continue, but until then, the Maricopa County Unified Command will continue to provide support to our long-term care facilities, healthcare, and first responders. Thank you.
Thank you very much, Robert. We will now take questions, and Joanna Molina is prepared to answer these questions as well in Spanish after our subject matter expert answers your question. So, Chad, do we have anybody with their hand raised?
Peter Seymour has a question for Dr. Sunshine.
Okay.
Peter, your microphone is live.
Hello, good afternoon. So, Doctor, your instructions for day camps, from what I gleaned, are there any special instructions for overnight camp where the children will sleep overnight for maybe a week or two at a time? And are there any overnight camps happening in Arizona that you know of during the pandemic?
All right, very good question. I can only speak from my personal experience with Boy Scout camp this year, but Dr. Sunshine can answer that from a medical perspective.
The CDC has provided guidelines for both types of camp, day camp and overnight camp. And I can't speak for what's happening outside of Maricopa County. A lot of overnight camps do happen outside of Maricopa County just because of our really hot temperatures here. Some of the things that people can think about is trying to make sure, again, that nobody who's infected actually attends the camp. The advantage of the overnight camp is that it's more of a closed-off community, so you have less individuals interacting outside the camp. So in some ways, that's a little bit safer. But then the disadvantage is that you have individuals sharing a cabin space and sleeping overnight. And the main recommendation for that is you want to have people sleeping from head to foot so that if droplets do come out of the mouth during sleep, that it hits someone else's feet rather than their head. And one recommendation is actually to use those plexiglass barriers in between the bunks at the camp. So there are a number of other recommendations that you can find in the CDC guidelines that apply to those overnight situations.
La pregunta fue, ¿cuáles son las instrucciones que se deben de dar para los campamentos de noche donde
All right, everybody, so it appears that they have switched to the Spanish portion here in Maricopa County, Arizona. Coronavirus update. They're kind of talking about summer camps getting underway, not just like day camps, but overnight camps as well, including having students stay in bunks. So that's what we've been listening in on here. A lot of people excited for this afternoon's expected launch, an hour and 20 minutes away. Everyone's kind of keeping their toes and their fingers crossed, hoping that all systems will be go despite the weather out there. I'm going to take you out to the state of California, where they had an update earlier today about exactly how and when schools might reopen. So let's listen in.
I'm going to try to share the screen here. I'm going to ask our AV folks to share the screen so that it doesn't seem to be working on my end. So what I want to share with you is our data related to funding source for those individuals who've been hospitalized in the 5-county Austin MSA. And what this slide is showing you.
Set for about 30 minutes.
All right, everybody, that was the wrong video that played there. Here is the update out of California.
An answer to our partners in the media, which is via the Zoom chat, which I'm monitoring, and we will get to that at the end. So without further ado, it is my honor to introduce State Superintendent Tony Thurmond.
Thank you, Kendra. Thank you to our friends in the media and to Californians who are following us today as we have this conversation. Today, we intend to talk largely about the reopening of school in the fall. We also want to talk about it in the context of our work to close the digital divide. And clearly now more than ever, our students need to have access to devices, laptops, and pads, and have access to the internet. And so very pleased that today joining us from Verizon is Maggie Hallback, who will be talking about the commitment that Verizon has made in a very targeted way for the Los Angeles School District, which is our largest district. And that commitment literally will mean hundreds of thousands of students will be able to get access to both a device, a computing device, and a mobile hotspot in a way that is incredibly economical and needed. And so, Maggie, thank you. We're going to give you an opportunity to say a few words about that. We'll tell you a little bit about some other companies that have been helping, but we're also going to have a really frank conversation. We need a lot more companies to step up. And, I'm just going to put it in frank terms. We've got hundreds of thousands of students who do not have a computing device. And where we're headed in terms of getting our schools reopened, we absolutely are going to need California's companies to come and support California's kids. And so that's a little bit of what you can expect for today. I also want to share with you that the California Department of Education will be putting out some guidance on how school reopening will take place. I often refer to it as a guidebook. It is our attempt to do a kind of how-to and to help school districts answer questions that they have about how to reopen. I'll give you a few highlights of what you might expect when that guidance is ready. We anticipate that we'll be releasing that guidance formally in early June. And so I would say that within days and weeks, we're prepared to release that. But today, we'll share a few examples of what we expect to happen, and we'll take your questions about how this is all going. Just to kind of catch everybody up, as you know, our schools, all 6 million students, have been in distance learning since March. Again, want to commend our students and educators and family members for their resilience in these very difficult times. Our campuses have had to be closed to students in order to keep them safe, but education has continued. Sometimes there's bumps in distance learning. We know that. We've worked hard to work through those bumps. We literally provide at the Department of Education webinars every single week on how to do distance learning, how to serve students with disabilities, how to serve students who come from families where the English is not their first language, and we will continue to do that. If you do a snapshot of where we are, a point in time moment of where we are now, for many, our school districts are about to wrap up their school year. We're entering, we'll be in June in just a few days. And for the most part, many school districts are coming to a close. Congratulations again to our seniors in the class of 2020. Many of their counties are offering them the opportunity to have virtual graduation ceremonies, sometimes a parade, because we believe that we've got to celebrate the accomplishments of our students, even though their accomplishments have happened under the most difficult and unexpected of circumstances. And so congratulations to the class of 2020 everywhere in the state of California. You should be proud of your accomplishments, and we encourage you to continue pursuing post-secondary education. And we know that that can happen in California. So with schools ending their school year as we speak, that means that things shift to summertime. And so naturally, summer, like always, means that there'll be a little bit of break, an opportunity for some, fatigue. People have worked hard during distance learning. students and staff. And so there's an opportunity for a little bit of a break. It's also the opportunity to begin planning for when school's going to open. Again, just want to remind you that there's not going to be a common open for every single school in the district. We've got 10,000 schools. There is no one size fits all for our schools. And so local school districts and school boards make decisions about when schools open. What we do at the Department of Education is we try to guide our schools to help them be prepared for opening. So we pay attention and chart when schools plan to open. We get our guidance out as quickly as possible, but we've actually been talking with school districts about the guidance so that we can calibrate it with the work that they're doing, with the plans that they're making, and so that we also can address questions that they have. And so in the last week, we've literally met with 1,000 school district representatives. We held a web meeting last Thursday with representatives from more than 1,000 school districts. We followed that up with conversations with each of the county superintendents of education, who themselves organize the schools in their districts. And so we're having all those conversations. So summer means that there will be planning for the reopening of schools. You know, summer is also a time to address some enrichment opportunities. We know that there are learning gaps, and that's not a new thing. That's not unique to COVID-19. Even prior to COVID-19, our state and our country has been working to close learning gaps, achievement gaps and opportunity gaps. And yes, having the impacts of COVID-19 exacerbates those gaps, but we do work to address them. Many of you know I've named a task force of leaders to help us think through strategies for how to close those gaps. And I'm grateful to school districts who put together summer programming that is directly addressing it. And if I could give just one example, I had the chance to serve, to make a few remarks with the town hall for Val Verde Unified School District last night. Deeply impressed to hear that in Val Verde, they have built a summer program that is focused on addressing learning gaps. And the focus of that program is on literacy and reading, a very key approach to helping our students. Our students are always learning. And so even with gaps, we have to know our students are always learning. But again, kudos to Val Verde for really thinking through using literacy as a key way of addressing how we accelerate learning, even in times like COVID-19, and especially reading for students in grades kindergarten through third grade, a critical point in time for our students. And so that's where we are. Summertime, some time for planning, some time for some enrichment. Districts, as they are able, will be engaged in some enrichment programs. A few districts have said they may even start their school year just a little bit early, a few weeks early, as a way of giving students a chance to spend some time accelerating learning. But we do know that when school starts, no matter what a district does, we know that the things that have always happened will continue to happen. The best folks to do assessment about where a student enters are the classroom teachers. And I'm grateful to our teachers. We know that our teachers will assess our students where they're entering. And if they need some additional support and some intervention on how to be on grade level, we know that our teachers will provide that. We know that it's hard. There are a lot of questions and people have concerns about how distance learning goes and how much time someone gets in front of a computer or on a website. We want you to know that our teachers are incredible, and we know that they will continue to assess student need and help them to get on grade level. And we'll work with system leaders to think through all kinds of questions like, if there's going to be distance learning, how do we make sure that it's consistent across classes? That doesn't mean that everyone's going to be teaching the exact same subject in a class. It just means that we want to make sure our educators have access to standards and guidelines for how to make distance learning happen in the most appropriate way, that we give some training and some resources to our educators. And of course, we have to continue to address the digital divide. You're going to hear me talk about the digital divide multiple times today, because we're quite frankly putting out a call to California companies and foundations and individuals who can do more. I'm grateful to those companies that have helped. T-Mobile, it's been really helpful in their ability to provide hotspots, and the California Department of Education has been coordinating with companies like T-Mobile and Verizon and Amazon and others to essentially distribute more than 100,000 hotspots already throughout our state. 21,000 computing devices already to districts in need throughout our state. But of course, there's a gap in supply. And so there are more orders on the way, but we're waiting and we're pushing to move through that kind of backlog to get devices in the hands of students because they're going to need it. Here's a little bit about what you can expect when the Department of Education releases its guidance in early June. Much of it is stuff that we, are already hearing from the CDC and others about how do we keep students safe in school. Here are some of the things that we expect. We expect that when it comes to face coverings, that students and staff should be wearing a face covering at school. We expect that we're going to have to maintain physical distancing, social distancing at school. And so that means smaller class sizes at every school. That means smaller numbers of students on buses. We know that our best work to prevent the spread of infection is our preventative work. And so that means that at schools, there will be individuals who will be taking temperatures of students. And if we follow the lead of many of our childcare centers that are still open right now, that are working to take care of the children of our healthcare professionals and our first responders and essential workers. And I just want to give a shout out to healthcare workers and to essential workers and first responders and the childcare staff that are taking care of their students and doing such a great job and have found ways to do that without an increase in any infection. I want to give them all a shout out, and we ought to take a page out of their book to know that a big part of what we do means taking temperatures at school, and in some cases asking parents to take the temperature of their children before they leave home. And so that if a young person is not well, that those are issues that will be addressed. I want to talk a little bit about what many schools are calling a hybrid model of instruction or a blended model of instruction. The reality is that many of our school districts have surveyed parents, and parents are asking, some parents are asking for distance learning. Other parents are saying, hey, I've got to get back to work. And so I appreciate that you're getting ready to give me the in-class instruction. And so we expect that there will be a balance of instruction between distance learning and in-class instruction. And we actually think that that balance is going to be helpful to many in our state. The more distance learning we're doing, that means that we can have fewer students on campus, and that means we can have smaller class sizes, which is going to be important. We know that space can be tough, and we're going to have to use every part of the campus to make sure that we have 6 feet of distance when students are sitting in a desk, 6 feet of distance, however they're taking their lunch, 6 feet of distance on a school bus. We know that we need these things, and distance learning is a great way to help us get there. Now, in order for us to really strengthen distance learning, again, we have to have those devices. And I'm just going to give you the straight up facts. These are numbers that may be hard to hear, but they are the truth. And the reality is that we've had a digital divide in this state, in this country for far too long, for decades, long before COVID-19. And I think that COVID-19 has exposed us and our vulnerabilities as a state and as a nation, and the need for us to do more to close the digital divide. And so we've taken it upon ourselves at the California Department of Education to say that we're going to help provide an educational response to COVID for our students that envisions their needs for technology, but that we're going for the moonshot. We want to go beyond just responding to the needs as it relates to COVID-19. We feel that this gives us a sense of urgency and a sense of motivation to move, to say that once and for all, we will close the digital divide. We're drawing a line in the sand, and we're saying we've got to close that digital divide. And we're saying we need help from everyone to make that happen. We need help from California companies. We need help from foundations. We need help from individuals who can help. And as I point out to you, that right now we know immediately some 600,000 students are waiting for a computing device. And 300,000 to 400,000 students have an immediate need for an internet hotspot. And so by my math, that means that California needs at least $500 million to help us address the immediate needs of our students who need access to a computing device, who need access to a mobile hotspot. And so if you heard nothing else from me today, I hope that you will hear a renewed call to action from those who will help our students to get the devices that they need. I'd like to give thanks to the governor and the first partner and the State Board President of Education, Linda Darling Hammond, and our staff at the Department of Education, who've been doing great work to secure commitments from foundations and individuals and from companies. I'd like to thank the many companies that have made contributions directly of supply and equipment, and others who've made financial contributions that allow us to purchase those computing devices. But there's no other way to say it other than the fact that more is needed. You know, $500 million is really the minimum number. And if you think about it, you can think about it as a whole, or you can just break it down into small parts, is what I like to think about. That means that 100 companies that make a commitment of at least $5 million to help our students have the success that they need. We can get there in any different way, but we're talking about a minimum of $500 million, and we're putting out a call to companies that will help. Now, companies can help in different ways. Some companies have chosen to give in specific cities or regions that are important to them, like Verizon. And you're going to hear a little bit about Verizon in just a moment. And we're grateful that Verizon has chosen to focus in the area that is important to them, Los Angeles Unified, but they're also saying they'll work with any district with the offerings that they have. So thank you for that, Verizon. I want to call out the founder of Twitter, who has made a commitment to support the Oakland Unified School District, and a shout out to Mayor Libby Schaaf, who's put a call out to those who either do business or want to be partners in the city of Oakland and to the Oakland Unified School District. And a shout out to all the great educators in Oakland Unified who have been saying all along, we need more devices to support our students. And so I you know, as I lift up Oakland and the mayor and Twitter, I want to say that that Twitter and Verizon have given us another way that companies can get involved. And if you choose to make your commitment in a way that's specific to a region that you're working in or you want to work in or is important to you, we can work with any configuration. We know that our mayors of our largest cities, San Francisco, London Breed, and mayors in San Jose and other cities, Stockton and so many places, we've heard from our mayors who are doing all that they can to bring their business leaders together to support the needs of our students. We can work with you. We just need to have the commitment from the companies to say that these are all of our California kids, and we're going to do everything that we need to do to help them. And so this is a high-level overview of where we are as we approach the reopening of school in August and September. We have to now sprint forward to those openings, and that means making sure that we get commitments to provide those devices. And so companies know that we're already reaching out to you today through this press conference. We're reaching out to you through letters. We're reaching out to you through calls. But we'd like you to call us too. And so anyone who hears my voice and hears my message, we're putting a call out to you to do what Verizon has done, to do what Twitter has done, to do what T-Mobile has done, to do what Amazon has done, to do what Google has done, to come forward and make an offer and to make a commitment that supports the students in California. We absolutely know that COVID-19 has had a devastating effect on the economy in California and in our nation. And right now, our California legislature is working with our governor to try to come up with a budget and fashion a budget that allows us to address all the additional needs that we're going to need. You know, that we're going to need more face coverings. We're going to need more cleaning supplies. We're going to need personal protective equipment. We know that our schools need support, and they cannot do this without cuts to the budget. And so that means we need other partners to step up, none more important than the federal government. And I want to thank Speaker Pelosi and the members of the California delegation who have been leading the call to say that the federal government has to help our schools, has to help our states, has to help our cities and school districts, our local municipalities, all need support. No one could have envisioned a scenario like COVID-19 and its impacts. And the reality is that the economy has been deeply impacted by COVID-19. And so that means we need the help from the federal government. And I invite all those who are, watching this broadcast, hearing this message, to reach out to those in the federal government. I know that many in the Senate have said that they won't support, a federal stimulus package, but it's needed. It is greatly needed. And again, I'm grateful to our California delegation, Speaker Pelosi, who's joined our calls to talk about the importance of connectivity. Thank you for joining our calls, because we believe that internet connectivity needs to flow like electricity. And even beyond corporate donations, we're going to need revenue to build infrastructure in rural communities that have been without the infrastructure for internet connectivity for far too long. I'm grateful to the legislators who've joined me on our task force for closing the digital divide, co-chaired by Senator Connie Leyva. I'm going to call out those legislators because they represent areas that have been hardest hit by the lack of connectivity, and they're doing something about it. Senator Mike McGuire, Assemblymember Jim Wood, Assemblymember Cecilia Aguiar Curry, Assemblymember Eduardo Garcia, Assemblymember Miguel Santiago, Assemblymember Autumn Burke. I am grateful to you for working with us. I'm grateful for the internet service providers who are working with us. I know that sometimes we've pushed you in a hard way, but you're stepping up, and we appreciate that our internet service providers are really delivering a message that they will provide free internet to those who don't have it, that they have plans for low-cost internet, and I'm going to give them a shout out too, because they're stepping up. But don't think we're not going to ask you to do more. We need to make sure that we get to connectivity for all of those that we serve. And I want to thank all of our internet service providers for what you do. We're going to continue to ask for your help. And in a minute, you're going to hear from Margaret, who's going to talk to us about what Verizon is doing. And I'm going to get my notes together, and my team's going to give me a little note on all the companies so I don't miss any of the internet service providers. But we're going to make sure that we give you a quick shout out on the work that you are doing. So if you hear nothing else, know that as we approach the opening of school, closing the digital divide is more important than ever, and we need support. We need support from our federal government. We need you to come through. We've been in touch with the federal government, even about meals. In California, we provide meals across 5,000 different sites. I want to thank all of our schools for doing this, our classified staff who are delivering those meals. I want to thank them all. I'm going to mention a few groups who are helping and ask my team to just send me the quick note of the different internet service providers that I want to shout out. But I want to make sure that everybody understands that we've got a coming together of so many sectors who are helping us. 5,000 sites where meals are provided, classified staff who are delivering those meals and providing those meals, many volunteers who are also supplementing that. Thank you for what you are doing for California kids. We know that food insecurity is greater than we've ever seen. And for those reasons, my team and I have been in direct conversation with the leadership at the U.S. Department of Agriculture to say that we need more flexibility in the revenue that has been allocated by Congress to enable us to be able.
All right, everybody, Pilar Arias hopping in here just to let you know that Mike Page has launched a second SpaceX launch stream specifically for the launch. So if you want to hear and see all things launch related, there is a second stream. Mike is manning it now. Christy might be manning it later, maybe me as well. Depends on how long all the action continues. But again, coronavirus related news is going to be here on this stream. If you want all the launch action, we've got another stream dedicated just to that. You can find it by going to youtube.com/Fox10Phoenix, where you can find that stream. Meanwhile, we are taking a live look at the President and First Lady getting a tour in Florida ahead of the launch while listening to the latest about California schools reopening on the right-hand side.
And then if there are ways that other parts of the state can benefit, we want you to talk about that too. I'm turning it over to you, Margaret, and then I'll take it up after you're done.
Thank you, Superintendent Thurmond. I really appreciate your time today, and Verizon could not be more excited about what we really see as a groundbreaking structure. We are very thankful to you, Superintendent Thurmond. We are also very thankful to LAUSD Superintendent Bootner. In mid-March, Verizon immediately saw that distance learning was going to become the new normal for a period of time. Little did we know how extensive it was going to end up being. We had an opportunity to partner with Los Angeles Unified to address a very significant digital divide problem in providing internet service at home for these students that were thrown immediately into a distance learning situation. On March 23rd, Verizon and LAUSD executed an agreement that provided 120,000 students with free internet service. And then we received outreach from the first partner to assist in answering the governor's call to action. And we stepped up and expanded our offering in response to Governor Newsom's call to action. And we expanded that, committing another 250,000 lines. But what we were able to then do, again, with LAUSD's thought leadership, as well as Superintendent Thurmond, your thought leadership, we were able to execute an agreement between Verizon and Los Angeles Unified School District to extend that agreement to every state of California school district. And so this no longer is just a Verizon and Los Angeles Unified School District relationship. We have now been able to provide a structure and a simple process for every single school district in the state of California to take advantage of this Verizon, State of California, Department of Education, and Los Angeles Unified School District relationship. And so we would ask that if there are school districts that are listening and they are interested in finding out more about how to take advantage of this incredible service and solution to bridge the digital divide in the state of California, we would ask that they reach out to their account team, or they can contact Verizon at 855-343-7283. Verizon wants to thank the teachers who are really doing some incredible work right now. Verizon also wants to thank the students for their resiliency. They will look back on this time with an incredible storytelling capability of where were they and how did they react and respond. And then I would also like to thank the Superintendent Thurman, as well as Superintendent Bootner, as well as the first partner, Jennifer, and Governor Newsom. It is incredible, the thought leadership that the state of California is exhibiting. And Verizon is really, really proud to be able to support the state of California's mission. And we are here to continue partnering with the state of California to bridge the digital divide. Thank you, Superintendent Thurman.
Maggie, thank you, and thanks Verizon for that incredible offer. I appreciate you putting out a phone number where people can call if they want to be able to get involved and get help, because there's nothing worse than hearing about something and then there might be barriers to how to access it. So thank you for making it barrier-free and accessible and easy for folks. And so this is fantastic. We are excited to work with you. And I want to give a shout out to you and others who've worked with our task force on closing the digital divide. I know we're pushing you all the time, but you continue to come back to the table and you deserve to be acknowledged for that. Here's the list and we'll share it because each of these companies has internet service offerings that are in some cases free, in other cases very, very low cost and discounted to support low-income families. And no one needs to give a social security number or your personal financial history. All we want you to do is say you have the need and get what you need. Comcast, Cox Communications, Charter Spectrum, AT&T, Sprint, of course, Verizon, and T-Mobile. If I've forgotten anybody, my apologies, but it's important for us to acknowledge these internet service providers. Yes, we have more we're going to be asking of you. We've made the ask that you provide free internet to any student in the state who does not have it. And we appreciate your yes on that. I need to acknowledge the state of California for making money available for computing devices and to promote internet connectivity. The California Public Utilities Commission, through the work with the governor and the Department of Finance and our staff at the Department of Education have been very creative in allocating $25 million to help school districts access connectivity. And so we know that there are just so many who have made commitments, Lenovo and Microsoft. We're going to be shouting out companies every single week because we think that the good news needs to be told. And we hope that we are flooded with opportunities to shout you out. This is your opportunity to step up. You can do it in any way you want. You all know how to reach me. You can call my cell. You can Facebook message me. We've established a designated email way that you can reach us at donatech@cde.ca.gov. And so we're going to segue to taking some questions in a moment. They've been coming in. You've probably heard my phone is just, beeping and dinging, and the messages are coming in as people are asking. And we're going to take some questions here from our colleagues in the media. But we do want you to know that every school district is writing some plan for how they intend to open. We don't favor any plan over the other. We actually share what is being worked on. Someone had asked about Los Angeles Unified School District's plan, and we're happy to work with them. And Superintendent Buettner, thank you for what you're doing. And Superintendent Cindy Martin in San Diego, I know that she's really helped us to think through a number of our ideas, and she shared what she's doing and figured out a way to make sure that all the students in her district have access to a computing device that they can use at home. There's so many superintendents, and I'm grateful. I'm grateful to the Superintendent's Advisory Council. I'm grateful to our task force on reopening that includes organizations in labor and management, all working together. I'm grateful for the focus group that we're going to have later this week, largely supported by the California Teachers Association and by the California Federation of Teachers and our staff at CDE. This focus group will give us a chance to hear from teachers in their own voice, the things that are going to be important to how their classes are set up when we reopen with physical distancing requirements and conditions in place. And so we'll take some questions to the communications department at CDE. If we have some questions, now would be a good time for us to take some questions. I'm going to turn it over to you so you can queue up some questions that we can answer for the media.
All right, Superintendent, this is Kendra Britt here. I have a question. It says, what kind of specific cooperation is CDE getting from the ISPs on its digital divide task force to help districts provide free internet for all students where infrastructure already exists in urban areas such as Oakland? For example, with the example we learned about today with Verizon and LA Unified, is this something that Comcast could possibly do in Oakland?
Thanks for the question. The question's about what kind of cooperation do we get from the internet service providers, and specifically the question was, can Comcast provide what Verizon has provided, and can Comcast do that in Oakland? I'll say what I know, and then Comcast, we'd like you to speak to what you're able to do. But I can tell you that Comcast has a low-cost internet package that they provide that allows families to get internet and to be able to receive at a very low cost, well below market cost, a laptop computer to use. Many, if not all, of the internet service providers are providing this, and they are now working with us to see how they can make their connection to manufacturers benefit Californians, meaning they have relationships that can get very low cost laptops into the hands of our students and their families. I'm going to be asking my staff at the Department of Education to get calendared and prioritize a meeting that is focused just on this question. How do we get those devices that internet service providers can get at very, very low cost? How do we get those out in a broad way in the community? And so I would say that the internet service providers have been cooperative. At times, the conversations have been tough. We've just been direct. And my sense is that the internet service providers are doing more. They've accepted our offer to provide our invitation to provide free internet to those who don't have it. We've asked them to also work through any barriers that people experience when they're trying to access the low-cost internet offerings. And sometimes there's some barriers. These are big companies. And so sometimes the directive might start at the leadership of the company, and it might be that there might be some folks in the company who haven't quite gotten the message and gotten the memo. I have to say, the internet service providers have been quite responsive in taking that feedback that we give them and then making sure that those barriers get removed. Matter of fact, each of these companies has assigned a liaison, so we have someone else to call when there's a problem, because we don't want people getting stuck in a feedback loop or calling on the phone and they can't get anybody. And so I would have to say that our internet service providers have been responsive. And while we've had tough conversations, they've been good partners, but we're going to keep asking more because we know that there are many places in the state that, quite frankly, the internet service providers just haven't invested in the infrastructure for them to have internet. And so I'm not going to dwell on the past, but I'm going to make it an expectation that we have them and us work more now going forward to change that and to make a new reality for Californians. Is there another question?
Yes, piggybacking a little bit on what you just said, we had a question asking about a brief update on the Digital Divide Task Force and maybe just some insight into the next steps and what you might be working on.
You know, as we talk about the Digital Divide Task Force, we focus all the time on how do we build a plan that allows us to close the digital divide once and for all. That plan has to be able to think about our current needs. It also has to be able to think about our future needs. And so at some point, we're going to be able to say that we've been able to get computing devices to our students in California and mobile hotspots. But we're also going to need to be able to say how we look forward. Every time a new student enters our school system in preschool or kindergarten, that's another student who needs to have a device. And so our planning has to envision our current needs and our future needs. And the task force is focused squarely on that. I want to thank the legislators on the task force who are literally writing the plan to help us to close the digital divide. And anybody can help. We welcome your help. We just always say that we don't do meetings just for the sake of doing meetings. Some people think that the word task force means nothing's going to get done. Each and every one of our task force has a hard timeline for a deliverable that has to happen. Our task force on reopening schools has a deliverable to provide a guidebook that we're going to provide in early June. And every week we've been providing updates on what that task force does. Our task force on closing the digital divide has already made progress on expanding internet accessibility for many low-income families and those who need it. But we are not done yet. We're not resting on our laurels. We got some work to do, and we're not going to stop until we cross the finish line. So stay tuned for updates on the Digital Divide Task Force. It is focused on how we can get companies to help us get to that $500 million that we need minimum for supplies and equipment. I say minimum because that number is even bigger when you think about the infrastructure that we need in the state so that rural communities can have access to internet. And we're going to keep working on that. The task force is driving us to progress, and we're going to continue to work on it, and we'll continue to give updates as our work comes about.
Great, and just a reminder to those interested as well, all of our previous hearings are recorded and available in the archive video on the Facebook page. Last question, Superintendent, is you mentioned earlier that the reopening guidance that CDE is issuing will be coming out soon. Is there anything that you might be able to tell us about it? Give us some, what schools might expect, and maybe a little bit of insight as to whom you have consulted with as you've been developing this.
Thank you. Our task force on reopening schools is heavily focused on getting input from practitioners. You heard me mention that we've done focus groups. We're doing focus group with teachers. Last week, we did a virtual support circle with students. Our students have given us incredible ideas. We've done support circles with parents and educators, but our task force is very driven by educators who represent labor perspectives and management perspectives, teachers, superintendents, principals, classified staff, everyone working together to deliver a message on how it is that our schools will safely reopen. And so we've consulted everyone. As I mentioned, we've done a web call where we invited all 1,000 of our school districts to participate. You can imagine how hard it is to have a conversation with 1,000 organizations represented on one web call. But I want to thank our superintendents from the 1,000 districts for what they've done. They participated. They sent us their questions in advance so that we can give them answers on that web call, and to make sure that we incorporate their answers in our guidance. Again, want to thank our county superintendents as well, who have given us direct guidance on their experience and what they're hearing from the individual school districts in each of their 58 county areas. And so we've really consulted all of the educational practitioners. We've also consulted health and science and health and safety experts, because we don't think this can be done unless we address health and safety needs in our schools. And so for those reasons, we're grateful to our partnership in the governor's office and many of the cabinet secretaries, and our direct work with the Health and Human Services Agency, and our direct work with Cal OSHA, the division that provides occupational and safety health information for workplaces. And they've continued to give us input and technical assistance. All of our guidance will be informed by health experts and by education practitioners. So many to thank: the California Teachers Association, California Federation of Teachers, California School Employees Association, who's our classified employees, SEIU and ASME, who also have a number of classified employees, the Labor Federation, our Association of School Administrators, CSESA, our County Superintendent's Organization, the Association of Small Counties, to get the perspective of small and rural and frontier counties. A group called CASBO, our chief business officials who've given us information. Our California School Boards Association, who are giving us insights and thoughts that we need to be thinking about. So many associations coming together, co-chairing all the committees and the breakout groups that are part of our task force. Again, expect for our guidance to be released in early June. I would put it at days and really days and weeks, but I think closer to days away from a release. We want to make sure that we get it right. We pull all these groups in so that we can calibrate the information that we're.
All right, everybody, there's only a couple minutes left on this California schools reopening update, literally 2 minutes and 40 seconds. I'm going to take you out to the House floor live here on News Now. You know there's going to be some coronavirus-related comments from the congressmen and women.
So the Senate did, in fact, take up the bill. And what did they do? Two people who spoke, Mr. Burgess and Mr. Woodall, who voted with the majority, with the 2/3 of Republicans, who said this is a good bill. This is a good bill for our country, for America's security and America's safety. As did Mr. McCarthy. As did Mr. Scalise. As did Mr. Thornberry, the ranking member of the Armed Services Committee. As did Mr. Rogers, the ranking member on the Homeland Security Committee. As did Ms. Cheney, your conference chair. As did Mr. Cole, the chairman of the Rules Committee, ranking member. Amen. And 120 other Republicans. Now, there were, of course, as is not surprising, differences. This is, as the Speaker has said, a very controversial bill. It always is a controversial bill. My friend, Mr. McGovern, and I, who vote together almost all the time, are going to vote differently on this bill. I'm going to vote for it. He believes there are not enough protections in here. But there are more protections in here than when those named voted for it. And 80 members of the United States Senate voted for it. 48 Republicans. 48 Republicans. Now, what was different when they voted upon it and 48 Republicans of the United States Senate voted for it? There had not been a snap of the fingers, vote no. Not an order from on high, vote no. Not a president who has been beating the drum, and frankly, his supporters have been beating the drum that somehow the law enforcement community, the FBI, the CIA, the other this and that and the other law enforcement agencies broke the Constitution. This president shows less respect for law enforcement than any president I've seen at the federal level. So he said, vote no. My friend, with whom I work, the majority leader, called me the other night and said, you ought to pull the bill. The minority leader. I keep wanting to make us, you know why I do that? Because we were all in the majority when we passed this bill. It wasn't a majority-minority bill. It was an American bill. My friend, the minority leader, said, pull this bill. I won't go into the rest of the conversation because we have private conversations about where we're going to go and what we need to do. But the only thing that has changed, Madam Speaker, is that Donald Trump has said, vote no, to 126 people who voted with 152 Democrats for America. And by the way, the people who are voting no also voted for America. They voted for civil liberties, which we honor. And we could respect every person who voted because they voted out of conviction, not of party loyalty, not of a, yes, sir. They voted their conscience. They voted their conviction. I wish this chamber were full, but we have to be distanced. I hope some of my colleagues are listening on both sides of the aisle. This bill is like every bill, not perfect. But as the Speaker said, it must pass. Why? To protect America. And we need to continue to keep making it better. My friend from Massachusetts will make sure that we focus on that. And I honor him for it. So I ask my friends, vote your convictions. Remember how critical you were of a candidate for president who said, I first voted for it and then I voted against it. How critical you were. But you're flailing around to find a rationalization for your change of vote is sad. Vote yes. On the rule, on the bill, vote for your country. I yield back.
Members are directed to direct their remarks to the chair. Gentleman from Georgia.
I thank you for that admonition, Madam Chair. There's only one person on our side of the aisle who can clear up all of that confusion in 1 minute. And I'd like to yield that 1 minute to our leader, the gentleman from California, Mr. McCarthy.
Distinguished minority leaders recognized for 1 minute.
I thank the gentleman for yielding, and I thank the majority leader for his comments. It reminds me back to the days when I was majority leader and he was minority whip, and we used to be able to have colloquies. I yearn for those days again. But let me respond to much what you have said. I respect you greatly, but I just think you're wrong. When I walked in the room, you said we did not want to meet. You know that's not true. Simply look at the board today. How many Republicans are here and how many Democrats? We'll give you an easy answer to that question of who wants to meet. Or why don't you look just simply a month ago? Only one side put a plan out of how to bring Congress back. We don't have a schedule. We don't know when we're supposed to come. One day you say yes, the next day you say no. I think it's very clear what side wants to meet. It's very clear based upon 231 years of history. For those members not in the chamber and sitting in their office watching on television, you ought to pay attention to this very next vote. You're going to do something that no member has ever allowed to do before. You're going to change history, not for the better. While millions of Americans are going to be tuned to their television to watch us put people in space, you're going to watch more than 70 members on the Democrat side stay home and say they could not make it, but they still want a paycheck. And you just listen to the majority leader question the Republicans of whether they want to meet. I watched my own state of California. Now we get to go to church. Now we get our haircut today. But in Congress, what do you get? You get no accountability. You see, the one thing the majority leader said is true, that people vote for us. Yes, they do. They vote for us expecting us to vote for them. They do not expect you to give that vote to somebody from another state. Our Constitution, our country expects us to convene, just as history has shown every time before in any crisis we have. I heard the majority leader question, not going through the speaker, but one of our own members, on a speech that he gave just a few minutes before, Congressman Chip Roy, about whether he wanted to meet. Well, let's look at some facts. You are called back here to vote on a bill authored by Chip Roy, the congressman, to help small businesses, but his name will no longer be on it. And the only reason we're going to get a vote on it because the speaker had to pledge to somebody to vote for the $3 trillion bill that we'd vote on it. And once we found out everybody loved the bill, lo and behold, we can't let a Republican have the name on the bill. So we changed the bill number, didn't change the bill, but took his name off. He's no longer the main author of the bill, even though it was his idea. Something you could be very proud of on the other side. You played politics well that day. Chip Roy will tell me, though, he doesn't care who gets the credit. He just wants to help the small business. I look forward to the member who took his name and tried to campaign on that. That's a lot of character on your side, by far. I hope you're proud of that, because I don't think anybody in the country is. Now let's just look at some facts. I respect the chairman of the Rules Committee. I read his reports, and even in April he wrote a report about proxy voting, and he questioned the constitutionality of it. I don't know if the Constitution changed between then, but I don't believe it has. But let's look exactly at the facts of what you have. Now, I think many of you will say in your own states, things are getting better. I know in my home state, we can go to church. Yes, we can get our hair cut. Restaurants are opening up. But 2 weeks ago, you'd probably argue it was a little worse. At that time, only 12 Democrats couldn't make it here to vote for their $3 trillion bill. Now there are more than 70 that are supposedly signing something to say they physically can't make it here now. I wonder if any of them are having a fundraiser today. Let's go through the facts. The Constitution requires in-person assembly. If you hang your hat on the House can make their own rules, then why don't you make a rule that Republicans can't vote? Why don't you make a rule that women can't vote? You can make the rules, but you can't make unconstitutional rules. The Constitution deals with this and tells us we should assemble. Yes, that's why August 14th, after this building burned in 1812, the War of 1812 and 1814, they still convened. It wasn't here, but it was in a hotel. But you think, oh, modern history allows us to do this. Well, you know what your modern history allows people to do? If the member can't vote on the proxy, you allow the staff to do it. That's literally what your rule says. If you don't have it, I'll put it in record right here. It states, I'll underline it, and I'll provide it to you. If you want to read it out loud, you're more than welcome. If a member cannot provide electronically, a staff is allowed to put the vote across. That's what you wrote, that's what you passed. Even one proxy vote dilutes the voting power of every member. We have an unbelievable country that people lend their power and voice to members of Congress, be you a congresswoman or congressman, and hold you accountable every 2 years. You're going to have people on this floor voting for more than 5 members from 5 different states. In California alone, your largest delegation, more than half of the Democrats stayed home. I'll guarantee you they all cashed their check this month. That means 19 million people in California will not have their voice heard. Maybe somebody from Connecticut will vote for him. More than 70 members will vote by proxy. That's 49 million Americans who did not count because you gave it to somebody else. But you should be proud of that. Proxy votes have never been allowed to count towards quorum. But what are you going to do on this rule? There will be more bodies voting no than voting yes, but you're going to win because you got a vote in a pocket. The Democrat plan permits a staffer to vote by proxy on behalf of a member who is unavailable. That is totally true. It's in the rules right here, and I'll provide it to you. A member, let me read it to you since you have a hard time reading. If a member is unavailable to email or send a text message, a staff member may transmit the instructions at the direction of the member. Is that a staff member? Does that say anywhere in there that only a member can vote? I have not yielded my time, but I read your words. A member can vote by proxy while attending a political fundraiser under this plan. A member could be at a fundraiser watching on television and said, well, let me pause for one moment. I didn't want to go back to D.C. even though you asked me to, but I need to put my vote in. It's okay, I'll give somebody from another state to do it. The McGovern regulations state that members can only vote using proxy voting if they are physically unable to make it to the Capitol. I don't know what happened in the last 2 weeks when only 12 could not make it, but now more than 70. I'm concerned for them. Must be something very serious. All members had nearly 2 weeks' notice ahead for this vote. 2 weeks you had to plan. For 231 years, members found a way to get to D.C. If this rule or bill passes, it'll only be because of proxy votes will make up the difference. So if my friend over there thinks someone is going to vote differently, yeah, they are. Even on the Senate side, they've told you, whatever you pass in here under these rules are not constitutional. If you can make this type of rule, you can make anything. People with glasses can't vote. Unheard of. Yes, we raised a lawsuit. Yes, we believe in a previous question that people should vote no on this. It's a violation of the Constitution. It's a dereliction of a duty of elected officials. It will silence the voice of people, the same constituents that you took the oath to represent. I think of all the things this country had challenges with. Never did this body not find it was essential to meet. Never did they question to change the rule to empower one over another. But they have done just that. They have done just that. If you are a member of Congress, if you are home sitting there because you cannot make it, and you think you're going to send your message to your staff or to send it in, you might want to change, because maybe McGovern will change the rules now. When you were sworn in, you upheld your hand to uphold the Constitution. This is your moment. This is your time. Read Article 1, Section 4, Section 5, and Section 6. We even compel people to go gather you to bring you to these chambers. What's interesting to me is that the other side is willing to endanger our Constitution just to empower more power to the majority itself. It'll be interesting to see those who go back to their constituents and say, I will represent you because I can just phone it in. I deserve to be reelected because I passed that off to another member to vote for you. It's interesting to find that maybe when you raised your hand, maybe when you thought the Constitution changed, it hasn't. So yes, just as the majority leader said, he wants you to look into your heart to how you're going to vote. Do that. I hope we all come back to this floor and we all look up. I'm not sure how the vote will go. Will you have a little P by the name that says a proxy? Will we be able to tell by a proxy that somebody from another state voted for you so the rest of the country can see? How will you tell the country today that's opening up more, that's sending astronauts to the space, that you want to close Congress further and you want to deny their voice one last time? This is not about opening a campus. This is about restoring the voice to the American public that we have done for 231 years. And for you to ever question who wants to meet, let the public just see the scoreboard at the end of the day. I think it's easy to answer that question, not by voice, but simply by your feet, who's willing to show and who's willing to work for them. I yield back.
According to the rules, members shall address their remarks to the chair, and the chair will strongly admonish all members to do so. Gentleman from Massachusetts.
Madam Speaker, I've been here for a while now, and I've never quite heard anything like that. I mean, blatant mischaracterization of what the facts are. The gentleman suggested not once but several times that the rules allow staff members to vote for other members in this chamber. That is just not true. I mean, no matter how you want to look at it, it is just not true. But the gentleman repeated that falsehood over and over and over and over again. I asked him to yield so I could read the end of the sentence that he didn't want to finish, which is, and that member must confirm the instruction by telephone to the member serving as proxy before the vote may be cast on their behalf. The gentleman knows that that's not true, but yet here we come to the floor and he repeats over and over again something that in the written instructions and the guidelines that he was referring to says the opposite. I mean, are things that broken here that we cannot even agree on the basic facts? I get it. If you don't like what we're doing here, that's fine. But I mean, let's not misinterpret and twist and distort what we are trying to do here. Yeah, the gentleman, had a plan. We actually, we delayed moving forward on trying to change the rules to operate remotely because the gentleman said that he was willing to work with us to try to figure out whether we could come to some sort of accommodation. And you know what his plan was? His plan was we all come back and all the members in this chamber get prioritized over all of our constituents, and we get tested every time we come back so that we can operate here safely. So my doctors and my nurses and my first responders and those who work in our grocery stores and those who work in homeless shelters and in food pantries who can't get tested, we're all so special, according to the minority leader, that we should be prioritized and go to the top of the list. And that was part of his plan. Forget about it. I don't know about your constituents, but my constituents would find that totally unacceptable, and it represents a tone deafness that I haven't heard in a long time here. When he talks about no accountability in this process, I don't even know what the hell he's talking about. I really don't. And again, the idea that somehow staff can vote for members, that's just absolutely not true. Absolutely not true. I don't even know how to respond to what the gentleman just said. It makes you understand why so many people are cynical when they look at this chamber and they see the exchanges that go on here. I get it. We have disagreements on issues. We have disagreements on, whether we should move forward with Pfizer or not. I have disagreements with my own leadership on that. Those are honest disagreements, but they're based on conviction. They're based on fact. You can disagree whether or not we should be able to operate remotely during extraordinary times like pandemics. I get it. We can argue about the constitutionality. I think we are on strong constitutional grounds. You can argue the opposite point of view. But to make things up, to come down here and to twist what we have done here, it's just unacceptable. It is unacceptable. We all ought to be better than that. We're trying to figure out a way to operate during a very difficult time in our country, where probably today over 100,000 people will have lost their lives. And notwithstanding the President of the United States trying to downplay that and say, no big deal, it's not much of anything, it is a big deal. I've lost valued members of my community to this disease, and I know you have as well. So we're trying to get through this, and hopefully this is short-lived, and hopefully we can get back to business as normal as quickly as possible. But if this comes back in the fall, we need to be prepared. And so, under this proposal, if you want to be here, you can come here and you can operate in person. But as we're all finding out, that's difficult, even in committee hearings. Rules Committee is the smallest committee in the House, and we can't even meet in the Rules Committee. We're meeting in the Ways and Means Committee room or the Transportation Committee room, which is amongst the biggest committee rooms in the chamber, because we're all trying to follow the advice of the attending physician. So come on, we can debate whether this is the best way to move forward or not. That's fine. But let's not make things up. With that, I reserve my time.
Gentleman from Georgia.
Thank you, Madam Speaker. I'd ask my friend from Massachusetts if he has any speakers remaining.
Amit.
Well, I'm prepared to close if he is. Madam Speaker, I yield myself the balance of the time.
Gentleman's recognized.
Thank you, Madam Speaker. Madam Speaker, you've heard the thundering defense of the constitutionality of a constitutionally questionable proxy voting procedure. That's what our motion is in the previous question. My friend from Massachusetts is absolutely certain that every constitutional scholar in the land is on board and believes it's absolutely fine, which is good news for those of us who want the district court to decide, because the constitutionality can be sorted out in the courts in no time flat. If it's this settled of a question, we're saying just give it a couple of days, let the court have an opinion, let's go ahead and sort this out. If it's a non-justiciable issue, then we'll learn that. If it's so clear that it's okay, why won't we allow time for the court to take a look? My friend from Massachusetts says we've had this debate and the House has spoken. That's undeniably true. Now, to be fair, it's spoken a bipartisan way against this, in a partisan way in favor of proxy voting, in a bipartisan way against proxy voting. Yes, the House has spoken, and in a bipartisan way, we have serious concerns that we'd like to be addressed. If we defeat the previous question, they will be. It's not going to slow down the underlying bill. It's not going to slow down any other important issues on the House floor today. Simply delays proxy voting that has never before happened in this chamber until the courts rule on its constitutionality. Madam Speaker, the underlying provision is an extension of our Foreign Intelligence Surveillance Act measures. This is something, as the majority leader said, that we've done in a bipartisan way, time and time again. I've been a part of that bipartisan coalition. Today, we have a Senate bill in front of us and a bipartisan House amendment that improves that bill. What you didn't hear from the majority leader, what you didn't hear from the Speaker, is that the Rules Committee did not allow that bipartisan amendment, and we now have a take it or leave it from the United States Senate piece of legislation. I get it, that happens to us sometimes, but it doesn't have to happen to us today. We have a bipartisan option, a bipartisan choice. We collectively, if we pass this rule, will choose to ignore that opportunity. An opportunity that in a bipartisan way we agree both protects national security and protects civil liberties better than the underlying bill. Madam Speaker, I don't know how many of my colleagues decided to show up for the vote today. We'll soon find out. Each one who's voting by proxy is going to have to go through you and the member they've designated. The two issues before us are serious issues, and they are threatened by the underlying constitutional issue of the manner in which we'll vote, as will every single vote we take until this measure is litigated. Let's litigate first. Let's not throw all of this important work into question. If my friend from Massachusetts is right and it's crystal clear legally, we'll find out in no time flat. But if my friend from Massachusetts is wrong, then we'll prevent the next round of litigation that calls into question every single bill this House acts on between now and then. I want to close, Madam Speaker, by saying I don't question my friend from Massachusetts' love of this institution or his understanding and knowledge of the Constitution. He's in a tough spot as the Rules Committee chairman. We have a crisis in front of us. It was his job to move something forward. The report he wrote earlier this year reflected his wisdom. The measure this House passed reflected his wisdom. He's got a very difficult job, and that's why you hear the very passionate defense he's making of what will become known as the McGovern language. But let it not be said by any member of this chamber that his intent is anything other than serving this country and serving this House. He is in a very difficult spot, but I know that his heart and his intellect are 100% with the people of this country and in service to this institution. I regret that we're on different sides of this particular issue. Vote no on the previous question, defeat it, add this litigation time out. If we can't do that, then I need you to defeat the rule, colleagues. Defeat the rule, and let's take a better bite at this decision with the bipartisan amendments that we have before us. With that, Madam Speaker, I yield back.
Gentleman yields back. Gentleman from Massachusetts.
Thank you, Madam Speaker. And let me thank my colleague from Georgia, Mr. Woodall. You know, he is, this is his last term, and believe it or not, I'm going to miss him. He's a spirited debater. But what I want to say, and I say this sincerely, I appreciate his advocacy for his point of view. I usually disagree with it, but I know it's based on principle and conviction, and he sticks to the facts. He doesn't come to the floor and make things up. He actually sticks to the facts, and we have disagreements on those facts. And that's the way debates should be. They should be based on what is real, what are the facts.
All right, everybody. Thanks to our executive producer. We have an update from Los Angeles County, California, live on coronavirus. I'm going to take you there. We may return to the House floor in a little bit. As you know, a lot of this debate, even though it's about FISA, they are talking about coronavirus. So we may return. But out to Los Angeles County, California right now.
And what we all need to do to make sure that we're moving through recovery safely. So I would agree with Supervisor Solis and all of the board members that this is this is the steps that we're taking because we feel confident with all of the support that we have from our communities that we can, in fact, move forward on a recovery journey aligned with the state. So, next question.
And next we turn to the line of Claudia Pescuda with KNX News Radio. Please go ahead.
Hi, Claudia. Question. You didn't exactly address this. Do you have any concerns about the pace of reopening? Thank you.
At this point, if you're asking me as a Board of Supervisor, my opinion is
that...
Sorry, I was asking... Dr. Ferrer? We're a little delayed on the microphone, but I'll just say something briefly and turn it over to Dr. Ferrer. I believe that we are actually following along the lines of the governor's order, and I do believe that our public health officer will always take us down the right approach, which is based on data, scientific evidence, and of course we look to see what our population is at our hospitals. I think those are the things that are driving us, that we need to be careful because we're still not out of this area that we know we have to be very mindful of. So I know moving ahead, it seems like it's slow, but actually, we're I think, doing very well. In consideration to our population, we are one of those counties that has the largest number of COVID patients and deaths, and we want to make sure that we keep bringing that curve down. Dr. Ferrer?
Thanks so much, Claudia. And I think the supervisor said it best. We're moving forward. This is the recovery phase. We feel very confident, and we feel very confident because of all the work everybody has already done to get us here. Hospitalizations are down, our deaths are down. The number of cases is up, but that's a good thing, as I've noted, because it just means a lot more people are getting tested, but our positivity rate is also down. We do have to all go carefully, and by that I mean we have to be diligent about doing whatever we can do to protect each other. But yes, I feel confident that we're moving forward in a manner that's very respectful of the resources we have here and the need, in fact, for us to be on a reopening, safer in the community, safer at work journey. But we have to be on this journey together. So thanks for the question. We'll take the next question.
And next we turn to the line of Dave Lopez with CBS 2 News. Please go ahead.
Yes, good afternoon to both of you. Following up a little bit on that, Doctor, it appears the county's asking for a variance, which will probably be approved. I mean, I'm not positive, but it seems that you can meet those numbers. But my main question is this going to be as simple as it's all depending on us, the masks, the distancing? I mean, is it that simple, or is there more to this that could set us back?
I think that's a really excellent question. So a lot does depend on us as individuals, but I've also said a lot depends on us as sort of people who are in institutional settings. So as individual people, we do our part, we keep our distance, we wear our cloth face coverings everywhere we are when we're in contact with other people. We avoid crowds, we wash our hands, we stay home when we're sick. As institutions and people who are part of institutions, we also take care of each other by making sure at our institutions we're doing all we can, that we've reconfigured space, that we're still allowing people to stay home when they can telework and that makes sense, that we're not creating additional risks by bringing people back to work. So retail experiences should look different, office experiences should look different. When we're at our houses of worship, those experiences should look different. So I do think things will be different, but I think it is in that difference that we're doing what I call infection control, maximizing, stopping the spread, many different ways, a lot of cleaning that needs to happen, a lot of hand sanitizer, bathrooms need to be well stocked, and then doing everything we can, particularly to protect our workers, so that they, in fact, are not having too much exposure to other people who could be transmitting the virus. So yes, I think it's simple in one sense, but for everybody who's reopening, you know that there are protocols that you need to adhere to, and that may not be so simple, which is why we've been saying all along, we are reopening, but I urge businesses and institutions to take their time to make sure that when they are open again, they're doing it in as safe a manner as possible. And we'll take the next question.
Thank you. Next, we turn to the line of Jacqueline Cosgrove with the LA Times. Please go ahead.
Hi, thank you so much for taking my question. Dr. Ferrer, I was wondering, yesterday at the Board of Supervisors meeting during the closed session, you provided some data to the board about that showed that LA County was ready to apply for a variance. Last week we were talking about how the county wasn't going to open up until July 4th. I'm wondering if you can explain what changed in a week and when you are going to publicly release the data that you showed them in closed session. Thank you.
Yeah, thanks so much for that. I didn't really, I don't think I presented any data in closed session. We're working on a variance application today and pulling together the data. I do know the criteria for submitting for a variance, and I was able to speak about that. Our testing, our positivity rate is down. We've increased our capacity to do contact tracing. We have, shored up, and this is again with the help of EMS and the Department of Health Services, the PPE supply. The hospital capacity remains very strong. So, there's a detailed form that needs to get filled out for any county that's submitting for a variance, and we're pulling together all that data today and feel confident that we will meet the criteria, and we will hope to submit by the end of the day today. And I don't think there's really a disconnect. We've been on a recovery journey, and I think that July 4th date is a date that really says, we will be continuing to reopen between now and July 4th in a phased-in approach. We've always talked about a phased-in approach. It's never been one day we're closed, one day we're open. And I do think Supervisor Barger was referencing that this is a journey, we're on a reopening journey. Nothing's really changed. We weren't eligible for the variance last week. This week we are eligible. We have met the criteria. Particularly, it was an issue of our positivity rates, and we're now there, so we'll go ahead and apply for that variance. But we have time for one more question.
And our final question comes from the line of Lee Ross with Fox News. Please go ahead.
Thank you. Dr. Ferrer, of the 48,700 known positive cases, how many instances have you come across of repeat positives per individual, meaning someone who had tested positive, for lack of a better word, recovered, and then tested positive again? And whatever that number is, I'd be obliged for your analysis of that figure. Thank you.
Thanks. I'm sorry. I don't have that number. The best that we are doing right now is we're hearing, and it's mostly through researchers and scientists and clinicians, we're hearing of isolated cases where people have tested positive, they've recovered in the sense that they've felt fine, they completed their isolation period, and then, a few weeks later, they tested positive again. They felt sick again, got tested, and tested positive. So mostly what we're looking at is data that we're receiving from clinicians, and we're looking at the research on this issue. We haven't really had the capacity to be able to go into the testing data and look for what is a reasonable question. Look and see if we have matches, people who tested positive and then a month or two later came back in and tested positive again. But I am very confident that there are a lot of clinicians and researchers that are looking at this very issue about can you be positive, think that you've recovered, and then test positive again? And is that either that you've had the infection twice, or is that you actually never stopped shedding the virus enough to test positive on a PCR test? But we'll now go to remarks in Spanish. Thank you.
Buenas tardes y gracias por acompañarnos.
All right, everybody. Christy Larson is going to be joining you all here on the News Now stream on YouTube and on coronavirusnow.com in a few minutes. But I still have some tricks up my sleeve. Some coronavirus updates from across the country. I'm going to take you out to the state of Florida now. This was actually a pretty lengthy news conference, coronavirus related, earlier today. And it's because it was talking about these proposals from the theme parks, Universal, Disney, about reopening amid the pandemic that we are still dealing with, even though a lot of these stay-at-home orders are expiring and a lot of businesses are starting to reopen, including casinos in Las Vegas. How do you properly social distance and keep everybody safe in an environment like theme parks? Let's listen in.
The moving forward with reopening because of that low positivity rate. As of yesterday, the Department of Health reported that our positivity rate here within Orange County is about 2.8%, which is lower, about half as much as the entire state of Florida, which hovers somewhere around 5.7% in total positivity rate. So Dr. Pino also shared with us that over time, even though we have about 1,850 positive cases in Orange County, active cases remain a fraction of that. 87% of all those who have tested positive have recovered, and that leaves somewhere around 320 people who are still active with the virus in our community. We know that likely there are others who are asymptomatic but are also positive, and so the backdrop of what I'm saying here is that the virus is still alive in our community, which speaks to the necessity that as we reopen, we must balance the safety concerns in this healthcare crisis. Yesterday, I heard a good quote from Dr. Pino, and he said that this is the battle between what is dirty and what is clean. And certainly as we reopen businesses, the focus of this task force is to ensure that we reopen businesses in a clean, safe manner. And so with that, I know that we're going to have a number of presentations today from some of our major theme parks with their plan of actions. I've had the opportunity to preview their presentations, and so I really look forward to the dialogue of the entire body today as we move forward. So with that, let me reiterate that I do appreciate the volunteer time collectively that all of you have contributed to making Orange County successful in the reopening of business and commerce here within our community. And with that, I'm going to turn it over now to Mr. George Argale, co-chair, to lead us forward with the meeting.
Thank you very much, Mayor. Thanks for the update on how we're tracking here in our community. That is great news, and it's really a reflection of the efforts, basically with your leadership and your team, that's helped position us to where we can be today with a very strong agenda and some important presentations again. So once again, on behalf of my co-chair, Tim Giuliani, and myself, pleasure to welcome all of our task force members back to address this great agenda we have in front of us. So with that, I'm going to go ahead to that moment we all look forward to, taking the role of our task force members. So as before, please respond when I call your name, and remember to unmute your phone or speaker on your computer. So with that in mind, we'll begin, as we have in the past, at the top of the list with Advent Health, Dr. Scott Brady.
Hi, this is Vincent Hsu covering for Scott Brady, who was unable to be here today.
Yes, thank you, Dr. Hsu. We appreciate having you back.
Thank you.
FNN, Jesse Martinez.
Good morning, George. Present.
Good morning. Black Business Investment Fund, Inez Long.
Good morning. Yes.
Career Source Central Florida, Pamela Neighbors. You want to please put your phone and computer on mute until your name is called, please. All right, Central Florida Auto Dealers Association, Evelyn Cardenas.
Present.
Church Street Entertainment, Doug Taylor.
Good morning, Mr. Chair. Present.
Thank you. City of Orlando and Orlando Venues, Alan Johnson.
Good morning, George. Present.
Good morning. Curly and Penn, Dan Ward.
Good morning, George.
Good morning. Garden Restaurants, Dave George.
Good morning, Present.
Don Julio's Mexican Kitchen, Florencio Larry Rodriguez. Larry Rodriguez.
Good morning.
Larry, you there? There you are. Thank you. Dr. Phillips Center for the Performing Arts, Kathy Ransberg.
Good morning, George.
Good morning. Florida Department of Health in Orange County, Dr. Raul Pina. Dr. Pino. I know you'll be with us later today in the agenda as well. Florida Restaurant and Lodging Association, Carrie Burns.
Good afternoon. Present.
Thank you. Highwoods Properties, Steve Garrity. Steve Garrity. Okay. High Regency, Brian Combs.
Good morning, George.
Good morning. J. Henry's Bar. Tricia Johnson.
Doug Taylor, motion for approval.
Chuck Woodall, second. Chuck, thanks for the second. All those in favor, please unmute and say aye.
Aye. Aye.
Aye.
Aye.
Aye.
Aye.
Aye. Thank you. At this time, any opposed, please unmute and say aye. Hearing none, please show the minutes approved. Turn it back over to George for public comment.
All right, as always, we want to be sure to comment and share that in an effort to comply with CDC social distancing guidelines and for the safety of residents and task force members, the Economic Recovery Task Force will conduct meeting virtually. Orange County remains committed to providing an alternative platform for residents to have the opportunity to submit their public comment. I will ask the Orange County staff to read the public comments we received online and add it to the public record. Please note public comments received that do not include the required information will not be read. Comments that extend beyond the set time limit will not be read in their entirety. However, the resident's entire comment will be entered into the public record. Please note that the time allocated to each individual for public comment via online submission may be reduced from the normal 3 minutes based on the number of speakers. So Lucas, do we have any public comments for today's meeting?
Yes, sir. We have 5 public comments for today's meeting. We will begin them now. Our first public comment comes from Ms. Patricia Parrott, address 1759, Lady Slipper Circle, Orlando, Florida 32825. Economic Recovery Task Force in public comment. Where are the warning signs of every business entrance for polypropylene and other chemicals in use and MSDS sheets for every chemical at the door? MSDS sheets are OSHA regulations. My tongue swelled for 3 days after entering Waterford Target after no warning signs of the polypropylene. People stating eye irritation, redness, itching, entering Florida Mall. no mall number to call to ask chemicals in use, and individual stores do not have information. Clinics writing seen high numbers of patients with mask irritation. Mr. Pino, actually it's Dr. Pino, not advising food dye allergies can cross-react to polypropylene in the mask and air. Pregnant people not given MSDS sheets showing any formaldehyde or chemicals in the mask that can affect their embryos and fetuses. Lawyers will be advertising, can your small business survive a lawsuit? Federal DOJ ADA investigations from improper procedures with employees and customers asking their medical condition. Taking temperatures with no medical certification to advise on high temperatures. People forced to stand in 100-degree heat outside with a mask, and employees getting temperatures of 102 and 104. Customers wrongly ignored, told to drive home when this could be true core body temperature and they need medical care. Research proves just 10 minutes in the heat with mask alters the thermal regulation and can lead to hypothermia. At moderate work rates, 50 to 70% maximum oxygen uptake or maximum exercise capacity, respirators impedes the loss of heat from the face and can result in hypothermia occurring sooner than it otherwise would. There is also an effect of heat in the ability to recognize dangers, make coordinated movements, and perform manual tasks. As deep body temperature increases, dexterity, cognition, and motor skills degrade significantly. One of the most dangerous effects of overheating is disorientation and not being able to recognize the direction to safety in the event of extreme danger. This inability to recognize safe passage has contributed to past deaths. Our second public comment comes from Isabel Sam, 4818 Native Dancer Lane, Orlando, Florida, 32826. Good afternoon, ladies and gentlemen. I would like to tell you a brief story of my family's history that ties into the story of the United States. My mother's family lived in Spain during the Spanish Inquisition, and they were Jewish. The family that survived were the ones that decided to ignore the social conditioning, changed their names, hung a pig on their front porch, and took the first boat to South Africa. The ones who went along with the social conditioning were murdered. In South America, socialism started taking over, and my grandparents chose to ignore the social conditioning and left their children become citizens of this great country. On my father's side, I have family members who chose to ignore the conditioning from King George and fought in the Revolutionary War during the middle of a smallpox pandemic. Today, we have all kinds of draconian conditioning that's trying so hard to get through this hysteria over a virus that is so tiny that mask manufacturers are putting warnings on the boxes the masks are sold in, telling the public that the mask cannot prevent you from catching this virus. We have doctors out of California reporting that they've seen a year's worth of suicide attempts in 4 weeks because of these shutdowns. We have economists warning that we're marching into something much worse than the Great Depression unless we get back to work and life. The United States and Orlando were formed by brave people who chose to question tyrannical laws. I would like to encourage you all today to be brave like our ancestors and completely reopen Orlando and Orange County. Thank you, Isabel. Our third public comment comes from Matt Colis-Bari, owner Kings Point Box LLC, 7075 Kings Point Parkway, Orlando, Florida, 32819. Good afternoon. My name is Matt. I own a small gym in Orange County. We have been seriously impacted by the shutdown. I heard that Orange County may be offering $10,000 grants to small businesses. That help is greatly needed. I was wondering how I could go about applying. Any information would be greatly appreciated. Thank you in advance for your time and consideration. We'll refer this specific comment to staff for follow-up. Our fourth public comment comes from Dennis Freites. His address is 9453 Westover Club Circle, Windermere, Florida, 34786. And we will need a timer on this one as well. COVID-19 testimony comments. Hi. First, thanks for the great things you're doing for our beloved Orange County. We need to reopen our economy with proper precautions now. Based on the coronavirus infectious pandemic situation, empirical, scientific, and other facts, the logical and the best thing to do in order to prevent and minimize death is for the government, federal, state, county, and cities to mandate until there is a vaccine to follow all CDC, U.S. Center for Disease Control guidance. To follow CDC guidance, government rules that should include wear PPE and make it mandatory. As a business, when going to a medical facility to get treated, don't spread bad germs to others, must wear when going out to stores, other gathering places, or traveling, planes, buses, trains, ships, at least until you're vaccinated against the COVID-19. N95 or N99 face mask or alternative homemade mask with FM2.5 5-layer filter. Next section is practice. Physical.
Miami, they are very active with respect to the state in general. For testing, we have, as of this morning, 1,849 cases that are accumulative testing, and we have tested over 66,000 people in our county. Our accumulative positivity rate is about 2.8. It continued to decrease. And also, you can see on your right some of the metrics. In county by county testing, I would like to call your attention to the graph in yellow below. Those are new cases by day. And those are by the day that are reported to us. If you can see, it goes up and down, up and down, up and down. And that means it's unstable, the pandemic. It still has not been fully controlled. And it goes up and down. And that's what we have to be careful with, is those up that ended up in a large outbreak. We are following, we know that that we are going to see right now as we put a lead into the wide community distribution. What we are going to see are some outbreaks, and we are following a few around the county, but there is no one that is out of control. We have managed to stabilize some of those areas where we have high incidence. So this is the metrics that we are following. The number of ER visits for flu-like or influenza-like is stable, as well as the number of EDBC for COVID has continued to decline. Where you see an increase in yellow is in the number of new cases, but it's just, this data can be misleading because that's just the total number, not with relationship to the number of tests that has been performed. And then in red, you have the positivity rate, which continue to be low. I would also like to show you, let me see if I can take this out right now here. Always have issue with this part here about sharing. I would like to share with you a density map that we have done with by zip code and rate. And rate takes in consideration the population size in each of those. Let me bring it active. Here it is. Let's see if it shows. Okay, here's the map. This is our county, and this is just fresh, up to May 25th. From the 12th to the 25th, we are selecting, we have a moving target now for every 2 weeks. And you have the rate per 10,000 resident in each of the zip codes in the county. You can see that the highest activity right now is in 32703 and 32824. In those areas, we have 2 outbreaks that we are following, and it could be the reason why we have seen this increased activity in those 2 areas as those tests are assigned to those 2 areas. We will be starting calling the attention to employers and others on break rooms. We have a few cases that we have been able to track to break rooms in the workspace where people congregate and don't think to the hygiene to be as efficient as is being in general areas for the general public. So that's an area that we are going to concentrate our efforts as we continue to educate the public and employers on what best practices we should be putting in place. That is my update.
Thank you, Dr. Pino. Do we have any questions, Dr. Pino, on his update?
Chuck Whittle, I have a question for you, Dr. Pino. Good morning. How are you?
Good morning, Chuck.
Dr. Pino, despite opening all the businesses, it seems like from what you just showed us, the data is showing that we're continuing to go down in cases. Even though we have more documented cases, that's because of more testing, but the percentage of cases is actually declining. Is that correct?
The percentage of positivity rate is low, yes.
And do we meet that 15-day trend yet that is starting to point us in the direction of phase 2?
That's a moving target in the sense that, 14 days is will move as we move in time. So it depends on the time that you measure. Now, let me see if I can bring this graph here. It's a PowerPoint. Let me bring it quick. There is, let me see how can I phrase this one. There is, when you compare last 7 days to the prior 7 days, there is a slight increase in the positivity rate, but it's minimum. It will come up. It's a PowerPoint. As soon as it comes up, I will share it. But the last week, the number of cases is higher than the prior week. Now, we also doing more testing, and the positivity rate has increased slightly when you compare week to week, but not significantly enough that we are concerned. We prepared this document for the court because the court have to present it to the district for, let me see if I can share it, came up, share it here. And let's see where that PowerPoint is here. Let me share it with you as soon as it come up. So.
All right, guys, it is the top of the hour here at 2 p.m. in Arizona. Just want to give you a brief update on COVID-19 numbers across the state. We do have more than 1.69 million Americans who have been tested positive for COVID-19, as you can see up on your screen. That 99,000 number, unfortunately, that is the number of deaths that have been reported of people who have died from coronavirus here in the area, in the United States. And we have tested a lot of Americans. We have done more than 14.9 million tests of COVID-19 here in the United States. So those results are obviously showing then of those 14.9, 1.6 do have been tested positive for coronavirus. Just to give a few numbers of who's been the highest with the amount of coronavirus positive tests, we do have a lot of states who are reporting their numbers in. So New York actually obviously has been one of those epicenters. They have currently 77,637 hospitalized from coronavirus. Now also up there is New Jersey. They have 16,373 who are hospitalized from coronavirus. Then you go down to Connecticut, Florida, followed by Massachusetts and Maryland. So we do know that a lot of these states have been doing a lot of daily briefings. We've been bringing them to you here on News Now, also on coronavirusnow.com. That way you can stay up to date on the latest, what each state is doing about COVID-19. And since we did talk about this 99,000, that number of deaths, let's just click on the recovery, because I always like to show positive news here with you guys as well. 384,902 have been confirmed as recovered from COVID-19 in the United States. Now, a lot of people wondering what are some of those other countries. Well, that's on your left-hand side here. Brazil has the second most number of cases with 391,000. Russia has 370,000. United Kingdom has 268,000. And then followed by Spain. So China, where the epicenter is, their number is still sitting around that 84,000 mark. I think when we first started seeing cases here in the U.S., China had been kind of plateauing at that 80,000 mark. And now obviously many countries where people have traveled back and forth, obviously it's hard to keep that containment of a virus that is so contagious. So many countries have surpassed China, where it originated from. You can always go and get the latest news articles and updates on coronavirusnow.com. We're going to move past that Florida parks thing. We can always go back to it, but it seemed like not the best format for us to be playing here in the afternoon. So I want to show something that did happen a little bit earlier here today. We're going to go out to Nancy Pelosi and House Democrats. They talked about COVID testing in Washington, D.C. So I thought that was interesting, just because we have not always gotten to hear a lot from the D.C. area, and especially hearing what they may be focusing on is obviously testing, since it is another place that has a high population size. So we're going to go out to that right here on News Now. Then we're going to continue on with more like Illinois, Detroit, Austin. There's a lot of places that we haven't gotten to here yet. So once again, thanks for being here with us. Going to head out to Nancy Pelosi and House Dems talking about COVID-19 testing in the Washington, D.C. area. And I know I just said it, but we actually are going to change our minds. I see we have a live press conference going on. We always like to go to live events instead of recorded events. And since that Nancy Pelosi event had happened earlier here today, we're going to skip it for now. And we're actually going to be going out to Maryland. It looks like Maryland is giving an update on COVID-19 in their state. So let's go jump into that right here for you guys on News Now.
Progress of COVID-19. This information is now available on our dashboard at coronavirus.maryland.gov. The State Department of Health is now using the same rolling 7-day average that is recommended by the new federal CDC guidelines. In Maryland, our statewide positivity rate peaked 41 days ago on April 17th, when it reached 26.91%. Since then, it has dropped by more than 50%, down to just 12.8% statewide. The positivity rate in Baltimore City is down 54% from a high of 27.38 on April 19th. To 12.71% today. Baltimore County is equally low at 12.72, and both of them are slightly below the state average. Prince George's and Montgomery counties, while still above the rest of the state with respect to positivity, are also seeing dramatic decreases. The positivity rate in Prince George's County has dropped by nearly 50% from a high of 41.96% on May 2nd to a current rate of 21.66%. And Montgomery County has also dropped by more than 50% from a high of 32.64% to now 15.84%. The average daily death rate has also dropped by more than 50%. Since the peak, which occurred nearly a month ago on April 29th. Total hospitalizations are down 22% since their peak on April 30th and down 17% in just the last 14 days. The number of patients in ICU has been on a steady level plateau for 28 days since April 29th. Over the past 2 weeks, we have been encouraged by all the successful stage 1 reopenings all across the state and by all the improvements in the important data and metrics statewide. All of this progress allows us to now safely move forward with the completion of stage 1 of the recovery plan. Effective Friday, May 29th at 5 p.m., restaurants, as well as social organizations such as American Legions, VFWs, or Elks Clubs, etc., will be able to begin safely reopening for outdoor dining, following strict public health requirements consistent with the CDC, the FDA, and the National Restaurant Association. Restaurant patrons must be appropriately distanced with no more than 6 people seated at a table. Restaurants are required to either use single-use disposable paper menus or sanitize reusable menus between each use, and to sanitize outdoor tables and chairs between each customer's seating. All restaurant staff must be trained in current COVID-19 health and workplace guidelines. Restaurants must begin screening procedures, including daily temperature checks of all staff, and masks or face coverings must be worn when interacting with other employees or patrons. We are also strongly encouraging local leaders to find innovative ways to help support our restaurant businesses. We love the idea of closing streets for outside seating in Little Italy and Fells Point in Baltimore City, on West Street and Main Street in Annapolis, on Bethesda Row, and in other towns across the state. Allowing for the closing of streets and expanding into parking lots and public outdoor spaces can help expand the footprints, allowing for safer outdoor dining, and it can help many of these struggling restaurants to survive the crisis. Also effective at 5 p.m. on Friday, many other outdoor activities will be able to safely resume, including safe youth sports activities, following CDC guidelines with limited low-contact outdoor practices focused on individual skill building, with limited group sizes, limited touching of shared equipment and gear, and the ability to engage in physical distancing while not actively engaged in play. Youth day camps may resume for outdoor activities with capacity limitations of no more than 10 individuals in a group, and daily COVID symptom checks for youth camp staff and campers. No out-of-state or overnight campers will be permitted, and physical distancing and mask will be required for staff and camp attendees. Outdoor pools may also reopen with strict safety guidelines, including 25% capacity restrictions and strict physical distancing and sanitation measures. Patrons will be required to sign in and sign out, and pools will be required to post signage warning anyone who is sick not to enter. Drive-in movie theaters will also be able to safely reopen. As we did with the beginning of stage 1, detailed information and guidelines regarding these additional reopenings is now available at open.maryland.gov/back-to-business. The Maryland Strong Roadmap to Recovery Plan was based on a flexible, community-based approach. And at the request of county leaders, we empowered counties to make certain decisions regarding the timing of reopenings in their individual jurisdictions. 23 out of Maryland's 24 jurisdictions have now either entered stage 1 or have announced their plans to do so. And now, as of Friday at 5 o'clock, all jurisdictions statewide are able to move forward with fully completing stage 1 reopenings. Our coronavirus recovery team will be continuing to watch all of the data very closely, and if these encouraging trends continue into next week, we would then be in a position to begin entering stage 2 of our recovery, which would mean a lifting of the order and allowing other non-essential businesses to begin reopening. While we are moving to safely reopen our economy and put more people back to work, we want to continue to strongly stress the need to follow CDC guidelines. The fight against this virus is by no means over. We must all continue to remain vigilant, particularly as we begin to come into contact with more people. Lower risk does not mean no risk, and safer does not mean completely safe. Just because you can do something does not mean that you should, particularly if you are a person in a vulnerable category or if you are around someone who is. If you can stay home, you should continue to do so as much as you can. You should continue to avoid crowds of people. Outdoor activities remain safer than indoor activities. And if you can work from home, you should continue working from home. It remains critical that Marylanders continue practicing physical distancing, staying 6 feet apart, wearing masks in indoor public areas, including retail stores, and that they avoid using public transportation unless it is absolutely necessary. Our long-term recovery can only be effective if everyone continues exercising personal responsibility for ourselves, for our families, our coworkers, and our fellow Marylanders. 48,423 Marylanders have already been infected. 8,281 have been hospitalized. 2,270 Marylanders, and now over 100,000 Americans have lost their lives to this deadly virus. And though we continue to make great progress toward recovery, COVID-19 is still very much a deadly threat, and our responsible behavior is absolutely critical in the continued efforts to defeat it. Unfortunately, there are still some people who are clearly not taking this pandemic seriously, who are acting recklessly, and whose actions are needlessly putting themselves and others at risk. And if too many people engage in this type of behavior, it could threaten to cause another spike, which could cause even further destruction to our economy. But thankfully, the vast majority of our citizens clearly understand that while doing things like avoiding crowds and practicing physical distancing and wearing masks may be inconvenient, that these are some of the best tools that we have to continue to slow the spread of the virus and to put us in a position to rebuild and restore our economy and to finally defeat this invisible enemy. Time and time again during this difficult period, Marylanders have stepped up and risen to meet this unprecedented challenge. And while we still have a long way to go, thanks to each and every one of you, we truly are on the road to recovery. And I say thank you, and with that, I'll be happy to answer a question. Yes.
You mentioned empowering the counties. As you announced this completion, as you know, Montgomery County has still yet to set a date for its reopening. We had an opportunity to question the county executive, Mr. Elrich, today, and he again declined to set a date, despite the fact that his own health officer said significant progress had been made on metrics and they are moving forward in the right direction. As I'm sure you were aware, on Monday in a newspaper story, the county executive had said he was hung out to dry on this issue of local jurisdiction in regards to reopening. We asked him today, how can you say you were left holding the bag when you asked to hold the bag? And he said he wanted, and this is his words, magic words from you to explain to his constituents why he was making these decisions and why the metrics were different in his county. Can you say something to Maryland County residents tonight about what's going on in their county in regards to reopening? And at any point, would you step in and withdraw that empowerment?
Well, I don't have any magic words, but we've been working, I think, very well with our local leaders, and our plan, which we rolled out quite a while ago now, called for flexibility and working with the various counties, knowing that different counties were in different points and were being affected differently. The county leaders, we were having weekly calls, the county leaders begged for and requested that flexibility and the decision-making ability on their individual counties, which we gave them, and then some of them seemed to say we shouldn't have given them what they asked for. Look, I don't want to criticize any of the county leaders. I know they all have very difficult jobs. As I mentioned earlier, Montgomery County and Prince George's County are higher than the state average. Baltimore County and Baltimore City are below. But Montgomery County, Prince George's County particularly, is challenged, and Montgomery County is higher. So I'm hopeful that the county executive there will listen to all the best advice, follow the numbers, and make the decisions that are right for his county. I don't know that he's aware of the latest information. This is new CDC guidelines, the fact that his positivity rates have dropped by 53%. There seems to be some confusion. The county leaders aren't really paying attention to the state plan. They're kind of making up their own metrics. I heard one of the county executives say, our number of cases is continuing to increase, and we can't do anything until that goes down for 14 days. Cases are going to go up every single day until we have a vaccine. I've said the case numbers, as we test 300,000 people, every day you're going to get additional cases. That's not really what we look at. What we look at is the hospitalizations, the ICUs, and these positivity rates, all of which are trending in the right direction, including Prince George's and Montgomery County. They're doing great. They started out in a really bad place, but they're all following the same trend of downward, cut in half. So I think they ought to move forward.
That's what I'm saying. Do you think Prince George's County, is it time for them now?
I think Angela also Brooks has announced that June 1st they will be moving into stage 1, and I think she made that decision based on all the best information in her county. And Montgomery, I don't think he didn't. I didn't hear what his announcement was. I believe the mayor of Baltimore has taken some steps towards stage 1. I think Angela announced, Angela also Brooks, County Executive Prince George's, announced that on Monday she will move into stage 1. I believe Montgomery now is the only one who has not set a date, and they probably need to.
There has been photographs right around the state, down the hill here, Ocean City, elsewhere, big crowds of people. We did just get a 2-day uptick in the hospitalizations. Are you concerned that behavior over the last couple of weeks is harming the trend?
Well, so I mentioned a few moments ago in my remarks that there are some people that are not taking it as seriously as they should, and some people's behavior that is reckless. The vast majority of people are really paying attention. They're being thoughtful. They are being careful. But I was a little bit shocked to see some of the photographs or the video of people on the boardwalk in Ocean City with some of those crowds, which didn't appear to be too safe to me. And I think the mayor of Ocean City, I believe, is trying to take some measures. They put signage and they had police officers that were trying to create more distance. But I think they're going to be taken some additional steps to try to be more careful. But you can't control everyone's individual behavior. We can continue to strongly urge them, and they have to take more steps to be safe. But for the most part, I think people were generally pretty good. On the 2 days, number 1 or 2 days does not make a trend. That's why we look at, our plan says 14 days. The new CDC guidelines talks about 7-day averages. It's why I said we want to keep watching this into next week. If those 2 days become a solid week of numbers going up, then it's a concern. Let's slow things down. If it's just a blip and everything else continues to go down as it has consistently, then we'll be ready to continue to take steps to move forward.
I have a question getting back to the numbers and the data and the,
Sorry, I'm going to come
the cases, the people who died from coronavirus.
Yes, Kate.
Have you had a chance to look at any numbers in terms of a breakdown of the COVID-19 deaths in Maryland according to pre-existing diseases? I ask because of the UK, for example, there's this stunning research that showed a large number of their deaths. People had diabetes, there's obesity was a factor. Have you seen any sort of trends or numbers so far as far as Maryland?
There's no question that the death rates are much higher for people that are older and that have underlying conditions. I don't know the exact stats of today, but there's no question that healthy, stronger, younger people, while they're not immune, their death rates are much lower, and that people that are older and or that have some of these underlying conditions are much more vulnerable. So that's what I mentioned earlier. As we open up things, those types of people and the people that live with them or that are around them, if you're with somebody in your family, that's one of those categories you've got to be particularly careful.
But no specific underlying condition that you've seen so far?
Any particular, I think there are a whole number of underlying conditions that cause you to be more vulnerable, but no one that really stands out.
In terms of you mentioned about personal responsibility, and you mentioned some of the fellows who disheartened to see. I know you don't want to say police or law enforcement want to galvanize it, arrest you, but should there be some type of penalty if you're not following, if some people are not following the CDC guidelines and others say that?
So when people are violating the law or any of the orders, there are penalties and guidelines. On the guidelines, the CDC guidelines and the things that we're recommending, then people are not going to be punished for not following the recommended guidelines. They're just some of their other folks that are there with them may try to explain to them that they should be. Yeah, I don't know exactly what the question was, but that's not completely accurate. I didn't listen to the testimony. When I announced the acquisition of, it's not 5,000, it's 500,000. I said, and Luke is sitting here in the front row, asked the question. I said this is one important part of a long-term testing strategy, that it was only part of it, that there were still 9 components missing, that we needed to have swabs and transport tubes and reagents and lab capacity and all these things. That was a month ago. And we've been in the process of acquiring all of those things. We announced 2 weeks ago that we got swabs and the transport tubes from the federal government finally. We created our own reagents, and we're ramping up lab capacity. Matter of fact, this week, the University of Maryland lab that we invested in is beginning to, they aren't quite up to full capacity yet, but we haven't even announced it yet. They're now processing and beginning to process those tests. So, but yeah, there are multiple components, as I announced, and we've been acquiring them all over the past month since I announced them.
When can we see them?
When can you see what?
When will we see that these kits are being actually used?
So we just reached 10,000 tests a day, 300,000. It was part of a long-term strategy. You won't actually see them because they'll be in the lab, which we're now opening, that we're building. They go to the lab facility. There's some misnomer. We keep saying, when are we going to get them out in our county? They're never going to go to a county.
When will the lab see?
The lab has them now. They're now processing them.
And they're processing them and using the test kits?
Yes, they are.
50 new deaths announced today.
That's I can hear you.
50 new deaths announced today. Many people are still concerned that the state is reopening too quickly at the expense of public health.
Yes.
Statements like that from public health experts. What do you say to people who think we're moving too quickly?
Well, I understand. Some people believe that we're moving too quickly, and some people believe we're moving too slowly. We have a plan, which was, put together with a coronavirus recovery team made up of some of the smartest doctors and scientists we have in the state and in America, and they believe that we're going about it the right way. There was a Washington Post poll last week that said 85% of Marylanders believe we're doing a good handling it about the right way. There's some people, there's certainly 5 or 10% that think we're going too slow, and 5 or 10% maybe think we're moving too fast. But most people think we're going about right. And I understand there's going to be criticism on both sides, and we're not going to make everybody happy. But we're taking the best advice we can. We're following all of those various guidelines. We developed a plan. We're following the plan, and we think we got it about right.
Governor, in the case of the revenue that the state has been losing through all of this, is it better or worse than what you initially thought or what you initially projected? And you've been concerned about it ever since the beginning. Are you more concerned now, less concerned?
It's a great question. So the comptroller did some revenue losses projections for the fiscal year that's ending July 1, and it's not going to be as bad of a loss by July 1 as he had anticipated. However, the long-term loss, I believe, is going to be higher than most people anticipate. We had all the governors, we had an NGA call with the head of Moody's Analytics a week or so ago with all of the nation's governors, who said that state governments should anticipate a 30% drop in revenues next year. That's pretty dramatic. I think if you look at the state of New Jersey, Governor Phil Murphy, Democratic governor of New Jersey last week, cut his budget by $10 billion. And his budget's about the same size as ours.
Governor, why aren't any of your public health advisors here today or the last press conference? And did your advisory team unanimously support the states moving fully into phase 1?
Yeah, I'm not sure why the folks are not here other than we're limiting the number of people in the room. And if one of you guys wants to give up your seat, we'll bring some of them in. Yes, the coronavirus recovery team has unanimously supported these moves.
Governor, I have an unemployment question, speaking about the lost revenue. As you know, a lot of our outlets have been inundated with stories from people, heartbreaking stories of people not being able to get their unemployment. We've heard these stories about the backlogs, the wait times. Can you update us on what's going on with unemployment? Has any capacity been added to the system to deal with this backlog?
Yeah, this problem of unemployment is the one that is extremely difficult because so many people are really suffering, and it frustrates the heck out of me when you can't immediately get people the money that they really need. Not all of it is something we can fix, though, unfortunately, because this is a federal program. It's new. And it's been very complex and hard to implement. And so, we created a website, one of the first in the country. Now I think maybe 20 states have them. Ours was the only one really functioning. It wasn't functioning very well the first 3 or 4 days. Had like 9-hour waits, and we were 180,000 people in line. About 3 days later, that was fixed, and you had 1-minute waits. But as I mentioned a couple weeks ago, the website isn't the issue. It's a federal program. They've changed guidelines at the federal level 12 times since the program came out a few weeks ago. We have been able to process, I think, 400,000 claims, hundreds of millions of dollars to help people. Unfortunately, the federal requirements require them people to refile every week. So I've heard people say, well, I got it the first week, but I didn't get it the second week. Well, federal law requires you to go back on every week, which creates tremendous difficulties. The website is handling most people. But there's going to be a certain percentage of people, and out of 400,000 people got paid, 100 and some thousand couldn't handle it on the website. They have to talk to a live human being, not just somebody to answer the phone, but a real professional that understands the complexities of the federal law and can help them, because otherwise they automatically get rejected. If they don't check all these things, They don't get paid. So we have 250 extra people working in there. We brought in 450 extra phone lines, working around the clock. We built the website. It's still not helping everybody. And the sad reality is, there are a lot of people. I don't know what the percentage is nationwide, but I think around 20% of people just don't qualify, so they're not going to get paid. So the questions are, why haven't you fixed unemployment? Why haven't we all got our checks? Well, because federal law won't allow us to pay them, and because they couldn't, go on the site and get it done, and they have to talk to a person, and people haven't been able to resolve all their claims. But a huge chunk of them, I don't know what the percentage is, sadly are not going to get the checks ever because the federal government won't pay them.
I just want to clarify the stage 1 and stage 2.
Yeah.
And I understand the roadmap is a kind of a work in progress. It's not definitive, but a couple of the things you mentioned, the camps and child care type things and restaurants are in stage 2 or the medium risk category. So I'm anticipating people will say, well, hey, what about social gatherings, my gym class, my aerobics class? So we haven't officially entered stage 2. Can you give us a date when that might happen? 2 weeks from now?
So yes, that's a great question, Kate. It's a little confusing. Some of the things we did partial, like we're not opening up day camps, and we're not fully opening pools, we're not fully opening restaurants, but we in stage 1, we were able to partially do something. Let's let kids in small groups go outside and play, be part of this. Let's let people in the pool as long as they're safe. Let's let them do dining outside, but not inside. Same thing many other states have done. Stage 2, I said we may be able to move forward into that as soon as next week if we continue to see the positive numbers. The fact that hospitalizations, as Brad pointed out, went up 2 days was a little bit of a, hey, let's wait and see what that does. If they keep going up, it's a concern. If they come back down and the trend is still down, we're in a much better position. So there's no exact date, but we didn't say we're going to do it by this date because part of it is watching those trends and those numbers to say, and running it by our coronavirus recovery team, are we safe to do this now? Do you believe now that we've done this and this and this, can we now move on to this? And we have really smart guys that come, ladies and men, that tell us and advise us, and they say, we believe you can do these things now. Or, hey, we have a rush on the hospitals, our numbers are changing, let's put the brakes on a little bit. That's weird. Thank you all very much.
All right, guys, once again, that was a live update from Maryland, hearing their latest on COVID-19. Here's once again a look at those numbers across the U.S. In total. More than 1.69 million Americans have been tested positive for coronavirus. We're going to continue things along that we haven't gotten to here yet today. Of course, if another live event pops up, we'll bring that to you here on our News Now stream and on coronavirusnow.com. But I want to go out to Nancy Pelosi speaking with House Democrats on COVID-19 testing in the D.C. area. It happened a little bit earlier today, so once again, if a live event does pop up again, we'll switch things back on over. Until then, here's Nancy Pelosi and her team.
Is spaced sufficiently? Good afternoon, everyone. Here we are. When we invited you to this meeting, we were going to be talking about 3 things: testing, testing, testing. Testing to open up our economy. Testing to send our kids back to school. Testing to defeat this villainous virus, the coronavirus. Little did we know that we would be coming here almost at the exact time when our country would be registering 100,000 people dying from the coronavirus. 100,000 people in about 100 days. Think back 100 days. We just observed Memorial Day. Think back to President's Weekend. Would you have ever thought that we'd be observing 100,000 people? So I'm honored to be here with our distinguished whip, Mr. Clyburn, Frank Pallone, the distinguished chair of the Energy and Commerce Committee. They're going to share their views about saving lives by testing. There have been outstanding forces in the Congress on this subject. We're also delighted to be joined by Representative Robin Kelly of Illinois, who was the chair of the Congressional Black Caucus Health Brain Trust. Grace Meng of New York, a leader in this House of Representatives, a member of the Appropriations Committee, Mr. Pete Aguilar, another member of the Appropriations Committee, and Deb Haaland, a new member of Congress, chair of her subcommittee on natural resources, all of them leaders in the Congress, and with something to say from their standpoint generationally, geographically, ethnically, and committee-wise, and the rest. So in our first bill, March 4th, we wrote it in February, passed it in March 4th, testing, testing, testing. That was what the bill was about. We thought that the executive branch would act upon that. They did not, but we put out that commitment. By the time the president signed CARES 1, which was March 28th, we had March 4th, March 14th, and then March 28th, our third bill. We had some funding for hospitals and healthcare and the rest there, PPE, addressing the spread of the coronavirus. And then when we did the PPP interim bill a couple of weeks later, that was a place where we put a big chunk of money for testing and for hospitals and the rest. Still, we had not seen what we would have expected from the administration. So over the weekend, they put out something. I won't call it a plan because it wasn't a plan. A plan has a strategy, it has a goal, it has a timetable, it has benchmarks, it has milestones. It didn't have any of the above. No guidance, real guidance for how we can test, trace, treat, isolate, defeat this virus. In our bill that we put forth in the HEROES Act, we provide just such a strategic plan of action. And I'm so pleased that our distinguished chair of the committee, Mr. Pallone, is here to talk about it. For a long time, Mr. Clyburn has been talking about how we do outreach into underserved communities. He used examples of previous health issues in rural America where they had mobile units going out to reach out to people, to provide services to them, to save lives and limbs, as it turns out, lives and limbs. In the bill that we passed, the HEROES Act, it strengthens the testing and contact tracing by requiring updated testing plan with clear benchmarks and timelines, as I mentioned. It provides $75 billion in grants to support testing, tracing, and isolation, with a special focus on addressing disparities on how this villainous virus is assaulting communities of color in our country, and requiring culturally and linguistically appropriate strategies for increasing access to testing and tracing. It's one of three pillars. Our first pillar is honor our heroes, state and local. Open our economy, testing, 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 money in the pockets of the American people. Three pillars of our HEROES Act legislation. This is the testing pillar. It is essential for the economic recovery of our country. It is essential for the health and well-being of the American people. It is essential to sending our children back to school. It's usually always about the children. So we expect that we will go to the table to do the smart thing that scientists all advise we must do if we're going to win this battle against the virus. We must test. It's central. We must trace. It's central. We must treat. It's essential. The Republican leader in the Senate says, we think we need a pause. I don't think the virus is taking a pause. I don't think hunger is taking a pause. I don't think job insecurity is taking a pause. I don't think paying your rent takes a pause. We don't need a pause. We need action. And today we're focusing our action on testing, testing, texting. And with that, I'm pleased to yield to the distinguished Democratic whip of the House, the gentleman from South Carolina, Mr. Clyburn. Now, how are we doing this? I go over here. You go over there.
All right, and that is a good time to stop because we do have more live events popping up here across our board at News Now. Going to jump out to Governor Ducey here in Arizona with a live update on COVID-19 in the state.
Some transparency as to who is exactly deciding how this money gets allocated, how it's going to trickle down to the public and the small business.
So, thank you, Billy. It's a good question. You're right. These are large numbers, and we wanted to make sure that they got out to the local leaders so that they could make their decisions. We are not going to lord over them as the state in terms of what decisions they make. What Mayor Jen Daniels has in Gilbert is going to be different than what's needed in Prescott, Arizona. So they will have the flexibility at the local level to make those decisions. And I'm going to let them speak as to what they're going to do and who's going to consult with them in terms of the distribution. And they all have different ideas as to where those dollars are going to go as well. So I'll open it up to the mayors and supervisors.
So I know for us, we're going to, on June 11th, we'll be taking recommendations from our city and staff, and we'll have a work session to specifically talk about how can we best implement these dollars to serve our Chandler community and to stimulate businesses.
So in Newman County, I spoke with the county manager last week on this subject, not knowing exactly how anything is going to be designed, and it is brilliantly designed with maximum flexibility for us. And so my idea is, what I believe we'll do is we'll put together a panel or a committee and seek public input, and so that we can have, it's not just the elected officials making all the decisions. Of course, we'll make the final decisions, but I want to take input from our community to find out where the greatest need is, where can we most wisely apply those dollars. And so, and nothing will be hidden. I mean, it's all done in public, and there will be full transparency at the end of the day.
Anybody else?
In the city of Peoria, we have already put together a small business task force and a small business advisory committee. And so we're taking information from both of those different organizations in different ways and seeing how we can put that to work. What are their specific needs for their specific types of industries? And it's a cross-section of industries in Peoria. And so we want to know what they need, and we will designate a portion of this funding specifically for grants and loans. And we will get that out into the marketplace as quickly as we possibly can to meet the needs that they have.
One thing that I think is positive, and this was the input directly from the mayors, was that they have specific needs and differing needs depending on where they are in the state. I get to visit with all the governors from across the country, and in many of these settings, the governors are running the small business loans or grants out of the governor's office. Arizona is a big state with a lot of growing cities, a lot of really new cities. And I thought that the mayors and the supervisors were better equipped to make that decision, so they're going to have that flexibility.
Governor, I would just agree with that, only because we're a relatively young city. I think we're the fifth youngest in Arizona. We haven't been hit. Tourism isn't really big for us. So through our business navigation team and reaching out to the different businesses, I think we'll be using it in a much different way than maybe a Bisbee or a Tombstone that really has gotten hit hard from the tourism. So that flexibility will come in very handy for different towns.
Thanks, Tom.
Do a different question. We'll go to Joshua from the Republic, and then we'll go to Melissa from ABC 15.
Hi, Governor. I was hoping you could expound a little bit on whether or not this will be distributed per capita or whether it will be able to each locale apply individually, and why this isn't the full $1.86 billion figure that I've seen around the past couple of weeks.
Thank you, Joshua. Good question. We're using the same formula that the Treasury Department has used to distribution to the states based on the 2019 census. The reason that it's not the full amount is there are going to be needs that are yet unforeseen at the state level. We're all trying to get a handle on our revenues and where our economy is. But we wanted to make certain that we had enough that we could continue to pay and replenish our unemployment insurance benefits.
So as far as application goes, is this something where each locale will have to apply to your office or to the CARES fund directly? Or
There will be no application necessary. I mean, the dollars are we're going to work through the budget office and distribute these dollars.
Melissa?
Governor, what is the breakdown of the $441 million per person for the rest of the state? And how does that compare to like Phoenix, which got $183 per person directly from the Treasury? And do any of the city leaders and the county leaders feel like they're getting less and that's a detriment to their community versus these big cities?
We used the same formula. I don't know if you're aware of the total round number. I know the $441 million number. I think Gilbert's $29 million. Is that accurate?
It is. So Gilbert's going to be receiving $29.2 million from this fund. And really what that means to our residents is probably different than what it means to a Phoenix resident. So I don't like comparing cities to each other. It doesn't help any of us to do that. It does help us, though, when we can prioritize and allocate the funds directly to meet the needs of our residents and our businesses. So that's our focus, and we try really hard not to make comparisons. We all add a different flavor to the state, and it's all of us together that makes the biggest difference.
Mitch from 12, we go next.
Governor, I noticed who's here. You've taken things to make sure we know everybody who's here. They've had a chance to speak. We appreciate that. Noticing who's not here, though, there's nobody here from Pinal County, and that's a county that has made noise with their board of supervisors and with their county attorneys about suing the state for more dispersals similar to this. So was their exclusion from this event intentional, and was their lawsuit, is that going to prevent them at all from getting any money?
I'll take it. I will. Yeah. Why do you? Wait. The question was that there's no one here from Pinal County. What county is the city of Maricopa in, Christian? Okay, I was just curious. I thought it was. Hey, can I answer the question?
Yes, I would love
Okay. There's no lawsuit necessary. The funds are distributed. Next question.
Governor, let's talk about why it took so long. It's been 2 months since the President signed this bill, sent $1.9 billion specifically for these type of uses to you. You've sat on it for 2 months. Now you're giving 25% of it or 30% of it to the cities and sitting on the rest. So help us understand why the delay, why we have people like Pinal County upset, and why you're not giving them.
This is a significant amount of money, Bob, which we get to spend once. We wanted to do it the right way. We wanted input from local leaders as to what was needed. And we also wanted to have some idea around our revenues in Arizona, where our economy was. And we met last week, I think it was, late last week, and was able to hear the direction from the mayors and county supervisors. We then had a line of sight to the amount of dollars that we could put forward, and also what we thought was a best practice. We also wanted to make sure that we had the proper flexibility from Treasury and the guidelines from the federal government, which has been expanded over the last several weeks. So we're able to spend these dollars once, but today or tomorrow, they'll be in the mayor's and the county supervisors' hands. And I've always thought that the government that governs best is the government that's closest to the people, and they'll be able to make the final decisions for what's needed in their community.
Let me ask Governor, follow up a little bit on what Bob said. Out of 1.9, we're giving out a percentage. How much of this are you reserving for the state, for your office, whether it's unemployment or anything else? Are you saving some of what we thought was supposed to go out to the cities for the states?
We're not reserving anything for my office. We are going to have needs at the state level. We have over 500,000 people that have filed for unemployment insurance benefits. Those are dollars that need to be replenished at the state level. It can come in a number of ways. These dollars are eligible to help pay unemployment benefits if necessary. We're looking forward to starting to move people off the unemployment rolls and onto the employment rolls, but you also need to have some kind of balance and replenishment in that fund to avoid additional taxes on Arizona small businesses, and we want to do that as well.
Okay. The other half of the question is my understanding that these dollars, 441, is earmarked for public safety and health. I hear mayors here talking about aid to small businesses and everything else. That sounds like a little bit of squishability to me. So explain to me how you use public safety dollars to help small business.
We are looking at the public health and safety budget at the local and county level. We are making that budget payment for them, and they can take the available funds that have been supplanted and use them what's best in their community.
Go to Dennis next.
I just want to follow up a little bit on that. Mesa, Phoenix, Tucson received some of their money, with some of that and using this to help homelessness, pay for rental assistance, food assistance, things like that. This money, are these smaller cities in town able to use that money for those types of programs?
Yes.
Will they?
Well, you can ask the local cities and towns.
The answer is yes. The answer is
Will
yes,
they be able to
absolutely.
use this money to back up any lost revenue due to the stay-at-home order? I mean, sales taxes could be a big hit. Would you be able to use that?
These dollars will be COVID-19 related.
Ben, so I have a question.
Different, of course, your governor. The mayor of Scottsdale was pretty upset about some of the crowds that we saw, particularly in Old Town over Memorial Day weekend. Scottsdale police have said we don't have the authority to enforce social distancing, safety measures, or anything like that. Given the orders that you've given at the state level, is there any teeth left that you've provided for local law enforcement to actually enforce people to keep a safe distance and protect each other?
So I want to begin by just saying how thankful I am to the citizens of Arizona for how responsible that they've been. We're going to have a public health briefing later this week. I'm going to be able to share with you where we are in terms of the trajectories and symptoms and cases and hospital capacity, as well as where we are on testing. I'll give a little bit of foreshadowing. It's going to be more good news in terms of where Arizona is. Mayor Lane did speak out on the situation in Scottsdale, and every local leader has that opportunity to speak out. I also have had some of the leaders of different authorities reach out and say they're responding on a complaint-based priority, and they've been able to also assist with this. And I know that they'll continue to do that.
Were you pleased with thousands of people in Old Town Scottsdale?
I'm pleased with the people of Arizona. I know there are always going to be situations that you guys want to focus on every time we get together, rather than the millions and millions of people in our state that are behaving responsibly.
Okay, but I think those people go out to other places where they may not be responsible, right? All those people that are in Old Town Scottsdale eventually make it out to other places.
You know, it's interesting that you bring that up, because everybody here understands that. Okay, the objective here is that we slow the spread of a virus. We have public health numbers that I show to you every week and post every day at 9 a.m. at azhealth.gov. Arizona's headed in the right direction. Thank you to the citizens.
But Governor, I think it was missing the point out in terms of Ben's question here. You have authority to tell businesses what they can do under your executive orders. The ability to tell Bob and I to stay 6 feet apart does not exist, which is what the cities are asking for. Why won't you give local...
I want to say again that I'm grateful. Our law enforcement leaders have used education and communication to achieve this successful result to date, and I'm thankful to them.
We're going to go to people who haven't had a chance to ask a question. Antonia, go ahead, and we have to wrap it up.
Governor, would you be willing to, I know that other places, for example, with like Resort Pool, where we saw those large crowds over the weekend as well, there's a recommendation that they self-quarantine. Would you be willing
I'm going to defer to Dr. Kara Christ on any quarantine orders that would be necessary. This would be something that would be left more to an epidemiologist or a public health expert. What my goal has been is that we get our arms around the public health crisis that was in front of us, make sure that we have the capacity to care and comfort for anyone that is sick and ailing, and we are able to do that today in Arizona. Now we're in the process of safely and successfully reopening our economy, and I want everyone in Arizona to know that if you are outside of those risk factors of having an underlying chronic health condition or comorbidities, that Arizona is safely and squarely of the Centers for Disease Control and Prevention Phase 1, and it is safe for you to go out and take a loved one to eat, to go shopping, to visit one of our retail establishments.
We'll take one more question from someone who hasn't had a chance. Well, that's about the time we have, guys. We appreciate it. As we talked about,
trying to get the Republican National Convention to come here to meet.
The president is welcome in Arizona anytime he would like to come. This is the president's sole decision, and I expect him to make the decision that's in the best interest of the election cycle and the electoral map.
thank you, guys. We got to get back to the meeting one more time tomorrow. We appreciate you understanding. Thank you.
Thank you, Kevin.
Thank you. Good to see you, Bob.
All right, things wrapping up here in Arizona. Again, the governor is staying strong with the stance that numbers are getting better, and so he is on board with the way he's been reopening the state. All right, so we are going to continue to move things along here for you guys. Going to head back out to those House Democrats and Nancy Pelosi presser about testing in the Washington, D.C. area.
Go over there. I'm not passing it by.
Thank you very much, Madam Speaker. Today, we are witnessing the 100,000 people who have perished in this country because of this virus. This virus has visited every family, including my own. Our colleague, Maxine Waters' sister, we lost her to this virus 2 weeks ago. On March 19th, as we held a caucus via the telephone, I said to my colleagues that this challenge offers us a tremendous opportunity to restructure things in our vision. I was vilified for that by some of my friends on the other side of the aisle, but the fact of the matter is, our vision is embodied in the pledge that many of us grew up every morning reciting. Our pledge of allegiance to the flag closes with the vision of this country, with liberty and justice for all. I don't back away from that. My reason for existence is to help this country live out that pledge that many of us know has gone unfulfilled for many, many years. Just this morning, the Washington Post has published a pretty significant interview that it had with Senator Marco Rubio, the Republican senator, who chairs the Small Business Committee of the Senate. He talks in that interview about his own parents who came here. One, a maid, and one, a bartender. And he says that if this pandemic was here 35 years ago, he talked about what it would have done to his family, because both of them would have lost their jobs working in the service industry. And he talks in an interview about how the structure that we operate under in this country subjects those who work in service industries, those who cannot work from home, how this virus is devastating their communities. And he used the term in his interview today, the structure that we have, irrespective, if you set all the other differences aside, discrimination, you set aside race, ethnicity, the structure is of such that it renders these families incapable of coping. The select committee that the Speaker has appointed me to chair held its first briefing 2 weeks ago. And in that briefing, we brought 2 commissioners, Republican commissioners, I might add, to talk about former CDC directors, to talk about what it would take to reopen safely. Both of them said it's testing. We got to test. We got to trace. We got to isolate. And we got to treat. That's what has to happen. And as the Speaker just indicated, that non-plan that was published by this administration, that non-plan talks about delegating or relegating all of the testing to the states. That sets up a state-by-state approach. We cannot offer the kind of coordination that we need for the country to recover. And so, as the Speaker indicated, I have a personal relationship with testing. I worked with Senator Hollins years ago when he was in the Senate. We discovered that in South Carolina, we were leading the nation in amputations because of the late detection of diabetes. My wife, who transitioned last September, fought a 30-year battle with diabetes. So Senator Hollins and I worked together to send mobile units throughout rural South Carolina. And we dramatically reduced amputations. So when my wife passed away after her battle, she still had all of her limbs. But when her daddy passed away 30 years earlier, he was a double amputee. That's what testing will do. Early detection, and sets up the kind of tracing that we need so that we can isolate effectively and treat efficiently. The administration needs to maintain its responsibility to coordinate nationwide what we need to overcome this pandemic. And with that, I'll yield to my longtime friend, the gentleman from New Jersey, Mr. Pallone.
Let me, first of all, let me thank our speaker for putting this press conference together today and all the things that she's done to stress testing. Every time we talk to her on a conference call, it's testing, testing, testing. And then let me also say about Jim Clyburn, what he just said in terms of the significance of testing and how to achieve it is right on point. We're not going to be able to reopen this economy unless we have an effective national testing strategy. That is the key. And that's the key to eliminating the virus, because as we reopen, there may be new hot spots that occur that have to be closed again. And we're not going to be able to achieve an end, if you will, to the pandemic without effective testing. Now, the president has failed us. I can't stress it enough. This is a national emergency. He acts like it's going to be state by state. I drove down here yesterday, right? When I come from New Jersey, I can go through New Jersey, Pennsylvania, Delaware, and Maryland in about half an hour, right? How does it make any sense when you have a national emergency to have each state doing its own thing? The only thing that I can see from this report that we've been critical of over the weekend is that essentially this administration is providing technical assistance to the states. That's essentially what it is. You come up, New Jersey, you come up, California, with your plan. We'll look at it, and then we'll let you implement it, and we'll give you some help. We'll give you some supplies. We'll send the CDC if you want some assistance. But that's not going to work. When I talk to the administration people, they don't see it as a national plan. They say, okay, New Jersey's trying to achieve 7 or 8% of its population being tested. Another state, Texas, might be at 2%. And that's fine with them, because they're not even setting a national goal as to what kind of how many people you should test in your state. In addition to that, the supply chain, we're relying on that same broken supply chain that has existed for medical supplies. They need to appoint a national czar who passes out and basically coordinates the supplies, because otherwise, just as we did with medical supplies, we're going to see the same thing with this testing capacity. We're trying to build the testing capacity across the country, but the states are going to have to buy things through private enterprise, compete with each other to get the actual test kits and the supplies to actually do the testing. So this is the problem. What we're saying is in the HEROES Act is essentially we want to change that. And this is why the HEROES Act has to pass, because when the president gets up and says, well, everyone can be tested and we're going to have millions of tests, that's not a promise that he has the ability to fulfill if he doesn't have a better national strategy. So I just wanted to give you an example. In the HEROES Act, and I don't like to read legislation, but I'm going to read it in this case. It says, the plan shall identify the types and levels of testing necessary to monitor and contribute to the control and reduction of the virus, okay? It says the plan must include specific benchmarks with clear timetables regarding how to ensure sufficient availability and allocation of testing materials. And it talks about that for vulnerable communities. And then it talks about the fact that we have to do testing in a non-health situation. So let me give you an example, like an employer, right? An employer decides that they want to reopen, right? There isn't anything that the federal government or the Trump administration is providing about how you go about reopening, how many people you have to test before they can go back to work. If you do tracing, how many people have to trace back and be isolated? Nothing like that. That just doesn't exist. You could even use it for houses of worship, right? The president said over the weekend, well, everybody should be able to go back to church or synagogue, right? Well, how is that determined? And how is that linked to the testing of the people that would go to the church or synagogue? Does that mean that 10% of those people that go to that mass or to that service this Sunday will have been tested? No, there's nothing like that. That's, again, left up to the states to decide. So what we're saying is if we don't have clear benchmarks, how many people have to be tested? If it's not uniform across the country, if we don't have uniform tracing and clear timetables for exactly how that's going to be done, we're never going to eliminate this virus or significantly cut back on the virus. And finally, the most important thing is transparency. So what the HEROES Act says is if you've got to be transparent. We want reports on exactly how many people are going to be tested. We want reports on how many people are going to have contact tracing. We want to know how successful have you been in meeting these national goals. That's all we're asking. It's not a difficult concept, in all honesty, but if the president continues down this path of just leaving it up to the states and, you're on your own, we'll give you a little help here and there, then we are never going to be able to reopen effectively and put an end to this virus. And the most important thing is pass that HEROES Act, Senator McConnell take it up, and if the president's not willing to do this now, then we will mandate it by law. And next, I'd like to introduce Robin Kelly, who's a member of our Energy and Commerce Committee and the chair of the CBC Brain Trust.
Thank you, Chairman Pallone, and thank you, Speaker and Whip, for all of your leadership. The president doesn't want to have a national strategy because then he'll get blamed if something doesn't go right. So it's easy to say the states need to do it, so then the states take the blame because he's not responsible for anything. But as chair of the Congressional Black Caucus Health Brain Trust, I can tell you that we certainly need more testing in communities of color, the very communities that are home to our frontline and essential workers. The HEROES Act will bring testing and critically important contact tracing and mobile testing to more American neighborhoods. We can't always expect families to travel long distances during a pandemic, and not everyone has a car. My district is urban, suburban, and rural. Maybe in the city people can get around, but I can tell you in the suburban part of my district, and especially the rural part, if you don't have a car, you're in trouble. We need to put more testing resources in our communities so those most at risk can get tested. Unfortunately, once again, the Trump administration has no plan. I think it's by design. This time, the lack of a plan means that Americans are dying from COVID-19. Communities aren't being effectively tested, and we aren't bending the curve as much as we could. Whip Clyburn talked about a lot of us have been affected. I lost my uncle 10 days ago. The chairman talked about churches. He went to a church of 60 people. 16 people were affected by the virus. Frankly, the failure of the Trump administration to have a testing strategy means that more Americans will die from this virus. It's time for Mitch McConnell to stop confirming unqualified judges to the federal bench and hold the vote on the HEROES Act because testing saves lives. But the HEROES Act does much more, and I want to highlight a few other elements. Matching fund waivers for our first responders so they can get the PPE they need to keep themselves and communities safe. Grants to medical schools in diverse and underserved areas, including HBCUs. We not only want to be the victims, we want to be a part of the solution. Grants for technology to build capacity and learning for health workers and centers serving communities of color. Additional CDC reporting, even though the last report was garbage, and a field study on COVID-19 racial disparities, because less than 3 pages with links is just not good enough. A modernization of health data collection, especially health inequity data, and culturally appropriate COVID-19 awareness campaign. Let me be clear, these provisions coupled with the testing that the speaker always talks about on the HEROES Act will save lives and help us get through this crisis. Again, I want to thank Speaker Pelosi and Whip Clyburn again for their leadership on this important issue. And I'd like to introduce my colleague and classmate, Congresswoman Grace Meng of New York.
Thank you, Speaker Pelosi, Whip Clyburn, Chairman Pallone, for organizing today's press conference on the Trump administration's lack of national testing strategy. While President Trump took time this weekend to play golf, my constituents in New York were looking for testing, delivering PPE, and burying their loved ones. 100,000 Americans have died in our country because of COVID-19 since early February. And President Trump has clearly failed to lead us through this national health crisis. And we have gathered here since late February in bipartisan briefings, asking for strategy, asking for help. He has continued to downplay the threat of the virus, try to absolve himself of all responsibility, and has wasted so much valuable time and lives as people needlessly die. And now he wants to reopen the economy, despite his failures. And of course, we do need and want to reopen the economy, but we can't do it safely without a rigorous and bold plan in place. I've been in Queens, in my district, since this crisis unfolded, and I can tell you that this must be in place for our economy, not just in New York, but across the country, and our way of life to return to normal. New York and Queens County has been the epicenter of this public health emergency. 1/5 of the 100,000 people who died are from my home state of New York. My district has seen it all, from surges of patients flooding our hospitals, hospitals on the brink with limited staff, PPE, our elderly population succumbing to COVID-19 in nursing homes, small businesses in financial distress, families at risk of homelessness, and essential workers risking their lives to keep our cities running. We did not have sufficient testing capabilities at the beginning of this pandemic, and we still don't have a robust plan now. I will tell you, as a parent of 2 school-age kids, our schools have a more robust and centralized system for testing and tracing head lice than this president does for the coronavirus. And it means that we can't test everyone who may have COVID-19 symptoms or healthcare workers who work in high exposure areas because of this lack of strategy. My constituents might be asymptomatic. They might not know that they have the virus, and yet they continue to go to work. They might have to return home to overcrowded living situations, and they might be in nursing homes, potentially contaminating people around them. So consequently, it makes our fight against this highly contagious and invisible enemy even harder. As we're battling all these changes, COVID-19 has ravaged our communities of color, especially the Black and Brown communities, and has only exacerbated already existing vulnerabilities, inequalities, disparities, especially in access to health care. Inadequate access to health care, including language barriers, financial obstacles, not having health insurance, increases these disparities amongst already vulnerable populations. Elmhurst Hospital, the hardest hit hospital in the country, is in my district. The area around the hospital is one of the most ethnically diverse locations in the country, where more than 125 different languages are spoken. Additionally, health disparities are often magnified for individuals who have limited English skills. For weeks after the public health emergency was declared, the federal government provided little or no information about COVID in any language other than English, leaving millions of people in the dark. And that is why passing the HEROES Act is a transformative step forward, as it would deliver a clear national testing strategy and $75 billion to ensure that we stop the spread of the virus by testing and tracing people. And I thank Speaker Pelosi for her tireless leadership. This bill would ensure public health departments use culturally competent and multilingual strategies to provide awareness of COVID-19, access to testing, and actually reach the people. The Senate must immediately pass the HEROES Act. The American people cannot wait another day. Thank you.
I want to thank the Speaker and the Whip and Chairman Pallone for putting this press conference together and for their steadfast advocacy in support of robust testing strategies. We're here today because our communities cannot afford any more inaction. Our communities cannot afford to wait while the Senate and Republicans ignore the crisis facing this country. And our communities know that we need national, robust testing that was included in the HEROES Act. Simply put, we need a plan. That's what the HEROES Act is so important. The bill lays out $75 billion to create a national strategy to increase testing and contact tracing, funding that is crucial in communities like mine in Southern California's Inland Empire. The lack of a national testing strategy by the Trump administration has led to a patchwork between healthcare providers, the counties, and the states, and our local communities. While our local governments are strapped more than ever, they're being forced to create a plan based on this pandemic. That's why the HEROES Act is desperately needed. Not only does the HEROES Act increase the testing capabilities, but the thoughtful strategy to help medically underserved communities like mine moving forward as we reopen our economy. We know that people of color are experiencing infections at a disproportionate rate, which has led to a higher rate of hospitalizations and infections and death in these communities. In a recent ABC News poll, 26% of Latino respondents said they know someone who's died of the coronavirus or complications from the coronavirus. And it's easy to understand why. In many parts of our country, Latinos overwhelmingly make up the service industry. This means that many members of my community are risking their health and safety every day as essential workers while our country struggles to reopen and while Senate Republicans do nothing. Latinos are more likely to live in multi-generational homes, increasing infection rates in the communities and within their families. That's why the HEROES Act includes grants for schools in underserved communities and requires reporting to Congress on the race and ethnicity of those receiving tests, hospitalizations, and other metrics that we know communities most in need can get the help that they need. Too often, communities like the Inland Empire are left behind, but the HEROES Act gives us a fighting chance. As the Vice Chairman of the Appropriations Committee, I was proud to play a role in getting this legislation through the House, and it's time that the Senate get back to work and do the same. And with that, I'd like to introduce my colleague, Deb Haaland from New Mexico.
Thank you all so much. Thank you, Speaker Pelosi, Whip Clyburn, and Chairman Pallone for your leadership in addressing the urgent need for a bold nationwide testing strategy. We all know that a healthy workforce provides for a healthy economy, but this administration has failed us. It has failed to ensure that at the least, all essential workers have the confidence to know that they will not contract this virus at their jobs. This administration has left states, cities, and tribes to fend for themselves, to fight for testing supplies, and has been unforgivably slow to ensure communities have what they need. Currently, Indian country is suffering a disproportionate number of cases because the agency charged with the health of Native Americans has been sorely underfunded for decades, in fact. And that's why House Democrats included $2.1 billion for the Indian Health Service in the HEROES Act. Currently, there are significant concerns by tribal leaders about testing machines across Indian country, giving an overwhelming number of false positives. The supplies to Indian country came way too late and have not caught up with the spread. For example, in Rapid City, South Dakota, the second most populous Native area, a tribally managed healthcare facility was only given 24 testing kits per week. The HEROES Act will provide $64 million for urban Indian health centers. On top of this administration's testing failures, the facts are that many Native communities don't have running water, electricity, or broadband internet service. This administration has not given Indian country what it needs to fight this pandemic or shown that it even cares. And at this point, I'd like to ask Leader McConnell, does he care about Indian country? House Democrats took action to make testing free, and now it's come to the time that we have to take direct action to ensure this administration meets the benchmarks to increase testing and contact tracing so we can reopen safely and responsibly. And I thank you all for caring about this issue. And I yield back to Speaker Pelosi.
Thank you very much, Congresswoman Haaland, Madam Chair. As you can see, my friends, whether it's California, Pete Aguilar, Illinois, Robin Kelly, New Jersey, Mr. Chairman, Frank Pallone, New York City, Grace Meng, Deb Haaland, New Mexico, Mr. Clyburn, Mr. Chairman, Mr. Whip, Mr. Clyburn, South Carolina. Is that all of us? And California as well. All over the country, we have the same message for the President. Mr. President, take responsibility. You heard that in every comment that was made. The refusal to take responsibility is taking lives, livelihood, and again, the vitality, the life of our democracy. This testing is the key. It is, you cannot cross the threshold inside to outside to open the economy unless you have this key, which is testing. I hope you had some appreciation for the breadth of knowledge, the depth of commitment, and the specificity of suggestions that our colleagues are making here today. They represent the concern of the House Democratic Caucus. More importantly, they represent the concerns of their constituents. Constituents who want, obviously, to open up, want children to go to school, want to be healthy. Testing, testing, testing. So I thank them all for their leadership, for being with us this afternoon on this nearly around 100 days since the first death, 100,000 deaths later. We've got to put a stop to it. Thank you all very much, and with that, be pleased to take any questions. Yes, ma'am.
Madam Speaker, understanding everything you're saying about testing, parts of the country are starting to reopen. We are seeing reopening plans. How soon do you think the country should reopen? How should we handle that? Is the president handling that correctly as well, especially regarding political conventions? Should we assume political conventions should go forward?
Well, let us say we all want the country to open up, but science tells us that there is a path, a healthy path, to open up in a healthy way. And that path is testing, tracing, treatment, and isolation if necessary. No, I don't think the president has handled it well. I don't even think he gives good example by wearing a mask, for heaven's sake. Not to protect him if he feels invulnerable, but to protect others. That's why we wear masks. The number of people who should be in church, a number of people who should be at any gathering, those are determinations that are made locally, and I respect that as we unfold this opening. I don't think there's anyone who would say at this point that tens of thousands of people should come together for a political convention, no matter how great an ego trip it is for somebody. It's dangerous for so many. So, but let's hope and let's pray that a vaccine is imminent, that a therapy or a cure is nearby, but they aren't. Testing is. Let's go there. Let's go there first. Yes, sir.
Madam Speaker, can you describe where you are with the status of these ongoing negotiations, obviously given the Senate Republicans' sort of flat-out rejection of the HEROES Act? And have you had conversations with the administration, with Leader McConnell? What is the state of play?
A week and a half ago, we passed on the floor of the House the HEROES Act. HEROES Act, we gave nearly $1 trillion to states and localities to meet the needs of their constituents, of their people, to meet the needs of the American people. It went to them to meet the expenses they incurred fighting the coronavirus and also for the lost revenue. A week and a half ago, we passed a bill with a great strategic plan, thank you, Mr. Palone, for testing. A week and a half ago, we passed a bill to put more money in the pockets of the American people. That was our offer to the Republicans, invite them to negotiate. When I read in some of my local metropolitan journals that it was partisan and nowhere to go, nobody said that when Mitch McConnell put forth his bill, CARES 1. Nobody said that when he put forth the next bill, right, Mr. Clyburn? The interim PPP. It was an offer. And we came, we negotiated, we turned those bills around, and we had bipartisanship. So I would like the same, shall we say, courtesy extended to the House Democrats for our putting forth our disciplined, focused, necessary legislation to kill the coronavirus, to open our economy, to send our kids to school, and to again, honor our heroes, our state and local workers, our healthcare workers, our first responders, firefighters, police, emergency services, transportation, sanitation, food service. Did I say that already? Teachers. The list goes on. Let's honor our heroes. Let's end this virus. Let's do that. And if they want to say no, I have news for them. The American people are on to this across the country, and my colleagues can attest. There's a drumbeat that says we need to do more. They need to do more. So my interest is with the message to the American people, send the Republicans in the Senate, that it's we cannot take a pause. We have to end the death, the dying. We have to open the economy. We have to do so in a way that gives more opportunity for access to care, to credit, to opportunity in our country. Because as Mr. Clyburn said, this is an opportunity. Every crisis is. Yes, ma'am.
Would you be willing to take the testing portion of the HEROES Act and put it forward as a standalone bill, the way you're doing with the PPP legislation later this week?
Our bill it has its oneness. It has its integrity. The only piece we took out was that PPP because really every day made a difference. It was urgent. So too with testing. If I thought that they would pass it, I would. I think that maybe they don't share our value on that, or else they would have done it themselves. So we have to use other leverage in the bill as we go forward. Yes,
Madam Speaker, on the topic of reopening, the mayor of D.C. announced they're going to start rolling back the restrictions in the District of Columbia on Friday. Does that play into your decision at all about ending the state of emergency in Congress and bringing the full House back as opposed to keeping proxy voting and so forth going on longer?
Well, we are pretty much fully, we have a large number of members who are here. Again, it's transportation, it's individual situations with the virus and with someone who might be in their home, who might be susceptible. But we're here, and for those who can't be here, we have the proxy voting. It is there for 45 days, starting today, right, Mr. Thompson? It's starting today, 45 days. If we see a need at the end of the 45 days, then we can extend that. But our timing was predicated on the Sergeant at Arms and giving us the signal that we could put this forward.
So you wouldn't end it sooner than 45 days if conditions in D.C. continue to improve? Or elsewhere in the country?
Well, let's hope and pray that they do, and then we can cross that bridge. We can cross that threshold when we come to it. Anybody? Yes, sir.
The House is voting this afternoon on this FISA
Excuse
bill.
me, just one second, if you hold on that. Any other questions and for my colleagues? Anything you'd like to say about any of the questions that were asked? Step up. Ms. Byron, anything? I don't think so. On the, whether we should take the testing piece out, whether what we think about the Republican. I said the same thing. That bill will never pass the House when they put forth their bills. That bill will never pass the House, right?
There's one thing I might mention, Madam Speaker. One of the things that we have in the HEROES Act is language, thanks to Frank Pallone, that asks the Federal Communications Commission to step up its allocations of billions of dollars that's already appropriated so that we can use this money now to do the broadband as necessary, Grace Ming talked about. Just South Carolina alone will reap $353 million. We asked them to do that by June 30th. And that is a piece of legislation that I'm going to be introducing along with Representative Upton of Michigan. That bill is being filed today because we think it's critical to spend out that money between now and June 30th because little children stand the threat of losing a second year of school if we don't have broadband available to them. And so the Speaker has worked with me, and we are going to propose that as a separate piece of legislation. Thank you.
Mr. Clyburn has been a champion working with, again, the Energy and Commerce Committee, Mr. Chairman Pallone, on this issue of broadband. It will be even more significantly put forth in our infrastructure bill, which we hope to bring up soon because it is so necessary. We thought it was necessary before, right? But then with district learning, with telemedicine, with so many things that are happening electronically, it's absolutely essential. We can have a whole press, well, we have had whole press conferences on that. So unless there are any other questions on testing, tracing, treatment, isolation? Yes, sir.
Thank you. The House is voting later today on this FISA
Yes.
bill, but you're no longer voting on a bipartisan amendment by Zoe Lofgren to limit the collection of internet search history. Why not? And if the underlying bill goes down, what's the recourse? What's your next move on that?
Well, we passed a bill a while back supported by the two chairs, Mr. Schiff of Intelligence and Mr. Nadler, the Committee of Jurisdiction of Judiciary. It passed in a very bipartisan way, actually a veto-proof amount, bipartisan, went over to the Senate. The Senate amended it in a very positive way. 80 senators voted for passage of the bill, 80 senators. Something like 30-some Republican senators voted for the bill. And it was more progressive than the House bill. The Leahy-Lee amendment took it to a better place, in my view. So that's the bill that's what is sent over to us. That's what we'll be voting on today. And if there if the members, Congress will work its will. If Congress doesn't want that, we have our original bill that we'll send back over.
But why not the Lofgren amendment? Why is that not being?
That is up to them. We thought that we might take up, that was under consideration. Then the Wyden amendment gives different things, and we decided that where the votes were to go with the. Look, my long history in intelligence going back to the early 90s, either as member, ranking member, or ex officio all these years, we have to have a bill. We have to have a bill, and we have to have it signed. The administration, Attorney General Barr would like nothing better than not have a bill. Then you don't have all these protections that are built into our bills, and that's really what is essential about having a bill. Otherwise, you could just have an extension. But if you want to improve the protections, because it's always about security and civil liberties, so security and privacy, that's the balance you have to strike. And that bill in the Senate goes a long way, and it is strongly bipartisan. So that is the Rules Committee reported that bill out today. It's up to others in terms of consideration of different amendments. Mr. Clyburn's the vote counter, but we salute Congresswoman Lofgren. Congresswoman Lofgren is a real champion of civil liberties in the Congress of the United States, and she's just been remarkable, a very senior member of the Judiciary Committee, and she really opposed the first bill that we passed. The Leahy-Lee amendment was a vast improvement over it. Although our bill was good enough, this bill is much better. We hope that it would be the bill that could get the signature of the President of the United States. But we can, all kinds of things have been considered. This is the path we'll be on today. Thank you all very much. Oh, yes, sir. One more?
I want to know your thoughts, Speaker Pelosi, on what's happening in Minneapolis with George Floyd's death and what should be done. Should the DOJ get involved?
You know, today we're talking about disparities and access to testing, disparities and access to health care, and the unfairness of it all. Mr. Clyburn began his remarks, as he usually does, talking about liberty and justice for all. This is such a tragedy. It's a crime. I feel so sad for the family, but also for just the community there. We had some conversations about this on our caucus call earlier today, and we have a couple of, some are hearings, some are forums and all the rest to continue that conversation and where we can go from here. There's a commission on the status of young African-American men. It's a bill in the Judiciary Committee that we've been talking about now, and all of a sudden, all the more necessary. Congresswoman Frederica Wilson has been talking about that for a while, including intensely yesterday and this morning. So it breaks your heart. It just breaks your heart. It's so sad, but there has to be liberty. There has to be justice there. Mr. Clyburn, may I yield to you on this?
Well, let me first of all thank you, Madam Speaker, and I thank our former colleague, Vince Ellison, Keith Ellison, I'm sorry. I saw him and listened to him last night, expressing tremendous amount of regret of this. It's kind of interesting. I spoke of Senator Rubio's comments in the Washington Post this morning. That my memory serves, the commission on young males, etc., that the speaker just spoke about. I think he mentioned that in his article, not that one I read this morning. And the necessity for us taking a look at restructuring. And we started in a bipartisan way. One of the things that we have worked with here, Democrats have worked with this administration on restructuring some things in our judicial system. In fact, Senator Klobuchar last night mentioned the fact that when she was the prosecutor, she followed what was the structure in place at that time, and she said, we got to change that. We got to restructure. I just think that we ought to really take a look at this pandemic, look at everything that's happening around us, and let's admit the fact that it's time for us to restructure some things in our society. We got to restructure things so that we can build out broadband, so that local, low-income communities, rural communities can receive the greatness of the society. We got to restructure things so that we can have online education for our children. We can have telehealth for rural and low-income communities. That's the only way to make the greatness of this country accessible and affordable for everybody. And justice is really at a threat in this country. And Rubio talks in this article about how if we do not do this, he sees real calamity in the not too distant future for our country. I've been seeing it for some time now, and that's why I've been silent this morning, because I go out there, I talk to people, I stop on the street corners. When I walk up down these hallways, I nod at the speaker and to Frank, but I spend time with the people who are scrubbing the floors and moving the furniture. I talk to them about their children. I talk to them about what their experiences, and I can tell you, we have got to do something to restructure things.
I know that you do that, but do they call you Mama? They call me Mama. Let's just close this by just mourning the loss of 100,000 people. Grace mentioned that such a large number were from New York State and how Elmhurst Hospital in her district was affected. Let's also just remember all those people in nursing homes. Like 40% of the deaths, I think, are in nursing homes. So very, very sad and heartbreaking for families. And of course, with me, it always comes down to the children. We want to be sure that when these people go to work, that they have the PPE and that they are tested so that they know when they come home, their children will be safe. I just close with the story Tlaib, Rashida Tlaib, Congresswoman Tlaib told the day we were passing the CARES Act. She showed a picture of a beautiful little 5-year-old girl who just died of coronavirus. Her father was a firefighter, her mother a police officer. What's the question? How did she get this? And of course, they're big advocates now for testing about that. 5 years old, bringing home to the children. So we've got to stop this vicious thing because it's taking from our children, our parents, our grandparents, whatever, and everybody in between. And we have a responsibility to get the job done. That's why we say to the president, stop making excuses, take responsibility. That's what the president of the United States is supposed to do. In the meantime, thank you, Frank Pallone, for the wonderful legislation. We hope to soon get it passed into law, one way or another, and make a big difference for our country. Thank you all very much.
Good afternoon or evening, everyone, depending on where you're watching Fox News Now from. It's 3:46 here in Phoenix, Arizona, 6:46 there on the East Coast, Washington, D.C., in particular, where we're witnessing the first family on Marine One heading back to the White House after heading down to Florida for a scrubbed launch today. But that is A-OK. We're already discussing plans if the launch happens on Saturday to be able to stream it all for you here on News Now. Hope you all are having a great week, a great day so far. While we're watching Marine One take off here, I do want to let you know the unfortunate news that Nancy Pelosi just mentioned in that news conference that we were showing you all. Yes, the United States has surpassed 100,000 deaths as a result of COVID-19 here in the United States. I'm kind of repeating myself, but it's a stark reminder that we are still experiencing this pandemic. A lot of people are still being impacted, families, friends, loved ones, despite the fact that a lot of communities, a lot of states, counties, cities are reopening. The stay-at-home orders are being lifted. Lots of people are still being infected, and unfortunately, a lot of people are still dying as a result of the coronavirus. So yes, here in the U.S., we have surpassed 100,000 deaths. That number standing at 100,047 to be exact from Johns Hopkins University. Now, the states that are most impacted: New York, New Jersey, Massachusetts, Michigan, Pennsylvania, Illinois, California, Connecticut, and Louisiana. So again, Marine One back in the D.C. area, taking the first family to the White House. In just moments here, I'm going to take you out to the state of Washington for an update from Governor Inslee.
Ready? Good afternoon. When this COVID crisis began, we knew the only way we would have to fight in the first battle against this virus was to essentially prevent us gathering. We knew this would be a challenging time. We knew that we would all have to find new creative ways to go about our lives so that we could jointly attempt to corral and suppress this deadly virus. And we know that in Washingtonian, many Washingtonians, their way is the way of the Spirit. We know that people treasure religious gatherings. So this has been a difficult issue about how we simultaneously defeat this virus and maintain our congregations. And as I've said before, this crisis may affect our physical connections, but we should not allow it to stop our emotional connections. And that is one reason why we deliberately made our prohibitions in this area flexible as to meet the needs of different organizations. So I'm pleased today to announce that we will be able to ease some of the restrictions on religious gatherings in a safe way as our state continues on this journey forward. During this time, in the last couple of months, it has been very heartening to see religious congregations find ways to remain emotionally connected through electronics and otherwise. It's also been really inspiring to see many of these organizations be very active in helping their neighbors, not just those that are in their congregations. But today I'm pleased to be able to announce new additional guidance for religious groups, both in Phase 1 and Phase 2 of our plan to reopen Washington. I'm joined today by three religious leaders who will have some comments. They're Anila Afsali, he's Executive Director of the American Muslim Empowerment Network of Puget Sound, Rabbi Yosef Shrox of the Chabad Jewish Center of Olympia, and Bishop Shelley Bryan Wee of the Northwest Washington Synod of the Evangelical Lutheran Church in America. Now, we're going to announce some measures, but I do want to encourage people, if they can continue their creative ways of congregating that have been successful for them already, that would be great. So here's what our new guidance would state. For in-person services, the following activities with the appropriate health guidance can be safe to begin with. First, in Phase 1, and essentially this would be allowed throughout the state of Washington right now. So right now in Phase 1, outdoor religious services can be held on the organization's property or immediately adjacent, up to 100 individuals using face coverings. And congregations will be able to do this multiple times during the day. For areas of the state that are now in Phase 2, and that is increasing, indoor religious services will be held at 25% capacity of the facility or 50 individuals, whichever is less, again with face coverings. And again, that can be held multiple times during the day. Also, for those counties that are currently in Phase 2, In-home services or counseling at a person's residence with 5 total individuals or less are now going to go forward. And if these gatherings include people from outside one's household, everyone involved should wear face coverings. Now, these numbers exclude staff, not volunteers, needed to run the service. There are some broad aspects of this. Well, the religious services covered in these new guidance include all worship services, religious study classes, religious ceremonies, religious holiday celebrations, weddings, and funerals. This also means there's no limit, as I've said, on the number of these events that could be held throughout the day. Now, there are certain parts of our services we'll need to defer for the moment, including some choirs. Singing in the congregation is allowed, but with face coverings. And this is because the science has been pretty clear on this, that this virus is transmitted, of course, through our exhalations. And the louder we project our voices, the farther this virus travels. So we're also encouraging congregations to see if they can maintain a voluntary log of attendees at these services and try to retain it for a couple of weeks. This is volunteer for the folks who want to volunteer their information. And the reason for that is if an outbreak occurs, and we have seen this, unfortunately, in our churches, certainly we saw it in Skagit County, this information can be really critical to help these congregates get knowledge about their potential exposure so that they can protect themselves and their families as soon as possible. We think that makes sense because I think it's common to the texts of all faiths that we have an obligation to care for one another. We know that we have seen a lot of creativity. We know that will continue, and we have found ways for organizations that can meet the safe way of meeting, and we appreciate the things that have been going on already. Now, there are some things that make common sense and follow the science right now that we're asking folks to abide with. First, we of course need physical distancing, and that means that we really need a full 6 feet between pews and between seats in all directions, or where people stand, and they need to be identified by markings to help people really understand the distance we need to keep for each other during the services, and of course we need to wear face coverings. We need to make sure that employees are educated about COVID-19 and how to prevent transmission. And that includes teaching employees how to self-screen for symptoms so that people don't come in as an employee of the church and unwittingly spread this virus. Organizations will need to cordon off, clean, and disinfect areas where someone who has had potentially COVID-19 has been positive have been. And there are some good CDC guidelines about how to go about that. We also need organizations to provide the personal protective of equipment for their employees and ensure hand washing and frequent house cleaning to sanitize facilities. Soap and running water works with all faiths, I'm told. So there are additional details in the guidance we're releasing today, but that's a quick run through. And now I'd like to turn to some comments to Anila, Yosef, and Shelley. And let's see, would that Anila start our comments? Are we starting with Anila? Yes. Anila, thank you for joining us, and thanks for your help with the broader community. We've had many discussions, and we appreciate our discussions with all the faith communities.
Yes, absolutely. Thank you so much, Governor Inslee, for your leadership. And assalamu alaikum, peace be upon everybody. My name is Anila Afzali, and I'm with the Muslim Association of Puget Sound, or MAPS, and also on the Faith Action Network board. Based in Redmond, MAPS is the largest Islamic center in Washington, serving over 5,000 families across Puget Sound. The Muslim community recently completed the beautiful month of Ramadan. We celebrated Eid. Our mosques are usually bustling with activity during these times, with people praying, breaking fast together, and celebrating. This year, of course, was very different. We missed out on so much of the communal aspects of these blessed days, even though we did what we could with the restrictions. MAPS was the first mosque in the nation to make the difficult decision to cancel our Friday services. And we did so recognizing that we don't worship our places of worship. We worship God, and we are commanded to preserve life and uphold community well-being. The Quran states that if anyone saves a life, it shall be as though they saved all of humanity. And of course, there is a strong desire among Muslims to return to our mosques. Our hearts are longing for that. But we want to do so in a safe way without sacrificing the most vulnerable. So we welcome the new guidelines today as a step in that direction. And we look forward to continuing work with the governor's office and county officials to preserve human life and health as we find ways to safely reopen our places of worship. We cannot wait to be in phases 2, 3, and 4, inshallah, God willing. But in the meantime, because our faith values also manifest in service, we continue helping our neighbors in need. Like other mosques and Muslim relief organizations, MAPS through our MCRC program has been providing crisis relief, including distributing over 85,000 pounds of food to the hungry, providing over 125,000 in rent and utility help, free virtual medical services, and more. And we will continue to do that. We stand ready and committed to do our part to support safety for all and serve the greater good. We are also contemplating how to emerge from this crisis in a way that ensures a new, better reality for everybody, because normal was not okay for so many people. And with that recognition, I send prayers to some of the most vulnerable right now, including those in prison or detention, those who lost their income, those who are not covered by relief packages, the frontline essential workers, and those directly infected with COVID, as well as, of course, the governor and his team and other leaders as they navigate us out of this crisis. May faith, wisdom, and heart guide us all through this. Thank you very much.
Thank you, Anila. Yosef.
Thank you. Thank you very much, Governor Inslee. Thank you, Anila. Thank you, Governor Inslee, for your bold leadership throughout this entire ordeal, being so dedicated to the preservation of life and sparing no efforts to keep all Washingtonians safe and healthy. You know, one of the things that this pandemic has brought to the forefront is the inherent and equal importance of every individual. The Torah, the Bible, teaches that when God created the world, all other species, animals, plants, etc., were created in herds by the hundreds and thousands, but the human was the only one that was created alone. And that teaches us that every person is like an entire world. And as the great spiritual leader, the Lubavitcher Rebbe of saintly memory, once explained, that within each individual stands the entirety of the community, because the community is only complete when it is constituted by all its individuals, each with their own unique qualities, abilities, and contributions. And in the giant community that is our great state of Washington, as we faced a crisis, it was inspiring to see, especially under your leadership, Governor Inslee, how we all went to great lengths, closing our businesses, schools, and even houses of worship in order to save the lives of individuals. We may not know them personally, irrespective of who they are, because after all, we each share a divine spark. Every person in our great state is an entire world. My wife Rivka and I are blessed to co-direct the Chabad Jewish Center in the Olympia area, and we serve as the representatives of Chabad Lubavitch here in the state capitol. And your announcement today brings us great joy, as it is indicative that hopefully the worst is behind us, and it will enable our community to resume many of the core communal rituals that are central to our faith, and will enable us to draw good energies from one another, help us heal together, while still maintaining utmost care to ensure everyone's health and safety. And I imagine the news will similarly be received with great happiness by our sister communities around the state, especially with the timing of today's proclamation being just a few short days ahead of the major Jewish holiday of Shavuot. On Shavuot, we relive the giving of the Torah, the Bible, on Mount Sinai 3,332 years ago, through an annual public communal reading of the Ten Commandments. Now, of course, that couldn't have been possible this year without the decision you shared today. We plan in our congregation to go a little further than the framework you set in place today, and to add a few extra precautions, to be extra cautious, and my colleagues at Jewish communities across the state tell me that they will be doing the same based on their unique local needs and concerns. But at the same time, we remain steadfast in our commitment to be there in any way we can for the homebound and most vulnerable among us who are weathering this prolonged and challenging isolation, because although we may be physically separated, we are united as a community. I'm deeply grateful to you, Governor Inslee, and your entire team, those I interacted with, Rochelle Davis, Dante Payne, and I'm sure so many others who invested so much effort towards enabling a safe reopening of spiritual services. And may God bless you, Governor, with endless strength as you lead the battalions of elected leaders, public servants, frontline healthcare providers, first responders, and essential workers in the fight against the coronavirus. And may God bless this great state of Washington and all of its residents with health, life, and prosperity. Amen.
Thank you, Joseph. Before Shelley speaks, you just made me think of something I want to say, and that is that one of the great things about what the faith communities are doing here by acting safely, obviously they are protecting their own flock, their own congregation, the people who are in the faith facility with them, but they're protecting everybody outside of multiple faiths. You know, when a person in the Hebrew faith wears a mask that prevents the transmission from going out, that then ends up infecting a Catholic or a Muslim or any other faith, this is all truly an all faiths issue, because everything we do in the church is protecting everyone else of whatever faith or without faith, without the broader community. And that's why I appreciate the responsibility that has been shown by so many people in the faith communities. With that, Shelley.
Thank you. God's peace be with you. Like so many faith communities, we in the Christian church yearn to be back together again. As a pastor and as a bishop, my calling has been to gather faithful people and share the message of Jesus Christ. I did not accept God's call to ministry in order to tell people to not enter church buildings. But this is a strange time. As one of 3 Lutheran bishops in the state of Washington, serving in the Evangelical Lutheran Church in America, partnering with over 300 congregations, we continue to wrestle with how we are the church in the world today. You see, as Christians, care of neighbor is what frames our daily walk with Jesus. As leaders, in order to uphold the sanctity of life and protect the most vulnerable, we need to take into account that what is safe in one part of Washington is not safe in other parts. We have to hold in tension liberty and safety. Governor Inslee, I thank you so much for your careful work in establishing guidelines. And I know this has been difficult for you with the many voices you have been hearing. I think that what you are recommending holds the desire to gather and to be safe well. I would caution that as these guidelines are followed, we need to be mindful of the numbers of cases of COVID in the part of the state that we are in, the ages of the people who are worshiping, and the best practices established by the scientific community so that our worshiping communities do not spread this virus further. In the northwest part of Washington where I serve, which includes the most cases of COVID deaths in the state, I will prayerfully continue to encourage online worship, and I will patiently wait with expectation and anticipation for the day we can all gather safely in person again, when all can gather, from the most healthy to the most vulnerable, and we fill church buildings to overflowing again. I faithfully believe this is true. I strongly encourage that as people begin to gather again using the governor's guidelines, that good protocols are in place so that all are protected. As Christians, we're committed to following Jesus Christ, loving our neighbor, and we continue to be informed by the scientific community. Remember, my Christian sisters and brothers, we are being the church now. We are worshiping now. We are loving our neighbor now. We are the body of Christ now. We are being church in the world now. And God's Spirit is here. May all that we say and do reflect the love of Jesus Christ. Thank you.
Thank you very much. I appreciate it. I should note that this guidance followed many conversations with multiple congregations in the faith community, and I found a commonality in the discussions with them because regardless of their faith, they all share a commitment to their fellow people in the state of Washington, which we appreciate. So with that, happy to stand for some questions. Oh, yes. No, I think there's a few more things the state needs to know about before we stand for questions. First off, I just want to make sure people knew that our Department of Health has approved 7 more counties to move forward to phase 2. This morning, that was added to that group, Thurston, Walla Walla, and Kittitas. That means that 24 counties have been able to transition to phase 2 in our 4-part Safe Start recovery plan. Clallam, Kitsap, and Klickitat are eligible to apply. They have not applied for a step forward. We think that may be forthcoming. The variance application for Clark County remains on a pause for further discussion because they've had an ongoing outbreak investigation that we are in the middle of taking a look at that county. We hope things are able to improve. We remain hard at work determining our next steps forward as a state on June 1. We're going to have more details to share with you in the days to come. But I do, as we've been clear now for some period of time, we do not believe that every county will be able to move forward at phase 2 on that particular date. We'll have more to say about this in the next few days. We know we've made tremendous progress in our state. We've remained united, and I look forward to continue to be united in this step forward in our state's onward quest. With that, happy to stand for his questions.
First question comes from Rachel with AP.
Looking at the phase-in process, some counties that are still in phase 1, like Skagit County, have argued that the state's eligibility metric makes it impossible for them to advance, and that the metric should be based on evidence of broad community transmission and not include cases related to close familial contacts or clusters like nursing homes. So are you considering broadening those metrics for some of those counties as we move forward? And then also related to the guidance you just issued, if there currently isn't a statewide requirement for face coverings for places like grocery stores, why require them at religious services?
Yes, well, we're going to have more to say about face coverings probably either Thursday or Friday. So we will be having some requirements for enterprises to encourage the use of face covering in retail establishments. This is very important because the science is now becoming abundantly clear that face coverings can really help reduce transmission. They can help make sure that when I wear a face covering, I protect you. And as you know, when you wear a face covering, you protect me. And so this is a demonstration of our commitment to our neighbors and the folks in our grocery stores. To wear a face covering is a substantial benefit. So we'll have more to say about that probably Thursday or Friday. We do know that the facilities in our faith communities can be very ripe for transmission. We saw dozens of people in one choir practice in Skagit County, in part because we know that singing is a very vibrant activity that moves that virus around, where people are close to one another for sometimes an hour or more, unlike retail establishments where it's a little shorter period of time. So it is a little different environment. And we're finding that people who want to follow the science realize that this is simply a simple thing that we can do. And it ought not to be a partisan thing either. I've been inspired by Republican governors, DeWine in Ohio and other Republican governors, who've said, look, this is just a common sense thing. This is not an ideological statement. It is a statement of caring for your neighbors. So that's our thinking on this. As far as broadening the criteria, we may have more to say in the future, but today we've established some criteria as we go early. There could be changes at a later date. We are still considering those. We look at this science literally on a daily basis. Yesterday, we had our most recent briefing from the Institute for Disease Modeling, which was very helpful. There was some good news in that, and we are still continuing to think about the criteria going forward. So it is possible that there will be some changes, and those changes will be based on science that we're still learning literally on a daily basis. So we'll have more to say about that in the upcoming days.
Next question comes from Joe with the Seattle Times.
Two-part question, Governor. Number one, do you stand by your Employment Security Department Commissioner Susie Levine in light of the hundreds of millions of dollars last year to fraud groups in unemployment payouts? And number two, has there been any discussion about having some counties like King County or Snohomish or Pierce make their own decisions starting June 1 or after to when it's safe to reopen?
Well, what I stand against is the moral outrage of this international conspiracy that turned the virus of COVID into the virus of crime. And these criminals deserve our scorn and our condemnation and our righteous anger. And they ought to be pursued, and they will be. And the department now is involved in a very vigorous effort. And they've taken quite a number of measures, which obviously we don't disclose so that the criminals don't learn about our activities. But I can tell you that they've been very vigorous. There has been some success in the over hundreds of millions of dollars that have already been recovered because of these vigorous efforts. And we thank some of the law enforcement activity that's been involved in that. We know that we are not the only state that has been attacked, unfortunately. And we know that not only are these people to be lambasted with the strongest language we can imagine for taking public money, but also because they've delayed our ability to pull tens of thousands of Russian right now who are waiting to get to unemployment. That process has been delayed not only now because of the tenfold increase of claims, but because of the necessity of fighting these criminals. Now, I can't see vicious activity of a person do to another person in the middle of blacks. So I stand against them, and we're doing what we can. A question about, we got another question about, what's your first question?
There's been discussions about having individual counties take decisions when it might be safe to reopen phase 2.
Well, in some sense, do have the ability to maintain their own restrictions. They do have that ability. In fact, we Kittitas County to move to phase 2, local officials could maintain their own health restrictions, would be more so they to do that. We need to have some slide minimum standard for this. These things can run across very quickly. The difficult part of this, I think, for all of us, or many of us, to really grasp is we have knocked down fatalities. Fatality is a tragedy. We've reduced that significantly. We've seen the rate of fatalities go down. We've had a little reduction in the rate of infections and a little reduction of the rate of people who are hospitalized. But the evidence remains clear that this can spring back very quickly. I think there was just today I read, it may have been in your newspaper, Joe, about some assessments about the King County situation, which is to some degree the true in many counties across the state, that we need to replace, as we remove the social distancing, we need to effectively replace that with another weapon. And that weapon is the weapon of testing, contact tracing, and isolation. And we need to make sure that those weapons are in place and usable at the same time that we remove these social distancing rules. So the state appropriately is making sure that we have that in place as we move through these phases, and we are doing that. So I think that we are on the money. We've made substantial progress. We have, many counties right now. I don't know the exact percentage, but it is a significant proportion of our state that are now. We have 24 counties now that are transitioning to phase 2, and several in the process of making applications. So we're making real progress in our state. That should not be forgotten.
Next question comes from Alex with Cairo.
Yes, 2 questions, Governor. On unemployment, for people who are being told that it's going to take months for them to get their unemployment checks, but the rate really do now. What's the state doing now? Considering the first protections of the Constitution, why do you feel that you have the...
All right, everybody, the choppiness of this video came from our sister station KQ13, up in the Seattle area. So it's almost over. Just want to give you a heads up. But yes, this is from the record from earlier.
Nuts not being able to get your unemployment compensation. I don't want to sugarcoat that at all. waiting the month to get that check. Now, some of those claims, there are real questions about them, but one way or another, we get them adjudicated. So the department is doing everything possible, increasing the capacity of the department to process these claims. And unfortunately, many of the claims come in with information that make them raise questions about whether they're legitimate claims. And so that's an adjudication process. It's quite labor intensive where people have to ask questions and get them answered to figure out if those claims really ought to be paid. So what the department is doing is dramatically increasing their capacity to do that. They've hired about 500 people already in the last few weeks, with another 300 coming on in the next couple of weeks, I believe, to have more people to adjudicate these claims. They've also come up with a plan to go through the administrative personnel and the technical support personnel that are necessary to significantly increase the capacity to process these claims. I just saw the dashboard on the status of those efforts today. It's very comprehensive, and it involves hundreds of people. Now, this frustration, let's recognize why this frustration exists. It exists because we got hit by an unprecedented event that has not happened in the last century in the state of Washington, which has increased the number of claims by a factor of 10. And I think people, even though it's frustrating, hope can understand that that's going to present us all with difficulties. So I just want to tell you, this is intensely a priority for me, and I make sure that we do everything we can to increase that capacity as quickly as we can. Now, the department has also done some things from a technical standpoint to increase its capacity. One of those things is to bifurcate the input of email and other traffic that comes in between those who simply ask questions and those who have claims, so that we can have a more intense usage of personnel to help those people who really have claims. So I spoke to to Susie Levine this morning about that. She thinks there's going to be significant
All right, good thing we go with the flow here on News Now and on coronavirusnow.com. That feed, well, the video was almost over anyway, but it just cut out on its own. Sorry about that, everyone. We're taking a live look at New York City. This is Midtown Manhattan, right outside of the Fox News headquarters there across from Radio City Music Hall. I have been here a couple times, and I really enjoyed it. I like New York City a lot. It's not the same New York City that I visited. You see the empty streets there, but slowly but surely, life is getting back to normal. But with all the loss of life and all the cases they've had in New York, they're still taking precautions as best they can. But more people are starting to come outside of their homes and start to enjoy nature a little bit. The weather looks quite nice out there right now. I'm going to take you out to the city of Detroit next on News Now and on coronavirusnow.com for their update from earlier today.
Deaths was yesterday. And again, I will take you through the numbers to see what we're doing. Are we going down from week to week? And again, as you can see, from 255 deaths 5 weeks ago to 169 to 100 to 71 to 42 2 weeks ago, 21 the last 7 days, and at least as of now, last Friday, we still don't have any deaths reported. And we're never 100% sure the way some of this reporting filters through. But everything we're doing is continuing to work. A week ago, we extended the fairgrounds testing to every single resident of the city of Detroit. And what I'm going to show you now will give you a sense of why I think I've been about the luckiest mayor in the country. There are few places where the citizens have embraced social distancing and masks like the city of Detroit. And so We've now done, we're upwards of 40,000 tests we've done, but I can see every day exactly what's happening. And every day we know what percentage of the people test positive and where they're from. When we started out, we were running testing positive 40 to 50%, everybody who came to the fairgrounds. Back then, we were only testing people with symptoms who had prescriptions. But if you look at basically late April through the first week of May, and about 12% of Detroiters were testing positive, and about 8% of suburbanites who came through the fairgrounds. But an interesting thing has happened, and you see it driving around this city. Detroiters have embraced the distancing. And what we have seen for the last 2 weeks is the rate of infection of Detroiters is now less than that of suburbanites. And so right now what we have is this, about 4% of Detroiters the last 2 weeks who have come through the fairgrounds have tested positive. What I believe that means is, as you go about the city, about 1 in 25 people in this city still have coronavirus today. Now, if you get in a group of 25 with no masks, it won't be 1 in 25. It'll be 5 in 25 or 10 in 25. That's how we got here in the first place. It's about 1 in 20 suburbanites in Wayne, Oakland, and Macomb County. But this will give you a sense of how deep the commitment has been. And if you just drive around the city and drive around the suburbs, you will see with your own eyes Detroiters have embraced distancing and masks at a way that reflects the value that we place on our neighbors' lives. And so now we feel like at the fairgrounds we need to go the next step. We recognize that we're part of a region. It was really important for us to make sure every Detroiter could get tested first. But the fact of the matter is, Detroiters go and visit the suburbs, work in the suburbs, suburbanites work and visit Detroit. We are one region. And unless we beat COVID-19 as a region, we're not really going to wipe it out. And so we've made the decision that starting today, anybody in southeastern Michigan can get a test at the fairgrounds. Don't need a prescription, don't need any money. You can get a free test at the fairgrounds. We want anybody in southeastern Michigan who needs one to come out and get one, but you have to get an appointment. And so if you call 313-230-0505, you will have an appointment in 24 to 48 hours. And we will be out there 6 days a week to test you. If you're a resident of the city of Detroit and you don't have transportation, we will get you a ride. It's a $2 ride in the specially outfitted Honda vans to keep you safe. If you're from the suburbs, you're going to have to arrange your own rides. But Detroiters, the ride service is still there, a $2 ride, and if you don't have the $2, we'll take you anywhere. So there's free transportation available to Detroiters. Suburbanites have to have their own ride, but as of now, the fairgrounds is open to anybody. There is no reason that anybody in southeastern Michigan, whether you have symptoms or not, and I'm going to keep saying this, most of the people with COVID-19 today probably do not have symptoms. It's been spreading because it is spreading from people who don't know they have it. It's why these masks are so important. It's why this national debate is so silly. If you have any regard for your family and your neighbors, you should be wearing a mask. It's to protect them, even if you think that you are healthy. And so I'm glad that we have progressed to the point where we can do that at the fairgrounds, and we can handle 1,200 tests a day. I'm confident we can handle everybody that is scheduled. Normally at this briefing, I stick pretty much to COVID-19, but there's another disease in this country that's been with us a lot longer than the coronavirus. Last February, a young man by the name of Ahmaud Arbery was jogging in Brunswick, Georgia. He was killed. And for 3 months, the Georgia police and Georgia prosecutors did nothing about it until a video surfaced that forced them to, and that video showed that Mr. Arbery was murdered. And as this country was absorbing those very disturbing images, on Monday, we saw George Floyd, a man in Minneapolis who they said was suspected of being a forager. And we watched the life be choked out of him by a police officer who continued to put his knee on his neck, even when the people around said, "You're choking him." And the claim that the police had made that he said resisted arrest, if you saw the video that was released today from the nearby store, cast serious doubt on whether he put up any resistance at all. And in its own way, a video that was just as chilling came out of New York City in Central Park, where a white woman who had been walking with her dog off the leash, clearly in the wrong, and was politely confronted by a black man, opened her cell phone, called the police, and said, "I'm being threatened by an African-American man. Please send the police." And she did it in full confidence that because she was a white woman, even though she was lying, that she expected when the police showed up, they would believe her over a black man. If these stories don't break your heart, you're not human. And for anybody who thinks there is not a racial problem in this country, think about the way black men are being treated in these very different parts of the country, Midwest to South to New York. In one case, we watched a man have the life choked out of him by a police officer who was acting with complete indifference to Mr. Floyd's humanity. In another case, the police and prosecutor knew full well what happened and had no intention of charging the white men responsible for gunning Ahmaud Arbery down on a basis that they said he was trespassing. They had no intention of charging. And in one of the most diverse cities in the country, New York, a white woman had no doubt she was going to be believed by the police department over the man who she knew was black. These are issues that we struggle with here in Detroit as well as every other place in the country, and Chief Craig and I spent a lot of long conversations the last few days. He would be here right now, but he's on a large call with a number of young people that he committed to talk about these issues himself. But he's been talking about the fact that when he became a Detroit police officer in 1977 in a largely white department, his first week on the job with a senior white cop, and he was so excited to be sworn in as a police officer, gets in the car and the cop says to him, "Don't talk, don't touch the radio. I don't want you here." Since 1977, Chief Craig has been fighting discrimination in law enforcement. He's really devoted his life to it. And when this last incident occurred, he made sure the video in Minneapolis was circulated all through the department as more training to try to prevent this. And we had a terrible incident in January last year in the 6th precinct where a woman's car was towed and she walked home in the freezing cold, and the officer was so insensitive. Not only did he make just vile racial comments, but he didn't think there was anything wrong with posting them on social media. And the chief went in and restructured everything in that area. It is an ongoing fight. And I said to him, if there's one thing that we could do to be
All right, everybody, I'm going to take you out to the city of San Diego, California, our neighbors to the west, because they're providing a coronavirus update live now.
To the books we read, the performances that we watch. But our arts community has been hit particularly hard. Venues have been shut down. Audiences are staying home, of course, and nonprofits have been forced to cut back. But local artists, just like the rest of us, they've been feeling the pain of this pandemic, but their spirit is so incredible. And here in San Diego, we've had a thriving arts and culture scene, and we want to ensure that it continues, and we continue that this scene is even bigger and better than when we get on the other side of this. To that end, and to support our local artists, we are announcing today that we have $1 million in arts funding available to help. This funding comes from private donations and a small fraction of developer impact fees that are earmarked for public art projects. We're going to distribute this funding through two separate $500,000 initiatives through the city's Arts and Culture Commission. Both initiatives are going to support local artists while fostering a love and appreciation for the arts across this great city of ours. The first initiative is called SD Practice, which will support local artists through the direct purchase of artwork. This puts money into the hands of our local artists while at the same time expanding the city's civic art collection for all San Diegans to enjoy. This initiative is made possible through a $500,000 gift from the late Thomas O. Rasmussen, who spent his life admiring and collecting temporary art. The second initiative is Park Social, which will call on local artists to create projects that reflect the natural beauty of our amazing parks in San Diego. The goal is to create moments of reflection throughout our park system with these works of art. Park Social is made possible through a family bequest and the fees developers pay through the city's Public Arts Fund. I want to thank Jonathan Gless, who is here working on these important initiatives and really helping to find new opportunities to showcase our local artists, who we are also very, very proud of in San Diego. Now more than ever, we have discovered the importance of arts connecting with each other, finding obviously meaning, purpose, and just the ability to get out there and just experience new things. We look forward to implementing these two programs to support our artists and to bring some smiles to our public spaces. And with that, I'd now like to invite Jonathan Gless to say a few words. Jonathan?
Thank you, Mayor. So I'm very pleased to be here today to help the mayor announce these two initiatives. These are not just $1 million in funding. These are really unprecedented in scale in San Diego. And they're going to be a game changer for the way that artists in San Diego interface with our community. As the mayor said, there's two initiatives, SD Practice and Park Social. SD Practice is going to allow us to directly acquire artwork by San Diego artists. Our city's collection is more than 800 pieces large. We have pieces that date back to the early 20th century. And very importantly, in these days, the collection was really built by artworks from the WPA era, during the Great Depression, with the federal government invested in artwork by national artists. And these artworks became part of city collections across the country. We still enjoy those artworks here in San Diego. SD Practice is going to allow us to build on that tradition that was started almost a century ago in creating a collection in the city of San Diego that, very importantly, is not just of the highest quality, but a collection that reflects the cultural and ethnic diversity of our city. That is one of our primary goals with this collection, is to make sure that when we have finished acquiring these pieces, we have a collection that not only is in every city council district, but also looks like San Diego. We're very excited about this opportunity. Park Social is going to allow us to contract up to 18 artists to do site-specific projects in parks across the city. Beaches, trails, formal parks, neighborhood parklets, we'll be able to create projects across the city in parks, excuse me, in our park system. Really importantly, not only is it going to be in every city council district, but it's going to encourage people to travel throughout the city, not just in the parks they know and love, but also in parks that they haven't visited before. This is going to be a way for artists to be part of re-inviting us to our parks, as well as our tourists. So we look forward to working with our artists in the coming months to bring them into public space in a way that we haven't before. Thank you so much, Mayor, for allowing this opportunity.
Thank you, Jonathan, and thank you to not only yourself, but all the members of our city's arts and culture. This is going to be a welcome addition to art and culture across the entire city. Topic number 2 today, I want to congratulate our voices of our city choir on their phenomenal performance last night on America's Got Talent. I think a lot of the nation was taken by surprise last night as they really got to see firsthand the premiere of this phenomenal group. This very special group of current and formerly homeless San Diegans and community members shared their very moving experiences on living on the streets. It takes a lot of courage. It takes a lot of courage to get up in front of millions of people, and they absolutely delivered with an amazing performance. This morning I had the chance to speak with the executive director and co-founder of the choir, Steph Johnson, and congratulate her. She said the group was overwhelmed by all of the outpouring of support, and it really is, I think, going to help open the doors for the choir for so many other things. It sounds like they're going to be in high demand, and rightfully so. So on behalf of all San Diegans, I want to say how proud we are of the choir, congratulate them on getting the famous golden buzzer last night. And of course, that means they are now automatically in the finale of the show, which is set for August. Congratulations, and thank you to Voices of our San Diego Choir for continuing to represent our city and to make us proud. If you missed their performance, you have to check it out on YouTube. Topic number 3. Continue to share stories about how San Diego businesses are reopening in the right way. Normally, of course, I've highlighted how San Diegans are stepping up to help those in times of our great need. But as I mentioned yesterday, we're switching up a little bit this week and sharing stories about San Diego businesses doing things as they reopen across our city. Typically, what I want to talk about is how important the arts are to our city, but I wanted to share how in Scriptu and their pop-up urban art shop in City Heights are reopening safely to support our public artists. Typically, Inscriptu is a print company that offers laser engraving, digital printing, and custom design services. In response to the pandemic, they have opened up a mask and sign pop-up right next door to their location. And they hand out homemade masks, plastic face shields, and store signage in multiple languages to artists reopening businesses, all made by local artists. Assist those folks reopening their businesses. And as we continue to reopen retail and other services as part of a phased reopening plan, Inscriptu has installed strict social distancing rules. They've implemented curbside pickup. They've bolstered their online ordering and payment processes, really doing everything the right way. As I said, stepping up to help San Diego. So I want to thank Inscriptu for reopening, showing how it can be done to keep our community safe, and as we reopen and continue to reopen San Diego's economy. Thank you for that. I don't know if there's any questions on today's topics from members of the media. See you none. Thank you. Thank you, Jonathan, everybody at Arts and Culture, and I look forward to tomorrow's update. Thank you. Clear. Fast one today. Good job, guys. Thank you.
All right, everybody, we just lost that live picture. I'm going to take you back out to Detroit.
The same thing you see everywhere in the country. The more that a police department is staffed by people who come from the community, who reflect the community, the fewer of these incidents you have. we're going to be hiring 300 police officers in this city over the next year. And we got folks out here now who may have been furloughed from your job or laid off for your job, who maybe hadn't been thinking about the police department as a career. But if there's something in your heart that says you think you were meant to help people, and that you see everybody as having value, no matter who they are, we're hiring now. And so if you go to joindetroitblue.org, we'd like to see a department that continues to get built from this community. But I just wanted today the Arbery family and the Floyd family to know that we may be a long way away, but the heart of everyone in the city of Detroit is with them right now. As much as we share pain with each other, we also have to take the time to share success. And I want you to get a chance to hear from Crystal Perkins right now, because we have a section of this city that's almost underwater in the far east side, Jefferson-Chalmers, lowest point in the city of Detroit. We've got the highest Great Lakes and Detroit River water levels in 100 years. And that neighborhood was very much at risk of being underwater. And the law says it's the responsibility of the neighbors to build up seawalls at the back of their properties to protect their neighborhood from the flooding. But as we learned last summer, we got 25% of the neighbors who didn't build the appropriate seawalls. And there wasn't time to get them fixed before this spring's flood came. And so with the support of the Army Corps of Engineers, the city moved decisively. As you'll see, it's not the most attractive solution, but if you see the damage being done by flooding in other parts of the state, I think you'll agree that what we did was right. And the woman who's led this highly successful effort from the beginning and is nearing the end, I wanted her to show you what she's done and what your fellow Detroiters have done for the Jefferson-Chalmers neighborhood. With that, I'll turn it over to Crystal Perkins.
Thanks, Mayor. So last year in the Jefferson-Chalmers area, we experienced record level flooding. The streets were covered. The city vehicle I drive is a F-350, and the waters were halfway up above the tire on the street of Ashland. So last year, we experienced record level flooding. The NOAA, the National Oceanic Authority, has projected the levels to be even higher this year. And so far this year, we've already seen 8 inches higher in Lake St. Clair than we did in June of last year. Last year, what we did was, along with volunteers from the city of Detroit and the metro area, GSD workers, we filled in place over 400,000 sandbags. We went out here, we spent long days in the hot summer. We went out here 3 different occasions to make sure that we did what we could as a city to help mitigate the flood in this area. This year, we found a better solution. It's still a temporary solution, but it's more long-term than the sandbags. It's a little bit unattractive, but it's a better attraction than the sandbags. We installed a product called Tiger Dams. Now, we installed this product in over 350 residential properties, and then we also have one street that doesn't have any residential properties on it. Their bags are flexible to conform to the different configurations of the yards. There's some right angles we can make to make sure that we are bending and curving around the areas. The neighbors, so far the residents in this area, have seen tremendous difference this year. We had a rough weekend of rain and wind 2 weekends ago. And what we noticed in this area, that the Tiger Dams are doing what they are supposed to do. We started our project April 9th. We are near 85% completion. We expect to be on the last street, which is Riverside, next week. Residents will see us on Clink Island beginning tomorrow.
All right, and so thank you, Crystal. At first, I was getting some notes from people who didn't like the orange, and then after the dam broke at Midland and the Tiger Dam held in that stormy weekend, everybody texted back and said this was terrific. And so, Crystal, you and the team have really done a remarkable job. The way we have had to deal with a once-in-a-century pandemic is everybody's had to pitch in. And we've had enormous support from members of Detroit City Council, all of whom have in their own ways contributed. But Mary Sheffield has been relentless in going out and seeking donations. She used to work for the Wayne County Sheriff and had a particular interest in making sure the prisoners and the sheriff's deputies were safe. And she's been making sure that people in this community don't go without food. And she wanted to be here today to thank the donors that she's lined up that have helped so many Detroiters. Councilmember Sheffield.
Thank you. Thank you, Mr. Mayor. And good afternoon, everyone. I know this is my first time being here, so I want to first start off by just sending my condolences to every single resident here in the city of Detroit that has been impacted by COVID-19. I think oftentimes we report numbers and we see the data, but we forget that these are our community members. And for me, it did hit home when my father was impacted by this virus. In fact, many of my relatives have been impacted by COVID-19. And so I want to just send my heart and my prayers and condolences to anyone who has been directly impacted by COVID-19. And even in the midst of what we are deeming a crisis, I do believe that there is hope. There is positivity, and there is good things that are coming out of COVID-19. And so as I travel throughout the city of Detroit, I do sometimes see, people who have low spirits, who are, battling mental health, who are, taking this in a very hard way. And so I just want to be a sign of hope to let people know to keep your head up high. We are getting through this together, and I cannot be more proud of the individuals throughout the city of Detroit that I continue to interact with, particularly our first responders, our essential workers, who when I'm in and out of the grocery store, they're asking me, are you okay? Are you safe? Be safe. When in fact, we should be telling them to be safe, and we thank them for their service. So I want to also just thank our essential services, our frontline workers who are working in and out every single day to keep us safe, and just to lift them up and say thank you for what they're doing throughout the city of Detroit. I wanted to report on an effort that my office kicked off, which is called Masks for Inmates. We all know that since GM started manufacturing the mask here in Detroit, they've been providing them to the city for quite some time. But we wanted to request a donation specifically for the most vulnerable in Detroit, and that is our inmates throughout the Wayne County Jail. And so we want to thank GM for the partnership. We were able to donate over 7,000 masks to the inmates at all three jails. That is the Dickerson facility in Wayne County 1 and 2. We donated over 6,200 gloves and also over 200 face shields for the staff throughout the Wayne County Jail. And this, again, is not to slight or to say they did not have the PPE needed. We just wanted to make sure that they had adequate amount and that they had a sufficient supply just in case they needed extra masks and gloves and PPE. So, again, we would like to thank GM for that effort. And then lastly, we all know that our senior homes have been hit really hard. My district represents the most senior buildings throughout the city of Detroit. And so as we were in and out of the senior buildings, we oftentimes would hear how the seniors did not want to come out for food. And so we kicked off a program that we're actually launching today. And every single week, we're going to identify at least anywhere between 4 to 8 senior buildings. We will be pulling up in a U-Haul truck, and we will be dropping off fresh produce and also frozen meals to our seniors. Hopefully, we'll have anywhere between 200 to 300 boxes per senior building to allow our seniors the comfort of not having to go out if they don't have to. And so I just think it's important that we protect that population as well. They've been hit pretty hard. They are the most vulnerable in the city, and so we are excited to partner with DABO and other organizations to provide meals to our seniors. And we're also encouraging senior buildings to please contact my office if you would like to be put in the queue if there is a need in your building. Our office number is 313-224-4505, and we plan to get to every single building throughout the city of Detroit. Lastly, Mr. Mayor, I do want to thank your leadership. I want to thank the leadership of our Director of Fair and really everyone. I had the opportunity to go to the testing site, and I can say it was very professionally ran. I went one day and didn't feel like I needed to come back because everything was taken care of. And so what we're doing here in Detroit, I think, really sets the tone. I was on a national call with members, elected officials from all over the country, and I was able to see and compare what we're doing on the ground here to other cities. And I can say that I am quite proud of the leadership that we have here in Detroit responding to COVID-19. And before I close, I did want to touch on both George Floyd and Ahmaud Arbery and echo the sentiments of our mayor, but also say that not only do I think it's important that we hire a police force that represents the community, but we also want justice. I think most of us are tired of seeing this. We know that this is going on for quite some time. We want justice. And I'm just going to say that again, we want justice. And I commend every single organization that continues to effort around this issue. It has been ongoing in our community for far too long. It must end. And I'm going to end again by saying we want justice. Thank you, Mr. Mayor, for having me today.
Thank you, and you're absolutely right. This country needs justice. Councilmember, you're doing a great job, and thank you. Before I turn it over to Denise Fair to give you the statistics, this is the first time we've been here since we lost Fred Westbrook, and it's a reminder that even though the number of deaths have diminished, every one leaves a hole. But Fred Westbrook was the president of the Bus Drivers Union, who brought that union through bankruptcy, fought for them every step of the way, preserved the bus driver's job. I worked with him the first 4 or 5 years, and he had retired and did not get the opportunity to enjoy his retirement the way that he deserved as a result of this terrible disease. And I want the Westbrook family to know that the city of Detroit family is with you, and I know you're planning a funeral as soon as the governor lifts the limits, and if I don't put you over the limit, I will be there. And with that, I'll turn it over to Denise Fair.
Thank you, Mayor. So today we are reporting 10,902 COVID cases and 1,349 deaths from this virus. Now, while our week-to-week data is continuing in the right direction, we must continue to take precautions to protect ourselves against COVID-19. We are continuing to protect our most vulnerable citizens, our seniors. So we are now visiting senior apartments. We've now tested over 2,300 seniors in 36 facilities to date. And the infection rates continue to remain low, now at only 1%. So today we're going to go to 6 senior apartments, and those include Freedom Place Tower, River Towers, Teresa Maxis, University Meadows, and Village of Bethany Manor. So we are scheduling another 30 facilities between now and next Friday. And so if you look on your screen, you'll see that we are going to visit several more, and I'm going to read these. That includes Eden Manor, Evangelical Manor, Friendship Meadows, Garden View Estates. Let me get that slide back up. And if not, that's fine. Garden View Estates on Van Buren, Robert Holmes Teamster Housing, Jennings Senior Living, Camper Stevens, Sheridan Place 1 and 2, Woodbridge Senior Village, including Selden and Tower, Across the Park Apartments, Medical Center Village Senior, Orchestra Place, Philip Simmons, Gateshead Crossing, Oak Village Square Apartments, 8330 on the River, Riverbend Towers, Bellamere Apartment Homes, Forest Park Place, Orchestra Towers, and also Warren West Apartments. So we will be at those apartments over the next week and a half. Now switching gears to nursing homes. So recall that we tested 26 facilities, including about 2,000 nursing home residents in about 10 days. The infection rate was 24%. Since then, we've continued to retest all the 26 facilities, distributing PPE, providing education, and now, as of tomorrow, we would have finished retesting all those 26 facilities, and the infection rate is much lower than it was, about 5 to 10%. COVID-19 is not over yet. We cannot become too relaxed as the summer approaches. We've all heard the stories, and we've seen pictures of large parties and similar gatherings in other cities, which led to spikes in the number of COVID-19 cases. And I do not believe that we want to go backwards on the progress that we've already made in slowing the spread of this virus. So let's continue to be vigilant, and let's commit ourselves and encourage those who we care for, no matter what the weather is, to wear a mask, to wash our hands, to practice social distancing. This is pivotal. And even if you're at the workplace, it's really important to continue these precautions. COVID-19 is real. And we have to deal with the fact that this is our new reality. So let's do what we have to do to stay and remain healthy. And so with that, I'll turn it over to the mayor.
So one last thing before we take questions, and I just want to thank Elisa Maleo, Charity Dean, and the entire team that has run the PPE operation for the business startups. So we opened up for new businesses, or for businesses we're going to reopen on Tuesday. We opened up from 9 to 12 on Memorial Day morning. I didn't know who was going to show up. I went and showed up. 600 businesses came through and picked up their supplies Monday morning, so they'll open on Tuesday. Another 1,100 yesterday, and another 1,000 today. We're going to have 2,000 businesses, almost all of them small businesses across this community, open. And that's going to mean people going back to work. And I believe we are not that far away for seeing some type of limited restaurant opening. All of that depends on what Denise Fair just said, continuing to honor this. When I see groups of 25 and 30 people gathering outside of parties, stores, and gas stations, which we're starting to see a little bit of, if that continues to happen, this virus is going to spike back up, and the governor is going to shut us back down. And so as these businesses reopen, it is all the more important that everyone continue to honor the requirements to wear the masks and keep your distance, and we can start to get people back to work. And with that, we'll take questions.
Mr. Mayor, how would you rate the federal response to the coronavirus pandemic here in Detroit and in the state? And how do you think that the citizens of Detroit rate the federal response?
Well, I take it by agency. I don't see the federal government as a unifying thing. The FDA has been terrific. Dr. Steve Hahn has been enormously helpful in getting our test kits into the country, in getting the Abbott testing sets that we need. Dr. Redfield at the Center for Disease Control embedded a staff of 4 people with the Detroit Health Department. We led the nation in response to getting every single patient in nursing homes tested, and the CDC was a full participant. On the other hand, national messages that are divisive and telling you not to wear masks are enormously damaging. And so with some agencies of the federal government, we've been extremely well supported. I think in other ways, the federal government has not been helpful.
Mayor, we have just a couple of off-topic questions. One from the Detroit Free Press wanting to know if you have any updated response or reaction to the change with former Mayor Kilpatrick, with the news that he's not apparently going to be released from prison.
Yeah, I don't understand. I don't. There's not much point in this, but how could everybody do all these stories without ever getting a confirmation from the government he was being released? So I don't know any more than what I've read, but as I've said many times, my relationship with Kwame Kilpatrick is personal. It's deep. I'm not objective when it comes to him, and I hope he has an opportunity to contribute to the community. And when that day comes, I'm going to be supportive of him.
Okay, and last set of questions regarding a report from Bloomberg today that a company called Beximo, a mask face mask producing company, was going to locate in Detroit. And they wanted to know if you were aware of that, if you have thoughts on it.
Nothing happens by accident. So we are recruiting, and I've said this over and over, we're recruiting jobs into this city nonstop. This comes from a process we've been at for more than a year. A fella from Bangladesh by the name of Mashroof Habib, one of the largest denim clothes manufacturers in Bangladesh. And we have been recruiting him to open a jeans manufacturing site here in the city of Detroit. COVID-19 put a wrinkle in that, but he came together with some partners and said what we need to have manufactured right now is PPE. And so nobody picks Detroit at random. This is a result of Kevin Johnson and the DEGC team and our economic development team. But Mashroof Habib sat in my office for about 2 hours a year or so ago, and he's been texting and calling me, telling me he's coming back. And so I think there is a real opportunity to make clothes in America again. They're virtually all imported. They come from Ethiopia, they come from Sri Lanka, but we've seen this on the medical supplies. When we outsourced our medical supplies to other countries and all of a sudden we're in a pandemic, we're relying on other people to make what we need. And I think it's time we start to make clothes back in the United States, and we've been working on that for the last year or two. And I didn't expect that PPE would be the first plant that comes, but we're working on finding a site right now. And we're really glad to have an investment from really a fine international company.
Great. And one follow-up from Channel 7 on that same subject. Apparently, Beximo said that affordability and diversity among residents in and around Detroit were a couple of key considerations, and wanted to get your thoughts in terms of what you saw as Detroit's strengths in this process.
So I don't want to say too much, but all of the international clothes manufacturers, every label that you wear or that you know, is looking at this question of can they make clothes in America. And I have pitched them on the fact that we have a lot of folks out of work who are hardworking people by nature, willing to learn new skills, and would do a great job. And I have been pitching Detroit as a potential national center for making clothes in the United States. And so obviously that pitch I knew with Mr. Habib, we had convinced him when he was going to make his jeans. If this is the first one that comes here, and we do this is the reason that Fiat Chrysler came to Detroit for 5,000 jobs instead of going to Alabama, is we've got hardworking people who are ready to go to work. And I think this is the right place. If you're going to make things, Detroit is where you ought to come.
All right, that's the last question.
Right. Thank you all very much.
All right, everyone, we're taking a live look at the United States Capitol, in our nation's capital, Washington, D.C. Congress is at work, at least the House. They are voting. Matter of fact, let me find out exactly what they're voting on here. Because we were showing you their debate from earlier today, which was on FISA, but of course they were talking about coronavirus, COVID-19. So it appears, I'm trying to get some more info here. Yeah, they're considering the FISA reauthorization bill extending authorities through December 2020. Some members for the first time will be using proxy voting due to coronavirus. That means they are not physically present while voting. I'm going to take you out to Austin, Texas. They had sort of a Q&A today. I want to find out, I know it is coronavirus related, but I want to find out exactly what the conversation was about. Our sister stations all provide us this great content. Let's see here. This Q&A was about Austin Public Health question and answer session regarding coronavirus, COVID-19. So let's listen in.
I'm going to try to share the screen here. I'm going to ask our AV folks to share the screen so that it doesn't seem to be working on my end. So what I want to share with you is our data related to funding source for those individuals who've been hospitalized in the 5-county Austin MSA. And what this slide is showing you is a breakdown based upon insurance status. You can see that there's state insurance, there's federal insurance, there's private insurance. But I want to point out that 29.3% of those hospitalized in the MSA are uninsured. This is a substantially higher number than the percentage of uninsured in Travis County, which in 2018 was about 17%. So again, this is concerning for us, and it's concerning because folks who lack health insurance also lack access to other things which are determinants of their health. And I believe this is why we're seeing a higher proportion of these individuals who are being hospitalized in our community, because they don't have access to care. They have unmanaged heart disease and high blood pressure and diabetes and a number of other things that are going to impact the severity of their disease from COVID-19. Again, we can't solve all the problems that underlie our health status in this community right now, but it is a stark reminder that these things that go unmanaged through a lack of a national healthcare system, a lack of commitment to insurance for all people, are really impactful in situations like this. And it's certainly something that we need to keep in mind going forward, that we need to prioritize as a community, because it is costing all of us, and primarily it's costing these individuals in terms of their health and sometimes in terms of their lives. And I'll turn it back over to you for questions.
Okay, if there are no additional updates, I will invite our pool reporter to begin the Q&A portion of this news conference.
Thanks. This is Olivia Aldridge from Community Impact newspaper. First question is from my outlet. Austin Public Health has put out testing goals through December that show us hitting 40,000 tests in June and 60,000 per month between July and December. Can you outline how you expect to increase current testing capacity by about 500% by July and sustain that through the end of the year? And where might those tests be coming from?
So I'll begin to address that. So some of our testing goals are based on, there are some assumptions that we've made in developing what those goals might be, and that is that there's availability of tests to the community to reach that goal. Again, it is a lofty goal. It's something that we do in partnership with the community. We know that there are retail pharmacies that are coming online. There are also our other community partners like Community Care and the hospital systems that will also be providing some of those testing capabilities. However, we at Austin Public Health have our community-based testing available. We're able to ramp up to about 1,750 tests per day. And right now we are only seeing about 200 people per day, even though we've been doing a lot of media push to get people who may be underserved or people who are unavailable to get it through a traditional mean. It's an opportunity for the community to get free testing if they go to our COVID-19 test and take the assessment. We also plan on doing and looking at doing mobile testing and targeted testing. It includes that in that testing assumption.
Great. Next question is from Reporter Austin. We saw videos on social media from bars that did not respect the capacity and social distance guidelines this past weekend, but there hasn't been any news about penalties for doing that. Are you planning to respond if bars keep ignoring the guidelines?
The city of Austin has an enforcement group that is combined with Austin Code Enforcement, and the fire department. And so typically that it is a complaint-driven process where individuals would need to call 311. But then also when we are starting to see an increase in the number of folks that are being in public spaces, including being in bars, et cetera, our folks have the ability to go out, and we want to be educational and provide that information to them about the safety of how logistically they should set up their business. And our environmental health staff as well are a part of that team, which includes our restaurant inspectors. So we definitely are wanting to be more proactive and provide education to those individuals because we're concerned about the health and safety of our community. Thank you.
From Co-op Radio, Austin and Travis County's low contagion numbers have been said by Austin Public Health and the mayor to be the result of thoughtful individual social distancing. Has APH's view of this behavior changed since we began reopening?
I'll take that one. I think that we're all concerned about some of the increased risk-taking activity that we're seeing. You just mentioned the bars, and that's certainly an example of that. Anecdotally, we've heard reports. I've certainly seen a decrease in the social distancing and mask wearing to places where I have been. And it's important for the community to understand, and this message is getting very confused right now because we're in election year. And, I think in many circumstances, the public's being told you have to choose public health.
All right, everybody, they're no longer voting. They are debating on the House floor. I do want to listen in live here on News Now and on coronavirusnow.com.
46, the Law Enforcement Suicide Data Collection Act, which requires the FBI to establish a data collection program that gathers data on law enforcement and former law enforcement suicides at the local, state, and federal levels. We consider this bill today in response to a growing epidemic of law enforcement suicides in America. Tragically, more than 227 U.S. law enforcement officers took their own lives last year, an increase of more than 50 deaths from the year before. While law enforcement officers are tasked with the responsibility of protecting our communities and responding to often dangerous emergency situations, the number who have died as a result of suicide has, in recent years, exceeded the number of officers lost in the line of duty. My community has been particularly affected by this issue. Last year, the New York Police Department lost 9 officers in a deeply troubling string of suicides. With long, late hours, regular traumatic experiences, life-threatening situations, and work in constant proximity to firearms, law enforcement officers are at an increased risk for mental illness such as post-traumatic stress disorder, depression, and anxiety. A number of reports over past decades indicate that law enforcement officers have an increased risk of suicide when compared to the general public. While suicide is currently the leading cause of death for law enforcement officers, the nearly 18,000 law enforcement agencies in this country lack a unified reporting mechanism for collecting data on these tragedies. Without the proper information and statistics, law enforcement agencies and local, state, and federal leaders are hindered in their ability to educate, prevent, and respond to this epidemic of suicides. This bill directs the FBI to establish the law enforcement officers' suicide data collection program to prevent future suicides and to promote the understanding of suicide in law enforcement by collecting information from federal, state, and local law enforcement agencies. Data allowed to be collected pursuant to this bill includes details relating to both suicides and attempted suicides, including the circumstances and location of each event, as well as demographic information of each law enforcement officer and the method used in each incident. It is imperative that the law enforcement community, mental health professionals, Congress, and the American people better understand the extent of and the reasons for this crisis. The bill, therefore, also requires public reporting of the FBI's findings so that Congress and others can best support state and local agencies who are grappling with the day-to-day consequences of officer suicide. I am grateful for the bipartisan effort to address this important issue. In the House, our colleague, Representative Mike Quigley, authored H.R. 3735, the companion to this Senate-passed bill. I commend him, and I commend the bill's Senate sponsor, Senator Catherine Cortez Masto, for their tireless work on behalf of law enforcement officers and their loved ones. I support this bill. I urge my colleagues to do the same, and I reserve the balance of my time.
The gentleman reserves. The gentleman from Pennsylvania is recognized.
Thank you, Madam Speaker. I yield myself as much time as I may consume.
Gentleman is recognized.
Madam Speaker, I rise in support of S. 2746, the Law Enforcement Suicide Data Collection Act. Last year, Congress passed and the President signed into law the STOIC Act, a bill that I introduced with my good friend, Congresswoman Madeline Dean. And that bill improves mental health treatment for our nation's law enforcement officers. But today, we are once again taking action to address the disturbingly high suicide rate among our police officers. The Law Enforcement Suicide Data Collection Act, which I'm a very proud co-sponsor of, would require the federal government to track suicides within the law enforcement community. According to Blue Help, which is a nonprofit working to reduce stigma attached to mental health for those in the law enforcement community, according to Blue Help, a record number of current or former police officers died by suicide last year. 228 current or former officers died by suicide in 2019, compared with 172 in 2018. Since Blue Help began collecting data over 4 years ago, more law enforcement officers have died by suicide than all other line-of-duty deaths combined. Organizations like Blue Help do the best they can to track these tragic instances of law enforcement suicide. However, there is no comprehensive government effort to track attempted suicides and suicides in the law enforcement community. Line-of-duty deaths are tracked through the FBI's Law Enforcement Officers Killed and Assaulted program.
Back out to Austin, Texas we go, everyone, because they are not talking about the coronavirus right now on the House floor.
You have to choose public health or the economy. Those are the only two choices, and that's simply not true. We're looking for the sweet spot in the middle that optimizes public health and the economy. And that means that when we go out, we should do things safely. We should wear our masks, we should social distance, we should continue those personal hygiene practices that we've been talking about for months now, because if we can do those together, we can optimize the benefits of public health and the benefits to our economy. If we don't act responsibly, we risk failing at both things.
This is a question from Austin Business Journal. Is there any update since last week's council work session on the clusters of COVID-19 by workforce, particularly construction, and targeted testing by industry? How many of the 14 clusters identified between May 7th and May 22nd on the dashboard are in construction?
So I can provide some information on the clusters. So the clusters, again, as we begin to reopen, we are beginning to see more and more different types of clusters now that people are going back to work. Construction has been one area. It has been challenging for us to kind of narrow down where people may be because as an example, you may have a general contractor who has several subcontractors. So again, we are trying to work and develop an initiative that we can provide some targeted outreach to those areas. There has been some reluctance for people to actually come in and take advantage of testing because if they are identified as positive, there may be concerns that they may be out of work for a period of time because they are under a control order and need to self-isolate for a 14-day period. Again, this is an area that we're continuing to look at. Construction's a big area, but we are seeing clusters within food service areas and other industries as well.
Question from Univision. Considering the most recent data, which states that 76% of the people hospitalized during the week of May 18th to the 24th are Hispanics, why don't we have Spanish speakers during these press conferences? And I also want to know more about the work that the task force has been doing to assist the Latino community. And notes that at a couple of events that took place this weekend, it seems like those individuals were disregarding social distancing or using mouth covers.
The department has several employees that are Spanish speaking. We are working very closely with our communications corporate office to ensure that our marketing strategy and media strategy will include individuals that are reflective of the population that we are wanting them to reach. And so we are moving through that and refining that process. So we will have more media on channels such as Univision and Telemundo, as well as having radio commercials as well on those Latino and Latinx channels. During this response, our work has led with an equity lens. The department has partnered with our chief equity officer, and we have also started to collect some information from some of our Hispanic leaders. We will continue that process to collect that information from them. And as a community, we are going to develop a plan that we will implement. We know that it is very important as we are doing the work that we do partner with our community-based partners that have those relationships in the communities with whether it's Latinx or African American or Asian population. It's important for us to have those ongoing partnerships because those partnerships, whether they are a contracted partnership or just an agreement that we're going to work together on this effort, it's very important that we do all of this work with our partners as the City of Austin. Thank you.
From KView, there have been models that indicate we could have a second surge in Travis County in June. Can you discuss your concern about that possibility?
So we are concerned about that. And, you know, the models, the UT model, other models are all suggesting that, you know, beginning mid-June and, you know, particularly towards the end of June, that we may see a significant increase in the number of cases and hospitalizations. You know, these models are based on assumptions. And part of those assumptions are that people are going to be more risk-taking. And the more risk-taking means more cases, and more cases mean more hospitalizations and deaths. The models aren't predicting the absolute future. And it's important to remember that we as a community can change what that future looks like. It is based upon our social distancing, our personal practices, the masking in public. It's up to us. It's up to us to keep the numbers down. It's up to us to keep businesses open. It's not just the government that can do this for us. It's each individual, each family that has to commit to doing both things well. And if that's the case, then we can change our future. We can change the weather forecast for COVID-19 in our jurisdiction, and we really do need to do that.
Right, from the Statesman, another question about testing capacity. How close are we to reaching the ideal testing capacity of 2,000 tests per day? And what's our testing capacity today? And is there concern that allowing more people to get tested will result in more shortages?
So right now our testing capacity is about 1,750 tests a day just through our drive-through site at Austin Public Health. As was mentioned earlier, you know, we're seeing in the neighborhood of 200, 250 On busy days, sometimes closer to 350 a day. So we have extra capacity at those current testing sites. I think that our hope is, and certainly the information that we're receiving from the labs and from the state and federal government, is that the testing situation will continue to improve. The availability of test collection kits, the kits to run the test will become more available, and certainly we're seeing evidence of that with a retail pharmacy outlet opening up sites here in Austin and across the state. So again, the APH component is one piece of the puzzle, but we do rely on a partnership with community care, with Austin Regional Clinic, with our hospital systems, and they've all been engaged partners. We are still working on a collaborative process to bring that data into one place so we have more accurate information regarding the total number of tests being done in a day, as well as the percent positive. That percent positive test will help us as one of the supporting indicators for when we need to enhance testing and potentially when we need to be more concerned and dial things back in terms of becoming more protective.
KUT asks, last week Mayor Adler said that some testing facilities in the city, there are more tests than people coming to get tested. Is that still true? And if so, will APH lower the bar even further for who's able to get tested?
So again, we are not maximizing the capacity that we have at those testing sites. And the bar is pretty low right now. The risk that we have with lowering the bar, you've seen some communities who, are testing everybody that comes. There's a bit of a diminishing return, and the tests are utilizing taxpayer dollars to perform the tests. And if the return on that investment is very, very small, those resources might be better utilized to care for people or to utilize for different public health measures. So we don't want to have a 0% positive testing rate, but we do want to make sure that we're testing enough. So we'll continue to reassess that situation. We are reaching out to targeted groups, as was said before. We are reaching out to our minority communities, our Latinx and our African American communities, to ensure that they have adequate access to testing. We're examining different strategies for testing folks that may not be able to make it through a drive-through site. And again, this is a partnership across our community, and we expect that together as a community, we'll be able to reach the goals that we need to maintain public health.
Fox wants to know, just for clarity, whether the concern should be more about the hospitalization rate or all COVID-19 cases in general.
So the hospitalization rate that we focus on, and that's really our key indicator of when we're in trouble, is utilized because it is less amenable to variations in the amounts of testing being done. So that is a relatively fixed ratio. It's a fixed indicator. And it also points to the chief concern that we have. And that chief concern is overwhelming our healthcare system. When we overwhelm our healthcare system, we exceed the capacity of our hospitals to care for people. That will lead to excess deaths. It will lead to excess exposure of our healthcare workers. And that's what we really want to try to avoid. So utilizing that hospitalization rate as the key indicator is really the most useful and the less, it's an indicator that's going to be less variable based on the amount of testing that we're able to do.
Question from Estonia. As you just pointed out, hospitalizations are a key indicator of whether we're at risk of overwhelming our hospitals. So what are some steps APH might take if the 7-day average exceeds 20 new hospital admissions a day?
So tomorrow we expect to have a press conference to discuss the measures for dialing up or dialing down based upon the hospitalization rate, as well as some other factors that we're going to be monitoring. So we'll have more information on that tomorrow.
From KXAN, how worried is the city about the accuracy of testing as it increases the number of tests? Are there certain tests you are more or less confident in, and which test is primarily used?
So Austin Public Health is using the PCR test. So this is the gold standard for testing right now. We're not utilizing any antibody testing, for instance, to make decisions about individual care. We are working with the University of Texas on a seroprevalence study, which will use antibody tests to make some population determinations of exposure and prevalence of disease over time.
Austin Chronicle asks, are the options for surge hospital capacity and isolation centers APH laid out a few weeks ago still available now if cases spike?
Yes, those options, as we do our planning, we are always planning and looking at the various scenarios. We use the data that Dr. Escott mentioned, and we work with our partners collaboratively at the hospital systems as well as other emergency systems. And so those options continue to be available for us to set up. Thank you.
Another question from Community Impact. What would some potential next steps be for the city and county if we see hospitalizations spike in the next 7 to 10 days?
Again, we'll be discussing some of those options as well as the trigger points tomorrow. This is a difficult balance because of executive orders from the state in relation to essential businesses and opening of businesses. But I feel confident that if Austin sees a substantial surge in hospitalizations, that the state would agree that it would be time to dial things back, at least locally. As I discussed last week, different jurisdictions, different metropolitan counties and cities across the state of Texas are going to experience surge at different times. And therefore, that local decision-making, that local control is going to be very important so that individual jurisdictions can make determinations for their community to ensure that we don't exceed capacity and have unnecessary deaths.
Reporting Austin asks, have you advanced in the creation of a task force to further prevent contagion within the Hispanic community in Austin?
The department is working with the, it's called a education and community cabinet. And that specific cabinet is a team of city employees as well as elected officials. And so that cabinet is going to continue to work with a community engagement process to develop that process where we will hear directly from our Latinx leaders in our community. We have begun, we have received some information from them as well and recommendations. And so we are going to be a part of that process as well. So more to come with that. Thank you.
Right, from Co-op Radio, there are generally 3 potential outcomes resulting from reopening: a decline, a continuance of the plateau, or an increase in the number of cases. What are the signs that APH is closely monitoring to see which is the case?
Again, we're looking at a number of factors. That's the hospitalization rate, it's the number of new cases, it's the doubling time. We have a whole host of factors that we're monitoring. And again, we'll be discussing those in further detail tomorrow, as well as a new dashboard that we're going to be creating so that the community can monitor that also. We want the community to understand the things that we're watching so that they can watch also, so they can adjust their activities based on that. And again, one of the reasons why we created the staging of risk that we sent out a couple of weeks ago is that the community can be knowledgeable, they can make decisions based on their individual risk and their household risk. It's important to remember, and I think sometimes the message is getting confused. When we talk about clusters around construction and other service industries, when we talk about our concerns about the Latinx community and African American community, this should not translate to, I'm not one of those people, so I'm not at risk. There is widespread community transmission of COVID-19 across the United States. That's a simple fact. It is widespread across Texas. So what we're describing is hotspots we're seeing right now. Those hotspots may change in the future. So it's important that the community understand that we're all at some degree of risk, and that risk-taking behavior is going to increase that likelihood of bringing COVID-19 home to their family. So it is critical that all of us across the community, regardless of what your occupation is or what your race or ethnic background is, that we continue to use caution so that we can at least maintain that plateau and hopefully see a decline in cases.
In the interest of time, we have time for 2 more questions.
Thank you. KView asks, is the city of Austin willing to appeal to the state and the governor for more local control in the event of a surge?
I think that appeal has been constant. I think that again, we are oftentimes, this is being painted as a battle between the state and local. I think there's a lot of areas of agreement. I think when you see the state's comments, the governor's comments, it's always, they're always cautious. He wants to open the economy, but he wants people to be cautious. There is a balance there, and I think that we're all talking about that balance. But we also need to all appreciate that different jurisdictions, different cities and counties are going to be at different stages in this outbreak. And we absolutely need better local control so that we can tailor our response and tailor our caution based on what's happening in our community.
Final questions from the statesman. Have local health officials been successful in gathering and combining infection data from private partners and other municipal and county governments? How well do city and county numbers reflect the infection rate within the MSA? And do you believe numbers could be higher than what's reported?
I'll answer that. I think by virtue of the state reporting rule, we have been able to gather information from our local partners and physicians since it's required by law to be reported to the local health department. So it does provide us an opportunity to receive cases both from either the laboratory or from astute clinicians out in the community who are reporting cases into the health department for follow-up. We are working very closely with a public health region, which we're in public health region 7 of the state health department, and our local neighboring jurisdictions to make sure that we're sharing information, because oftentimes we do receive cases of theirs and they may receive cases of ours that require some follow-up. Again, we do know that there are clusters that are involving residents of both communities, like differing counties. It may be related to a particular site, and we're having to work with them closely because the site might be in their county, but the cases are in our county. So we're working very closely and diligently with them to make sure that we're able to respond as quickly and effectively as possible.
Thank you, Olivia, for asking those questions of our speakers today. Now I will ask if any of our speakers have any final thoughts that they would like to share.
I'll go ahead and get started. I will just say that, for Austin Public Health, especially for the staff in epidemiology and public health emergency preparedness, this is a very real a response that we're having. We're actually communicating with cases or families who have family members who've succumbed to the illness. So it really is, it can be stressful and for our staff, just because they're dealing and communicating with those people. So it does hit home for us on many levels. And we just want to make sure that we are protecting our community at large the best that we can.
Throughout this response, we have led with an equity lens. It is so important as a health department to work with all populations to ensure the health and safety of marginalized communities. We are always looking forward to working with our community partners. Throughout this response, we have been in communications with several individuals that have provided information to us, research to us, and so we are always receptive to hear from the public. We know we cannot do this work alone. Lastly, it is so important as an individual, whether you're a single individual or you are in a marital relationship, it is very important for you to make the best decision for you and your family. When you are thinking about, should I go out to dinner? Should I stay home? Ultimately, we want to protect our vulnerable populations. We want to ensure our health throughout the community. We want to make sure that our programs are reaching individuals that may not normally be reached with other efforts. And we're going to do everything we can to ensure the health and safety of our entire community. Thank you.
And I'll close by saying Austin and Central Texas have done a great job at flattening the curve. We have to continue those efforts. We have to continue to protect ourselves, to protect Austin, to protect Texas. And it's not only protecting public health, it's also protecting the economy. If we go out, let's do it safely so that we can keep both things, we can grow both things, and that we can do both things effectively.
Thank you to our speakers and everyone joining us this morning. That concludes this morning's press conference. Thank you.
Thank you.
Thank you.
Taking a live look at the White House in our nation's capital, Washington, D.C. Yes, everybody. We've got congressmen and women on Capitol Hill live now on the House floor, but they're not speaking about coronavirus relief or anything coronavirus related. So I'm not showing you the House floor right now, but I hope you all are having a fabulous evening. Did I say it was Tuesday earlier today? Because it's Wednesday. I'm getting my days all mixed up, everybody, because to me right now it's my Friday. I won't be back here on the News Now set until Monday. I just Facebooked and tweeted that. Is tweeted the proper term? Anywho, you can tell my mind is already on vacation mode. But please stay in touch with me. Facebook, Twitter, Instagram. I am on Snapchat, but I never use it. No, I'm not on TikTok. Stay in touch outside of streaming hours. I'd really appreciate it. And I do post pictures and videos of my adventures, so you never know where you might see me ending up. But now, of course, during this pandemic, it's a lot harder for a lot of people to travel and do a lot of the things that they love to do. But I am hiking a lot. Social distancing, being safe, and I love to get outdoors for sure. Okay, everybody, I think next I'm going to take you out to the state of Illinois. I just got to make sure that neither Mike nor Christy played the Pritzker update. Nope, doesn't look like either of them did. So again, we're going to listen in on Illinois Governor Pritzker's update from earlier today.
Public briefing. I want to begin by thanking Jackie Joyner-Kersee for her just welcoming us to this neighborhood, to her center. I know that there will be activity here during the summer as we begin to reopen so many things across the state. She's been so dedicated to the children of this community and frankly to children all across the nation and set such a great example, and so it gives me great pride to have her standing here with us. I spent this morning in Meridosha with our Illinois Emergency Management Agency Director, Brigadier General Alicia Tate Nadeau, and with our National Guard Adjutant General, Richard Neely. The community there has really pulled together to fight the floods. And even the Triopia High School football team got out there to help build up the levee and keep their neighbors safe. Over the last few days, nearly 60 members of the Illinois National Guard have worked with local emergency management officials to protect the community there by depositing 150,000 sand along the Illinois River to supplement local flood prevention operations. National Weather Service projections had indicated massive potential flooding in the area. This work has likely saved many lives and prevented hardship for hundreds more. I want to take just a moment to say that our Illinois National Guard is second to none in the United States. Throughout the COVID-19 crisis, hundreds of Guard members have played a crucial role in protecting Illinoisans, including those right here in East St. Louis. Where rain or shine, the Illinois National Guard is operating our Metro East state-run drive-through and walk-up community testing center right here on the property. And that's what we're here to celebrate and call attention to today. I'm joined here at the community center by Mayor Robert Eastern, by St. Clair County Board Chair Mark Kern, East Side Health District Public Administrator Elizabeth Patton Whiteside, Leader Jay Hoffman, Senator Christopher Belt, and Representative LaToya Greenwood. This testing center is one of 46 that we have across the region of Restore, Illinois. That includes our 27 federally qualified health centers. Each day, this drive-through site can receive up to 500 samples from anyone who needs a test. These are free for the public to access. Tests are available to any essential worker like a grocery store clerk, a nurse, or a pharmacy worker, any first responder, anyone with COVID-19-like symptoms, anyone with a compromised immune system, or anyone with known contact with a COVID-19 positive case. We want testing to be as easy as possible for Illinoisans. You can find a testing site nearest you. If this isn't the closest one to you, you can find it online at coronavirus.illinois.gov. Again, coronavirus.illinois.gov. And speaking of testing, over the last 24 hours, out of 17,179 total tests, 1,111 came back positive. That's a single-day positivity rate of 6.47%. Remember that these are pure diagnostic tests. Illinois does not inflate our daily testing reports with antibody tests. That brings our statewide total of confirmed positive cases to 113,306, with over 800,000 tests run to date. The vast majority of those individuals who tested positive have already recovered or are experiencing a mild enough case that they're recovering at home. As for our statewide hospital numbers, as of midnight last night, we have 3,826 Illinoisans in the hospital with COVID-19. Of those, 1,031 are in the ICU and 592 are on a ventilator. I'm also saddened to report that we have lost another 160 Illinoisans in the battle against COVID-19, bringing our statewide total of lives lost to 5,083. These are real people whose lives came to an end because of this pandemic. They are grandparents and uncles and aunts and parents, cousins, children, friends. They had whole lives that were cut short because COVID-19 knows no boundaries and only seeks to destroy. We can never forget that. May the memories of those who were lost be for a blessing. For those watching at home in other parts of the state, East St. Louis is in St. Clair County, home to one of the pilot contact tracing initiatives the Illinois Department of Public Health has launched to help tackle a public health situation of this magnitude. In this work, I'm proud to announce that IDPH and St. Clair County Health Department will be joined by the East Side Health District here in East St. Louis, a trusted organization that has dedicated itself to community-based health services here in Metro East for over 70 years. It's exactly the kind of partnership that's going to help us reach and support more people, and I'm glad it will become one of our first two major contact tracing expansions. I'm proud today to be here with the leaders of that operation. For more on that I'd like to turn it over to one of the greatest county chairs in Illinois, St. Clair County Chair Mark Kern. Mark?
Going to have to remove my mask for that one. So to put this in perspective, because I think all the days seem to run together, on March 14th in St. Clair County, we had our first COVID positive diagnosis. March 16th, our governor came here to St. Clair County to talk about the state's plan and the executive order that he had put into effect the day before we actually had our first positive, limiting what was going on in the state and allowing people to stay safe and telling them how to do that, whether it was through washing your hands or the cleanliness part or telling people to stay home. And it was on that day that we launched our effort here in the county. Through that point, we've worked diligently with all of our mayors, our first responders, certainly with our state representatives, Hoffman, Greenwood, and Senator Chris Belt, all who have been an integral part of this effort to be able to get PPE. When we started out, we were seeking masks and hand sanitizer and hospital gowns. Those things were all in short supply. Their efforts through the governor's office made sure that not only all our first responders and our hospitals and our dentists and our doctors and our long-term care facilities had what they needed, but they made sure they had it in a timely fashion. IDOT trucks pulled up and are pulling up on a regular basis in front of our EMA office, delivering pallets of PPE to make sure that people are taken care of. The people that are out there fighting this fight for us, to make sure they are safe. So we've now entered into, as the governor said, the tracing portion of this project. Testing has been ramped up. Initially, and Liz will verify, inside Health District area at Touche Hospital, when the governor came here at first, we had 14 tests at Touche Hospital, 14 tests for that hospital to be able to run their operation. Now tests are flowing, and just at this site alone, we have the opportunity to do 500 tests a day. That is a major accomplishment in a fairly short period of time. The tracing grant that comes here now will allow us to take people and talk to them if they're diagnosed COVID positive, have people to call them on the phone, ask if they're staying at home, ask who they were in contact with during the point which they were contagious, and be able to make this operation move into the next phase, which is containing COVID if there are hot spots to make sure they don't break out so that our county can go back to as close to normal as we possibly can. None of this would have been possible without the state of Illinois and the strong leadership of Governor Pritzker and the strong leadership of his people that are behind me, the state representatives, the state senators that understand St. Clair County, its people, and work hard with it every day. Special thanks go out to Mayor Eastern, who's been a strong part of the team, Team St. Clair, as well as Liz Patton with Eastside Health District. Hand in hand, we've worked on this issue, and we appreciate everybody's support. Thank you. I have no X. Oh. At this time, I'd like to introduce the mayor of the City of Champions, Robert Eastern, mayor of East St. Louis.
Good afternoon. I'm very excited about being here. Thank you, Governor, for all the hard work you're doing, and I echo everything that Chairman Kern said. You know, this COVID-19 situation and pandemic has been very fluid. You know, that we couldn't have planned for this, you know, so we just executed kind of on the fly, and your execution was well, Governor, so I appreciate that for everything that you're doing for my city, our state, and our county. Yes, the tracing grant will be very impactful here in East St. Louis, but the most impactful thing that we can do right now in order to make that grant even more impactful is get tested. We're standing here at a phenomenal site here at JJK. We need to utilize the site. There's different things that have came out of this COVID-19 that allowed the city and those around us to come together as one unit and unify. You know, we were able to give out free meals with the Urban League. They'll be back June 6th. You know, but all these initiatives and all these things that are happening is a result of COVID-19 and those working together to make a better East St. Louis, a better St. Clair County, and a better state. And if we could not do this without State Representative Greenwood, our State Senator, State Representative Jay Hoffman. So we appreciate those people for working tirelessly, on the behalf of East St. Louis and our citizens. So there's been a lot of people working together. Like I stated, the clergy have came together. They started an initiative, 6 feet in the street, to see what is the new norm that's going to be after the COVID-19, the new norm. So we want to make sure that everybody that has a part in this, I want to just give kudos to those people. I'll give kudos to everyone that has put their tireless effort in here, and make sure that we use this tracing grant to the best of our ability so we can get back to the normality of the state of Illinois and the normality of St. Clair County and East St. Louis. So at this time, I'd like to introduce Elizabeth Patton Whiteside.
Good afternoon, everybody. As the Public Health Administrator of Eastside Health District, whose jurisdiction within St. Clair County is East St. Louis, Washington Park, Cahokia, Brookland, Centerville, and parts of Fairmont City, I have been given the monumental task of trying to contain the spread of the coronavirus within my community. And I must say, it is a monumental task. Everyone is aware that the Black and Latino adults are far more likely to experience serious illness and death from COVID-19. Underlying health conditions such as diabetes, hypertension, and obesity are some of the risk factors serious illness and death from COVID-19. Underlying health conditions such as diabetes, hypertension, and obesity are some of the risk factors. And 792 negative clients. One pending case because we haven't gotten the results for that case yet. And sadly to say, 19 deaths. Now that might not sound like a lot to a lot of people, but for a community of our size, that's a great dent in our community. I recently addressed many reasons and myths that prevented people from my community from receiving the COVID-19 testing, and I urged them to get tested because in that article, I addressed the thing about I don't want to get tested because I see police there, or I've got warrants, I don't want anybody to follow me, or the test hurts, or anything like that. I addressed all of those myths. The test does not hurt. It's just a swab in the nose. The police, they're here for you to help with crowd control. Nobody is trying to run anybody's license plates and look anybody up, okay? Now, everyone knows to wash your hands. They know to cover your mouth, wear a mask, refrain from shaking hands, use hand sanitizer, and all of that. But we need to do a robust job of contact tracing. Now, Mark Kern said a little bit about what contact tracing is about. So I am thankful to the Illinois Department of Public Health efforts to reinforce the need for this contact tracing in our community. Contact tracing is simply investigating who a positive COVID person came in contact with for 10 minutes or more. That's all. Now, as we reach out to these individuals, we monitor them daily for 14 days for signs and symptoms of the virus while they are either in quarantine or in isolation. But that's not all that we do. Yes, we contact them daily, but we are a resource for them. We are there to help them. This is a very important and needed job within our community. We are their lifeline for continued resources for help. We are not there to blame you or create any stigmatism that goes with one knowing that you have or may have been exposed to this virus. We don't care. We're there to help you. Any help that may be it mental, physical, or emotional, we are there for you. So when we call you, if necessary, Be willing, ready, and able to participate in this process of contact tracing. It is to help everybody. So thank you again to Governor Pritzker and the IDPH team, St. Clair County team, and the Health District family for having the confidence in our agency to allow us the opportunity to follow up on the positive clients and all of the contacts within our community in St. Clair County. Now I will have Governor Pritzker to come back up.
Thank you very much. Thanks so much, Elizabeth, for the fine work that you're doing to protect this community from COVID-19 and to help people who might get COVID-19. I want to remind everybody that the tests are free. And indeed, if you are COVID positive, your treatment will be free either through Medicaid or through your insurance. And we will make sure that no one is stuck with a bill for COVID-19. We really just want the people of Illinois to be safe and healthy. Before I take questions, I feel compelled today to use this platform to address what happened to George Floyd in Minneapolis and to Breonna Taylor in Kentucky, Ahmaud Arbery in Georgia, and Christian Cooper in New York City, and countless others whose memories we cannot allow time to erase. Events that echo what we have seen happen to too many people, too many times, in too many places. And yet we as a people have not yet found the humanity to stop these vile, horrid acts from happening, to truly contend with the racism that permeates our society, and then to root it out. As a white elected official, I feel a special responsibility to speak out today and to own the obligation that I have to shape public policy in a more equitable direction. Being black in America cannot be a death sentence, but it is. In some ways it is. And it's dangerous to pretend otherwise. We must actually do something to change that reality, to make it so that men like George Floyd are not killed on a street corner gasping for air in broad daylight, one moment alive and the next moment gone. People deserve to breathe. They deserve to live. George Floyd's family should not have woken up today in a world without him in it. This investigation requires all possible accountability and transparency to deliver the closest thing to justice here. But it will never bring George Floyd back. I'm especially saddened that amidst all the other challenges that we are facing right now, that people of color have this extra burden to bear, as they have for too long. This moment must become a call to action for Illinoisans, for Americans to see the humanity in every person, no matter their race, their religion, their socioeconomic status, or their sexual orientation. To George Floyd, to his family, may his memory be for a blessing. And with that, I'll take questions from members of the media.
So we'll be taking questions from our pool reporter and then taking questions that we received online. Microphone on the floor.
Good afternoon, Governor. Welcome back to Downstate. It's good to see you again. So first, where's Dr. Ezike today?
She was not able to join me, but she's hard at work, trust me. We've got a lot of work going on contact tracing and everything else at IDPH.
Good to know. First comes a question from my colleague Lexi Cortez at the B&D. So we're hearing from readers who say that nursing home residents and their families are just devastated that they're not able to see each other because of the restrictions on visitors. What's your message to those families and residents? How do you answer questions about when they can see their loved ones again?
This is so incredibly difficult. I think you know, and the readers at BND know, that it was even before we put the stay-at-home order in place indeed one of the very first things that we had to do to deal with COVID-19, that we had to cut off visitors to nursing homes and long-term care facilities, because it was clear early on that one of the most vulnerable populations is our elderly. And it was in nursing homes in places like Washington State where we had already seen outbreaks that were taking people's lives too quickly without any ability really to treat them fast enough or to rehabilitate people once they'd gotten sick. So this was something we were trying to prevent desperately in the state. We had to shut down visitors. We also started doing medical checks on every staff person on every shift so that we could try to prevent people from bringing COVID-19 in. That was in early March. I mean, that seems like years ago now, and I'm sure for family members too. As you know, we've continued that policy, and indeed we've made it even more difficult for people to enter into long-term care facilities because, you know, COVID-19 doesn't live in a facility. It comes in with somebody, and then it spreads. And so the 1,200 plus long-term care facilities, nursing homes across the state. We've tried to make sure that we're on top of wherever the outbreaks are and also where there are no outbreaks to keep the people out and to make sure that we're keeping COVID-19 out. When will visiting resume? I must admit to you, the CDC is telling every state that this may be one of the last things in dealing with COVID that will happen is new visitors or visitors being able to come back into those facilities, because it is precisely from those visitors, even those who are asymptomatic, who may not think that they have COVID-19, that you get an outbreak. And so I can only tell you, I'm listening to the Dr. Ezike and others and the CDC when I tell you that at least for the time being, we can't allow visitors back in.
This is for me. What's the amount of the grant to St. Clair County for contact tracing? How much money?
I'll get you the number. I don't have it on me, but I mean, we've allotted, I think, a reasonable amount of money, because this is not going to be a short-term endeavor, and it is going to, you know, to the mayor's credit and to Elizabeth's credit, there's going to be hiring involved here. So there are people who are looking to enter the healthcare industry where there are job opportunities. This is actually a good way to enter. You don't have to show up with any training right now. When you show up de novo, you know, as somebody who's never done this before, you get trained. It's free. The training is free. You get trained, and then you become a contact tracer, and that's the beginning potentially of a career path for many people.
One thing that I'd like to clarify from your statement earlier was that Illinois does not include antibody tests in its numbers statewide, but we've heard from our local health department, the St. Clair County Health Department, that they do include positive and negative antibody tests in their numbers.
So at the IDPH, when we receive our numbers from laboratories, so it's different at the local level, they'll get all of those results. When we report results, we take all the serology tests, the antibody tests, out of those numbers, and we only report those that are what are called PCR tests. Basically, it's the test to tell you whether you have COVID-19 now. The antibody test, it tells you whether you may have had COVID-19 in the past.
This is the last question for me, and then I'll get to the orders. A lot of pools in our area are really antsy to either have a decision one way or the other whether they can open or not. Mm-hmm. Do you have any updates on that?
In the fall, you're talking about for schools in the fall?
I'm sorry, pools.
What'd you
pools?
Say? Pools.
Yeah,
oh,
swimming pools.
Sorry, I thought you said schools.
Sorry.
It's a great question. It's not a decision that I'm going to make. Again, I've left this to the doctors, but I will say that what you ought to watch for is on the DCEO website, that's the Department of Commerce and Economic Opportunity, where we have listed all the guidance for phase 3, and then we'll continue to update that guidance and guidance for phase 4. That's where you would find when the release of information about when pools might be able to open.
This is from Monica DeSantis from WJOL Radio in Joliet. There are nursing homes that still haven't tested their residents or staff yet for COVID-19, like Our Lady of Angels in Joliet. Where are the tests, and shouldn't nursing homes be a priority for tests to protect the most vulnerable in our society?
They are a priority, and I think actually there's an article today about the challenge, right? There are more than 1,200 nursing homes in the state. If you think about the numbers of people that are represented in those nursing homes, you're talking about more than 20,000 people. Indeed, it's actually many more than that, staff and others. And so in order to be able to test all of those people, we're only doing averaging about 23,000 a day, and that's statewide in every capacity. So that includes all the other congregate settings in which we're testing. So in order to do it, we've got to set aside tests, which we've done, and then go and get to every single one of those facilities. Now, what we would send the swabs, because that's all we're really doing is collecting specimens. We've got to get enough swabs and then send them, and we have been doing that as we receive enough swabs to each one of those nursing homes. So we will get to every nursing home. We are doing it, in fact, as quickly as we can with the supplies that we have. But it is our intention to test everybody across the state. We're starting with the facilities that, first of all, we're starting with staff everywhere. We're also starting with the facilities that don't have COVID-19 in them so that we can keep it out. If you find one or two people have it, you can segregate them, get them to isolate, and save a facility from having an outbreak. In the facilities where there are outbreaks, we are testing staff first and separating the residents in those, and ask the private owners of those nursing homes to do that to separate the residents. So we're getting to it, and again, I'd like to do it all at once. If we had the national leadership on this subject, if we had the supplies available, we could do this much more quickly, but we're getting to it as fast as we can.
This is from John O'Connor at the AP. The CDC says that the current antibody test is wrong half the time.
Right.
What is the status of antibody tests in Illinois? How many have been done? And does the fact that up to half of them could be wrong affect any of the state's policy decisions?
So from very early on, what we've said is, although we receive the serology information, in other words, the results of those tests, we set those tests aside. We actually have a committee at IDPH that has reviewed and come up with their own view of what to do with those serology tests. John O'Connor is correct. Half of those tests seem to be inaccurate. So what does one do? Well, if we could segregate the ones that we think are inaccurate, in other words, there are different types of serology tests, and know which ones are accurate, and we're trying to go through and figure that out, we could then take the accurate ones and determine some things. But I must tell you, and something I said several weeks ago in one of my press conferences, serology tests tell you perhaps whether somebody had COVID-19, but it doesn't tell you whether they're immune from COVID-19. Even though originally that was the hope and thought, it's still not proven that if you have the antibodies that you can't get it again. And so that's the challenge here. Is so we've put those aside. We're looking at trying to keep people from getting COVID-19 in the first place. We're certainly looking at all of the studies that are being done of serology tests around the world, not to mention around the United States, and we'll make some decisions based upon the results of those research projects.
This is from Kelly Hoskins with KTVI Fox 2 News in St. Louis. What are you doing for communities like East St. Louis? Are you getting them enough? You addressed this a little bit. Are you getting them enough testing? How about economic help? Yep. And what are you doing to clear the gap that exists? This is a second part of the question.
Yep.
What are you doing to clear the gap that exists in downstate Illinois as far as lower case counts, lower death counts, and what are you doing to help those communities that are frustrated by having the same rules applied to them and maybe not getting as much aid as cities like Chicago?
Hopefully I'll remember all. I think that was three questions. Let's start with East St. Louis. East St. Louis is very important to me. From the earliest moments that I came here, I was just saying this to some folks earlier from the National Guard, that East St. Louis is a community that's been forgotten, frankly. And so when I think about what we need to do to assist East St. Louis, I think about trying to first create economic activity. Put aside the moment we're in, which is COVID-19, in which we need to secure people's lives and their health. But if you and you've seen we have a facility here at the Jackie Joyner Kersey Center where people can get tested, and we've provided free treatment and so on. So there's and we've worked together with St. Clair County and other facilities, other hospitals. But I'm thinking about the economics of this area. From the beginning, my thought has been that we've got to make sure that that people are able to start businesses, that there are people that are able to get on their feet and actually get economic activity going in the communities of East St. Louis. So we've been trying to. we have low interest loans. We have loans for communities of color that are dedicated to communities like East St. Louis. That's one thing from an economic activity perspective. In this moment, when so many people have lost jobs, so many people are struggling, we've banned evictions across the state of Illinois. We've provided rent assistance for people. We've made sure that people have health care, whatever they need, available to them. We're trying to build up the resources of health care within communities of color, in particular here. And so many, we could go through a whole big long list, and I've got it too, about the economic supports that we're providing for people, and particularly those who are most impacted financially by COVID-19, and those happen to be, guess what, the same as the communities that have the highest rates of death or the highest rates of COVID positive tests, and those are communities of color. So this has been a focus from early on. I think the minute that we heard and saw statistics that showed that in particular the black community had a higher incidence of death on a per capita basis than any other. That was the moment we began to put in testing sites everywhere that we could in black communities, and making sure that that we were educating people about the importance of washing your hands, of putting a mask on, and so on, and focusing that on communities of color in particular. There were a lot of people who had been told, and you can actually read articles about this, where those who run bots, the foreign countries that run bots, to convince Americans to fight each other, that one of the things they were promoting was that the black community was immune from COVID-19. You remember this? And so there were many people who had heard this, that the black community was immune, and then had not heard that, no, actually the black community is most susceptible in some ways, at least to the terrible consequences of COVID-19. So there's so much that we're dealing with at the same time to try to address this challenge in East St. Louis and for communities of color across the state.
This is from Katie Kim at NBC Chicago. Can you be a little bit more specific about where we're at with the contact tracing program? How many people have been hired? When will the program be fully up and running? And also, can you address people who are concerned about their privacy and people who are unwilling to share sensitive information? What kind of questions can they be expected to answer?
Sure. So let's start with, I did a press conference talking specifically about contact tracing, I think about a week ago, so I would refer you back, since they're recorded online. You can see everything that I said in my prepared remarks and answers to questions there. Having said that, the goal, so today, with the contact tracers that we have in the state today, we already have contact tracing, just for people who don't understand, because we were doing contact tracing before COVID-19 ever. Contact tracing for HIV, for example, is one thing that was done for contact tracing. But we have across the state hundreds of people who are in contact tracing. We start with that as a base. These are community health workers that are in St. Clair, SIU. They're also all over in counties across the state. So we start with that as a base. But when you need to do something as big as we need to do for COVID-19, what we need is technology so that we're all connected to the same database. That is, everybody's got the same app, the contact tracers, that there's privacy built into that, meaning that if someone tests positive and they have 5 contacts in the last 48 hours, that the 5 contact names and phone numbers which come from this person who was COVID positive, right? That those 5 contacts are contacted but not told where they may have come in contact with somebody who's COVID positive. So the privacy is maintained for the patient. And then the contacts are made directly to the people who need to be contacted. it's an enormous endeavor. Think about it. Today we had 1,100 reported positive cases. In prior days, we've had 2,000, 2,500, even 3,000 on one day. Think about that. Multiply that by 3 or 4 or 5 contacts over the prior 48 hours. And remember, 2,000 every day times 3 or 4 or 5, you know, that's a lot of contacts to make. So you need more than the hundreds of contact tracers that we have. So what we're doing is working with local departments of public health to make sure that they get contact tracing dollars so that they can hire up contact tracers and a few other community resource workers and so on to make sure that we're contacting everybody, and then that we're providing those people with resources in the local community, because if you have to isolate for 14 days, that may not be an easy thing for many people. And so if you need a hotel room, motel room to separate from your family for 14 days, we want to make sure you get fed. We have wraparound services. Everything is taken care of for you. If you're going to remain in your own home, maybe you live alone, we need somebody to deliver groceries and, you know, other services, pharmaceuticals and so on that you may need. So that's all the case. One last thing. Yes, how big is it and how long is it going to take? We're at about 30% of the contact tracing that we need today. We're doing about 30% of the contacts. We need to get above 60%. You might say, well, why not 100%? Because there are many people who don't want to be contacted, who never will answer the phone, you know, lots of reasons. Some people who are COVID positive who won't give you names. So we're going to get to hopefully about 60+%. It's going to take us weeks and weeks. I can't tell you how long. I mean, some people think it will take through August to do it. I'm hoping that we'll be able to do it much faster than that. But as fast as we can, we're getting the dollars out to the counties so that they can do the hiring that they need.
Kelsey, you have time.
Sorry, it was a 3-parter or something, and I wanted to make sure to give you a full answer.
This is from Jamie Monks at the Chicago Tribune. Over the weekend, IDPH began posting a statistic called the recovery rate, which was 92% as of Tuesday. Can you explain that further, and what does it tell us about the nature of the virus?
Well, again, what we're trying to do is to make sure that people understand that when you get COVID-19, it is not a death sentence. When you get COVID-19, in fact, about 80% of people who get COVID-19 experience mild symptoms to moderate symptoms and then recover. It's really 20% or so who get it and have something more serious. That doesn't mean they're going to a hospital necessarily, but you know, I think all of us at this point know somebody who has had COVID-19 who's been sick at home and had a hard time and then recovered. Also, some of us know people who have had to go in the hospital and then have passed away. And so about 1%, a little less than 1% of people who get COVID-19 pass away. That's the international statistic anyway. So what we're talking about is, you know, trying to report a number that shows how many people have already had COVID-19 that have recovered. Now, what I just gave you is a statistic of if you took a snapshot of a bunch of people who got it at the same time, you'd have 1%, 19%, and 80% roughly speaking. So the 92% is a reflection of many people who've recovered and have gone about their lives and haven't gotten COVID-19 again. So that's we're trying to give a number. We had not before provided a recovery number, but people have asked us to try to put that number out, so we are.
Just one more sports question.
Governor, this is from Kevin Powell at WGN Radio. Would it be feasible for Chicago to serve as a hub city for NHL when it returns to play?
NHL? I have my baseball mask right here.
And how much have you been in contact with Mayor Lightfoot, the Blackhawks, and the NHL about Chicago hosting games, players, and team staff?
So actually, as you know, the state is the one that sets the parameters for the for any play that might exist in the state. And then the city of Chicago, of course, has the ability to be more stringent than the state's parameters. So we've gotten contacted by all of the major leagues, right, by NHL as well as MLB and NFL and so on. Look, I am as anxious as I think many people are to get our sports up and running again. The problem is we can't put spectators in the stands today. There's just no way to do that safely according to the doctors. What the leagues have asked is not for that. What they've asked is for the ability to run games, whether we're talking about hockey or baseball or football. At this moment, they're asking for the ability to run games televised with no spectators. Even that, as you can imagine, think about two teams, all of the surrounding people who work for the team involved. It's a lot of people. So we've worked with them. They've actually come up with reasonably good plans, each one of the leagues. And I'm anxious, starting with baseball, to get baseball up and running again. And I'm hopeful that we will be able to do that going into July. But NHL, I can't answer what the timing will be or when the Blackhawks will be added again. But again, we're working with every league, NBA included, and NHL included.
Great. This question is from Joe Ostrowski at 670 The Score. Earlier this month, Las Vegas Casino started offering drive-through services so Nevada residents could set up mobile accounts with sports books. Is that under consideration at Illinois casinos so customers will have mobile betting once it goes live?
It is, and we're working on that. And we're also working on the ability for people to do it in person somewhere, to sign up for the app to allow them to bet.
This is from Gabrielle Franklin at WCIA. DCEO's personal care guidelines call for massage therapy treatments to last 30 minutes or less. Many massage therapists are commissioned by the hour. The new guidelines could cut into their pay, and some therapists say that they would likely make more money on unemployment and avoid the exposure to COVID-19 by not returning to work. Is there any way the 30-minute guidance could be reconsidered or more protective gear could be mandated to keep the therapist safe?
I'll bring that to the doctors. I'm not making those individual specific decisions about massage therapy, for example, but as it's raised here, and I'm sure that people have communicated with IDPH on this subject or with DCEO, who has a hotline that you can call if you're in the industry. So I'll bring that back to the experts and raise the issue to them.
This is from Dave McKinney at WDEZ. Assuming you signed the casino legislation lawmakers approved, what is the earliest point when you think a Chicago casino can be up and running? And do you have any thoughts for the mayor to consider about where the best location in the city would be? Also, can you provide an update about when Illinois' existing casinos will reopen and what specific social distancing steps will they need to take for that to happen?
Well, the first part of that question, I can't, I'm not going to dictate to the Chicago City Council or the mayor, when they would start. They have to contract with a lot of people before they could even begin to. They have to choose a site and then start building, but they also have to have a partnership with a casino operator. So I can't tell you when that'll happen, but I, would certainly encourage them to do it as soon as they can. Now, let me say that I'm not going to dictate the location of that either or try to discourage or encourage. I'm very interested in making sure that that we create the most number of jobs. The sooner that they're able to get it up and running, by the way, the better off the people of Illinois will be, the people of Chicago too, because there's a benefit not just to the city of Chicago, but a lot of revenue that will come to the state of Illinois, some of which will come here to St. Clair County as a result of its funding of infrastructure, because that's where a lot of those dollars will go. And the last part of that question?
Last part was, can you provide an update about when the casinos will reopen and what specific social distancing steps will they need to take?
No. I mean, honestly, it's not something in phase 3. There certainly are casino owners in the state of Illinois who have presented their ideas for that, but it's not going to be happening in the next phase. So I have to admit I have not focused specifically on it. And in the end, I don't know what the doctors will say or how long it will take them to kind of agree on something. I know that everybody's looking at Las Vegas and wondering how they're going to be able to do it. They've got rules in place, and I have to say it looks difficult to me, but I am anxious to see what the plans are that the casinos will present.
While on topic, Mitch Arment, he asks, Governor, will live horse racing restart on June 1? If so, what might that look like?
I don't think it'll restart on June 1. I think live horse racing will restart. I can't tell you what date, but again, it will be like other spectator sports where it would have to run without spectators, at least to begin with, and at least in the horse racing industry, that can be done. All the betting gets done really not at the location of the horse race. Much of the handle, as they call it, the dollars bet, are bet all over the world on races that occur in Illinois.
This is from Craig Wall at ABC 7 Chicago. Governor, today Dr. Willie Wilson sent a letter to President Trump and Attorney General William Barr asking them to intervene on behalf of churches to help, quote, those that desire to worship consistent with the recommendations and guidelines issued by the CDC, end quote. Your reaction?
Well, we've done a lot to open churches, to provide guidelines for churches, and indeed we've asked churches to bring us their plans for how to open safely. I want, as much as anybody, to make sure that people who want to worship in church or in a mosque or in a synagogue to be able to do that. I think it's an extraordinarily personal, important thing to so many people across the state of Illinois. I also want to make sure that people don't get sick doing it. And so we've guidance for drive-up services. We are working with churches on outdoor services. And then the question is, what's the population that you can get inside? What's the capacity that you could have inside a church on any given Sunday, as they say, any given day that one is having a service? And we just want to make sure that people are safe. So, we're doing that. The doctors are working on that. As you have heard Dr. Zike say, she would like very much for services to go back to some sort of indoor services. So I am hopeful that we will be able to accomplish something even more than we're already doing, but we're working very hard to get there.
This is from Joey Dania at KWQC. The John Deere Classic is scheduled to begin July 6th in the Quad Cities. The PGA Tour has yet to announce if fans will be allowed to attend the event. What conversations, if any, have you and your staff had with the PGA Tour about the event? And is there any scenario in which fans would be allowed to attend?
I can't answer that question. I know the PGA has been in touch with my staff, the Illinois PGA has anyway, and I just don't know what the status of those discussions are.
This is from Amanda Vinicki. What does it mean for the future of healthcare that a hospital transformation program was not approved during the spring session, particularly for hospitals on Chicago's South Side that say they can no longer move forward with a planned merger now? Should the legislature have passed a transformation program? What can or should be done to help residents in these areas?
And this is extremely difficult because I want that transformation to take place as soon as possible. The 4 hospitals that we're looking to merge for in total $1 billion in order to make that transformation take place. At this moment, with so many things in flux about our state budget, it was nearly impossible for the General Assembly to go forward with $1 billion program. And I know that timing, makes it very, very difficult for those hospitals. We have a real challenge in this state. Simultaneously with the introduction of Obamacare, which has been so tremendous for expanding health care in our state, we also have had challenges for hospitals that now are doing much more outpatient and not inpatient. And so the result of that is the hospitals don't have as much business revenue coming in the door as they were before Obamacare became the law. Now, so you have hospitals transforming, trying to figure out how to operate with more outpatient procedures to specialize a little more and so on. And then along comes COVID-19, where now that some hospitals have closed, here we have COVID-19 where we need more healthcare providers. And we have an outbreak and a pandemic and something that's really affecting much of the population. And so these things are kind of cross currents occurring with a budget that is, has been very, very difficult, revenues dropping off and so on. So I just say this is a situation none of us wanted to be in. I'm hopeful that we'll be able to get to hospital transformation with the assistance, again, with federal government help to replace revenues that are lost. We want to get back to transforming healthcare across the state so that everybody gets it and that we have enough facilities.
And our last question is from Benjamin Zamora at Telemundo. The National Association of Theater Owners in Illinois is asking to reopen movie theaters and theaters under Phase 3 with new safety protocols in place. Is this something the state is considering?
Yes, but not for Phase 3. It's something that we've contemplated for Phase 4, lower capacity and so on, but not in Phase 3. And I know that the theater owners would like it to be in Phase 3. It's just, it's very difficult to imagine it happening. Having said that, as we look at how we might do things in churches, the kind of the seating, the way that seating works out in a church acts very much like it would in a theater, for example. And so we'll be looking at how we can work these out in churches and then move to the question of theaters.
Great. Thank you, everyone.
Yep, thank you.
All right, guys, thank you so much for being here with us on coronavirusnow.com. And also on our YouTube stream. Just to let everyone know, we do have a second stream that has launched. It is showing the protests that are happening both in Minneapolis and Los Angeles for George Floyd, who had died because of police taking him into custody. I know a lot of people have been talking about the incident, seeing the video of the officer pinning down George Floyd with his knee. Floyd was saying he could not breathe multiple times before going unconscious and was later pronounced dead on Monday night. Now, protests happened yesterday. They continue today, not only in Minneapolis, but also in Los Angeles. We're giving you a look at both of those protests from our choppers. So if you do want to head on over to that second stream, you can do so. But we're going to continue to give you more COVID-19 news here on this stream with our coronavirusnow.com and here on News Now. So we are going to turn things on over to Wisconsin, get an update from them on their coronavirus numbers across the state.
Good morning, everyone, and thanks so much for being here today. I hope you had a safe Memorial Day. As with so many things, this year was certainly different, but I know that many Wisconsinites were able to find ways to safely enjoy the long weekend. There were socially distanced cookouts with just a few close friends and family, bike rides and picnics, and even some fireworks. The weather was ideal for visiting our state parks. I'm told that a number of folks were able to do just that. More importantly, I hope that everyone had a chance to reflect on the reason we commemorate Memorial Day each year, to recognize and honor the brave men and women who made the ultimate sacrifice to protect our freedoms and pay our respect to the families and loved ones they've left behind. As we continue to navigate these incredibly difficult times, I hope we can all remind ourselves from time to time that we should strive to be worthy of their sacrifice. Everyone can play a part in keeping our communities safe and helping our friends, neighbors, and loved ones stay healthy because we are all in this together. One of the most important things you can do to help others is to wear a mask or other face covering in public. Wearing a mask shouldn't be a political statement. It isn't controversial, and it's not hard to do. Masks can sometimes get a little warm or feel a bit awkward, but wearing one in public is a simple and necessary commitment to the common good we should all be willing to make. Most of us are still staying home as much as possible. We don't need to wear a mask at home or in our small groups of people who are practicing social distancing. For example, I don't wear a mask during these media briefings because I'm with the same small group of people each time. We're all practicing social distancing and staying home, and I want to make sure that all Wisconsinites are able to understand the updates I'm delivering. But I wear a mask on my way in and out of the Capitol and any other time I'm out in public. There's so many people who don't have the luxury of taking a mask off throughout their workday or choosing when or how to wear one at all. Our healthcare workers, including my daughter, wear a mask and PPE for 12-plus hour shifts. Those who care for our loved ones in nursing homes and our first responders, not to mention the workers who interact with the public day in and day out, keeping our grocery stores stocked, operating our transit systems, caring for our kids, and more. We need these folks to stay safe and healthy to keep our communities going. And they need us to help them stay safe by limiting spread of the disease. So let's all do our part to help on those front lines. When it comes to front lines of responding to COVID-19, our local governments are really stepping up. That's why today we launched the Roots to Recovery Local Government AIDS Program, a $200 million effort aimed at helping local leaders address some of their most urgent and unique COVID-19 recovery needs. The effort is funded by $200 million in CARE funding and will be administered by the Department of Administration. Of the $200 million, $10 million will be allocated to Wisconsin's tribal nations, with the remaining funds being distributed to every Wisconsin county, city, village, and town. Although some Wisconsin local governments have already received direct payments from the federal government, we want to ensure that every community and local partner has the resources they need to combat COVID-19 and keep the people of Wisconsin safe. The Route to Recovery grants will provide financial flexibility to local communities because they know what's best, or what they know what they need and how best to address the unique recovery needs of their friends, families, and neighbors. Some of the eligible costs for local governments include emergency operation activities, purchases of personal protective equipment, cleaning, sanitizing supplies and services, including those related to elections and to elections administration, temporary isolation housing for infected or at-risk individuals, and testing and contact tracing costs above those covered by state programs. It also covers paid administrative leave for frontline public health and public safety workers who are exposed to COVID-19 and are required to isolate while they're awaiting test results or if they get a positive test result. This paid leave is very important as these workers are putting themselves on the line to keep us all safe, and they shouldn't lose a paycheck if they have to quarantine after being exposed while working to keep us and our communities safe. Our Roots to Recovery grants are in addition to the $1 billion in resources previously announced that will fund the state's response to COVID-19, including the distribution of free testing supplies, PPE, contact tracing, community testing sites, and other valuable resources for communities across the state. These increased investments in our local governments from the CARES Act will support important work. However, more federal help is needed for both state and local partners. I will continue to advocate for additional federal investment in relief and stabilization funds for our state and local governments, and will continue to work with local partners and communities so that we can use federal funding to best support local governments across our state. Today, I would also like to take a moment to recognize Mental Health Awareness Month. This has been observed during the month of May in the United States since 1949, but the importance of this designation has certainly taken on additional significance amid the COVID-19 crisis. We know the pandemic is impacting the mental health of people around the globe, as well as right here in Wisconsin, bringing about new anxieties and depression or exacerbating known mental health challenges that people face. This is not limited to adults either. The parents of children need to know about the resources that are available to them. Wisconsin, we are fortunate to have many excellent resources available to us. One that I'd like to highlight today is a new offering by Children's Wisconsin that has been enabled by the foundation of a good corporate citizen, United Health Group. The United Health Foundation's 3-year, $2.5 grant to Children's Wisconsin is aimed at addressing a growing number of children who need immediate support amidst a mental health crisis. In the coming months, Children's will expand its offerings with a 24/7 mental health crisis response team that can provide immediate assessment and referral while improving the patient and family experience. We are grateful for an outstanding health infrastructure that includes mental and behavioral health here in Wisconsin that helps to safeguard and improve the emotional health and well-being of our citizens. We thank Children's Wisconsin and the United Health Foundation for continued innovations in healthcare so that the right services are available at the right time for those who need them. Don't hesitate to discuss concerns with your child's primary care doctor, another health profession, or a trusted resource in the community. Find a local mental health treatment provider. Text HOPELINE to 741-741 for support. And now, before Secretary Designee Andrea Palm gives her daily update, I'd like you to hear from one of the healthcare workers on the front lines, Dr. Aronica Williams, Chief Medical Officer for Milwaukee Health Services, Inc. Aronica, take it away.
Thank you, Governor Evers, for this opportunity. I understand that the purpose of these highlights of clinical staff around the state is to help bring the COVID-19 experience to life. Our organization started talking about COVID-19 in January 2020. As a Chief Medical Officer, it is my duty to highlight health topics and public health concerns that are emerging across the globe to ensure that our providers stay well informed, especially so that we know how to educate and advise our patients. At that time in January, COVID-19 was touted as being just like the flu. However, this virus has proven itself to be vastly different than many that we've seen in the past. Like many other health providers, I was glued to the computer reviewing CDC and WHO updates and COVID dashboards and immersed in conference calls with other like entities, trying to get a handle on what our collective response to this larger than life virus would be. At first, testing was so limited and PPE was so scarce, we felt very ill-equipped with the existing resources. It was a very humbling time. As the weeks and months passed, our clinic, along with the other Milwaukee area federally qualified health centers, were commissioned to become testing sites. Testing supplies and PPE resources became more available through various partnerships, and we were glad to contribute and serve Milwaukee's most vulnerable populations through this effort. To date, we have performed several hundred tests for symptomatic patients, and we are still testing every day. Nationally, we learned about the virus, its spread, and how to decrease the risk of acquiring it. We had more information in our armamentarium to help us further educate and inform patients. We were constantly updating our processes and procedures to match the ever-changing guidance from regulatory bodies. As such, our clinic's leadership had to make the tough decision to curtail operations, relegating clinic visits to patients who absolutely needed to be seen in the office, and canceling preventive visits such as physicals, pap smears, mammograms, and routine dental visits. And although we have developed our telehealth process during this time to offer patients the ability to still connect with their provider while remaining safe in their home, the overall reduction in services financially has impacted our clinic. But we realize that financial impact is not unique to our clinic. Several businesses in our state have been hit hard. It's been a challenging time for us all. As a primary care provider, I talk a lot about prevention with my patients. We are all familiar with the axiom, an ounce of prevention is worth a pound of cure. I couldn't agree more with COVID-19. After the weeks and months of research and testing, the best remedy for COVID-19 still continues to be social distancing, wearing masks, washing and cleansing our hands frequently, and sanitizing commonly used surfaces. COVID-19 has proven itself to be no respecter of persons. We have seen both the rich and the poor affected. We have seen people in all age groups affected, and we have seen so many succumb to it despite race and gender. It has literally taken life from us right before our very eyes. And because no cure exists yet, we must not become careless in our activities and our social engagement. I absolutely understand that businesses have to start opening back up. Countless business owners and leaders are looking at how to do just that and open their businesses in the safest way possible. As a doctor, my mission is to protect my patients in all that I do. As a chief medical officer, I make it my mission to protect my staff in all that I do. I cannot fulfill either of those missions if our community as a whole is so quick to resume the normal that we once knew and forfeit the public health gains that we have seen when safer at home orders were in place. This battle with COVID-19 is far from over. And although healthcare providers have seen some improvement in testing and supplies, we are definitely not where we need to be as far as resources are concerned. As I mentioned, this journey has been humbling and challenging, but we know what to do. There is talk of a second wave in the fall, but we have to remember that our decisions today will impact what we will be allowed to do tomorrow. I do not want us to go backwards and see a rise in cases in our state. Each of us has a responsibility to ensure the improvement in our community, and I'm asking each of us to do our part. Again, Governor Evers, I am extremely grateful for this opportunity to share just a small aspect of my journey. I will now turn over the discussion to Secretary Designee Palm.
Thank you, Dr. Williams, for your dedication to your patients, to your staff, and to your community, and for sharing your story today. Today, I want to talk about testing. Testing is fundamental to our ability to box in this virus, and we've made great strides here in Wisconsin. In fact, our lab capacity is one of our success stories. Working with partners across the state, we have taken our lab capacity from 0 to well over 14,000 tests a day in 2 months. And that is important to know, because that means that everyone in Wisconsin who needs a test can get a test. We want to make sure that everyone in Wisconsin hears this message, which is why we are announcing a new public service campaign today. You will hear us on the radio and see us on TV with a simple message: if you need a test, get a test. If you have any symptoms of COVID-19, or if you have been exposed, please call your healthcare provider. And to find out if there is a community testing site in your area, visit our website at dhs.wisconsin.gov/testing. I've shared the symptoms of COVID-19 with you before, but I want to emphasize that even if you are experiencing just one of these symptoms, or even if your symptoms are mild, you should still get a test. The symptoms to watch for are a fever of over 100.4 degrees, cough, shortness of breath or difficulty breathing, a sore throat, headache, chills, muscle aches, and a new loss of taste or smell. Let me underscore this, because I want you to know why testing is so important to you and to your community. The reason we test is to find out vital information. On an individual level, your test result helps you know whether you need to isolate yourself from members of your household and what kind of changes in symptoms to look for. At a community level, testing and contact tracing tells us where to look for more infections, and that tells us where to send needed resources to help stop the spread. So here's where things stand today. We have 210,605 negative tests, which is an increase of 9,731 over yesterday. There are now 16,462 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 599 cases over yesterday. Our total deaths have reached 539. Testing and tracing, these are integral steps to our public health response to COVID-19. And we can only take these steps as partners. DHS cannot test and trace alone. We need your help. So please, if you need a test, get a test. Remember to stay at home while you wait for your results, and please answer the phone if a contact tracer calls you. Wash your hands frequently for at least 20 seconds and continue practicing physical distancing. We will get through this together. Thank you for your ongoing partnership.
Thank you. And we will now open it up to questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And in the interest of time, only one question per reporter per media outlet. And we'll begin this afternoon with Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for doing this call. My question has to do with the contact tracing that you just mentioned. Where is the state at with the contact tracing, hiring all those tracers, and the new software technology that's helping kind of with the record keeping with those tracers? Thanks.
Thanks, Casey. So we continue to make progress on the contact tracing front, building up those resources with our local partners so that we're able to do the work we need to do to box in the virus. We have deployed or redeployed, about 400 state employees into this effort. We additionally have hired and onboarded 100 LTE contact tracers. We did that first tranche the week of May 18th. They have been in training and are about to hit the ground running here for us. And we are currently in a second round of interviews with additional candidates, and we are targeting